I think so. Now we are.
You see, you did it for us. We are now live on YouTube. Good morning, ladies and gentlemen of the state of Connecticut and elsewhere. I am State Representative Jonathan Steinberg from the town of Westport, 136th District, and co-chair of the estimable Public Health Committee, which today is about to initiate its final day of public hearings, which shall be not only good news to members of the public, but also to all members of the committee who have withstood a grueling schedule of public hearings and meetings, which are nearing their end. But today we have before us several important pieces of legislation, and there are a large number of people who are interested in testifying about these bills. We are looking at conceivably as many as 180 people who would like to talk with us today. If we choose to ask a ton of questions and to make extended commentary, I can assure you we will be here until the cock crows tomorrow morning. So I encourage everyone to stay as focused as possible at asking questions that are very pithy and clear, and that we try to limit the number of questions that we ask. This is not intended as any effort to keep anybody from asking any question they want, but bear cognizance of the fact on behalf of your colleagues and the viewing public that we want to hear from everyone, and we'd prefer not to have to hear from anybody at 3 a.m. when we may not be our freshest. So without further ado, as we typically do in the first hour of our hearings, we defer to elected officials and agency heads. And I want to welcome Commissioner Giuttani from the Department of Public Health and her support staff, who have done an amazing job on behalf of the state of Connecticut. Welcome, Commissioner.
Thank you very much, Representative Steinberg. Hello to Senator Anwar, Representative Steinberg, Senator Summers, Senator Huang, Representative Pettit, and esteemed members of the Public Health Committee. You can all hear me, correct? Okay. Thank you for the opportunity to testify before all of you today in support of House Bill 5500, an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. This bill makes several technical revisions to the public health statutes, and I'd like to highlight a few for you today, as there are several. Highlights of these revisions include allowing the department to waive outdated regulations related to clinical laboratories to make it easier for them to collect blood, platelets, and perform plasmapheresis without endangering the health and safety of the consumer. Please note that the department needs a revision to this section to allow these waivers to take place upon passage of the bill. Additionally, the bill requires healthcare institutions to provide DPH with staffing plans for a minimum of 3 days of staffing, at least 5 days prior to a strike commencing at the facility. At the time of the last potential strike, the department ran into issues with nursing homes not planning for staffing appropriately, which may have led to insufficient staff to properly care for residents. To further protect nursing homes, this bill adds infection control measures to the continuing education requirements for nursing home administrators to ensure they have a foundational knowledge of infection control measures. This bill also requires DPH to perform a scope of practice-like process for the practice of midwifery. Connecticut is one of 16 states and the District of Columbia that does not regulate the practice of midwifery performed by non-nurse midwives. The department occasionally receives calls from hospitals and OBGYNs or pediatric providers with concerns about the care provided by a midwife, yet there is no mechanism to regulate midwifery practiced by a non-nurse midwife. There are no state restrictions on who can call themselves a midwife or practice midwifery in Connecticut, except for nurse midwives. The department believes that a scope of practice-like process, which includes individuals from the profession and others involved in maternal and child's health, is the best option to provide guidance to assist the legislature in establishing a regulatory framework for this profession. The last section I'd like to highlight is one that establishes a doula advisory committee to develop recommendations regarding training and continuing education for the purpose of creating a doula certification program. Additionally, the committee will create a doula training program review committee to conduct continuous reviews of doula training programs and put forward a list of approved training programs that meet the certification requirements established by the advisory committee. Thank you for the opportunity to testify before you today, and I'm happy to answer any questions that you all may have.
Thank you, Commissioner. Have you submitted testimony with specific language proposals with regard to both the, the phoresis issue in particular? And I guess the question I also would want to ask is, are you in opposition to the bill related to midwifery until such time as scope of practice can be pursued as per usual process?
So I would like to ask if either, I'm sorry, your first question was around the phoresis question, right? Around the blood
Correct.
products. Okay, so I would like to ask if any of our staff know, I think what we wanted to do was just move sections to specific other areas in the statutes so that it could be regulated as a facility. So for the labs to be moved. So I don't think it's so much that we need to change language there per se. It's we have to move where it is from one section to another. And I believe that there is language on that. Jill, do you have anything further to comment on that specifically?
We do know that we do need to do more work on the clinical lab language. This is what we could do quickly to help relieve the labs, and we would like to convene a working group in the interim, and you will probably see legislation next session if we need it. Otherwise, we're just going to be updating regulations.
And just to be clear, that was Jill Kennedy from DPH.
Sorry,
Yes.
Thank you for that. We'll look at that very closely to make sure we get it right, but we're pleased that you do not oppose the fundamental legislation as much as just want to make sure that we get it right for purposes of implementation.
Correct. Now, in terms of your question around midwifery, in terms of that specific bill, I must say that I have not read the specific bill I believe that you're talking about. If there's a specific one that you want to alert us to, we can get back to you on that.
Perhaps I misunderstood. Your comments were intended to simply assure that that we address the outstanding issues with regard to midwifery regulation through the process. And are you suggesting this will be a priority for DPH in the coming year in terms of its queue of always lengthy scope of practice applicants?
Yes, I mean, I think that what we would like to be able to do is convene this and make it a priority and convene the scope of practice like review. Since this, for non-nurse midwives, we currently have no authority at all currently. And so by creating such a committee to do the review, we would be able to identify what could be put in place so that it could be a profession that has some oversight.
She was actually up before.
Representative Jenga, good morning. It's time to mute yourself. Thank you. Sorry about that, Commissioner.
No problem. But yes, it would be a priority.
Thank you. Just for that clarification. Representative Zupkis.
Thank you, Mr. Chair. Good morning, Commissioner. Thank you for coming here today. I know you were talking on House Bill number 5500. My question is on House Bill 5397. It is the declaring gun violence a public health crisis and establishing an advisory council. And I am curious to, number one, your thoughts, because it is going to be under your agency. There's all just gun violence. So will this incorporate that? Will this get to the root of the problem of gun violence? And why is it a public health crisis?
Did you get all that, Commissioner, or do you need to have it repeated?
So you broke up just for a second. So maybe you could just restate, was your question on whether this advisory council would be able to get to the root of all gun violence? Is that correct?
So that's, I guess, my biggest question, because we know there is gun violence, especially in the cities. And so I guess two questions. My first question is this going to get to the root of the problem?
Mm-hmm. So I think the key thing is that I know that there are several bills that are being looked at. And I think the key with the advisory council is that it does equip us with experts in the area and allows us to have the tools to identify what the key problems are, how to work with people in the community and leverage resources at DPH so that we can get to the crux of what you're talking about. So really the advisory council's goal would be to identify solutions that would work best to address the problem in the community.
So I was ranking a few years back on public health and public safety. And of course, guns is a big issue in that committee, as in my opinion, is where it belongs in judiciary. And there is already an advisory council set up after Sandy Hook happened, that godforsaken tragedy. There was a council that is already set up. So it seems like we're duplicating. Why would we not take the council that is set up, has been studying all of this for years, and use that and add on to it? Why are we duplicating this council?
So I think we're looking at trying to find the best way forward to be able to address this issue. I understand your point that there is a council that is already doing this. I think that we do have staff that sit on that council as well. What our goal at DPH would be is specifically to address the parts on community engagement and where our staff can influence and provide input to be able to create some of those public health interventions that complement the interventions that are being done by public safety. And so what I think our goal would be in all of this is to work with all of you to find the best way forward with all the bills that are out there to be able to accomplish the goal that we have at hand, which is to reduce gun violence and its effects overall. So for example, the impact that gun violence has on those who are not even the recipient of a gunshot, the impact it has on a community, the impact it has in a broader perspective is one that is certainly one of public health. The impact it has on other youth that might be influenced by things that are happening around them is one of public health. And so really bringing forward the public health impact of this type of violence is where we see our contributions to be. And identifying the interventions to work with people in the community.
Yeah, and I'm really hopeful that this is the case, because as long as I've been in the legislature and seen many gun bills and many proposals, it always affects the law-abiding citizens. It never affects people that don't have gun permits, that are, shooting each other without, and I've been saving articles. I have articles from the Waterbury Republican, felons having guns and killing and all these things, and it never addresses that. And that is the problem. It's not people that, use this as a sport, have their permit, law-abiding citizens. This is the crimes that are happening, and nothing has been able to fix that. And so I hope that, we're not duplicating efforts. I hope that everybody is going to be working together, not to take guns away, not to take, affect these law-abiding citizens, because they always do. They never affect the people that need to be affected by these gun laws. So I really hope, and there's so many other acts of violence out there besides guns that, it would be good to kind of bring some of those things in as well. There's stabbings, there's all kinds of things. And it's not just always about guns. So I hope all of this will be brought into that. Thank you.
Thank you, Representative. Though I have to say that I strongly disagree with your statements about never. It's very strong when we use absolutes. These gun laws that we passed since Sandy Hook and even before have had a profound impact. The mere fact that criminals use guns is not an excuse for not taking action. And I would also argue that there is nothing more lethal than a gun. They were intended and created to kill people. So that's a very different thing from a knife in my point of view.
I think we can agree to disagree, Representative. I'm not sure part of the big gun law was magazines can only hold 10 rounds, and so 10 to 11 rounds, one bullet. But it is I agree that it is a violence out there, but I'm just concerned that all these bills, I want to make sure they get to the root of the problem of what really is the problem.
Thank you. I'll just say to conclude that more guns do not mean more safety. In fact, I think the exact opposite can be proven via evidence. Senator Moore.
Thank you and good morning, Commissioner. How are you?
Good morning.
There is another bill. It's Senate Bill 477 that looks at creating a commission. Have you had an opportunity to look at that?
I believe I did, but honestly, I wasn't prepared to discuss that specific one today, so I don't have it top of mind.
Okay, I understand. And I don't want to put you on the spot for something. It's in Section 7, also talks about a commission. I had a question regarding some funding that Governor Lamont had put forth last year, $3.5 million or $3 million for gun violence prevention. Has that been awarded?
Are you talking about the current bill that is proposed, the governor's bill?
No, the governor spoke of doing something with gun violence at the end of last year with ARPA funds for gun violence.
I believe that is the governor's bill that is proposed right now. There's nothing else that has been done other than the current bill that the governor has proposed.
Okay. The only reason I bring that up is that the governor did in a press release talk about $3 million of ARPA funds that he was going to dedicate to gun violence, and that hasn't happened. And the reason I listened to Representative Zupka's comment about getting to the root cause of the problem. The root cause of the problem that we're talking about at a community level are community-based organizations that do this work when someone gets shot and someone has to go to the emergency to make sure there's not any more continued violence or retaliation. Community-based, where neither one of the bills is looking to take away guns from anyone, any place, but it's doing what Representative Zupkis would like it to do. Get to the root cause where the children are with community organizations who deal with this every single day. So when you get a chance, I would ask you to look at Section 7 for me, and I can have another conversation with you, because it's a continuing conversation and the bill is not fully written or drafted, and I'd like to have some input. So thank you.
Thank you, Senator Moore. I think overall we have the same goal and objective in both bills that are out there. And I think you addressed exactly the point that I was addressing before in terms of the engagement with the community.
Thank you. Thank you, Mr. Chairman.
Thank you, Senator. And for everyone's benefit, including members of this committee, the bill to which Senator Moore alludes only recently came out. I believe it's Senate Bill 477. Am I correct with that? So I advise members of this committee to look at that legislation as well. We will try to figure out how best to reconcile two bills with similar aims post JF deadlines. Representative Calvaros de Gra.
Thank you, Mr. Chair, and thank you, Commissioner, for being here this morning. It's wonderful to see you. I'm curious because as you're talking, I'm getting the sense that this is definitely more than an advisory council, which I think is probably a positive thing considering what we are seeing. And I would love for you to go more into like what kind of metrics are you looking at? What kind of data are you looking to collect? You know, research, staffing, all of those things. I'm just curious, what's the dedicated staffing going to look like for this also?
So I'm happy to provide some of that more information. We had addressed a lot of this in the governor's bill. And when we discussed that, we have one staff requested in terms of the funds that would come specifically to DPH, 1 to 2 at most. But again, I think a lot of the work that we're looking to do is to identify sort of root causes of the impacts of gun violence in communities, work with community organizations to be able to identify the most effective intervention strategies that we could do to reduce the impact that gun violence has, not only on the people involved in the gun violence, but on a community at large. So the ask for DPH alone is relatively modest in terms of additional staff that we would need. It's, a couple of people probably that we're asking for in this, but that's because a lot of the work, it's part of a larger bill, the governor's bill. And we are welcome and look forward to working with Senator Moore, with others who are working on this specific topic and with the various bills that are out there to try to put forward the best proposal that we all can agree on.
Thank you. And I think that in terms of when you're saying, these community organizations, I'm grateful to hear that because, communities often have some of the best possible solutions because they've already been working on them and, meeting those folks where they are, addressing the trauma in these communities. I think all of that is so important. So I really am looking forward to learning more about this and seeing how this develops because we certainly have an issue and we need to address all of it. So thank you so much for your time today.
Thank you.
Commissioner, I don't see any further questions. I know this is shocking. This may be the shortest experience you have with the Public Health Committee. But I want to thank you and your staff for spending time with us and invite you to stay with us for the next 14 to 18 hours if you so choose. But if not, we will move on to Commissioner Navarrete from DEMIS and her staff. Welcome, Commissioner.
Thank you very much.
Good morning. Good morning, Senator Anwar, Representative Steinberg, and members of the Public Health Committee. I am Commissioner Nancy Navarrete of the Department of Mental Health and Addiction Services. Thank you for the opportunity to provide testimony regarding SB number 450, an act concerning Connecticut Valley and Whiting Forensic Hospitals. I have here with me today CEO of Whiting Forensic Hospital, Jose Crego, Chief Medical Officer Tobias Wasser, and Chief of Forensic Services Rena Kapoor. DEMIS operates 4 inpatient treatment facilities for persons with severe addiction and/or psychiatric disorders. Inpatient treatment provides individuals with services that assist them to better manage their illnesses, achieve personal goals, and develop skills and supports that lead to living the most constructive and satisfying lives possible. The 2 largest DEMIS inpatient facilities are Whiting Forensic Hospital and Connecticut Valley Hospital. Whiting Forensic became a separate hospital in 2018. The hospital's plan for the appropriate care, treatment, and services for patients regardless of legal or correctional restrictions and coordinate administrative and clinical decisions regarding length of stay and plans for discharge and continuing care in the community. The department is eternally grateful to the legislature for their support provided in the behavioral health community. The legislators shared the sorrow and felt the same outrage as DEMIS in the wake of the serious abuse that occurred in Whiting Maximum Security Unit 5 years ago. This abuse will not and should not ever be forgotten. SB 450 reflects recommendations of the task force to review and evaluate CVH and Whiting Forensic Hospital, the Psychiatric Security Review Board, and behavioral health care definitions. While the task force deliberated, we moved ahead. DEMIS implemented significant changes in hospital operations to ensure the highest quality patient care. I would like to provide the committee with some of the changes made to assist in deliberations regarding SB 450. The improvements at the hospital include a CEO, Chief Executive Officer, who reports directly to me, the Commissioner of DEMAS, and leads the team at the hospital. A high-definition camera system monitored 24/7 by an outside security services agency. That's in use throughout Whiting Forensic Hospital and CBH. On-site random reviews of cameras by directors of nursing or other managers for all patient areas on all shifts, with a particular focus on individuals who require constant observation. In addition to monitoring patient and staff safety, reviews of the camera footage are used for staff education. So examples of good practice are then shared with other members of the hospital. Policies and practices have been developed, enhanced, and implemented, including enhanced review of restraints and seclusion and other significant events, improved timelines related to reporting and investigating allegations of patient abuse, neglect, and exploitation, annual mandatory training for all DEMAS staff on reporting abuse and neglect, and opportunities for staff to actually remove themselves temporarily from the milieu if they are experiencing stress in this intense environment. Hospital staff members have participated in surveys and focus groups regarding the hospital's culture. Staff, including newly hired recovery support specialists or people with lived experience, provide feedback to administration via work groups and town hall meetings. Regular opportunities for joint patient and staff activities build community in the hospital, and that occurs regularly. Whiting Forensic Hospital has implemented what's called Safe Wards, a 10-intervention milieu management system. This model shifts the unit culture to a recovery-oriented model. Safe Wards has decreased acuity on hospital units and resulted in increased staff morale and is a best practice nationally. Patients participate on many hospital committees, including programming, cultural diversity, and policy. The DEMAS Division of Forensic Services has hired additional staff to coordinate discharge planning and community services for patients under the jurisdiction of the Psychiatric Security Review Board. Whiting received licensure from the Department of Public Health, and there are efforts in place right now to pursue accreditation by the Joint Commission on the Accreditation of Healthcare Organizations, which is a very high standard. Whiting maintains restraint and seclusion rates well below the national average at psychiatric hospitals. $2.5 million in ARPA funding in the governor's fiscal year 23 adjusted budget will support 26 additional community placements for patients or clients who no longer meet hospital level of care, and $1.9 million in annualized funding will expand a pilot program from 3 to 15 beds to provide community competency evaluations and restoration to competency activities for repeat offenders of misdemeanor-only crimes. SB 450 seeks to make improvements to the functioning of the hospitals. While we share that goal, we would note that certain provisions of the bill need further refinement to address practical and operational issues. The department is happy to work with the committee to ensure the final bill language accomplishes the goal while reconciling with a system that must accommodate a myriad of interests governed by contracts, regulations, stipulated agreements, case law, human resource practice, and federal and state statutes. The task force also expressed concerns about the living quarters in work areas in Whiting. The March 31st bond agenda includes $3 million for planning and design for replacement of Whiting. I'd be happy to answer any questions you may have regarding this testimony. Thank you for the opportunity to testify on this bill.
Thank you, Commissioner. Could you do us the benefit of just amplifying slightly on the changes that you think are necessary?
As proposed.
As proposed.
So we are definitely in support of a new Whiting building. We agree with many of the comments that were made. The building is not built in a recovery-oriented fashion. The treatment milieu is in the basement.
there aren't large spaces for patients to interact with one another and to be able to interact with the staff. I think it was Mike Lawler who described this diamond shape where you need to walk through one unit to get to the next unit, and all of that is very accurate. So we are excited to be on the bond commission. We're excited to have the preliminary work being done to look at the site and plans to build a new hospital that will be the best for our clients and be able to emphasize recovery-oriented care.
Okay, so that deals with the structure of the facility itself. Are there any other comments you'd like to make about changes to process or to other recommendations that the committee should be aware of?
I am proud of the fact that we are licensed by DPH. So I think that the report does speak to additional wanting to have additional oversight. And we have Joint Commission accreditation, which CEO Joe Crego has been working very hard to bring the hospital along that line. And we've received initial feedback that is very positive. So I think we will be able to comply with those pieces of concern regarding oversight and accountability.
Commissioner, I don't know for a fact that you were listening in on our informational forum this morning, but I'm going to ask you one of the hard questions I asked then.
Sure.
There are concerns about the culture of the institution. There are concerns that even though there has been change, there are still aspects of the old paradigm, if you will, which are resistant to change. It's a very strong statement to suggest there may be elements of racism or bias that still remain within the culture there. And there are still some significant concerns. You heard mentioned concerns about the contract with Yale and some of the other ways things are being done. I'll just give you an opportunity to comment.
Sure. Thank you for those questions. So in terms of the Yale contract, I just want to point out that both CEOs of each hospital, CVH and Whiting Forensic Hospital, are state employees. So there is accountability through a state employee. Staffing contracts are used oftentimes in large hospital systems. We find this a particularly effective one in that it provides for, especially in this time of a healthcare shortage, it brings young people into the field. It trains them through fellowship programs. It mentors them. It fosters interest in psychiatry and forensic psychiatry, which is a specialty service. And it introduces them to public service. So these are folks that we may not ordinarily be able to attract into public service. And this is an excellent way to do that. I don't know if Dr. Kapoor or Dr. Wasser can add to that regarding their own experiences in working with folks that have come through that system and have contributed to the DEMA system of care. Dr. Wasser?
Certainly, Dr. Wasser, please go ahead.
Sure. Thank you. Good morning, everybody. My name is Tobias Wasser. I'm a psychiatrist. I'm the Chief Medical Officer for Whiting Forensic Hospital. So as Commissioner Navarrete alluded to, the staffing contract with Yale provides an opportunity for us to have access to some really intelligent, talented individuals who might not be able to otherwise recruit to work in our state system. I'll say that for the purposes of Whiting Forensic Hospital, also, I think to be very specific about the degree to which we utilize that contract. So all of our direct care psychiatrists are individuals who are state employees. And really the contract is used in a very limited fashion for two purposes. One is for consultants who are experts in forensic psychiatry. It's required in statute that the hospital have consultants in forensic psychiatry to provide risk assessments and management recommendations as individuals under the PSRB progress through our system. And then we also use it in a limited fashion to bring in forensic psychiatry leadership expertise to assist in the management and the clinical management of the hospital. But ultimately, as the commissioner stated, our CEO, Joe Crego, is a state employee. And so through that mechanism, we do believe that we still have sufficient accountability. The other thing it allows us to do through DEMIS's funding of that is to train individuals, not just in psychiatry, but in forensic psychiatry, and then recruit them to come on as state employees. And during my time over the past 5 years in this role, we have recruited a number of individuals who were fellowship trained in forensic psychiatry and then recruited to become state employees and provide high quality care to our patients at Whiting.
Thank you for that. It's conceivable we will be revisiting some of these issues and concerns as we go forward. We appreciate DEMIS's willingness to deal with a very, very long-standing problematic issues, really predate any of our participation, and a desire to make the institution as safe and enhance the quality of life for all those who are there. This is a big subject for this committee and for this legislature, and we expect to have further conversations about getting this bill ready to go, because we are intent upon doing something legislatively.
Thank you, Rep. Steinberg. I would also say that I'm very proud of our CEO, Jose Crego, who makes himself available to staff on each shift, on each unit. He makes rounds and he offers himself to receive. He has an open door policy. He offers himself up to receive feedback from all the staff, including forensic treatment specialists, nurses, clinicians across the board. So I don't know if you want to hear any more from Jose, but I think he's doing a fabulous job with his policies and updating his accessibility to our staff.
We'd be glad to hear from Jose if he has anything to add, but we don't want to force you to do so.
Thank you very much, and thank you, Commissioner, for the kind words. As the Commissioner stated, one of the areas that I see as a crux of my tenure here as a CEO is to, as you were mentioning earlier, the morale. And I think one of the things that I've heard loud and clear is that staff members don't feel a part of the decision-making process, don't feel that their concerns are heard, and things of that nature, as your earlier study suggested. So what I've done is I go out on a regular basis, as the Commissioner said. I attempt to visit 2 units per month on each and every shift to give staff an opportunity to speak with me directly, share their concerns, and then I get back to them with what I've been able to find out and what we've been able to do to address some of those concerns. Sometimes it's just acknowledging the fact that we're in a larger system and we'll all work to improve or work with the constraints that we have as a system. In other instances, we've been able to make small changes that truly improve the ability to help our staff. For instance, over one of the recent snowstorms, a staff member had mentioned to me the need to understand what hotels in the area provide government rates, so that they don't have to drive. The one staff member that was asking for that, and it may sound trivial, but she was driving in from New York, and during a storm, it can definitely be a potential hazard for her to go back and forth, especially if you have to stay a little bit longer. So preemptively, my office has sent out before each and every storm a list of folks, of hotels in the area that will accommodate our staff members overnight and give them a government and sometimes even better rate for them to stay there. As the Commissioner stated, we have town hall meetings daily. Each morning, there's a hospital-wide call that goes on that we encourage staff members from all levels to take part of. And then monthly, I have a phone call that is a general call for each and all staff members on second shift and then on third shift as well. And continuously, I think most of the administration here, Dr. Wasser certainly, and others on the administration round the units on a regular basis. And that's done not just for staff members, but we also get out and speak with patients. And we're able to hear from a firsthand basis how patients feel things are going, what concerns they might have. And again, allow us the opportunity to respond to them. And in many cases, apply the changes that they suggest. Thank you.
Thank you. I think it's also very important that we hear from current resident patients. I know that many were frustrated in their ability to sign up today because of technology issues. We were trying to find some time at some point during today's hearing to hear from a number of patient residents. And I encourage you, at least one member of your staff, to be listening in, because obviously that testimony will be taken very seriously as we consider remedies.
Absolutely, Representative Steinberg, just as you know, the hospital, we are standing by in both buildings to whenever the glitch is cleared up to ensure that those patients wishing to testify are able to do so. So we have many folks on the standby ready to provide that for our patients.
Thank you for your testimony today. Seeing no further questions, we will move on. Thank you. Next up is Charles Ferraro, State Representative. Welcome, Representative Ferraro.
Hello, how are you?
I'm great. How are you?
Very good, Mr. Chair. Thank you for allowing me to come today and testify. Good morning, co-chairs Dougherty, Abrams, and Steinberg, ranking members Wong, Summers, and Pettit, and members of the Public Health Committee. Thanks for letting me testify on the inclusion of the Connecticut Complementary and Alternative Healthcare Services Safe Harbor language in HB 5500. Currently in our state, there are many non-invasive gentle healing practices used by thousands of Connecticut consumers. In fact, the research shows that over 1/3 of the population is now using some form of complementary and/or alternative practice. Practitioners of these healing disciplines, such as aromatherapy, healing touch, reflexology, Reiki, and others, are providing these services to their clients through small businesses in almost every community in Connecticut. Potential clients of these services have a wide range of options when seeking relief and or comfort. The more information that a consumer has about their practitioner, the better it is when choosing a practice. Many of these non-conventional healthcare professionals are concerned that their practices can be considered in violation of health occupation laws for practice without a license, even though they are not practicing a conventional healthcare profession. Many such states as Minnesota, California, Rhode Island, New Mexico, Colorado, Maine, Arizona, Oklahoma, Louisiana, Idaho, and Nevada, as well as Massachusetts, have been proactive in this regard and have provided an exemption to licensing laws for the gentle practitioners if they avoid a list of prohibited acts and provide their clients with the necessary information regarding their practice methods and education. The language in the bill that provides the exemption can be found in Section 3 of provisions of complementary and alternative healthcare by unlicensed persons, which I've included in my written testimony, but will not be going into here unless there are questions. This section basically says that a person who is not licensed, certified, or registered by the state of Connecticut and who provides these services shall not be in violation of the law for unlicensed practice or provision of service if an occupation or profession, unless the person, 1, engages in any activity prohibited in Section 4 of the Act, or 2, fails to fulfill the duties set forth in Section 5 of the Act. With this bill, the complementary and alternative practitioner will have clear guardrails as to activities that they are prohibited to partake in. And if a complementary and alternative practitioner does not abide by the required parameters of the exemption, then current law will be in place, as always, to address the situation of unlicensed practice. Transparency between conventional practitioners and complementary and alternative practitioners is helpful to conventional practitioners. When complementary and alternative practitioners are practicing within the guidelines of the law, clients feel free to share their practitioner information and disclosures with their conventional medical practitioners. This often decreases their stress levels, offers additional healing and can often increase their ability to comply with their conventional treatments. I want to thank you for letting me testify in this very important piece of legislation, and I respectfully ask the leadership and members of this committee to include the complementary and alternative healthcare safe harbor language into HB 5500. This concludes my testimony, and if there are any questions, I will do my best to answer them.
Thank you, Representative. Let me start by asking, does the exemption that we're looking at today mirror language that has been used in other states? And do we have any data that suggests that the risk we would be taking on to free them up to some degree has not led to unexpectedly negative outcomes?
Thank you, Mr. Chair, for the question. It's a great question. The language that I brought forward is language that Attorney Diane Miller has championed in the other states, and the language is very similar to the other states. And the other states do have a history which can be tracked. And to answer your question, the liability, there hasn't been increased liability, and as a result of the language that's been put in place. This language merely gives solace and comfort to those practitioners who have already been practicing in many cases for generations. But because the broad base of the current statutes and public health statutes, they're open to the possibility that they can be legislated out of business.
Thank you for that. It's quite reassuring. Before I hand it off to Representative Pettit, I just want a point of clarification. I want to be clear that you're not advocating for the inclusion of the practice of martial arts as one of the alternative therapies.
No, I am not, sir, although I am very adept at it.
That we're very much aware of. That was a facetious question. Representative Pettit.
I know that. I know that, Mr. Steinberg.
Thank you, Mr. Chair. Representative Ferraro, I guess I assume the biggest concern would be along the same lines that Representative Steinberg was following. My understanding is that safe harbor protects people with alternative practice or doing the things they're supposed to be doing. But if someone practices outside of their typical guidelines or in areas for which they are not trained, they would still face appropriate civil and or criminal penalties if they were pursuing an inappropriate practice. Am I understanding that correctly?
Thank you for that question, Ranking Member Pettit. Again, that's also a great question, because the existence of this legislation in statute would actually make it easier to go after the bad actors and those that were not complying, with the regulations that are put forth in the legislation language that I submitted.
Is there any easy example you can give of that to illustrate it for the committee, or is that not easy to illustrate?
Well, if you refer to the actual language itself, in section 4, it speaks of what is not permitted by a practitioner, and there's just a quick list that says they are not allowed to conduct surgery, set fractures, or perform any other procedure on any person that punctures or harmfully invades the skin. They cannot prescribe or administer X-ray radiation, cannot prescribe or administer drugs, devices, or controlled substances for which prescription by licensed healthcare providers is required, cannot perform chiropractic adjustments of the articulation of joints or the spine, and cannot hold out, state or indicate or advertise or imply to any person that he or she is a healthcare practitioner licensed, certified, or registered by the state unless they hold such credentials. Additionally, there are disclosures in section 5, which go to transparency, and the practitioner's name and business address and telephone number must be displayed. The fact that he or she is not a licensed, certified, or registered as a healthcare practitioner by the state must also be displayed the nature of their healthcare services that are provided, and the degree of training, experience, and credentials or other qualifications, if any, that the practitioner regarding the healthcare services being provided must also be displayed or disclosed.
I appreciate that answer. Thank you, Representative. Thank you, Mr. Chair.
Thank you, Representative. Again, thank you, Representative, for your testimony today. We're going to look at your testimony and that of others with regard to this bill very seriously. We appreciate your input. Seeing no further questions, we're going to.
Thank you, Mr. Chair. I appreciate the time.
Moving right along to the Director of the PSRB, Vanessa Cardella. Welcome.
Thank you. Good afternoon, Senator Anwar, Representative Steinberg, and distinguished members of the Public Health Committee. My name is Vanessa Cardella, and I'm the Executive Director of the Psychiatric Security Review Board. I'm here today to speak in regards to raise Senate Bill 450. The board, a little history, the board has jurisdiction over all persons found not guilty for a crime by reason of mental disease or defect. The board is composed of 6 members, chosen for their expertise and appointed by the governor to serve 4-year terms. Equities are committed to the PSRB by the Superior Court, and this is a very small population currently membrane 147 equities. The vast majority of equities have been committed to the board for crimes such as murder, attempted murder, felony assault, arson, sexual assault. The legislature created the board in 1985 after determining there was not adequate oversight of the population. While the board's mandate is public safety, that is not the sole concern of the board. Data collected by the board demonstrates its commitment to maintaining equities in the least restrictive environment while ensuring access to community treatment. To that end, the board has maintained a 0% criminal recidivism rate for equities residing in the community for well over 15 years. Some believe that the board is overly restrictive and blind to the goal of psychiatric patients to attain recovery and leave the hospital setting, but statistics prove otherwise. Currently, 88% of our equities have community access. The board is subject to checks and balances since board decisions can be appealed in the Superior Court. Connecticut's legislature has created a public policy model that balances public safety and patient rights. Currently, the board approves temporary leaves for equities assessed to be appropriate to leave the highly structured hospital setting. SB 450 proposes to eliminate this oversight by the board. The board holds public hearings for these applications, which provide a forum for the hospital to support the requests, allows the victim to make a public statement, and ensures the right of the state's attorney to present evidence to the board. The elimination of this process will prohibit the state's attorney from presenting evidence, silence the victim, and remove the transparent process of ensuring checks and balances when transferring equities. Victims and the public would essentially have no notice of when this is to occur if the current board's process was to be eliminated. This undermines the public safety provision under which the PSRB was developed. It's important to note that equities are at their most vulnerable when first transitioning into the community, as it's their first time in their own custody. The board ensures that the community transition plans have the appropriate safeguards to ensure public safety as well as adequate treatment services for the benefit of the equities recovery. The board approves 94% of these applications. Historically, there's been complaints that the hospital did not submit temporary leave applications at a reasonable pace. And if this remains a concern, eliminating the board's role doesn't solve the problem. The board respectfully recommends that the committee consider allowing the equity and their counsel to submit their own temporary leave applications, as is consistent with the board's conditional release process for applications. As it pertains to the task force mentioned in Section 6 of this bill, the board welcomes the opportunity to demonstrate how it operates in service to the citizens of Connecticut and to the equities under its jurisdiction. As the executive director of the board, I'm committed to working collaboratively and transparently. I respectfully request that if the committee deems that such a task force is necessary, that it include a task force member who represents the victim's voice, a prosecutor with PSRB experience, and a person with PSRB experience, such as a former member of the board or an employee of the board.
Excuse me, Ms. Cardella, your time is almost up. If you
Okay.
please summarize. Thank you.
I'm ending, thank you. These additional seats in the task force will ensure that the stakeholders, all stakeholders, are adequately represented. I thank you for the opportunity to address the committee, and I would be happy to answer any questions you may have at this time.
Thank you very much, Director Cardello. We appreciate your desire for clarity and accountability in the work of the board. You have probably heard some of the testimony we had earlier from the task force, and I imagine you'll hear from some of the resident patients of Whiting later today. How do you respond to the concern that, and I hesitate to get into this only because this is not explicitly a public health committee concern, that when people are entered into the facility, it is exceedingly difficult for them ever to get out?
That's a great question, and I appreciate the opportunity to expound on that. So when someone is entered under the jurisdiction of or committed to the board, that sentence is determined by the Superior Court. And usually an equities journey starts in the setting of maximum security at Whiting Forensic Hospital. When the treatment team who is serving the equity determines that their risk can be better managed in a lower environment, then they put forth an application to the board, whether that means transferring from a max setting to a non-max or starting their community transition. So that's determined at the discretion of the treatment teams who know the equity best. Once those applications are received by the board, they're immediately placed on our agenda and a priority for our hearing process. And our approval rates are anywhere from 93 to 96% of applications set forth. So I think it's that data that I look to support my statement and my testimony, that to say we are invested in seeing people transition as soon as can safely be managed in the community or in a less restrictive setting.
Thank you for that. I'm not sure that totally covered it, but I understand your process better than I did. Representative Pettit.
Thank you, Mr. Chair. Thank you, Director Cardella. First off, thank you very much for your comments concerning victims. Victims of violent crimes often feel the forgotten party in many of these adjudications, so I very much appreciate that. I know this would be too much nuts and bolts. PSRB would you be amenable to allowing transfers from a higher to a lower facility like Whiting to Dutcher based on medical evaluations? Was that reasonable to allow that to be a mental health decision versus a PSRB decision, or am I misunderstanding the process?
Great question. So that is the current process. It's a misunderstanding that Whiting has to ask permission from the board to get medical treatment. Instead, they just notify us when that happens.
So if it's medically indicated to move someone, they notify you and that happens?
Correct.
Other states don't use PSRBs. Do you know what, is there an easy way to summarize what other states do as opposed to having this type of board overview that protects the rights of all involved?
Great question. So all of the states have some mechanism, if there's an NGRI or a defense or something like it, to manage and support each equity. I'm not familiar with every state. The closest I've come to gain an understanding is actually there was a report from the Office of Research and Public Affairs from the Treatment Advocacy Center in 2017, and they did a state survey of serious mental illness, major crimes, and community treatment. And in that survey, they ranked each state, and Connecticut was amongst the highest ranking, and that was because of the PSRB. I think what I saw from that report is the states that ensured that there was some kind of oversight to support the equity as they reintegrate into the community and ensure that they had access to services to maintain their well-being on the recovery journey had the most success and the lowest recidivism rates.
Thank you. And finally, just in general, the PSRB, is there a hierarchy of evaluation? In other words, is risk recommitting or recidivism always at the top, or is it mental health, or is the general public interest? What would you say is the rank order of the issues that you consider when coming to these complex decisions?
That's also a wonderful question. For us, I would say public safety is the equivalent of a person's recovery. So they're both a priority. And I think that's part of the bill that was set forth that we actually celebrate, because I think it memorializes and the board's mission. Public safety is the priority, but the best way to ensure public safety is to make sure that our equities have the appropriate access to care.
In terms of progression, does the PSRB often allow for a release with oversight to a halfway house or other facility, or is that a path that is not often taken?
Yes, so what you're talking about now is what a conditional release. And I don't know the exact numbers right now, but I think almost a third of our equities are on conditional release status. And that means that they're in the community on their own, receiving all of their treatment in the community. And we have more frequent meetings with that group and work very collaboratively with the community treatment providers.
And if you know, is there adequate funding for that process to go forward, or is this another case where funding prevents that from occurring at times?
There could always be more resources. I would say that there are, the state is left to its own discretionary effort to kind of find resources willing to work with our equities. Lots of times more private organizations would be risk averse. So I think always if we could, it would actually be a great idea for a task force to examine some of the barriers that exist with finding after placement, less restrictive community environments for our equities to be supported.
Thank you. And one last quick one, Director Cardell, how long have you served on the board?
I've had the privilege of serving on the board for a year. And there were two people who were in this position prior to me since its inception.
I appreciate your answers. I appreciate the latitude, Mr. Chairman.
Thank you.
Thank you. As a follow-up, Director.
Yes.
You're relatively new to the experience, fresh eyes, a little dispassionate experience. You've heard calls for the board to be disbanded in favor of something else. Do you believe the board can continue to function as currently constituted, or do you have any thoughts about a better format, a better paradigm for taking care of people like this?
So just part of who I am is I always feel like there's opportunities for improvement in all systems. I think the board serves a very important function, and I feel like if the general community and stakeholders had a better understanding of who the board is and what it does, they wouldn't necessarily be calling for its abolishment. I do think that we consider the priority of the equities and the safety and recovery of the equities as much as community safety, and it just speaks to, separate realities. I think what happens is, when any crime results in an NGRI finding, it's a tragedy. It's a tragedy for the victim, for the equity, for the community, and I think passions run high. And there's separate realities amongst all of these groups. And we are the one entity that considers all of them and has interface with everyone. So eliminating such a thing, I have a fear, would set us back to the situation prior to when we started, where there would be people in the community. The state of Connecticut has no way to compel anyone to continue with treatment. So medication, interventions, all of the things necessary to reduce risk. Specifically, and I'm not speaking in support of this, but there are no outpatient commitment laws. So only through the board do you have the ability to mitigate risk for, equities who are residing in the community. I say that to say also, just a little bit transparent about what I did before I was in this position for the last year. I worked and I oversaw several inpatient units at a mental health organization in in Connecticut, and I also worked and oversaw 2 different residential facilities who supported people with chronic and severe mental illness. And what I can tell you is when they ended up needing higher level of care and suffered a decompensation that was significant and severe, it was because they didn't have access to resources. And the board ensures that these equities have access to the resources that are imperative to maintaining their recovery. And I think what separates the equities who are placed under our jurisdiction is that there's been a nexus between their mental health and this very serious crime. So I think that that's what kind of sets us apart and this group apart, and calls for the special attention and the oversight that the board allows for.
Thank you for that. Yeah, I don't think anybody is suggesting we should dispense with the board and have no oversight. The only question is there a better model to achieve the same ends, knowing what we know these days and the issues that we've had? So thank you for that. Representative Clara Desditria has a question or comment.
Yes.
Thank you, Mr. Chair. Thank you, Vanessa, for being here today. I have a couple questions. First, how many hearings have you been involved with so far?
Good question. So we have 2 hearings a month, and I've been in the position for a little over a year, so almost 30.
Okay, thank you. And then my second one statement first. The intent isn't to disband, from what I understand, oversight, but maybe just move away from this type of system. And then my other question is, how long can the other PSRB members be on the committee?
So they're appointed for 4-year terms at the discretion of the governor. Excuse me. And many of our board members have been reappointed. So our newest members are our victims advocate, who was recently appointed within the last few months, and our psychiatrist, who is around the same time as me.
Okay, thank you. And then how many patients are at Whiting on the PSRB?
Are at Whiting exclusively? Yeah. In the max security setting? I'm sorry, I printed some statistics so I would be able to have it.
That's okay.
Do you mind if I answer in percent instead?
That's fine. You can answer that now, and you can always get back to us with the other numbers. And are you okay? You need to take a sip of water.
I'm sorry, I have a minor cold. 12% of our equities are in the maths setting right now, and any other numbers you'd like, I would be happy to offer.
Okay, thank you. You could get that to the whole committee, would be great. Thank you. Excuse my cat. He wants the answer as well. I'm sorry. Excuse me. Keep going.
That cat makes a lot of appearances in our public hearings. Thank you again, Director, for your comments. We look forward to any follow-up data you can provide us. I don't think anybody in this committee is cavalierly contemplating the demise of the board unless we can come up with a more effective means, but it's something we do need to discuss. So we appreciate not only your testimony today, but the hard work you've done to protect the people that the board is mandated to protect.
Thank you, Representative.
Seeing that we have now passed our first hour, we're going to begin alternating between members of the public and elected officials, agency members. So next up is David, I'm going to butcher this one, Iomi, followed by Monty Rattler from the Office of the Chief Public Defender. David, at least I got that part right. Or perhaps I didn't even get that part. Why don't we see what's happening with David, but why don't we move on to number 25, Jess Carruthers. Okay, not doing so well so far on the public. So why don't we go to Monty Rattler while we figure out who's next in the member of the public?
Hi, Jess is joining shortly. Sorry.
Could you define shortly?
In the next 5 to 10 minutes. I'm just getting a hold of her now.
All right, well, then we're going to put you back in the waiting room until such time as you're ready. Is Monty Rattler available?
I'm here.
Then why don't you proceed, sir?
Okay, Representative Steinberg and other distinguished members of this committee, I feel privileged to be given the opportunity to speak in support of Bill number 450. I think it's important that I introduce myself to give you a little bit of my background. I came into the public defender system 37 years ago in 1985, coincidentally the same year the PSRB came into existence, and also the year I completed a master's degree in counseling. For the last 24 years, I've headed the Psychiatric Defense Unit of the Public Defender Services, and the primary responsibility of this office has been to represent insanity equities under the jurisdiction of the Psychiatric Security Review Board. Also, over those years as head of this division, I have represented the Office of the Chief Public Defender on a number of committees created by the state of Connecticut or nonprofit agencies to address specific issues related to the general problem of mental health in the criminal justice system. And these have included the Governor's Blue Ribbon Commission on Mental Health, the Mental Health Policy Council, the Committee to Review the Competence to Stand Trial Statute, post-Sells versus United States, Subcommittee to study alternatives to incarceration for persons with psychiatric disabilities, the Father Jangers Center for Justice for People with Developmental Disabilities, Working Group to address prison overcrowding in the context of mental illness, the Insanity Equity Review Committee, and the Behavioral Health Subcommittee of the Criminal Justice Policy Advisory Council, otherwise known as CJPAC, and various work groups emanating from the Behavioral Health Subcommittee. Many of the current statutory provisions regarding alternatives to incarceration, forced medication, and the criminal competency process 5456D revisions came about from this committee and work groups that I actively participated in. I mentioned all of these activities that I've been involved with just to indicate that I have a very acute sensibility to the interest of the various stakeholders in the criminal justice system, including the state, including victims, including insanity equities, criminal defendants, and also my office having been located on the campus of Connecticut Valley Hospital, now Whiting Forensic Hospital, I'm acutely sensitive to the difficulties inherent in being a staff member, being an administrator, and being a patient. And I appreciate all those difficulties in those different roles. I would remind this committee that the PSRB came into existence in 1985 when forensic risk assessment was in its infancy. Not only have we seen sea changes in forensic risk assessment, but sea changes in mental health treatment paradigms.
Excuse me, Mr. Rattler, but your time is almost up. If you please summarize. Thank you.
Yes. I think that with respect to the Whiting Task Force, its holistic presentation of the problems related to the hospital and interrelationship with the PSRB, they make a number of recommendations, including abolition of the PSRB, but more importantly, they make particular recommendations with respect to what goes on inside the four walls of the hospital. I think the PSRB, like Ms. Cardell indicated, does have and can have a continuing positive role in the nature of outpatient civil commitment, at least with respect to within the parameters of a criminal commitment, which is like a criminal sentence. However, I believe that it should not have a continuing role in the intra-hospital movement of patients. Because in my experience, I see little value of that in protecting public safety. Otherwise, I think my role would be better served here answering individual questions, given my familiarity with the system.
Sounds like a good idea. Senator Summers?
Yes, good afternoon and thank you, or still good morning, and thank you for being here. I have a few questions that I would like to ask. The first one being, because of your experience in your background, could you walk us through, let's say somebody has committed a crime and they have to sit for a competency hearing. They're sent to Whiting. Can you explain that process to the people that are watching today? And then let's say they end up going to Whiting for NGRI, how they have to then come back to the PSRB to be moved to a lower security facility. I think that was lost in the last speaker under the PSRB, and some of the constraints that I know I've sat in a few of the hearings that you were in on why certain patients are not allowed to go into a lower security facility. And this system of once you're in, don't expect an opportunity to really get care and have an opportunity to, do your time, so to speak, and then move out to the community. Could you speak to that in detail? I think that would be really helpful for the people that are on this committee and also for people that are watching.
Yes, thank you, Senator Summers. I will give as brief a description, but as comprehensive as I can of the existing process. When a court commits an equity to the jurisdiction of the PSRB causes the equity to be institutionalized at Whiting Forensic Hospital, the state's forensic mental health facility operated by DEMIS. The committing court sets a maximum term of commitment, which is usually commensurate with the maximum prison sentence that a person could have been imposed on that person had they been convicted of the crime. Unfortunately, under current statute, that maximum term commitment can be continued indefinitely, in essence, making a person's commitment to the board under the jurisdiction of the board, possibly for a lifetime. Once they're admitted to the hospital, they're usually first placed in maximum security. And although the equities are in the physical custody of the Department of Mental Health and Addiction Services, many of the restrictions imposed on them during the confinement are at the discretion of the PSRB or in consultation between the hospital and the PSRB. The PSRB decides when and under what conditions an equity may be prepared for temporary leave and ultimately conditional release. The process for an equity to advance towards discharge is very lengthy and complex. It takes almost all equities many years to be recommended by the Whiting Maximum Treatment Team, the Hospital Forensic Review Committee, and the consulting forensic psychiatrist to even begin the journey towards discharge. An equity must first be recommended for transfer from Whiting Max to Dutcher, a less secure building where discharge planning may begin. Whiting Max and Dutcher have complex privileges systems. Before the discharge process can begin in earnest, equities must earn their way up privilege levels, which requires extended clinical civility and almost perfectly sustained behavior. After many months and years of treatment and unit rules compliance, equities then wait many more months or even years to even start transitioning process planning for a phase 1 temporary leave, which is community-based treatment where they have to come back to the hospital. Delays continue as the search for community-based programs begins and almost inevitably stalls. Finally, if an acuity is recommended for temporary leave, the first concrete phase of the discharge process, the DEMAS system of community services and supports is, and I hate to say it, inadequately resourced so that an acuity may have to wait months, sometimes even years before a community service provider has the service capacity to accept and agrees to serve the individual and agrees to abide by conditions set by the PSRB. Typically, when acuities are informed that their clinical staff recommend that they are ready for temporary leave planning, they're asked to pick a catchment area, and then acceptance by a provider is just the beginning of the discharge process. As its name implies, the leave is only temporary and may be and often is revoked for technical violations of the PSRB's TL orders in its memoranda of decision issued as to that individual, and sometimes through no fault of the acuitee, due to errors by the service provider or systemic problems in DEMAS's community provider system. Conditional release is the next concrete step to full discharge, is likewise just what its name implies, conditions on terms and conditions imposed and potentially often revoked by the PSRB. Many acuitees serve their entire initial commitment term and then are not even on conditional release, but are subject to recommitment terms for many more years. As I said, the PSRB can serve a valuable function akin to parole boards once they are conditionally released. And in essence, the PSRB can be a gatekeeper to the conditional release process. Someone on conditional release is no longer within the purview of the hospital system. I mean, I think Bill 450 kind of recognizes their role in that this legislation is directed towards what happens within the confines of the hospital. And hopefully that gives some more information that may inform further questions.
I was wondering if you could speak to what you touched on it, and I think this is an important thing to bring up, is that Connecticut has what we call continuous commitment. So somebody can be, at the end of their term, they can be recommitted without having to go in front of a judge. I know that that can be challenged, which is difficult. So if you could speak to that, and also what you've learned about other states when they have eliminated the PSRB. Obviously, they have other oversight mechanisms. And I think if you could start there, that would be very helpful. I'm not sure that people recognize we have this continuous commitment, which I don't think any other state has that. And you, as a former or current defense attorney, with the clients that you've represented, I have heard from other defense attorneys that have recommended their clients do not, try to use any kind of mental health or insanity plea, because they're once they're in, they have no hope of really getting out at this point. I'm not saying that we want to let everybody out that is a high risk or that has not gotten care that can be, rehabilitated, et cetera. And then the last question, I know I'm throwing a lot at you, but you have all this experience, is do you think in any way it's a conflict of interest that we have a outside entity running the facility? So you have Yale really running this facility on a contract without accountability from the state of Connecticut, even though they're being paid with Connecticut taxpayer dollars. And Yale is also the organization that decides the competency of individuals when they're going through the DOC process. So they're evaluating competency. And if they find you're not, they're the ones doing the evaluation that could then in fact send you right back to the organization that they're running. Could you speak to any of that, please?
I'll take the last one first, because frankly, that's beyond my capability of answering, because I don't know the details of those arrangements. So I'm really not competent to speak to that. In terms of the continued commitment issue, it really is important to me because it is decided by a judge, that ultimate issue. It's not decided by the PSRB. The PSRB makes a recommendation. But if somebody has not worked their way through the hospital system and been conditionally released and on conditional release for a number of years, it should be pretty obvious that very few judges will grant unconditional discharge. If there's any question about somebody's risk, they want the decision to be risk-free. And it really becomes an issue because you're comparing insanity acquittees who have been essentially in a hospital system that in many respects operates, almost like a prison system, for the same number of years that an individual has been in prison for that offense. And as we know, imprisoned individuals do not receive the same level of psychiatric treatment as an insanity acquittee has received for those many years. And prisoners, and since we don't recommend somebody pursuing an insanity defense, for reason of the lengthy commitments, those individuals are not receiving the treatment that they would receive, under the board otherwise. And when they reach the end of their sentences, they essentially walk out the door unless they meet civil commitment standards. Insanity commitments are a form of civil commitment. It has the same legal standard, danger to self or others or gravely disabled, but they're interpreted very, very differently. And these differences are really legal differences, but the fact that they're treated so differently introduces a level of confusion within the system and internal incoherence in terms of what patients understand, civil patients versus PSRB patients versus people who are in the hospital for civil commitment. And it just introduces a level of arbitrariness that really, has no place in a mental hospital. The other thing about the board participation in intra-patient movement is it introduces an adversary process to what should be clinical decisions within the hospital itself. We're not talking about release to the community. And you have state's attorneys, even public defenders who have very little experience in mental health, in risk assessment, in anything like that, essentially, driving the bus. And, I can't tell you how many hearings I sit in where the members of the board or whatever will say, my primary mandate is public safety. And, to the extent that they are concerned with, treatment of patients, they can't dictate how the hospital treats patients. And it just, the present system just creates way too much, confusion and does not really relate ultimately to public safety. I think that's, I may have missed one of your questions, but
No, thank you. I guess my last question would be, could you tell us specifically in the bill that's in front of us today, your thoughts on the sections that you agree with and sections you don't agree with? That would be helpful.
Actually, I agree with the sections that relate to the PSRB, and I've submitted on behalf of our organization or our division, written testimony to that effect. I believe that the one section that relates to the TL process would lead to, substantial streamlining and of the internal process. I don't think any of the sections, currently, directly relate to court proceedings that would bring it within the realm of the Judiciary Committee. And I think this is a very necessary first step in getting the process going. I just think it would be very, very unfortunate if some legislation did not come out at this point in time, pressing these issues forward.
I want to thank you, for your testimony today. It was very helpful, and let others ask questions they may have. Thank you.
However, I do not see any further questions. Thank you, Mr. Rattler, for your testimony. Obviously, you offer a unique perspective. We may be back in touch with you as we try to finalize and fine tune this bill. But seeing no further comments, we will thank you. We will go back to the public. We're going to give David Iome another opportunity. Just to be clear, since we have so many people testifying today, if you miss your turn, we're going to be not as understanding as we would be in the past. We are not inclined to go backwards today. So please be ready for your opportunity to testify. We will show a little leeway, but we're not eager to be dealing with number in the 20s when we get to the 120s. So David Iome, followed by Executive Director Vicki Veltri of OHS. Welcome, David.
Thank you. And I don't know if you can see me here, but I'm here to provide testimony opposing two bills, Senate Bill number 477 and House Bill number 5397. With respect to number 477, I pose, and this is an act concerning the public health of residents of the state. I oppose this bill primarily for the inclusion of a new Section 7 beginning on line 229. This section establishes a Commission on Gun Violence Intervention and Prevention. This 21-member commission will be structured, in my opinion, to support with taxpayers' dollars organizations that oppose the rights of law-abiding citizens like myself who own firearms, which is my federal and state constitutional right. Let these organizations get their funding privately and not with state funds. I feel that this is just another attempt for the anti-gun legislature to get public funding for anti-gun organizations, which law-abiding gun owners like myself oppose. So that's my opposition to Senate Bill number 477. I'm also opposed to House Bill number 5397, which is titled An Act Declaring Gun Violence a Public Health Crisis and Establishing the Office of Gun Violence Prevention and Intervention. This bill is not a gun violence. This bill is, I oppose this bill because gun violence is not a public health health issue unless you presently live in the Ukraine. It is a public safety issue primarily caused by criminals using illegally obtained guns. We have laws on the books that need to be strengthened by the legislature, and continuous annual funding of programs like the state's anti-gun task force, which has not been the case. The public health department certainly should not be the state's go-to department to oversee gun violence prevention. Furthermore, these sorts of initiatives seem to be intent to state fund anti-gun organizations that have their own agenda and goals. Eventually, I expect these efforts will infringe on Second Amendment rights of law-abiding citizens who own firearms. For this reason, I oppose this bill as well. And that's all I have to say.
Thank you for your testimony. Indeed, we passed a number of laws in this legislature that have been constitutionally sound and have advanced our desire to reduce gun violence. You made mention, sir, of your willingness to consider legislation that would address the problem at hand. What legislation, what kind of laws are you suggesting?
Well, there is, for example, there have been laws involving teenage crime, which have been weakened over the last several years. Those laws should be strengthened, and similar laws that have been weakened that put criminals out of prison. I think they should be strengthened so that they don't qualify for parole and then commit crimes once they're paroled. There is a state anti-gang task force that has been funded in the past, and then in years afterwards will get unfunded because of budget issues. I believe funding has been provided in the governor's budget to refund the state task force, which is a task force consisting of both state and municipal enforcement departments. And that is being funded this year, but there's no guarantee that it'll continue to be funded. But I think programs like this will reduce crime, which is what should be the objective of the of this bill.
Thank you. I understand that the thrust of your suggestions relate to stiffer sentencing. Seeing no further questions, I will move on next back to the members from the elected officials and agency heads. Welcome to Executive Director Vicki Veltri from the Office of Health Strategy, and then we'll move back to see if Jess Carruthers is available. Welcome, Executive Director.
Well, good afternoon, Representative Steinberg, Senator Anwar, Senator Wong, Senator Summers, Representative Pettit, and members of the Public Health Committee. The same Vicki Veltri, Executive Director of the Office of Health Strategy.
Is anybody else having problems hearing her? Vicki, you did something to your volume and we've lost all connection. Please try again. Unfortunately, we're not good with sign language either, at least most of the members of the committee. Here's what I suggest is that because the problems are technical in nature, we will make an exception and come back to you when you've figured out what happened. And we will go to Jess Carruthers if she's available.
Hello, committee members. I am available. Sorry about the delay.
No problem. Please go ahead.
Yeah, I want to thank you for your time and the opportunity to speak today specifically about HB 5397, the bill to reduce gun violence, to declare gun violence a public health crisis and establish a council on prevention and intervention. My name is Jess Carruthers. I currently work in clinical research at Memorial Sloan Kettering and work part-time at night to get a master's of public health focused on community safety. I'm also a proud graduate of Massac High School, class of 2015, and as a resident of Monroe, Connecticut, for the first 18 years of my life, I wholeheartedly support the passage of this bill. I was a sophomore at Massac on December 14th, 2012. I remember a lot about that day. The lab bench on my back as I hid in my chemistry class, my friend Luke's face across from me telling our small group what he could see on the classroom TV, Jenny, my friend next to me, sending texts to her mom, who is a teacher at a Newtown elementary school. That day still feels like sweaty palms, shoulders to my ears, darting eyes. It feels like an abandonment of orientation, and it feels like a broken 16-year-old agreement between myself and the world, the one that had told me things like this did not happen to children. And it wasn't these feelings of that day that propelled me to get my master's of public health, but rather it was the inaction of the adults in our community, the days, the weeks, the months, and years following. In the aftermath of Sandy Hook, I watched a political conversation unfold that could not agree on the causes of or solutions to this violence. And I watched officials meet the people's grief and rage with avoidance of head-on solutions and stagnation. The beauty of this bill is that it promotes evidence-based practices, and it allows people collectively to work together to find the truth and solutions. This council would be held accountable by the people and work in the interest of the people. Gun violence is not just school shootings, it's also homicide, which disproportionately impacts Black neighborhoods. It is a rise in youth suicide and homicide in this state, and gun violence is a public health crisis in Connecticut. It is a community diagnosis of anxiety, depression, trauma for the victims, for those close to them, and for the witnesses. Gun violence is the leading cause of years of life lost in the United States, which is an estimate of the average years a person would have lived if they had not died prematurely. And in my personal opinion, it is the most important metric of public health. It is a pattern in our society and therefore must be acknowledged, treated, and with urgency prevented. The children who have crouched in the classrooms of America and who have seen violence in their neighborhoods are getting older and recognizing the power they have in this collective action. And in this republic, it's the government's duty to be accountable to that call for change and a vessel in the people's pursuit of it. So I would be very proud of the state of Connecticut and of this body to take the first step towards that and pass this bill. Thank you for your time.
Jess, thank you very much for your impassioned testimony. Yes, I too remember very distinctly where I was when I heard about the tragedy in Newtown. And I will differ with you. I think this legislature stood up and did the right thing very quickly, passing some legislation that would address some of the issues that would come out of a tragedy like Newtown Sandy Hook, and has since then tried every year to move that ball forward. But I take your point that there's a distinction between what we do in these hopefully rare and horrific episodes of mass shootings and what we have done and perhaps failed to do with regard to the more everyday homicides that plague our communities. And I think to a large degree, that's what we're talking about now. I would not say what we did with regard to the aftermath of Sandy Hook was easy, but the task ahead of us to deal with gun violence on a much more granular level is a whole nother serious effort for us to address. And it's a harder task. We will struggle with it, but we very much appreciate your testimony and hope that what we're talking about today will lead to us fulfilling your expectation on what we need to do to combat gun violence in our communities. So thank you very much. I don't see any further questions, so thank you for sharing your testimony today. We will now attempt to figure out the mystery of Vicky Veltry's strange microphone. And after that, we will go to number 28. Yes, number 26, Prima Win. Vicky, give it another shot.
Honestly, Representative Steinberg, I do not know what happened. So I hope you heard my greeting to the committee. I want to thank you for having us here to testify in favor of Senate Bill 476, which is an act concerning OHS's recommendations regarding various revisions to community benefit programs administered by hospitals. This bill seeks to establish consistent community benefit reporting requirements among our hospitals in Connecticut, increase transparency about how the hospitals provide community benefits to individuals, requires meaningful engagement, community engagement, and participation in the development of required needs assessments and related implementation strategies. As you all know, under federal law, nonprofit hospitals, as a part of the process to substantiate their tax-exempt status, must disclose amounts spent on community benefits to the IRS in their Schedule H of IRS Form 990. These programs are really intended to be tailored to meet the identified needs in each hospital's respective CHNA, Community Health Needs Assessment, and to be carried out by a comprehensive implementation strategy. We're proposing this bill to update the benefit guidelines and in a manner that promotes the governor's commitment to addressing equity issues in health and healthcare and align that with current practice. It will shift responsibility from OHA to OHS with the support of OHA. We issued a report in 2021 that presented our findings on community benefit services and activities between 2016 and 2020. And that report offered state and federal recommendations to enhance community benefits and improve health. The bill before you really represents our recommendations at the state level. It's a joint proposal. It was done with the support and collaboration of the Hospital Association. And it includes for the first time some very significant and robust definitions around health disparities, health equity, community benefit reporting, community benefit partners, meaningful participation, and includes some very detailed requirements on community benefit reporting. So with that and understanding the list and the heavy amount of participation you're going to have today, I think what I will do is just say this bill, I think, is a really important bill. We worked very hard to compromise with our hospital association on what we think is a very robust bill before you today. Although we do have a couple of recommendations on language changes for clarification purposes, we do think this bill ensures that hospital community benefit investments are addressing each community's health inequities and distinct needs. It'll facilitate collaboration with diverse provider groups, which will lead to innovative, impactful interventions to address social influencers of health, or root cause of illness, and can ultimately improve healthcare outcomes and drive down healthcare costs. This bill really follows a national trend of better linking needs identified in CHNAs with community benefit investments made by hospitals, and will ultimately assist hospitals in identifying and addressing these health inequities and specific social determinants of health in their communities. I want to thank you for providing me the opportunity to testify today. And as I said, I think earlier, and hope you heard, I'm here with Kelly Cinco, our Director of Healthcare Innovation, and Brett Miller, who leads our community health work, to answer any questions the committee might have. So thank you.
Thank you for that. This bill reminds me of something we were talking about just last year. Is it fair to say that the language we see before us is fundamentally the same as we discussed last year? And would you be able to characterize that all interested parties, particularly the hospitals, have weighed in and are in accord on this language?
So in last year, we introduced a bill that I think had actually some components in it that this bill does not, that we took out and I will say spent considerable amount of time last session working with not only CHA, but actual hospital representatives from many hospitals to align our efforts and come up with what we thought was a very good compromise to make the reporting more robust, put some requirements on the hospitals about meaningful participation with their communities and engaging communities, deep down engagements in communities to address the community needs of specific hospitals. And we came out with a compromise. We didn't make it last year in our timing. So this bill represents it's that same bill from last year at the end of the year. It's not the same bill we started with at the beginning of last session, but the same bill that we proposed at the end of last session, which we ran out of time to submit. So we feel pretty good about this. We worked with the hospitals directly, the Hospital Association. We worked with some health equity partners last year on this bill to get it to you this year.
Thank you. Representative Pettit.
Oh, thank you, Mr. Chairman. Good afternoon, Ms. Veltri.
Good afternoon, Representative Pettit. How are you?
Gonna have to get up and walk. It's only been a couple hours. I'm getting stiff. The term meaningful participation. I see that the Health Equity Solutions in their testimony they've submitted have suggested a further definition. Is meaningful participation going to be in the eye of the beholder in the eye of OHS, or do we really need to have a very set in statute definition for what that requires of people?
Well, I think it was an area of significant discussion last year because community health needs assessments are really directed at the communities where the hospitals are located, right? So having meaningful participation means engaging the residents and the people who reside in that area. That's why I think if you look at what's proposed in this bill, it actually mentions that it needs to be targeted towards residents who experience the greatest disparities in that area. We felt that that captured the concerns that people had about ensuring that people who are most impacted by the needs in their community, whether it's lack of housing, whether it's lack of transportation, housing, healthcare, or other needs that are social influencers of health, could participate in this process. So we know there are additional suggestions, but this is the language we all came up with last year. So we're suggesting that we go forward with it.
Thank you. And finally, I think this bill makes the reporting of the information, it moves it from the Office of the Health Advocate to the Office of Health Strategy. Do you think that that's a good move? And will, in my experience, the past 5 years, the Office of the Health Advocate has been a fabulous resource for my constituents in terms of helping out on very specific issues. Will they still be involved in the process, be at the table for that evaluation, and OHS will deliver the report, or how do you envision that working?
So I have a little history here because I was the healthcare advocate for 5.5 years, and we had the community benefits reporting came to us back actually when Kevin Lembo was the healthcare advocate and I was the general counsel at the office. And we were doing what we could at the time. We were resource limited and collecting some information on community benefit reporting. About 1.5 years ago, we proposed to OHA, and it might be a little more than that, Ted Doolittle could correct me. We proposed to OHA that we enter an MOA with them to transfer that reporting to OHS. And the reason for that is OHS actually has a complete picture of our hospitals in terms of financial reporting and other reporting they provide to us. So it made a lot more sense for it to be housed at OHS. And we actually did work very closely with OHA to make sure that that transition was fruitful and that OHA had input. And then we issued a report. And that's the first report we actually put out, I think, this past year, 2021, I'm sorry, the years are blurring, on community benefits. So I do think it's appropriate for it to be at OHS, having experienced it being at OHA and not being able to do a lot with it because the constraints of resources of the agency and the focus of the agency, it does feel to me it makes more sense for OHS.
Would it be fair to say that with that transition that OHS will present more of the quantitative analysis and OHA can chip in terms of qualitative, in terms of very specific issues? Would that be a fair
Sure. Yes,
I
I think that's right. I mean, again, having that experience, I think lots and lots of consumers go for help to OHA. And I think input is always welcome from OHA and in fact, other agencies who want to weigh in addition to the communities, which is really where this bill is targeted towards, ensuring that we get community input down at the hospital service areas.
Thank you for that discussion. Thank you, Mr. Chair.
Thank you, Representative. Representative Gilchrist.
Thank you, Mr. Chair. Hi, Vicki. So good to see you. Thank you for being here. I have a few questions. One has to do with creating a minimum community benefit spending floor. And I'm just wondering, I believe, but I could be wrong, that in other states where they've done this work, they have included that. And so in the conversations that you've been having with the various partners, is there a reason that's not included in this proposal? Is there pushback on that?
Well, we introduced that last session, that bill, which was based on Oregon, and we couldn't get there. So we decided we would start here, right? Start at the beginning and at least collect these data. I think that's been some of the challenge with other states as well, even though states have gotten to a spending floor in some cases. Having data at the beginning, and I say this on these other efforts that we have in our office, without the transparency at the beginning, it's kind of hard to know where you want to get to. So I feel pretty comfortable with the bill we drafted. I think we engaged lots of people in it, and certainly last year in the negotiating of it. And as a matter of good faith, feel like that's where we'd like to go. It's the share we need to get this bill through, the one that we compromised on last year. So
I respect that. Thank you. And then my other question has to do with standardizing how hospitals calculate charity care. Does this proposal include that or no, not yet?
I don't believe it does. Brent or Kelly can correct me if I'm wrong, but I don't think it does at this point. No.
Okay.
Short answer.
And then my final, in an ideal world, so does OHS currently have the capacity to take this on, or do you think your agency would need additional staff to take this on?
No, as drafted, this bill, we've already kind of laid the groundwork for this and have been working on this for a couple of years. So we feel comfortable with our capacity on this piece, on this bill.
Okay, wonderful. Thank you. Thank you, Mr. Chair. Thank you for all your work.
Thank you, Representative. Just to clarify, though, this does not mean that OHS is not interested in additional staffing to deal with its CON issues.
That is correct. That is absolutely correct, which is why the governor, as I said before, has proposed 4 additional positions for the office, 3 of which are CON, and we absolutely endorse that. And I see Senator Elmore clapping because thank you.
I think everybody's clapping in one fashion or another, but I wanted to make sure that was clear. Next up, thank you, Executive Director. Next up is Primo Wynn, numbers 26, followed by Michael Gaylor from the state's attorney for the Division of Criminal Justice. Welcome, Prima.
Thank you. Good afternoon. Dear Senator Anwar, Representative Steinberg, and esteemed members of the Public Health Committee, my name is Prima Wynn, and I live in Norwalk, Connecticut. I stand in support of HB 5500, an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. I serve as the Executive Director of the Odyssey Family Executive Center of South Norwalk, where we have a mission to work in partnership with families, community organizations, and industry leaders to provide access to information, resources, and career pathways that position our families to have improved outcomes for their children and themselves. This policy proposal is essential to doulas in Connecticut. As a trained doula myself with over 7 years of experience, I understand the vital need for doulas to be recognized through certification. I also understand that there needs to be a thoughtful discussion around equity-based standards for doula certification. A doula works as a member of the client's multidisciplinary team. The intention of the doula relationship is to tap and develop a birthing parent's inherent power to make decisions for the well-being of themselves and their family. Connecticut has an opportunity here to avoid the intentional and unintentional barriers caused from doula certification policies that have resulted in more harm than good for Black women and women of color in other states. Doula work has been an inherent role for many women across multiple cultures and ethnic backgrounds for centuries. Our expertise comes not only from rigorous training and practice, but from the traditions and teachings of doulas and midwives before us that are unique to our cultures and our lived experiences. Today in Connecticut, there are independent doulas and organizations already doing this vital work. Their years of dedication, along with mental, familial, and financial sacrifice, have not been in vain. They have supported the continued life of countless birthing women and empower them to advocate for themselves and their children. I fully support doula certification in Connecticut that recognizes the high standards of community-based doula certification programs led by women of color. In Connecticut, babies born to Black mothers are more than 3 times more likely to die in their first year of life, and babies born to Latina mothers are more than twice as likely to die in their first year than those born to white mothers. In Norwalk, I have seen firsthand the need for women of color to have access to doula care. My families have experienced some obvious shifts in their provider care when they simply share that they have a doula. When I had a mother scared about some postpartum bleeding and did not receive compassion from her provider, it was the doula care that I provided through sharing evidence-based information and emotional support that brought out in her the confidence to ask some specific questions of her provider that got her the level of care that she wanted, but most importantly, that she deserved. The high level of trust that I and many doulas form with our families have proven to decrease stress and cortisol levels, and just the mere presence of a trained, culturally competent doula improves outcomes for mother and baby. Lastly, the certification of doulas in Connecticut will add to the current work being done in Connecticut to support women and families. Programs like home visiting through the Office of Early Childhood will benefit from increased access to doulas. The OEC has already recognized this importance of doula care, and this bill will contribute to the OEC's long-term goals to support families and the development of their children as early as possible. So for these reasons and more, I urge you to support HB 5500, an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. Thank you for the opportunity to submit this testimony regarding the doula profession. Thank you.
Thank you so much for your testimony. Truly appreciate it. And thank you for highlighting the value of doulas and what work doulas do, and also sharing some real examples that really help us understand this better. I have my colleague and friend, Senator Moore, who has a question for you or a comment. Senator Moore.
Thank you, Mr. Chair. I want to thank you, Ms. Nguyen, for your testimony. I learned about doulas in a formal sense about 4 years ago, working with several doulas on a committee to try to get you covered by Medicaid and to get you certified and created. So I want to thank you all for staying the path. I've been a fan ever since I've learned about it. And, you know, I had no idea how much a difference it could make to a woman in trauma, especially women, Black and brown women in trauma and the outcomes. And I'm also want to be thankful to the Commissioner of Public Health for considering this bill over the last 2 years and looking at it and working with you all. Is there anything in the bill that could strengthen the work that you're doing that you don't see?
Well, thank you, Senator Moore, for your continued support, and it's been greatly appreciated to have you lift up our voices, so thank you for that. You know, I'd say I think what we're proposing here, and I'll have some colleagues who are planning to testify later in the day that have been more closely involved in this work. But I think it's really ensuring that the organizations who are doing doula training in the state currently have an opportunity to continue to do that, to receive recognition for that work, and to ensure that there aren't limitations put in place that will make it harder for some new doulas who want to become trained to actually move through that process. I think there are individuals and organizations who have been doing this already for multiple years, and what we really want to avoid is having there be barriers put in place that will make it harder for them to continue to do their work. So from my perspective, I think ensuring that those organizations who are experienced and trained and have been doing this in their local communities for multiple years are able to continue doing that without any barriers being put in place.
Thank you. You know, I just read something again nationally about the lack of public health workers, and I think this helps address some of the problems that we're having with people being able to step in, be certified, understand the guidelines for it, and then create a pathway so everyone can participate that wants to participate in it. So thank you. Thank you, Mr. Chair.
Thank you so much, Senator Moore. Ms. Nguyen, thank you for your testimony. I do not see any questions or comments. We'll move on to the next person on our list, which is Michael Gaylor with the State's Attorney's Office, followed by Mr. Carl Scheisel with the Connecticut Hospital Association. So please go ahead, Gaylor.
Thank you. Thank you, Senator. Senator Anwar, Representative Steinberg, Ranking Members Wang and Pettit, and distinguished members of the Public Health Committee. My name is Michael Gaylor. I'm the State's Attorney in the Judicial District of Middlesex. For those of you who don't know, my jurisdiction is the one that prosecuted the employees of Whiting Forensic Institute who committed the abuse against the individuals at Whiting Hospital that ultimately led to the commission that reported to you earlier this morning. Speaking today on behalf of the entire Division of Criminal Justice, and I want to thank you for allowing me the opportunity to testify on Senate Bill 450. Specifically, the division opposes Section 6 of the bill, which seeks to create a task force to study the necessity for the continued existence of the Psychiatric Security Review Board. Simply put, the division opposes this section because it believes there is no question that the board should remain in existence. As Mr. Rattler and Ms. Cardella indicated, the PSRB plays a vital role in ensuring the release of individuals to the community, both on a permanent basis and on a temporary basis of individuals who have been found not guilty by reason of insanity. The individuals who have been assigned to the PSRB, committed to the custody of the Commission of PSRB, are individuals who, for the most part, have been committed violent crimes. Over half of them have been committed crime of murder. Nearly all of them have committed some violent offense. Unfortunately, many of them suffer from mental illnesses that are persistent and they cannot be cured. They generally have to be managed through antipsychotic medication. Many acquittees need to continue to take these medications for the rest of their lives. And if they go off their medication, decompensation generally results in a matter of weeks. They are then at the risk of becoming violent again. If they are put out in the community when this occurs and they are not being supervised, the public is at risk. The elimination of the PSRB would allow acquittees to be discharged from the hospital with no supervision in the community. This would inevitably have a tragic consequences for unsuspecting individual who encounters an unsupervised acquittee in a decompensated state. I would indicate that the PSRB plays a vital role, and they represent not just the interests of the public. They consider the interest of the public, they consider the interest of the victim, and they also consider the interests of the acquittee themselves. The stats reported to you earlier by Ms. Cardella indicates they are not draconian in any way. Many individuals are released, at least on temporary leave and on conditional leave. The powers of the PSRB allow them to monitor individuals while they are on release so that if they violate, they can bring them back in and maybe deal with the mental health issue before the individual presents danger to himself or others in the community. I would note, for example, one of the provisions in the bill, lines 236 to 243, purports to give the authority to provide temporary leave to individuals under the auspices of PSRB to the folks at the hospital where the person is staying.
Excuse me, Mr. Gaylor, your time is almost up. If you please summarize. Thank you.
I will do so.
Actually, Mr. Gaylor, what you're saying is very critical. So if you could just complete it, because I was going to ask you that question, I might as well continue.
Okay, I will. With respect to sections 236 to 243, again, it gives the authority to grant leave, temporary leave, to the supervisor at the hospital. It does so considering only the interests of the acquittee. Ask the supervisor to acquittee the psychiatric supervision and treatment would be advanced by permitting the acquittee to go at leave without considering the interest of the public or the interest of the victim. Presumably, the victim would even get notice that the individual is out on temporary leave. I find that to be a particularly dangerous situation, both for the public and for the victim. So the PSRB, if it's in the auspices of PSRB, on the other hand, PSRB has the opportunity to give notice to the victim. They have the opportunity to consider the interest of the victim, and they certainly have the opportunity to consider the safety of the public. And in doing so, they can request conditions be imposed on the individual that will ensure the safety of the public. So for those reasons, the division opposes Section 6 of the bill, and I want to thank the committee for allowing me this opportunity to testify, and I'm happy to answer any questions.
Thank you so much for your testimony. This is quite interesting, and I wanted to engage you a little bit more in this. First of all, thank you for you and your office to raise the awareness and the action, because that obviously was necessary. And here we are post-action to try and address what could have been done better. We had a pretty robust conversation, and I'm sure you've seen the task force report, which is very clear in their views on PSRBs. They do not think the PSRBs were effective, and they want that out. I also recognize that this was not a unanimous decision, but the PSRB in the existing form failed us. So you're suggesting that we should not get rid of it, but maybe modify it. And this bill is talking about not removing it, it's talking about studying it. But you're still sort of against even studying it, if I heard you correctly.
I am. I do think we have worked quite closely with the PSRB in many cases. We have several individuals who are under the auspices of PSRB from the Middletown jurisdiction. I've seen the way it operates. I feel that it does a really nice job of taking the considerations of all of the interested parties. As I indicated before, the stats displayed by Director Cardella indicates that they are not draconian. They are doing what they can to try to ensure the safety of the individual who is going out into the community, as well as the community itself. So I do think it would be time wasted. I don't think we could come up with a better system. I think they do a nice job. One of the things I would note that came out in the earlier session, the presentation that was made to you by the members of the commission this morning, they had indicated that there was a dichotomy between recovery and public safety as the auspices of PSRB. And they indicated that PSRB is focusing solely on public safety without regard to recovery. I think the two actually go hand in hand. And I think PSRB helps to meld the two. A person who is recovering needs the support provided by the services recommended by PSRB to be successful in the community. So I actually think PSRB helps to promote that recovery and helps to make sure that when the individual ultimately does go out into the public, that the person will be safe and society will be safe.
Mr. Gaylor, Dr. Hauser this morning also suggested something to that effect in our conversation. So I hear you, and I'm sure all of my colleagues hear you as well. I don't see anything in the bill which suggests that we're going to remove the PSRBs, despite what the report says. But the report is very clear that the status quo was not good enough. So I think we will continue our conversation offline, but your testimony and your clarity in where you stand is very helpful. So I do not see any other questions or comments, and I wanted to thank you again for your testimony. And next person on our list is Mr. Carl Scheisel, followed by Mr. Gary Winfield.
Thank you very much.
Thank you.
Thank you, Senator Anwar, Representative Steinberg, Ranking Members Pettit, Summers, and Wang, and members of the committee. I'm Carl Schissel of the Connecticut Hospital Association, and I'm testifying today concerning Senate Bill 477 and House Bill 5397. CHA's written testimony is available for your review. You will receive some oral testimony later today from my CHA colleague, Jim Acabellis, on SB 476, the Community Benefits Bill, but I'm here to talk about the two gun violence prevention bills. Connecticut hospitals have been collaborating with community partners, legislators, and other stakeholders for years to advance trauma-informed case management services to victims of violence. We share common goals of starting the healing process, supporting victims and their families, and preventing further violence. Hospital-based initiatives in Hartford, New Haven, and Bridgeport have focused on the needs of those who have suffered injuries from gunshots, stabbings, and blunt trauma, sexual assault, and victims of human trafficking. Violence prevention professionals often make an initial connection with victims while they're still in the hospital. They are available to victims and their families to coordinate victim assistance services. State laws adopted last year require DPH approval of programs to train and certify BPPs and offer coverage of these services under the Medicaid program. Such measures will promote the implementation of HVIPs and related initiatives across the state, and CHA and several hospitals were also proud to serve on the Gun Violence Intervention and Prevention Advisory Committee that was established by these laws. So the two bills being heard today and Governor's Bill number 16 each offer different approaches to addressing gun violence intervention and prevention. So I'm here to ask you to consider the following three factors as you reconcile these approaches. First, appoint an advisory body in the same way you appointed the advisory committee in Section 9 of Public Act 21-35 by legislative leadership appointments and including key commissioners in both the executive and judicial branches of government. Second, direct the Department of Public Health's existing Office of Injury Prevention to continue to collaborate with hospitals and community-based providers to establish a research repository and to develop the data dashboards that will drive our knowledge about what's happening in Connecticut. And then finally, appropriate funds to support those community organizations that are providing these violence prevention services. This could be done via a direct grant program, which may be administered by the Office of Policy and Management, or frankly, any other agency as you designate. These funds will help community providers keep existing HVIP programs funded while we await implementation of the Medicaid covered benefit. CHA appreciates your support as we all endeavor to implement a unified, consistent, and sustainable statewide approach for hospitals, agencies, and community-based violence intervention programs to deliver targeted case management services to victims of crime and their families. Thank you very much.
Thank you, Mr. Schissel. Actually, I had a question, but I know Senator Moore question is going to be far more deeper informed because the SB1 that resulted in and the committee that formed was the work that she had done, and also the report that you guys came out with was very, very useful to me looking at this. So, Senator Moore, it's up yours. Go ahead.
Thank you, Mr. Chair, and I don't think I could have the depth and breadth of what you could ask, but I'm going to take that. Good afternoon, Mr. Schissel. Thank you for giving your testimony. One of the questions I had planned on asking you was about the Public Act that created the advisory, and you did say that you participated in that. Your recommendations is to appoint an advisory body. That advisory body would go to who, in your opinion?
Yeah, so there are, of course, lots of different ways to do it. One approach would be to sort of follow the model of the Commission on Women, Children, Seniors, Equity, and Opportunity to have it essentially administered as a legislative commission. One of the challenges with gun violence intervention and prevention is that there are so many agencies that touch it. I mean, I think about the judicial branch, the Department of Public Health, public safety, as mentioned in earlier testimony. So in those instances where there's so many agencies that have pieces of it, it may make sense to try to consolidate it. And you can do it in three areas: in the executive, which would be sort of an OPM, in the judicial branch, in the, let's say, the Office of Victim Services. But frankly, I'm not sure those solutions are sufficient. It might make sense for the General Assembly to keep their eye on it. And you already have the existing model of the Legislative Commission with the Commission on Women, Children, Seniors, Equity, and Opportunity. So that might be one approach to addressing gun violence prevention that you may consider following. I know you have a tough decision to make on the subject, and I appreciate the opportunity to offer at least one solution. Thank you, Senator.
Well, thank you. You know, what I heard, and the reason this is so important to me as part of it is that I live in Bridgeport and I witness it on a weekly basis, community street level gun violence. I'm not talking about mass shootings. I'm talking about these young people who have arms and shouldn't have them, and the lack of coordinated programs to get to the root causes. I heard earlier Representative Zupka makes a good point. Is this going to make a difference? I think it would make a difference if we coordinated the funding and the programs, evaluated them found out what worked, what doesn't work. If there's something that's community-based that hasn't been evaluated, give them the resources to evaluate their programs. Stop funding things that don't work and pouring money into the same things over and over again without proven evidence that they work. Now, there's a lot of programs on the ground that are doing great work but don't have resources. The other point I wanted to ask about, so you're part of a larger group of people doing gun violence, right? And you've witnessed this over many years, this happening. Have you seen anything that brings everybody together statewide to address this gun violence among our youth specifically?
Yeah, the only thought that comes to mind is there is an existing collaborative that is trying to address the situation holistically. It was essentially a group of advocates, providers, agency officials, legislators, who all shared a common goal. And that common goal was to reduce gun violence in our state. Trying to figure out a way to memorialize those efforts and get it supported is really something that I commend you and Representative Gilchrist, and frankly, every member of this committee and the legislature who voted for the bills last year to get us started. But there needs to be a more direct focus on particular aspects of the problem. And I think we're moving in the right direction. And perhaps as you reconcile these three bills, we can get there. But I think the legislature plays a very important role trying to direct and manage how the state responds to this particular problem. I hope that's been somewhat responsive to your question. I feel like I didn't try to dodge it, but I'm afraid maybe I didn't give you as direct an answer as you were looking for.
But you did make a good point early on when you said there's many different parts of the state legislature and also commissions that are all touching this, but no coordinated services or someone looking at it as a holistic approach, like being responsible for the outcomes, right? Everybody's touching it. There's a little bit of money here. I mentioned earlier that the governor had said he was going to commit $3.5 million or $3 million of ARPA funds to do this, and that's yet to happen. Not because they don't want it to happen, but just a lack of coordinated services and someone looking at it. So I want to thank you, because it is because of the work that you all were doing before we created the advisory that I got a really great picture of what was lacking in the state and thought that a commission who could be held accountable for outcomes would be the answer. So thank you for the work that you've done in the Hospital Association. I appreciate it. Thank you, Mr. Chair.
Thank you. Mr. Hill, I wanted to just, first of all, thank you for serving in the advisory committee and the work the advisory committee has done. That entire report, I found that very useful and very enlightening. And I would encourage anybody who's not read the report to look at it in more depth. The hospitals had taken it upon themselves to start this work in trauma-informed management and risk reduction strategies. And is it fair to say that it was done because obviously there's scientific evidence it works, but it is a freebie? There's no support financially from any source to do this. Is that a fair understanding?
You know, Senator, thank you for the question. The end of your comment is a fair understanding. The genesis of these pilot programs, which began in Hartford and New Haven, the impetus, I think, was a combination. It was almost the desperation being felt in the community, the need for these professionals to connect families and victims in distress with the services they need, with what we were seeing in the hospitals, in the emergency department. So the hospitals and community partners came together to create these pilot programs in Hartford and New Haven. And once we realized that working together we could be more effective, it occurred to us that we were onto something. And it's all sort of grown from that initial spark that occurred in those two communities. So absent the existence of organizations and advocates in those two cities who were willing to answer those calls at 3 a.m. to come to the emergency department and meet with, individuals and families in distress in the aftermath of a violent act, really became the start. And so we would like to see those types of organizations arise wherever they're needed in the state of Connecticut. And Senator Moore mentioned some very encouraging happenings in Bridgeport as well. But as I think about how the state, can work, and I think about the money, that ARPA money that's sitting out there could be a nice financial bridge to those organizations that are providing these services to the commencement of the Medicaid covered benefit, which still has to take some time. We have to continue working with DSS to get the benefit worked out, and then we have to get a state plan amendment. The state has to get a state plan amendment approved. So it could be a matter of months, before we actually get the Medicaid covered benefit online. And what happens between now and then to keep the existing organizations and services in place, but also explore getting services more robustly online in Bridgeport and opportunities in Waterbury and other cities is really what we're talking about in the immediate near term. So I'm looking forward to continued progress, and we're at a unique stage where we do have the one-shot revenue sort of on hand to keep this movement going while we get to a more sustainable financial arrangement moving forward. Thank you, Senator.
Thank you so much. And all of us who hear the news, look about the challenges in our own communities and in our neighborhood, in our state, it's very easy to become hopeless. And as I learned about these community organizations and the hospitals, the two groups who've been the anchors of doing this work, you've shown us light and results and convincing results. And so this is very helpful. We are in the beginning of an era to put things together and be a part of the solution. So I wanted to thank you for your testimony. And I see Senator Winfield is here for his testimony. Thank you, Mr. Schissel, and welcome, Senator Winfield.
Thank you, Senator Anwar. Good afternoon. I am here to testify on Senate Bill 477. I feel, before I start, almost like a broken record. 9 years ago on January 28th, one of the subcommittees we created coming out of the Sandy Hook tragedy, I testified before that subcommittee. And what I said to the legislators involved, was that it would be a tragedy if we missed the moment. And largely on the issue of urban gun violence, we did. I came that day to talk about and to make real for legislators the life of a young man who his life was changed forever on an afternoon where his cousin, who had been keeping him off the street, was killed. And when that bullet ripped through the air, and then his cousin, it tore through his life as well, changing it forever. And his story, unfortunately, is not abnormal in some places. And I appreciate everything that we've done on gun control. But for a very long time, we have not put our shoulder to the wheel on this issue. Someone earlier talked about whether this was a public health issue or not. Public health is about preserving the public safety, health, and prolonging life. And if we're not dealing with this issue, if some of our children grow up in communities where life is not preserved in this way, then we are not doing the public health a service. I also want to briefly remember to make a comment, because Mr. Schissel right before me talked about the places where we intersect with this issue and mentioned judicial, public health, and public safety. That's the way the conversation always happens. It's education. It's every other area, because what we're really talking about are the things that, if we really want to prevent gun violence in these communities, the things that make these communities whole, that aren't functioning well for these communities. And so I don't come here today with any amazing magical solution. I come here saying, I know that there are multiple approaches, and that we could get into a sectarian discussion. That would be unfortunate. I don't want to be here 9 years later, saying the same thing I said 9 years ago about a slow but now mass killing of children in the state of Connecticut, and a legislature talking about what we've done on gun control, but not on this issue. And so what I implore you all to do is figure out how to bring all of this together for the children of our state. Thank you.
Thank you so much, Senator Winfield, and thank you for being right then, and thank you for being right today as well. I just wanted to ask you a couple of questions. Right now, there is this division. Every time we talk about guns, the first action in our society is, well, somebody is going to put another bill to take away the guns. But this is about gun violence prevention, and then there's a difference between the two. And could you help us live with this recognition?
Yeah, I mean, I've been before your committee multiple times. I feel like every time I come before this committee, I'm talking about the same thing, whether it's exactly the same issue or not. Really, what I think we are talking about today is not necessarily how we control how people get guns or how they use guns. We're talking about the results of having guns in certain communities and why people pick up the gun, right? That's a different thing. Why I pick up the gun is different. I pick up the gun because the end result for me is not what it should be. And then that extends to my child and my child and my child. And eventually you have communities like we see in Connecticut where you have intergenerational trauma, complex trauma, community level trauma that, as I said, I think about 3 weeks ago when I was here, we didn't talk about at one point. And those are the things that we need to be focused on dealing with, which is why you need the coordination that is in Senate Bill 477 to be able to figure out how do you deal with those things. It's also why I think it's important that we talk about those community actors. It is why my focus was on 477 because when you deal with those types of trauma, it's always important, but it's even more critical because of the complexity of the trauma that there's a community approach to it, that the people involved understand deeply the realities of those young people that I tend to mention when I'm talking about this. I just want to say this so that we know. In the last 10 years, the amount of gun violence that has happened hasn't really shifted, right? We've done a lot on gun control, but if we really want to shift those numbers, we have to do something about the reason that people pick up the gun.
Yeah, I feel, again, just hearing you again, I think that this would be an area where we can have complete alignment on the people who have concerns about restriction on guns and the ones who have support or oppose that view. This is about prevention strategy, early identification strategy, and fixing the trauma, which actually leads to the gun being an instrument of the harm rather than being the cause of it. And it's interlinked in so many ways. So you articulate it so well. I can't thank you enough. Every time I could just have listened to you all day, but there are about another 140 people who will not be happy with that.
Understood.
Thank you. Thank you so much, Senator Winfield, for your testimony and your words and your work. The next person on our list is Marie Paulus, followed by Representative Ann Hughes. Marie Paulus, you're next. Hi, welcome.
Good afternoon. Can you hear me?
Yes, very well. Good afternoon.
Okay, thank you. Good afternoon, honorable chairs and distinguished members of the Public Health Committee. My name is Marie Paulus, and I'm a dental hygienist in the state of Connecticut, and I'm here representing the Connecticut Dental Hygienists Association. I would like to speak in favor of amending House Bill 5500 to allow dental hygienists in the state of Connecticut to administer and monitor nitrous oxide. Licensed dental hygienists administering and monitoring nitrous oxide will enable more dentally anxious people, especially those from the most vulnerable populations, to be provided with a more relaxing and comfortable dental experience. In these times, especially after COVID, more people are in need of dental care, and they should be able to be provided with a more comfortable experience. It's true that many dental offices don't use nitrous oxide, but most that do are in pediatrics or serving special needs populations. And in order to do it right now, the dentist has to be present in the room. So in an office that employs multiple hygienists, which most offices do, they're not able to administer nitrous oxide to their patients because the dentists cannot split themselves up and be in all the places at the same time. So allowing this to happen would allow the dentist to be able to administer nitrous oxide to the child they're treating in their operatory, and then allow the hygienist to be able to administer nitrous oxide to their perhaps anxious patients in their operatories as well. All of the surrounding states around Connecticut do allow hygienists to do this. As a matter of fact, 33 states currently allow hygienists to administer nitrous oxide. So New York, for example, allows hygienists to administer nitrous oxide, and that would be who we would monitor, or I should say, model our requirements for nitrous oxide after. We have many hygienists who live in Connecticut and work both in New York and in Connecticut, and it prevents some difficulties for them because they have to get additional training in order to monitor and administer nitrous oxide in New York State, even though they're licensed here in Connecticut and they went to school here in Connecticut. Thank you.
Thank you so much for your testimony. Thank you. We appreciate you coming in and waiting and sharing your thoughts. Well noted. Thank you. Seeing no other questions or comments, we move on to the next person. That's Representative Ann Hughes. Representative Ann Hughes, followed by Greg Allard.
Thank you,
Welcome,
Senator
Representative.
Anwar. Thank you to Chairman Steinberg and Representative Pettit and all my esteemed colleagues of the Public Health Committee. I'm State Rep Ann Hughes of the 135th House District, testifying in strong support of HB 5397, an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention and Advisory Council on Gun Violence Prevention and Intervention within the Department of Public Health, which is where it should be housed. Collecting data on gun violence and making that data available and accountable to the public, making recommendations and implementing evidence-based, community-based interventions and strategies to reduce gun violence and coordinating resources for such programs. I gotta say, in the absence of bold, decisive scientific research done on the federal level, looking at you, National Institute of Health and CDC, Connecticut's got to take the lead on research and data collection on the emergency of gun violence. And it is an appalling emergency, especially as Senator Winfield and Senator Moore talked about. It's just become normalized in our cities and in the rise in youth and veteran suicide. And we cannot just normalize that anymore. Not to mention the generational, familial, and community-wide human costs that we are just accepting. This approach to public health emergency of gun violence is, I gotta say, sexy policy making. It'll save lives by centering those most impacted, the community of gun violence survivors and victims, those most in proximity and at risk of gun violence, and the trauma care community that are treating those impacted, and the health and research experts charged with collecting data and evaluating it. I gotta say, it's kind of akin to the MAPOC Council. This is our advisory council that must be comprised of those impacted to oversight. MAPOC Council is oversight of Medicare and Medicaid, home-based and community-based services. It's a standing council, and together this bill would have the coordination and evidence-based approach and solutions with oversight from this council's mission that is meeting not less than bi-monthly, much as the MAPOC Council does. And I gotta say, that's very successfully, because we have oversight over state-of-the-art data dashboard, making our MAPOC Council one of the nation's leading model in oversight and stakeholder approach to our Medicaid and Medicare services. We evaluate outcomes, we evaluate the waiver programs and the RFPs providing the critical services. Look, this council that this bill proposes, may not have one answer, but this collaborative approach, this strengths-based approach centering those at the table that are most impacted, this is good policy making. And the public, in a highly public accountable oversight of these layered services, that's got to be part of the approach. and getting expertise and funding and evidence-based intervention, coordinating all those resources, both state and federal, much like we did with this pandemic. This pandemic was a public health emergency that we garnered a lot of resources with immediacy. And I want to have that same approach and immediacy and urgency to this gun violence emergency that is a public health emergency. And then secondly, I join my colleagues in support of HB 500 and promoting culturally competent doula certification and care for increased access for especially women of color to decrease an appalling maternal and infant health disparities that we have in Connecticut. Thank you.
Thank you, Representative Hughes. Just within 3 minutes, you said all that needed to be said. It's good. Good. Anything that you may have missed, you would like to add?
I was really struck by Senator Winfield's observation that we have not approached this gun violence epidemic and public health emergency in the same way as we have approached other emergencies that, quite frankly, impact different communities. And that tells you who we value and who we are garnering the best research and the best state and federal resources to. And I say it's time to change that. It's time to change that with this bill. And I think that it does do that. And it stops normalizing the gun violence in, especially in our urban communities, especially the generational trauma that is endured. It stops normalizing that and making that an acceptable cost. It's not acceptable. It's not acceptable to me as a social worker, but especially as a legislator representing all of Connecticut as well as my district.
Thank you so much. Truly appreciate your testimony and your words of wisdom. Appreciate that. And staying well, next on our list is Mr. Allard. Welcome, Mr. Allard. You're next, and followed by Representative Comey.
Good afternoon. Good afternoon, Senator Anwar, Representative Steinberg, Senator Summers, Senator Wong, and Representative Pettit, and the rest of the members of the Public Health Committee. My name is Greg Allard, and I'm here as the president of the Association of Connecticut Ambulance Providers and as the vice president of American Ambulance Service out of Norwich. Today, I want to give you the opportunity to offer my testimony regarding House Bill 5500. Our association supports sections 21, which updates language to require DPH to submit information to the EMS Advisory Board. We also support section 22, which changes a definition or modifies a definition of authorized emergency vehicles to include paramedic intercept vehicles or other non-transport capable vehicles used in emergency response. The most important part of my testimony today, I believe, though, is in relation to an amendment that I attached within my testimony. And that is really calls for an amendment to section 19A-180I of the statute of the Connecticut statutes, which currently allows for volunteer, hospital-based, and municipal ambulances to apply to the commissioner to add one emergency vehicle onto their existing fleet every 3 years without the need for a hearing. We'd like to add commercial ambulance providers to that list as well. We've done some discussions preliminarily with the department, and they're in favor of this. We've had some discussions with members of this committee and feel their support there as well. And that's the end of my testimony, and I'm willing to take any questions today. Thank you.
Thank you, Mr. Allard. I just wanted to, so you're suggesting that we should have a mandate to have a new ambulance every 3 years in any of all the cities and towns?
So currently it's allowed right now where a municipal department or a hospital-based department or a volunteer department could add on another ambulance into their fleet without the need for a service application. So if they had 2 ambulances and they wanted to add a third one on, they don't really need to go through the process. You know, it's a costly and lengthy process to go through with a hearing with the state in order to do that. So that's already, the provision is already there for them to do that. We're looking to add on the commercial ambulance service providers to that list. It's been something that hasn't been necessary or needed before, but we'd like to add that on as a possibility. Again, a cost avoidance type of the situation to go through that long, costly hearing. And, it's not something that I think is going to be enacted every 3 years, but if the possibility exists, it's just an easier process, less costly and timely for the whole process.
And would it be fair to say that the current process is costly and time consuming and may impact the quality of services?
I don't think it would impact the quality of services. I mean, but again, it is definitely a costly and timely process.
Okay. Thank you so much for sharing that. We will definitely look at your recommended amendment and your suggestions. Thank you for your testimony. Next person on our list is Representative Comey. Welcome, Representative Comey.
Hello, thank you so much, Chairman Anwar and Representative Steinberg and all of my esteemed colleagues. It's good afternoon here. It's nice to be here. I know you might find this hard to believe, but I really do miss being on the Public Health Committee. You guys do such great work, and I appreciate your commitment and dedication to it, so thank you. I'm here today to show my support for HB 5397, an act concerning the Office of Gun Violence Prevention. I've been very concerned, of course, as many of us are, about what we can do to reduce and what more we could do to reduce gun violence, especially when something I've been focused on is when used to end your own life and to choose to die by suicide. So I would, rather than sharing my direct thoughts on this, I'd like to share my time today with someone who knows much more than I do with regards to the research and policy end of this. Carrie Raytheon is Associate Professor at UConn Department of Public Policy, and she has had a seat on the DPH Gun Violence Prevention Partnership, and her research focuses on child and family violence. So she's widely acknowledged author for her analysis of policy on gun control, and her work brings a lot of folks together, scholars together from everywhere, and shares with Connecticut, fortunately, to ensure that our response is based on research. So without further ado, Carrie, go ahead, and my time is yours. Thank you.
Thank you, and good morning, afternoon. I'm not quite sure where we are. I'm in Texas, so the time is difficult. I'm pleased to be here today and submit testimony on behalf of the University of Connecticut regarding HB 5397, an act concerning the Office of Gun Violence Prevention. I'm an associate professor, but I'm also the director of UConn Center for Advancing Research Methods and Scholarship in Gun Injury Prevention, or ARMS. The university supports the provision of this bill that would create an Office of Gun Violence Prevention within the Department of Public Health, and we are committed to work with that office to develop and implement strategies to reduce gun violence in Connecticut. As background, ARMS is an interdisciplinary research initiative at the university which seeks to advance high-quality gun injury and violence prevention policy and research. A central part of our mission is establishing partnerships to reduce Connecticut's firearm-related mortality and injury. ARMS consists of an interdisciplinary group of researchers at UConn, UConn Health, and Connecticut Children's. ARMS also houses a research interest group whose membership is more expansive and includes our colleagues at DPH, Connecticut Against Gun Violence, and other entities committed to rigorous gun violence prevention research. As a network of scholars, we disseminate and translate research both within and outside of the public health domains to ensure Connecticut's response to gun violence is robust. HB 5397 would create and fund a new Office of Gun Violence Prevention with the DPH. If passed, this bill would represent a significant step forward in Connecticut's continued efforts to prevent gun violence in our communities. This is a real opportunity to implement, evaluate, and strengthen the programs and policies that reduce gun violence. While I support this bill, I encourage the Public Health Committee to consider incorporating a broader research strategy into this office by considering the addition of ARMS as a research partner in this work. One potential model is for ARMS to act like a National Institute of Health data coordinating center. In the NIH model, ARMS would work with DPH to identify evidence-based programs, work with funded programs to create an evaluation plan, ensure evaluation data is collected properly and consistently across programs, and help programs demonstrate their success for future and sustainable funding. ARMS is well suited to provide this kind of objective and technical assistance. ARMS is already working with our state partners to use existing data to help us understand gun violence in Connecticut. We're working to create maps so that we can see who is dying from gun injuries, including suicides.
Excuse me, Ms. Raiston, your time is almost up. If you please.
Yes, I have one sentence, I promise. We are committed to working with DPH to fulfill the requirements of this legislation, and we seek to be a research resource for the state and to continue to partner with policymakers, practitioners, and service providers. Thank you so much, and I'm happy to answer any questions now or later.
Sure. Thank you so much, Dr. Raisian, for your testimony and the work that you've been doing. I think we have, with respect to yielding results, why have our previous policies not been as effective in reducing gun violence impact on our society, and why would the current suggested policy be a little bit better? If you could allude to that based on your understanding.
Yeah, so that's a fantastic and very comprehensive question. So one of the things I want to say is Connecticut is actually very effective. So, while our gun deaths are too high in Connecticut, and, we want to reduce gun death in Connecticut, we have one of the 5th lowest gun death rates in the country. We consistently, rank in the sort of bottom 45, which is good. This is actually where you want to rank, in the bottom. So a lot of what we're doing is working. This is an opportunity to strengthen that. And so I want to stress that, and sort of that also underscores that a lot of the work that is happening in Connecticut is being done by committed professionals that have a lot of expertise, but they probably need more funding and better support. I think where this bill creates a real strength of opportunity is coordination rather than fragmentation, right? We're stronger together. And we've had a lot of disparate programs doing the best that they can. But if we can work together, if we can create consistent measures, if we can create a systemic evaluation plan, if we can learn from each other about what works and what doesn't, then we can sort of cut to the chase immediately and do a more effective job. I also think where this legislation is really going to help us is harnessing data and research. There's just a lot we don't know in the state of Connecticut about where gun death is happening, where injuries are happening, et cetera. And without that information, we can't target resources appropriately, right? And so those kinds of interventions are what this bill proposes and would strengthen Connecticut's already strong response, in my opinion.
Thank you so much for your answer. I know a couple of my colleagues have questions. I'll start with Dr. Foster. Please go ahead.
Thank you so much, Dr. Anwar. Dr. Raisian, I'm so happy to see you here today. Thank you so much for being with us. It's wonderful to hear you talk a little bit about your area of expertise. I have a couple of questions for you. My first one is a lot of the conversations today, as we've sort of talked about gun violence prevention, have focused on specific types of gun violence. Can you talk a little bit about an Office of Gun Violence Prevention, about where are gun-related fatalities occurring, and how can an evidence-based approach make sure that we are addressing sort of the breadth and depth of the different types of gun-related violence that we should be considering interventions for?
Yeah, so, I think what's hard about gun violence, what I struggle an awful lot with, is that this is a multi-stream problem, right? So there's not one cause of gun violence. There's not one kind of gun violence, but even if we're thinking about community-based gun violence, which is what this bill is centered on, there's not one kind of community gun-based violence either, right? There is violence that happens in crime. There's violence that happens in retaliation. Both of those are related, but possibly distinct, right? And so I think what an office can offer is bringing together all of those different kinds of perspectives and thinking about why gun violence happens, and creating a coordinated response. So the researchers that we work with are in social work, public policy, communications, journalism, economics, criminology, et cetera. And all of those perspectives can be brought to bear. I think what the office can offer the most, Dr. Foster, is a coordinated response and bringing programs together so that we can talk to each other and cooperate rather than compete. And actually, I don't think I think that I don't want to oversell the competition, but I do think having more opportunities to cooperate and learn from each other is important. To address your first question, Dr. Foster, overwhelmingly, community gun violence is concentrated in our cities, and it very much disproportionately affects men of color. And that is a community that desperately needs our help and resources. But it needs our help more in just community gun violence intervention programs. One of the reasons that public health can offer some expertise here is thinking about the social determinants of health. What is it about the environment that sort of allows these causes to grow? And how can we address this both from a micro, what I think of as an individual level, a person level, and macro level factors, which includes jobs, crime. There's a lot of literature that's just about sort of how the landscape of a city affects gun violence, right? And so really thinking both at the individual level, but also about our communities and strengthening all of that holistically will be important for this office to engage in.
I've heard you speak on gun violence on previous occasions, and one of the things that it sounds like a office like this, particularly if they're using an academic partnership like with ARMS, could be set up for is success in addressing other types and forms of gun violence as well. I feel like I've remembered you sharing statistics around suicide by gun violence as well. And so I don't know if you could talk a little bit about that and why these players structured this way, particularly if we add that academic collaboration, would set us up for success in evidence-based intervention across multiple arenas.
Yeah, absolutely. Thank you for that question, Dr. Foster. So just as, 2/3 of gun deaths are gun suicides. And we've done a lot of work to reduce that. And that is has a lot of ties with mental health concerns, but also gun access. So suicides tend to be concentrated among older white men, and homicides tend to be concentrated among younger men of color. And we tend to think about these two forms of gun violence as being distinct because they often happen to different what we think of as populations. But actually, suicide among men of color is increasing, right? So it's not like these are compartmentalized, and we shouldn't think about compartmentalizing them. One of the sort of movements in public health, if you will, one of the places where the very current literature is thinking about is how to have medical providers, whoever that may be, talk to people about safe storage of their gun and harm reduction with their gun. Right. So if we safely store guns, I know this is legislation that this body has considered previously, so I don't want to belabor that. But if we safely store guns and make them more access for whomever is vulnerable, can't access them, that can reduce homicides, that can reduce intimate partner violence, that can reduce mass shootings, that can reduce suicides. Right. So there are things that we can do that can have effects across multiple domains of gun homicides and injury. And that's important for us to consider when we're thinking about, when we're thinking about scarce resources, both in sort of time, energy, and contact with people, what are the steps that we're going to take that have the highest yield? Those are the kind of evaluation strategies that a comprehensive office that's thinking across disciplines of research can bring to Connecticut and to our service providers, both in communities and in healthcare settings.
Thank you so much. Thank you. And I have Senator Moore next.
Thank you, Mr. Chair, and thank you for your testimony. I agree with a lot of what you've presented today. I have a couple of questions. In the way of research that you've done, how is it being implemented here in Connecticut?
I'm sorry, my research or the research for these evidence-based programs? I just want to make sure.
For the evidence-based programs.
Honestly, Senator Moore, I don't know the answer to that question. I think that what we need, one of the things that's so hard to do with research is to understand that we may have a model that's been researched in other settings, but then when it gets adopted in a different setting, it's difficult to know if that program is being adopted in the way sort of that the original research intended. We call this fidelity, right? And so this implementation science, without knowing about the intricacies of these programs, I'm simply not able to answer that. I'm sure the providers of those programs would do a much better job. So I'm just going to say that I'm not qualified to answer that and apologize.
Thank you. So, I know where the violence takes place. I don't need research to validate the lives that have been lost in Hartford and Bridgeport and New Haven that are underfunded. And research helps validate that. It helps drive the programs. But so many times what happens, and this is why this, the bill that I've introduced, House Bill 477, that is similar to what you're talking about, is important, because the answers for what is happening will not happen just with research. It will happen when the people who are doing the work on the ground are included. It will happen when communities have a say. And what I'm considering is making sure those people stay at the table, have some input, can implement some of the research that you do. But some of these programs that are working on the ground, doing the work every day, are small, community-based, people who have lost a loved one, right? And until someone takes the time to help them evaluate their programs to see if it works, they will be on the ground just doing the work without the funding that they need to do. So from a hierarchy, I appreciate the research, but if the research does not include the people who are being most impacted in Black and Brown communities by the type of gun violence I'm speaking of in this bill, then nothing is going to change. We will continue that cycle of a research, a book on the shelf, a report on the shelf that nobody ever does anything about. So I appreciate your comments, and I hope that you'll be engaged as we move this along, that we can come up with something that works for everybody in the way of community-based gun violence and addressing our youth. All those root causes that you mentioned are right. It's about poverty, it's about education, it's about housing, all those things. But if we don't start dealing with it at the root cause of where it's happening with the communities, we will just be here year after year repeating this information. And I just want to mention, we did 2 years ago, RIASAP in Bridgeport created a gun violence task force to look at it locally, to get the answers for Bridgeport area, what's going on here. And I think those voices are equally important as research from higher institutions. So I thank you, and as I said, I hope you will stay engaged in the process. Thank you for your testimony. Thank you, Mr. Chair.
Thank you, Senator Moore. I don't want to imply in any way that the research and the community providers should be separate. And I apologize if my testimony implied that in any way. I used to be a social worker prior to being an academic, so I understand that very much. My approach to research is that it's bilateral, right? And that you have researchers and you have people doing the work, and that they're enmeshed and that they're talking to each other so that the research can meet the needs of the community providers, right? So that they can continue to and be able to demonstrate what their program is doing. And so that if they're doing something that isn't working, they tweak it. If they're doing something that is working, they also tweak it to do it better, right? Like research is iterative and it is a process, and it requires all people. Researchers that just sort of do things without any context, that's bad research, Senator Moore, and I want no part of that. So please believe me when I say the words partnership, I mean that very strongly. I do think it's important that the grant-making body, the investor, be distinct from the person doing the work, from the person doing the evaluation. And I think this is important as well, so that sustainable investment from outside of Connecticut, federal dollars and other nonprofits can be used, and so that the organizations in our state can be competitive for those dollars. That would be part of my goal and what ARMS would be helping, hopefully, if engaged, to do to demonstrate that work and to strengthen that work in partnership.
Thank you. I agree. I just often don't see the research engage community other than the gathering of information, right?
Mm-hmm.
But the implementation and the continued consultation with community to say what's working, what doesn't. And that's why I think a commission would be the answer, that it's a dedicated group of people evaluating small programs, evidence-based programs, working together with the other departments to get this done. I've done the research to try and find out how much money has come into Connecticut for gun violence, what we're doing within the state of Connecticut through Office of Legislative Research, and we've not been able to find anything. And that's why I think it's important for a commission to oversee this project, to make sure it's done and have the follow-up and the teeth and the ability to pull in all those other resources to make sure that we're all included in decision-making and funding, and that we understand what really does work in our communities. And again, I thank you for your time and commitment to this.
Thank you as well.
Thank you.
Thank you.
Thank you, Mr.
Thank you.
Chair.
I have Representative Claire Dietra, who has a question or a comment. Go ahead, Representative.
Thank you. Thank you, Mr. Chair. Thank you, Carrie, for being here today. I just want to confirm, I thought I heard you mention something about Connecticut not having safe storage laws. Is that correct?
No, I did not say that. I think what I said was Connecticut, that you've talked about that in previous legislative sessions. Connecticut has some of the strongest safe storage laws in the country.
Okay, I wanted to clarify that, because obviously we pass that. We have it for your car and your home, and
you have some of the strongest safe storage laws in the country.
Yes.
So I apologize.
And I just, oh, no worries. That it may have been my mistake that I didn't hear you correctly, but I want to reiterate what some of my colleagues have said. We know there are issues with gun violence. I don't think no one is disputing that. But I personally want to see us get to the root of the problem. Why are people committing acts of violence with guns? It's not, and we know it's not the law-abiding gun owners. We know they're not doing anything. And we know bad people will always have access to guns, no matter what laws we pass. We can be the best in the country with gun violence laws. Bad people will get guns and use them. Not going to be able to change that. We need to figure out ways to help the people in these communities that are committing it, that may have mental health issues, and what the issues are, how we can address them, and how we can fix them. And to me, that's the most important thing, to fix what the issue is. And that's where I want to see all our money go, to fixing these issues with violence and guns. But thank you today. Thank you again for your testimony. Thank you, Mr. Chair.
Thank you. Seeing other comments or questions, I wanted to thank you, Dr. Riasian, and also to Representative Comey for your testimonies. And Representative Comey, we miss you. So whenever you want to, come back and join us, and join us in these public hearings, marathons that we are now. A 12-hour one is like a breeze for us. And so
I'll jump in right at the end. Thank you so much.
Thank you.
Thank you, Doctor.
And the next on our list is number 32, Melissa Kane. Welcome, Ms. Kane.
Thank you so much. It's wonderful to be here, Senator Anwar, Representative Steinberg, Senator Wong, Senator Summers, Representative Pettit, and distinguished members of the Public Health Committee. My name is Melissa Kane, and I'm the chairman of the board of Connecticut Against Gun Violence. I'm here today to testify in favor of SB 477 and HB 5397. I got involved with CAGV because of the relationships and impact the organization has had with legislators for many, many years, which has helped us pass legislation to reduce gun violence in Connecticut and help ensure that it is a safe state in which to live. There's no doubt that strong, sensible gun laws and adequate enforcement are essential. However, the type of legislation we have passed to date is clearly not sufficient or appropriate in focus to address the growing public health crisis of community gun violence. Last year in Connecticut, there were 118 gun murders, on average, one almost every 3 days, and it was the highest number of gun homicides in the state in 25 years. The root causes of community gun violence must be addressed. Conflict needs to be de-escalated and cycles of violence broken in order to reduce it. And that can only be done by adequately and consistently funding the organizations on the ground in the affected communities, the cities, who are doing this essential work and have seen real results. And as Senator Winfield said, it has to happen now. CAGV and our partners have been advocating for a vehicle to prevent community gun violence, to help coordinate and administer grants to these types of community and hospital-based organizations since the beginning of 2020. There was no legislation before the General Assembly, however, until Senator Moore got involved in response to horrific murders that took place between January and April 10th of 2021. Senator Moore galvanized the legislature to finally address the public health crisis of community gun violence, which led to the establishment of the Advisory Council on Gun Violence Prevention and Intervention as part of last year's Senate Bill 1. As you know, this bill also importantly declared racism a public health crisis. Senator Moore opened our eyes to what needs to be done and to what our response should be. CAGV would very much like to see Senator Moore's bill, SB 477, move forward, including some key language that is part of HB 5397. We believe the most powerful bill would include 5 key components: declaring that gun violence in Connecticut is a public health crisis to bring it the attention it needs, housing the solution in the Department of Public Health, where we believe it could have the greatest impact, establishing an ongoing advisory council, including the voices of those most impacted by community gun violence and community stakeholders to ensure accountability, including a robust data gathering and research capacity to drive evidence-informed grant making, and appropriating ongoing funding commensurate with the magnitude of this crisis, starting with $5 million in fiscal 2023 for operating expenses and grant making. I appreciate your taking my testimony into account, and I thank you for your time.
Thank you, Ms. Kane. Thank you for reading a lot for the people's minds. I have Representative Steinberg, who actually has a question or comment. Thank you, Representative Steinberg.
Thank you, Mr. Chair. And if you'll indulge me, 2 questions. First of all, there have been some questions asked about why would we house this new function if this bill passes within the Department of Public Health, as opposed to public safety, for example, because so much of our historic focus on gun violence has come from really the public safety side of things.
I'm sure. I think that's an excellent question. I appreciate your asking it. And I just want to start by saying that whether the grant making capacity and a dedicated staffing, I should say, lives within the Department of Public Health or whether it's a legislative commission is a decision for the legislature in consultation, I would think, with the executive branch. And I think is far less important than achieving what we all agree is paramount, which is reducing interpersonal gun violence, which is concentrated in the urban communities in Connecticut. But CAGV has recommended that the grant-making authority be housed in the Department of Public Health because that's where the Office of Injury Prevention sits. That was established in 1993 by legislative mandate, and its charter is to develop relationships with other state agencies and private and community organizations to establish programs to reduce interpersonal violence, including homicide, and to develop sources of funding to fund those programs. So there's kind of a blueprint there. But again, I would say I think it's more important than where the capacity resides is that it includes those 5 key components I mentioned, which are a grant-making process and criteria that leads to evidence-informed competitive funding of community-based violence reduction programs, an advisory council that includes the voices of those most impacted by community gun violence so that the communities can have a say, dedicated staff to secure and disperse the grants, provide technical assistance and ensure accountability, and a commitment to ongoing state and federal funding commensurate with the magnitude of the crisis. Again, we call for $5 million for fiscal year 2023. And as just was mentioned, robust data gathering and research capacity to drive evidence-informed grant making and coordinated approach.
Thank you for that. Yeah, we are going to debate very seriously the best place to house such a grant-making authority. But we see the importance of linking it with existing programs that the legislature put together years ago. One more question, if I might, Mr. Chair. You may have heard some earlier testimony, or at least commentary today, which we all agree that government hates to waste money. If we can avoid it, we want to only fund programs that are evidence-based and successful. But it's been suggested by some that we really don't understand the core underlying reasons why we have such gun violence in our communities. Are we really that ignorant, or do we have a pretty good sense of where we need to be putting our resources and our emphasis?
Well, I feel like I'm not an expert and can't answer that question, other than to say that the people that are partners that we know in Connecticut see where this is happening every single day. And when we talk about the 118 gun murders that happened in 2021, we talk about where they happened and we look at that. We know that it's happening and it's most concentrated in urban centers, and it's mostly we know the communities where it's happening. So I'm not an expert and I can't comment on that. What I can comment on is that it is, beyond the loss of life and the profound impact on these communities where that are experiencing these high levels of gun violence. Gun violence has a tremendous economic cost on the state of Connecticut, on all of our communities. And there's research from Everytown and Giffords that has estimated that gun violence of all kinds costs Connecticut taxpayers between $60 and $90 million annually. It's a huge cost. So when you talk about the cost of lives, the cost of communities, and the cost to taxpayers, and we talk about what we're asking for, which is $5 million to set aside where we see evidence-based programs on the ground in communities where we know the violence is happening and we know that they're interrupting cycles of violence. It seems like a really good investment.
Thank you for that. Yes, it does seem that what we really need to do is provide resources to programs we know are effective. Thank you for that. That's all for me, Mr. Chair.
Thank you so much, Mr. Chair. And next is Representative Senator Moore.
Thank you, Mr. Chair, and thank you, Ms. Kane, for your testimony. I think we agree that there is a problem. I think we agree on how to approach it. I think our challenge here is where it lies and how it's implemented. I appreciate you giving me so much credit for something I don't deserve, because this work was being done long before I got involved. I was moved by a larger group of people who were talking about gun violence, and I was brought into a meeting. And in that meeting, I believe Connecticut Against Gun Violence had been doing this work, trying to create an advisory committee, or trying to create a place through the governor's office to move some of this stuff in here, right? My participation really was the result of listening to other people, putting together the public act that created the advisory. And I said I could help. If there's something that I could do, I would do it. What really pushed me to get more involved was when the 3-year-old Rondell Jones was killed in Hartford that morning. And it broke my heart, just broke my heart, that a child who I don't know what that child would have contributed, what he would have given to the world, but the pain of a mother losing a 3-year-old to gun violence, that we need to address it in the communities, not necessarily with research, but with people who understand where it's coming from, what it's doing. And that's what this group of people did for me. They enlightened me on, there was people working together. And I think we all want the same outcome. I just believe we need to work together and follow the lead of the recommendations of the advisory, which your organization had a person on the advisory, and the 10 or 12 other people who were doing the work in the community, from the hospitals to people doing prevention to doing intervention. All those people working together came up with a recommendation. And I want to respect that recommendation that your organization was a part of also to do. We will still continue to look at where is the best place for it to land. I do want to say that there have been opportunities with the Department of Public Health and Public Safety to do something, and they have not. And that's why I often say you can't legislate love, you can't legislate the heart, but we can legislate people to get something done when it comes to losing the lives of this senseless gun violence that's taking place community-based in the community almost daily in Connecticut, in urban centers. We've got to address that. We have to have someone look at it and figure out how do we bring these people together to make sure the programs that work are getting funded, that we evaluate smaller programs that may not be evidence-based, but they're community informed. Because community for me is so important, and it's why I push 2 generations. That's why I push the fatherhood until we start looking at this as a holistic approach with families having a say at the table. Nothing is going to change. Government cannot always do it. You need the community. That's why nonprofits are so important to me also. So I thank you, and I hope we can come to an agreement and understanding of how this works and that we can get it done. We can't wait for any more research. We can't let any more children die in our cities. We have to do something now, and I appreciate your support of the bill.
Thank you.
But I want to make it clear, I do not want to take credit for the work that's been done by all these other organizations. I've just tried to be a vehicle to try and move some of this stuff to get something done.
Well, thank you. You have been a wonderful vehicle, and I agree with you completely. Thank you very much.
Thank you. Thank you, Mr. Chair.
Thank you. Thank you for everyone for your comments. I see the next person on our list is Bridgeport Generation Now Incorporated. Welcome.
Hi, good afternoon. Thank you. Good afternoon, Senator Anwar, Representative Steinberg, Senator Moore, and the distinguished members of the Public Health Committee. My name is Callie Gail Heilman. I live in Bridgeport, Connecticut, and I'm the president and co-director of Bridgeport Generation Now and a member of the Bridgeport Youth Gun Violence Prevention Task Force. Thank you for raising bills that address the crisis of community gun violence in Connecticut. I am here to testify in support of SB 477 and HB 5397. Founded in 2016, Bridgeport Generation Now, we're a grassroots resident-led organization with over 300 members. We build collective power by strengthening civic engagement in ourselves and our community, and we use the tools of community organizing to dismantle systemic racism and systemic corruption so that we can build the just, equitable, and livable city we know is possible. Part of our work is grassroots issue research. Our members take up issues in the community that we care about and research policy-driven solutions. In 2019, our members took up the issue of police violence and misconduct. And as our Public Safety and Police Accountability Committee researched best practices for strong police accountability, our members understood that it must go hand in hand with new approaches to public safety through a public health lens. In our 2019 report, our members cited research done by Cure Violence that shows that violent behavior transmits and spreads based on exposure, just like an epidemic disease. One of our key policy recommendations from that report was that we must focus funding and policy on addressing and eliminating root causes of violence, such as mental health, underfunded schools, high costs of housing, homelessness, and employment opportunities that have livable wages, among many others. It was from our work here that at the invitation of Senator Moore, we joined the Bridgeport Youth Gun Violence Task Force that was established in August of 2019. This task force is housed at RIASAP and is composed of representatives from Bridgeport nonprofits, clergy members, violence interruption programs, the Bridgeport Police Department, the Department of Emergency Services, and the hospitals. We meet to address the problem of escalating gun violence among youth in Bridgeport and discuss strategies. We share current activities and develop a vision for a violence-free Bridgeport. In our report, the Bridgeport Gun Violence Task Force proposed several recommendations, which included involving violence impacted communities in all aspects of the response and decision-making. It included that we would establish baseline data collection, that we would invest in prevention activities such as after-school mentoring, that we would intervene in the community through evidence-based violence interruption programs.
Excuse me, your time is almost up. If you would please summarize. Thank you.
Thank you. And that we would monitor and evaluate activities. So I'll just close by saying that I think we're all in agreement that gun violence is a public health issue, and it requires a robust response, and SB 477 and HB 5397 begin the work of getting us there. So thank you.
Thank you so much for your testimony. My colleague, Senator Moore, has a question or comment for you. Senator Moore.
Thank you, Callie, for coming. I really appreciate the work that you all are doing in Bridgeport Generation Now. So the task force in Bridgeport that was created, do you see where it mirrors some of the recommendations we've made in Senate Bill 477?
Yes, I think in terms of involving the violence impacted communities as part of the decision-making table, that was the very first recommendation to come out of our report. That establishing like a baseline of data was essential for understanding where we were going, but that most importantly, we would have, our task force was really committed to having, partners that were all approaching the issue from our different areas of expertise, but coordinating a response together. So, youth mentoring programs, we had Caribe youth leaders at the table. We had the hospitals there to talk about, how they, have what their trauma responses are. And and so it's that coordination of activity that we have been working on down in Bridgeport that I think mirrors Senate Bill 477.
Thank you. And one thing as you're talking, I thought about that's missing in all the bills is that we're not engaging our youth in some of the decision-making policies that we need to, that are most impacted by some of this work. And I think we should be considering if there's going to be an advisory that we have some youth that even been impacted through family trauma, gun violence, or who work in the community to make sure their voice is being heard. So we make sure we're including all the voices. So thank you for that. That just triggered that thought. Thank you for your testimony, and thank you, Mr. Chair.
Thank you.
Thank you. Seeing no other comments or questions, we want to thank you for your time and your testimony. We move on, expert on our list to testify, which is Karen Healy. Ms. Healy, you're next.
Hello, can you guys hear me? Good afternoon. My
Very
name
well.
is. Am I good? Okay, thank you. Good afternoon, Senator Abrams, Representative Steinberg, and distinguished members of the Public Health Committee. My name is Karen Healy. I live in Hartford. I'm a person in recovery for mental health, physical health issues. I've been living successfully in the community for 7 years. Before this, I spent 24.5 years living in inpatient psychiatric hospital between Hudson River State Hospital in Poughkeepsie, New York, Cedar Crest Hospital in Newington, and Connecticut Valley Hospital, CVH in Middletown. I'm here to testify in regards to SB 450. This experience has traumatized me even more as CVH did not help me get better. Being at CVH as a patient for me and watching things that happen did not help me. Sitting in a day room, watching people going off, staff talking about patients, people getting hurt by patients and staff getting hurt by patients, and just sitting in a day room where there was no help. I mean, it costs like now when I was at like $1,500, $1,600 a day to be a patient at one day, and I was not receiving any help, where I just sat in a ball in a chair or in my dorm on a companion sit doing absolutely nothing to better myself. And even though management of DEMA say they're trying to discharge people, they're not doing enough to make them believe they care. The system promotes abuse and gives no recognition to people who actually try to help. It took forever for me to be discharged, and nothing that happened to me in state hospitals ever helped me recover. When I was finally able to get discharged, many directors and managers of DEMAS and CVH told me that I would be back within 1 week, and I'm happy to say that they were all wrong. Now I'm working as a part-time, doing well, and thriving in the community. I actually had people, when I got discharged December 4th, Thursday at 11:33 a.m., I signed my discharge papers from CVH on Battelle Street South. I was told as I was walking out the door by doctors and people in the hallway going to the elevator, we will see you back next week. You'll be in the ER that weekend. And guess what? I still have not seen the site of CVH, and no one's ever heard to put me back there. People with mental health issues are humans, even though CVH doesn't treat us like that. For these reasons, I support SB 450 and agree with the recommendations of CVH. I appreciate your listening to my testimony. Thank you for letting me share about my experience at CVH, why changing the system is so important. Does anybody have any questions or comments?
Thank you so much for your testimony. I found it very, very useful, and thank you for sharing your experience and then your courage. Truly appreciate it. I do not see any comments or questions, so we wanted to move on to the person on our list. Thank you again, Ms. Healy.
You're welcome. Thank you.
Thank you. Is Mr. Tom Lilburn? Mr. Lilburn, you're next.
Thank you, Mr. Chairman and ranking members and distinguished members of the Public Health Committee. Thank you for the opportunity to testify in support with modifications of sections 1 and 39 in House Bill 5500, and that concerning DPH's recommendations regarding various revisions to the public health statutes. My statement will basically be about plasma donation, plasmapheresis in the United States, and why it's needed now. My name is Thomas B. Wilburn, and I am currently a resident of Madison, Connecticut. All my children are raised in Madison, and the health and well-being of all the children in Madison and in Connecticut are of great interest to me. I've been involved in the pharmaceutical industry for over 40 years in many capacities. I retired from Big Pharma, actually in West Haven, and I work now with a small trade association, Plasma Protein Therapeutics Association, that represents the very few manufacturers of medicines made from donated human plasma. I've had the privilege to get to know many of the patients whose daily lives involve using these life-saving medicines to lead productive and healthier lives. You may have known a family with a son with hemophilia, or perhaps a daughter with one of over 450 primary immune deficiencies, or a mother whose newborn has a blood type incompatible with her own, or a cancer patient whose immune system has been hurt by cancer-killing drugs, or maybe a burn victim or a trauma victim. And now I'll even add battlefield injuries. All of these and more are potentially helped by medicines made only from human plasma. It takes a tremendous effort to collect enough plasma to make these medicines. It could take over 1,300 donations to make medicine enough to treat one hemophilia patient for a year. It takes 7 to 12 months to make that treatment. Almost every state has donation centers that help collect human plasma, except my state of Connecticut has none. Yet patients in Connecticut benefit from the gift given by other donors. Every day in Connecticut, these medicines save lives. I'd ask that you support the effort to help patients that need plasma-derived medicines and make collection of plasma a reality in Connecticut. Please don't let these families that I care so much about go without these medicines and suffer. I'm simply going to say thank you for allowing me to testify, and thank you for your efforts on behalf of all of Connecticut.
Thank you so much, Mr. Lilburn, for your testimony. I wanted to confirm, I probably did not hear this completely. You're okay with the language of 5500?
We are okay, and there'll be another speaker following me that can define it more closely. But we are in favor of the language allowing the department to make changes of 30-year-old regulations that right now prohibit or hinder the plasmapheresis and collection of plasma in the state of Connecticut. So we are in favor of allowing DPH to make those. We'd prefer that they be harmonized with federal regulations. That's what New York State just accomplished. And now has multiple donation centers in the state. So that is the goal.
Thank you so much. I see Dr. Pettit has a question or a comment. Dr. Pettit.
Thank you, Mr. Chair. Mr. Lubin, just for my benefit and everybody else on the committee, what exactly right now is prohibited and what do we need to allow that's not currently happening to allow this process to occur? I don't think everyone completely understands.
It is some of the, it's not a prohibition as I understand it so much as a hindrance. The state of Connecticut requires that a physician be on site anytime plasmapheresis is done. That hasn't been done in most states for 30 years. The federal regulations are very strict, and the organization that I work with also sets standards and audits those collection centers. That being the case, we don't feel that it's necessary, and most of the community doesn't feel that it's necessary that a physician be on site every time plasmapheresis is accomplished.
So to cut to the chase, the Public Health Committee is in charge of safety based on experience from other states. When you have experienced phlebotomists, people skilled in plasmapheresis, not having a physician on site hasn't led to more mishaps, injuries, or problems, and it's not been an issue in terms of public safety in the other states that allow this.
Absolutely correct, sir.
Thank you very much. Thank you, Mr. Chair.
Thank you so much. Seeing no other questions or comments, we thank you for your testimony, and we'll move to the next one on our list, which is Mr. Gerald Richard. Mr. Richard, you're next. Mr. Richard, you can unmute and you can turn your camera on, and you're next.
Hello, can you hear me?
Yes, we can hear you, but we cannot see you. And if you want to turn the camera, you're welcome to, or you can continue to speak.
Well, I don't know why my camera's not working, but I will speak. Thank you, Chairman, and thank you, members of the Public Health Committee. The reason I'm testifying today is to oppose HB 5397 and Senate Bill 477. And the reason I'm opposing it is, you know, I'm 73 years old. I've been involved in the shooting sports and firearms nearly my entire life. I continue to participate in these sports. In fact, I was at a shoot yesterday and there were 40 people there. Thousands of rounds got fired and no one was hurt or injured. And it's similar to the 20 million target shooters across the United States each year. And in fact, the shooting sports have a very strong safety record. And so what concerns me is the term gun violence. What I find is that the responsible and widespread use of firearms tends to get painted with this term gun violence, and we don't differentiate between the responsible use of firearms and the criminal use of firearms. And that, I think, leads to a lot of ineffective public policies that haven't really been successfully implemented. For example, the state back in, I think, 2012 or 2013, representative at the time, Tong, advocated a gun trafficking task force. And it's still recognized that a lot of the crime guns in the state come from out of state, but yet that task force has gone unfunded for many years. The state has passed a lot of gun control laws in the last 8 to 10 years, and yet many of those laws are not prosecuted 60 to 80% of the time. So it really becomes questionable in how effective they are in reducing gun crime. And the state of Connecticut's management of the background check policy is ineffective. Gun dealers wait for hours on the phone trying to reach someone, having to dial multiple times. And so it's questionable how effective that's being administrated. And then the state also passed Ethan's Law, which part of that was about gun storage, but also created a firearm safety training for Connecticut schools. And that's a program that really hasn't been widely implemented. And I think that part of it is this term gun violence. And I also criticize the media. They talk about gun violence on the news, and yet there are programs showing people being shot and blood spattered, guns pointed at people, fingers on triggers, and all kinds of unsafe practices. And so I think if we really focus on the criminal activity and then implement many of the policies that have already been done, I think the managing the rest of the gun crime and firearm abuse incidents would become much more manageable. So I oppose this bill because I think that the term gun violence doesn't really focus or help us focus on the areas of greatest need. So thank you very much for allowing me to testify. I do appreciate it. Thank you very much.
Thank you. Thank you for your testimony. Seeing no questions or comments, we will move to the next person on our list, which is Carmel Kostritz.
Hi.
Hello.
Hello. Oh, just a moment.
Your camera is on now. Good. Go ahead.
Thank you. Thanks very much. Good afternoon, Senator Abrams, Representative Steinberg, ranking members Wong, Summers, and Pettit, and distinguished members of the Public Health Committee. My name is Carmel Kostolitz. I live in Cheshire, Connecticut, and I am a volunteer with Connecticut Against Gun Violence. It is extremely encouraging that bills have been put forward to this committee that include provisions to address the epidemic of community gun violence in Connecticut. I am testifying in support of SB 477 and in favor of the language in HB 5397, which is an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention, because it incorporates 5 essential objectives that need to be included in whichever bill is voted out of your committee. And I reiterate what other people have said before. It declares gun violence a public health crisis. It will be located in the Department of Public Health, where it can have the greatest impact. It has mechanisms to include voices of those who are most impacted by community gun violence. It includes a thorough database gathering and research capacity to support grant making. And lastly, it calls for funding that is needed to address the magnitude of this public health crisis. In the past year, several cities and states have created life-saving gun violence intervention programs, such as Washington State, New Mexico, and Oregon. I believe that Connecticut needs to support HB 5397 to help resolve the epidemic of community-level gun violence in our state. The state has ample resources to allocate the $5 million called for. This will ensure that there is dedicated full-time staff in the Department of Public Health, such as director, grant administrator, and support staff, to oversee the efforts laid out in the bill. There is an urgent need to take action. Last year, gun homicides were the highest in 25 years, nearly double the level in 2018. I've worked for many years with people suffering from chronic mental illness and have seen the impact of gun violence and suicide on families and loved ones. With more funding allocated for a designated Office of Community Gun Violence Prevention, we will be able to better protect vulnerable populations from community-level gun violence and to promote and support violence intervention programs. I hope that the esteemed members of the committee will recognize the gun violence epidemic in our cities and communities and agree to send HB 5397 forward to the legislature for approval. Thank you very much.
Thank you so much for your testimony. I do not see any question or a comment, so we appreciate your testimony, and that brings us to the next person on our list, which is Hal Bessel. Not seeing Hal Bessel right now. I'm going to move to next.
Hi, hello?
Hi. Yes.
Good afternoon. Yes, this is Mr. Baxter here.
Okay, please go ahead.
Good afternoon, everyone. Thank you for allowing me to testify this afternoon. Again, my name is Hal Bassel, currently under the PSRB. I've been here at Whiting Hospital for over 13 and a half years. For a while now, myself and fellow peers, we have been put in many unfortunate situations. Time after time, so many situations we've been faced with throughout the time in Whiting. We certainly believe it is now definitely time for change. If everyone, do you remember the old saying, things are looking up? Well, looking up will always change things for the better. Here's what I would say should occur with the PSRB as being amended or revised. One, allow the PSRB board members to step in when it concerns the equities readiness for release to the Free Society on conditional release, because their statement is protection of society. Allow the hospital personnel to make the decisions of discharge to and from Whiting to Dutch or less than chance security facility. We currently have many channels and parties to go through for discharge process. Two, members should have a term of time to serve on the board. The board should change out board members so there isn't any dictatorship, if you will. Oversight committee should monitor the PSRB board on an annual basis to ensure the PSRB members are performing their duties in an appropriate manner. Oversee reports, discharge requests, document 6-month reports written to the members of the board from WFH hospital personnel. Keep track of how the board members handle recommendations made by the equities legal counsel / hospital staff. For temporary leaves, requests, conditional release, oversight committee should oversee the recommitment process, allow the possibility of an honorable probate judge to take over the recommitment process if possible. 3, hold members of the PSRB accountable for wrong actions made or done by these members. Open discussion of how they handle cases with the utmost respect. No discrimination of any kind because of the patient's legal status. Make the board members more diverse, allow PSRB patients the opportunity to fully express themselves at hearings with the board. And now on to Whiting Forensics Hospital facility process on how patients should be treated. Adequate clinical groups geared to restoring patients' thought process. Clinical groups that focus on why a PSRB patient was put under the board in the hospital, such as index offense / psychosis.
Excuse me, Mr. Bessel, your time is almost up. If you please summarize. Thank you.
So I will summarize as the hospital should be able to provide the discharge process for members under the PSRB, such as the equities, and the board should only step in when that time comes for the PSRB patients to be released to society. I certainly believe that the hospital should have that process afforded to them, and we should, allow a probate judge to handle the recommitment process if they will. But that's all. Thank you.
Thank you so much for your testimony. Mr. Bessel, I wanted to clarify, you're currently physically at the Whiting?
Yes, sir.
You are, okay. And did you write the testimony yourself?
Yes, sir.
Okay, all right. And thank you for your testimony. So you're saying that you're satisfied with the PSRB and the functioning of the PSRB?
Well, I am satisfied with the way the process is going, but I would say that it should be revised as to some of the, authority that they have over the PSRB patients. I think some of their authority, they have too much power. I think personally, as I stated before, members of the hospital personnel should be in charge of discharge planning to and from on-campus facilities. And the PSRB should step in when it's time for discharge to full conditional release to society.
And how did you hear about this public hearing, and how did you learn about the PSRB related issues?
Well, currently I'm in PSRB equity, and I also participate in the Disability Rights Connecticut has a committee that I participate in. I was made aware through the advocacy department as well from the facility here.
Okay, I wanted to thank you, and I see Dr. Pettit has a question or a comment. Go ahead, Dr. Pettit.
Thank you, Mr. Chair. Thank you, Mr. Bassel. So if I understand your testimony, you'd like the medical and mental health physicians to be in charge of the medical decisions transfer between facilities. But when you have someone who's previously committed a violent act and there's consideration of release, you would allow that to be adjudicated by the current PSRB?
That is correct.
Thank you so much. I appreciate you really making the effort to testify for us. Thank you.
Thank you.
Seeing no other comments or questions, we appreciate you being here and hope you feel well and are healed back and come back in the community. Thank you, sir.
Thank you.
Seeing no other comments or questions, we move on to the next person on our list, which I understand is Alex Harris. Go ahead, Mr. Harris, you're next.
Hi. Sorry, I wasn't expecting to come up that quickly. Hello, my name is Alex Harris. I live in Ridgefield, Connecticut. Thank you for this opportunity to testify in support of HB 5397, an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention. Notable thanks to the sponsors of this bill, especially my own state legislators, Representative Amy Berger-Javallo and Senator Will Haskell. There should be no controversy, no delay, and no dilution of the contents of this bill in expeditiously making it law. This bill places no new restrictions whatsoever on any aspect of the sale, purchase, possession, ownership, or use of any firearms or ammunition. This bill corresponds to the common sense consensus shared by overwhelming grassroots majorities of all political parties and to the expert opinion of the medical profession and social sciences on reducing gun violence. Owing to our favorable state gun safety laws, Connecticut is far less dangerous than most states, but nonetheless, the toll of gun violence is far too high and must never be accepted as normal. HB 5397 codifies the robust, rigorous, quantitative analytic conclusions of the American medical profession and social scientists that gun violence is a critical public health crisis. The numbers do not lie, and there is no doubt valid dispute on that point. Logically following from that recognition of public health reality, HB 5397 creates an office and a program to fund systematic research, data collection, and analysis of gun violence, and to fund community-based programs to reduce such violence. Solutions to complex problems spring from systematic knowledge about the problem and customized experimentation with validated approaches to mitigate such problems. This bill begins the process of accruing such knowledge and empowering local communities to build programs to address the unique patterns and conditions of gun violence that they face. Thus, there is no reasonable basis on which any legislator, citizen, or interest group can validly oppose this bill. Please pass HB 5397 without delay or dilution. Finally, I want to call out a meaningless slogan that we've heard repeatedly today, that law-abiding gun owners do not commit gun violence. People who commit gun violence may well be law-abiding up until the minute they commit such violence. Let's discuss this bill on the basis of evidence and facts, and please leave meaningless slogans at the door. Thank you for your time and consideration.
Thank you so much for your testimony. Have Representative Berger-Javallo, who has a question or a comment.
Thank you, Mr. Chair. I really just have a comment, and at first I want to highlight the timing of this, since I have been in a meeting all morning and only able to switch over just as Mr. Harris began his testimony. Alex, thank you so much for waiting this out, taking the time, for sharing all of your meaningful comments most importantly, your opening. There should be no controversy. You are correct, sir. We really appreciate you sharing your point of view and for capturing that last piece based on what you've seen throughout the hearing today. So I just want to say thank you and have a wonderful day. Thank you, Mr. Chair.
Thank you. Seeing no other comments or questions, we wanted to thank you for your testimony. We appreciate it. And we'll move on to the next person. So just for everybody's benefit, you will sometimes see a little bit of a correlation on the names and the people speaking, because we have some of the individuals who are currently at Whiting who are speaking. And then that's why they have been signed by someone else so that they can actually be part of our conversation. Next person on our list is Elizabeth Frazier.
Oops.
Welcome.
Welcome. Good afternoon, Senator Steinberg. Oh, I just lost my notes here. Representative Jordy Abrams and Senator Anwar, and members of the Public Health Committee. I am Liz Fraser. I'm the Policy Director for the Connecticut Association for Human Services, a division of Advancing Connecticut Together. And I'm here today in support of SB 477, Section 7, which establishes a Commission on Gun Violence Intervention and Prevention, designed to coordinate the funding and implementation of evidence-based, evidence-informed, community-centric gun programs and strategies. I think it's important that we keep the issues of gun.
Your camera is off. I know it was initially on. I don't know if that's your intention or it was by mistake. I just wanted you to be aware.
I'm sorry. Thank you very much. I will just change the background here, but it wasn't unintentional. So I'll just, while I have the opportunity here, I'll put it back on here. Thank you. I apologize. I must have when I was getting my notes clicked up. So I guess what I would like to say is we need to really keep this issue in the forefront of our brains. And we need to lift up the horrors of gun violence and the potential solutions really as a statewide issue of public health. And I think this commission helps us to do that. And it includes the agencies and organizations and community voice that can provide research and information and really the gravitas to help move policies forward. And it's encouraging that this commission would seemingly be more than just a think tank. It would be a vehicle to secure and manage funding necessary to provide direct and more targeted and informed strategies. I do have this suggestion. Robust involvement of affected populations, especially including youth, is really essential. Agency personnel and advocates who have been doing this work for a long time certainly have a perspective that comes from experience, knowledge, and goodwill, and they know how the system works. They know about programs, evaluation reports, and what's happening in other states. And this is a smart base for a commission. However, for this to be truly transformational, we need to increase the participation on this commission to include that of affected populations, including youth, in true partnership. You know, they understand what is going on. They feel the anger, the anguish, and the ongoing pain. We need to begin to trust that they will have the ideas and innovations that might actually lead to the most impactful solutions. The problem is we don't often ask the right questions. Or if we do, we take the information, use it to get what we deem necessary for the project, and then leave them out of the development of a project or the evaluation process. This type of inclusion can't just be done for show. Just a couple of youth members may feel outnumbered on a commission of 20 or 30 legislators and professionals who do this for a living. This can limit their participation and quiet the real dialogue necessary to develop strategies that would lead to success. I suggest that the two-generation advisory board be considered as an example of a way to move forward more inclusively and authentically with community involvement. That statute language around that two-gen board states that 25% of participants on the advisory board must be the parents most affected by the policies being considered. They're identified, trained, compensated, and meet together as a subgroup. They have equal standing as part of the larger advisory board. This ensures that there is authentic discussion and sharing of varying viewpoints at every level of the work. I would also add,
your time is almost up. If you please summarize. Thank you.
Sure. I'll just add to that that goes along with programs and innovations. that new programs, that we need to have a track for new and innovative project ideas developed in the communities based on lived experiences. And, we need to give an avenue for those that know the best about what is going on to come up with the informed solutions. And I really appreciate the time and thank you very much.
Thank you so much for your testimony. I see Senator Moore has a question or a comment. Senator Moore.
Thank you, Mr. Chair. I'm sorry, my battery was running low. I had to run from one room to another. I want to thank you for your testimony, Liz. We've done some great work together, and I really like that suggestion that you just made about the 2-gen advisory, because that's the work of engaging families, parents, and commission, everybody working together to try to resolve or address problems and have a voice at the table. So I definitely will take that into consideration for my portion of the bill. I know that you are very helpful in us creating the commission that the Lieutenant Governor now runs for women and girls. That was the thought process from a large group of people in Boston saying this is a great idea. So thank you for your contribution and thank you for bringing that up. I had not considered that. I also heard someone earlier mention youth, so it's a work in process and we're going to make it as strong as we can to deliver it. So thank you.
Thank you very much. Thank you. It's an important topic. Bye-bye. You as well.
Thank you, Senator Moore. Thank you, Ms. Fraser. Seeing no other questions or comments, we'll move on to the next person on our list, which is David McKeever. Mr. McKeever. Welcome.
Hello.
Hi, Mr. McKeever. We can hear you, so please go ahead.
Good afternoon to all, and thank you for having me today to listen to inquiry, which I want to put in about a new facility. I have sent in a written letter about my regards into the new oversight, and the dismantling of the PSRB. I'm sure you can look through it and take my suggestions. But my thing is, I've been a patient here for a little over 3 years. I am also the chair of the steering committee of Whiting, which our motto is bring us your problems and we'll come up with a solution. I also have given the position of unit champion for a new innovative program, which is called Safe Wards. I feel Safe Wards may fail only because one of the biggest problems is that Whiting is so outdated. It's been around since the early mid-70s. And one of the biggest things that Whiting lacks is technology. We are stuck between 3 types of mental health committees. One is competency, which is brought over here by DOC. Another one is the civil committed patients. And then there's us, the NGRIs. When something occurs, only thing that can be happening as far as a patient hostility, we get transferred to another unit. And usually the patient that is hostile is sent over to the unit to cause another problem. A new facility with an assessment can help make Safe Wards successful, because that way, with the assessment rating of a high risk to a low risk, a patient who is in need of care can be put into the facility, which will help them with their care, I believe. Technology is very important. For one thing, they make watches that can basically tell your vitals, tell if you're in distress, even if you're in dire need or in distress, it will notify the proper authorities for whatever it may be. We can have this type of technology because, number one, our biggest asset here is our staff, FTSs, nurses, doctors. If they are harmed or hurt, they can't protect the patients. Some of us have great relationships with the FTSs and doctors, and when we lose them because of disgruntled patients, it kind of affects our treatment. So it's very important that technology be put in play to protect our FTSs. And I'm talking about little to no engagement with patients at all. one of the biggest assets as far as the FTS having to restrain a patient is taking them to the ground. They get hurt. And I feel a new facility should have some kind of flooring or something that will have a little bit of give so that the patient and the FTS or the doctors and nurses are not harmed.
Excuse me, your time is almost up. If you please summarize. Thank you.
So I feel in this new facility, we need more technology. We need to be more access to our FTSs. We're not bad people getting worse. We're good people trying to get better. And if we don't have the proper tools to help us to get better, without the technology, we're doomed to fail. So that's all I have to say. Thank you for listening.
Thank you so much for your testimony. We hear you loud and clear, and we are taking notes. And then when we have those plans, that will be kept into consideration. Stay well. Thank you. I don't see any comments or questions. We'll move to the next person on our list, which is William Zabe.
Thank you and good afternoon, honorable members of the Public Health Committee. Thank you for this opportunity to testify. My name is Bill Zabel. I live in Guilford, Connecticut. I'm testifying on behalf of Grifols in support with modifications of sections 1 and 39 in House Bill 5500. I serve as the president of North American Bioscience Commercial Operations for Grifols, a global healthcare company who is a leader in the development and production of plasma-derived medicines. Grifols owns and operates the largest network of plasma donation centers in the United States, with more than 300 centers, including centers in Massachusetts, Maine, and Rhode Island. Grifols does not currently operate any centers in Connecticut, in large part due to outdated regulatory requirements that are serious barriers in opening plasma donor centers in Connecticut. Grifols believes this legislation provides an opportunity for Connecticut to revise state laws regulating the operations of plasma donor centers in Connecticut to conform with federal standards. We also recognize and appreciate the conversations we've had with DPH over the last year, from which we are expecting more specific language to address plasma collection in Connecticut. We appreciate DPH's earlier comments today in the hearing with regards to regulations on plasmapheresis and the needs for them to be modernized. We propose that Connecticut mirror federal regulations on plasmapheresis, as New York State just did, or for us to continue working with DPH on language. Plasma donation is critical to helping save people's lives. Plasma is the portion of blood containing proteins and antibodies that are used as the starting material of making life-saving medicines. It takes hundreds, even thousands of plasma donations to produce enough product to treat just one single patient for 1 year. I would draw your attention to testimony submitted by leaders of the plasma user patient community, such as the Immune Deficiency Foundation and GBS/CIDP. States across the United States, including New England, have recently realized the importance of plasma and have implemented regulations that are favorable towards operating plasma donation centers. Over the last 5 years, an increased number of centers have opened in the states of Maine, Massachusetts, New York, and Rhode Island. However, none in Connecticut. Centers have significant impact to the local economy. Connecticut is currently missing out on an economic opportunity. Grifols plasma donation centers operate like small businesses. The initial investment in Connecticut construction of a center is approximately $5 million. Grifols also invests approximately $4 million to the local economy each year through payroll, donor fees, and other operating expenses. Grifols commits to a long-term investment in the local community, a minimum of 10 years, with an average center being part of the community for over 20 years.
Excuse me, Mr. Zeb, your time is almost up. If you please summarize. Thank you.
We regularly engage in chambers of commerce. We support local charities and participate in voluntary events. Grifols centers provide competitive pay, full benefits, and workplace development to an average of 45 people from the local community. These positions offer full-time employment, ranging from entry-level jobs with people from high school diplomas and range all the way up to medically trained professionals. In conclusion, we want to be part of the communities in Connecticut. We thank you for your consideration to these changes in regulations pertaining to the collection of source plasma in Connecticut. Thank you very much.
Thank you so much for your testimony, Mr. Zabel. And we have Representative Steinberg who has a question or a comment.
Thank you, Mr. Chair. You know, this is not the first bill that this committee has faced this session where we've been asked to consider the balance between encouraging new business and different business models and protecting the public health, which frankly is our sweet spot and it'll remain so. Explain to me in practical terms, other than perhaps just in terms of more jobs, which we appreciate, what are the practical benefits for the people of the state of Connecticut for us to be able to change our laws and enable you to open facilities in our state?
I think the biggest practical investment that we make in the state of Connecticut is recognizing there's people within the state of Connecticut that are also patients of plasma-derived protein medicines. There's a large unmet medical need around the United States for the medicines in which we produce. And I would suggest to you the 3.5 million people that live in the state of Connecticut actually benefit by what we do. And I hope that answers your question.
Not really. I was really hoping that you'd be able to tell me from a consumer healthcare standpoint what the benefits are in Connecticut. What would be wrong for every state but Connecticut having it, but plasma still being available to people in the state of Connecticut?
Could you repeat that question, please?
I guess what I'm asking is, this is the Public Health Committee. And if we're going to enable a commercial function, we'd like to feel confident that this is going to benefit consumers in a healthcare way in the state.
Absolutely.
What I was basically saying is, we don't have to maybe to do business here in theory to have access to plasma, do we? Or is there something I'm missing?
No, we need increased access to plasma, which is the starting material to making these life-saving plasma protein medicines. I would suggest to you that healthcare professionals like a Dr. Christina Price at Yale, who is treating patients that are yet to be diagnosed with simple diseases that should be diagnosed a lot earlier with primary immune deficiency or alpha-1 antitrypsin deficiency or hemophilia, need access to these important life-saving medicines. You can't get much more personal in caring for patients than caring for a Connecticut residents that's needed access to these medicines that perhaps doesn't have access because there's not enough starting material in plasma.
Thank you for that. One more question, Mr. Chair. You may mention that you've had some conversations with DPH. How close do you think you are to reaching consensus on exactly how we might move forward with this? You talked about ongoing conversations. As you're obviously aware, this is the shortest short session in modern history, and we are sort of on the clock already. So I asked the question in terms of, do you think we can get this resolved quickly?
I would hope we could get this resolved in the state of Connecticut. Being a resident of the state of Connecticut, looking at what other states have done, like the state of New York most recently, to align themselves with the federal regulation that gives us the ability to come into a state like Connecticut and actually increase plasma collection. So I'm assuming in the state of Connecticut, if we would agree that we could align our state with federal regulations, there's an opportunity for us to begin our work today.
Thank you. I guess, Mr. Chair, that's all for me.
Thank you very much.
Thank you so much. Seeing no other comments or questions, we will move on to the next person on our list. We are going to have Quickmire wait for a little bit. We have a patient who's at Whiting waiting. Crystal McKay, we'll take her. Since you were like a minute late, we'll take the next person and then we'll come back to you. Crystal McKay. Is Crystal McKay there? It's CBH inviting. Yeah, go ahead.
Here she is. She's here. Crystal McKay is coming in the room. They're listening. You may go ahead and start.
Hello. My name
Hi,
Crystal. Go ahead.
Hello. I'm speaking on
behalf of myself or Whiting for the hospital, about the new building, because we need a new building for Whiting because, for bigger space, for patients, and if it's gonna keep this same building, it's for the interior and outside, because I think the windows should be replaced because it need to be safer, because this is a very old building, and the heat need to be better monitored, because it's like the atmosphere in here is like very stuffy, it's not monitored right, so that need to be new. And just for betterness for overall, because things is like cramped space, and also for staff and other stuff, because we got a lot of art stuff and other things in here that it needs more room space for other stuff, for like art supplies and stuff like that, and etc. And just, if people coming in and out, that it should be bigger for more room, not to like inpatient people, for it could be better, because if it's COVID any kind of disease, for it could be open space for people to come and go and just have extra amount of room to move around and stuff. And anything else you want to ask me?
Thank you.
Yeah. Thank you.
Are you done? Oh, wait, we had a question.
Yeah, did you want to ask me?
Yes, I've got a quick question. When you said that there are temperature-related challenges that you have, do you get blankets when it's very cold? Do you get to stay warm when it's very cold or the temperature fluctuates in parts of the building?
Yeah, the temperature flux in part of the building. When it's too hot, they open the window. We do get blankets, but this heating system is very old, and so the temperature fluctuated, and so it's overbearing, And I had, not to talk about my business, I've been here before. The building need a lot of work on, so I believe that it needs reconstruction. It needs to be better. It needs to be improved, because this is the old building, And so if they is trying to get a new building, I think it need to be granted upstage need to be rebuilt like inside out. If they do move it, it need to be reconstruction inside out. It need update stuff.
Okay. Thank you so much for your testimony. We truly appreciate you coming in and speaking to us.
Thank
you. Seeing no other questions or comments, we move on to our next person, who is Sherry Quickmeyer. Thank you, Ms. Quickmeyer. Sorry if we had you wait for a bit. Please go ahead. You're muted. You're muted. Yeah, get her.
Here we are. Okay. Thank you very much. Chairman Anwar, Senator Abrams, Representative Steinberg, Ranking Members Wong, Summers, and Pettit, members of the Public Health Committee. My name is Sherry Quickmeyer. I'm the Executive Director of Common Cause in Connecticut. We are a nonpartisan, nonprofit citizens lobby that has worked to improve the way Connecticut's government operates since 1971. We have 1.5 million members nationwide and more than 15,000 members and activists in Connecticut. I want to thank you for the opportunity to testify before the Public Health Committee in support of Senate Bill 477, an act concerning the public health of residents of the state, and House Bill 5377, an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention. As most adults I know, I have friends, family, and acquaintances who have or are currently suffering from Alzheimer's disease or dementia, and I, like many, question each time I misplace my car or house keys or forget a name that it's a sign of disease or just a normal sign of aging. Early detection matters, and being diagnosed by a doctor is key to getting the care needed. That said, I want to commend the committee for considering enhancement of the care and accountability for assisted living services, dementia special care units, and all of the important places where people get the critical health care that our relatives and friends need. And I want especially to thank you for raising the important provisions of Section 7 of 477 for establishing a Commission on Gun Violence. We have the distinction as a country of having more than 170,000 deaths from gun violence since the Parkland, Florida massacre. And as the mother of 2 sons raised in a city who attended public schools where concerns about safety ramped up over their time to include armed security guards, metal detectors, frisks, security lockdowns, and intimidation, I weep for the families. And I keep losing my place, for the families whose children were killed by the neighbor or the neighbor's son who had no access or ability to care and had the access and ability to purchase a deadly firearm. Fortunately, there were no incidents of deadly violence when my sons were attending school, but there was fear, and there were subsequent incidents of deadly violence. But I have to say that fear of walking to school was dangerous, that each administrator was an enemy because she or he was responsible for patrolling the halls with a suspicious eye for danger, and feared that their school would be next in the horrible parade of deadly violence.
Excuse me, Ms. Quickmeyer, your time is almost up. If you please summarize.
Thank you. So I do want to make a point that the daily spread of gun violence from Virginia Tech to Columbine to Sandy Hook to Parkland to the deadly gun violence that claims the lives of adults and children in our schools, our churches, our parks, our communities, and our homes. These children have parents and grandparents. They are all our children, and they are living with the fear of violence and grief for the loss of friends and family members. Gun violence is not a partisan issue. It does not represent the Democratic or Republican parties. Prevention is not merely a conversation, the demand that must be made action.
Thank you. Thank you so much for testimony. We truly appreciate your testimony. Seeing no questions or comments, we will move to the next person. We appreciate your patience with us today. Thank you.
Thank you.
Next person on our list is Kate Rivera. Ms. Rivera.
Good afternoon. My name is Kate Rivera, and our family has been affected by gun violence. My son at age 14 was shot in the head and stomach. And it's really harmful, I believe, that the vast majority of the people that have testified so far are testifying from their very white, privileged, comfy, safe homes. And they're talking about these communities. So these are not the people that we need informing the decisions at the state level. We need people who are talking about our communities, in my community. Other parents who are scared when their kids are just walking out the door to go to the corner store, who know that they might not come back. Those are the people that need to be informing this decision, the decision making at the state level. And we also need to have kids who are at risk to shoot other people or to be shot. We need people that are in high school informing these decisions. The kids and their parents know what is needed. We don't need someone else coming into our community to tell us what should be happening in these communities. The other thing I wanted to mention to you is I previously worked at Project Longevity, and I object to the funding being attached to Project Longevity in this bill. While I worked at Project Longevity, I was in charge of the social services department, and I had no budget. I mean, none. There was no money to service clients. So the way that Project Longevity is done here is not the evidence-based way that the program is supposed to operate. I've talked to David Kennedy. I've been to events at John Jay. I know what it's supposed to look like, and that is not what's happening here in Connecticut, and we should not fund it the way that it is being used right now. Furthermore, I was asked, my office was embedded in the state's attorney's office, and I was asked by my superior at Project Longevity to falsify a quarterly report, okay, to say that we had money to spend on clients that we did not have. Obviously, I refused. 5 months later, money did come in, and the money that should have been used on our most vulnerable clients whose lives are literally at risk, to get them bus passes and groceries and, money for an outfit for a job interview, et cetera. That money.
Ms. Rivera, your time is almost up. If you please summarize. Thank you.
Okay, thank you. That money was wasted at Democratic Town Committee Chair Mario Testa's restaurant on a party, $4,000 worth of it. So Project Longevity in its current form should absolutely not be funded. And I was also taken out of the statewide narcotic gang unit Bridgeport police meeting because they were afraid that I would hear the names of the people most at risk and work harder to help them, which is true. In closing, our community knows what we need. We need Section 8 to help get families to safe places. We need safe houses for young people who are at risk. We need to fully fund Street Safe, like triple their, their funding, and to pay mentors, because mentors are flaky if they're not getting paid. Thank you.
Thank you so much for your testimony. And
if anyone has any questions.
Yeah, we do. But I wanted to just thank you for your testimony, and I'm so sorry about the trauma that you and your family have endured. We're sending our care and love to you. I do have two of my colleagues who have questions or comments. I'll start with my co-chair, Representative Steinberg.
Sure.
Mr. Chair, Ms. Rivera, I just want to make sure I understand you correctly. Because conceivably, you just made a very serious allegation about a program that this state has funded for a number of years. Are you suggesting that they corruptly used funds, or that they may have misrepresented availability of funds? I think those are two very fundamentally different things. And I caution you to be very careful about what you choose to characterize in this instance. Thank you.
Well, why are you cautioning me?
Simply because that's a very serious allegation, ma'am.
Right. And I think that you all should investigate it if you don't believe me.
But to be clear, if you wouldn't mind, if you could just repeat so we fully understand what it is you are alleging.
Sir, I went out of my way to hold for 3 hours so that I could tell you this. I don't take it lightly, and people's lives are at risk. And the programs in this state that should be helping people need to be actually doing that work.
I'm not sure you answered my question, ma'am.
Yes, absolutely. 1,000 times yes.
I'm sorry, I'm going to try one more time if I might, Mr. Chair. I'm asking what precisely you are alleging that the Longevity Institute did or did not do, so the members of this committee can understand.
Okay, Project Longevity would dangle the promise of Section 8 in front of clients. There was one woman in particular whose son had recently died. She was in a terrible mental space. She was not in a place where she should have been speaking. And Project Longevity used her and bribed her with Section 8, with the promise of getting Section 8 in order to force her to speak out at events. It was wrong. She needed therapy. She didn't need to be put on a parade. There was no money to use for my clients. There was no money. I could not give out a bus pass until I'd been there 5 months. In the 6-month period, there was no money. A matter of fact, I wasn't even getting paid, Mr. Steinberg. I wasn't getting paid for two and a half months at a time. Okay, we kept being told that, oh, the money will come, the money will come. And the money never came. It took a really long time. And that is also against state law. You know, people deserve to get paid within a timely manner. It was supposed to be every 2 weeks.
Okay, Thank you. That
And
answered
I was
my,
asked in the state's attorney's office to falsify quarterly reports.
thank you. You've answered my question. That gives us the basis for a follow-up.
Mhm.
Very much appreciated. Thank you, Mr. Chair.
Thank you, Mr. Chair. I have Senator Moore who has a question and a comment for you, Mr. Vera. Please wait for a bit. Go ahead, Senator Moore.
Hi, Kate. I really wanted to speak to what Representative Steinberg had said regarding Project Longevity, because it should be there. If you witness that, there should be a complaint filed on your behalf, but we can't sit here on a deaf ear and hear something like that without clarification. So thank you, Representative Steinberg, for mentioning that. Part of our desire with all of the bills that we're working on to do gun violence is to really look deep into the programs and evaluate them and make sure they're doing the work that they're supposed to do. And I'm not trying to validate your comments, but just saying there really is a need for us to stop pouring dollars into many programs that we just know the name of, or someone knows them and they got their money, but try to coordinate some of those services to make sure we can identify gaps in services throughout the state, not just in the way of policing, but mental health programs that keep kids off the street. And that is really the purpose of the legislation that we've gotten 477, is to coordinate, evaluate, monitor, figure out what works and what doesn't work. And so I thank you for your comments, but I do want to be careful of disparaging any single organization without having any facts or any filings against an organization, right? And I know you, and I know your situation and your child, and you have my heartfelt feelings on your son being shot, because I know what a struggle that was and that he continues to struggle. So I'm quite sure we're not turning a deaf ear on your comments, but I want you to know going forward, that is really what we be able to do, is evaluate programs and figure out what works. The other comment you made about the communities being involved, I totally agree. I listened to a person before, two people before you, talking about having youth engaged and having them be a part of the solution. I totally agree. And I'm really going to consider that as part of any changes that we make to the bill. And I thank you for your time. And I thank you for waiting to give your comments too.
Thank you. And I just want you to know that I am interested in being a part of the advisory board if you need parents that have been affected by gun violence, which I believe you do.
Thank you. Appreciate it. Thank you, Mr. Chair.
Thank you, Mr. Vera. Thank you for your testimony, and we may reach out to you later to get more into for the concerns you have raised.
Absolutely.
Thank you. Seeing no other comments or questions, we move on to the next person on the list. That is going to be Miss Nancy Ellisberg, followed by another patient at Whiting, Nicholas Simmons, and then we'll have number 48 after that. So Nancy Ellisberg.
Good afternoon, Chairs Abrams and Steinberg, Vice Chairs Anwar, Kushner, and Gilchrist, and ranking members of the committee. I'm here today to offer testimony in support of Senate Bill 450. I'm a resident of West Hartford and was a member of the Whiting Task Force, the former managing attorney for the state of Connecticut Office of Protection and Advocacy for Persons with Disabilities, and the now retired legal director of Disability Rights Connecticut. I am not testifying as a representative of any of these organizations, but rather reference them to show that my professional experience gives me a unique perspective with knowledge that is particularly relevant to the bill before you today. You have done tremendous work in trying to enact legislation that will enforce the recommendations of the task force. As my written testimony gives concrete suggestions as to what can make the bill even stronger, as did my comments at the briefing. However, there is one voice that is missing from this conversation. His name is Bill Shahade. Can you say his name? Bill Shahade. You're all on mute. You're all in your own rooms. You can say it, Bill Shahade.
If you
Bill
can't say
Shahadi.
it, thank you. Thank you. I really appreciate that. That means a lot to me. If you can't say it out loud, say it to yourselves. But Bill's life matters. He is the reason we are here today. He is the reason that you took it upon yourselves to form the task force and to propose this bill. But we haven't talked about him, and we should. Bill has lived at Whiting for many years and relies on the staff at Whiting for all his needs, for his food, his clothing, his hygiene, his housing, and his treatment. As we all know too well, Whiting failed Bill Shahadi. And as the task force made clear in its report, Whiting failed many, if not all, of the individuals under its care. How many Bill Shahadis have resided at Whiting, and how many others are still there? Just because we haven't heard of other cases recently does not mean that abuse is not ongoing or that the next Bill Shahadi is just waiting to happen. The task force's recommendations and your bill are trying to prevent that from happening. That is why you need to draft a bill that is as strong as possible. You can't legislate compassion. You can't legislate treating people with dignity, but you can legislate oversight to try to make sure that this kind of abuse doesn't happen again, or that it's caught at the earliest possible moment. You can legislate making sure that care is provided in the community wherever possible by providing funding to community providers. You can legislate training that will try to help DEMA staff understand their obligations to provide humane and dignified treatment as the Patient's Bill of Rights already requires.
Excuse me, Ms. Ellsberg, your time is almost up. If you'd please summarize. Thank you.
Thank you. Please review the recommendations of the task force, my written testimony, and including our recommendation that the PSRB should be abolished. We also would like you to look at section 12 of your bill because we don't really understand the purpose of that section, and we're concerned that it may lead to more funding for institutions as opposed to more funding in the community. And if you have any questions about my recommendations regarding my written testimony that I submitted, I'd be happy to answer them.
Thank you so much, Ms. Ellisberg. So I was going to start by saying, what is it that you're really recommending? You've been very clear. You've been very clear. I wanted to, I'm a little confused. The reason I'm a little confused is that I understand the value of the PSRBs. I heard Dr. Hauser this morning, and I also heard the state attorney's office. There is you're taking a position for a less than effective functioning entity to be completely abolished. And so what is going to be the solution going forward? There's a structure in place, and I understand other states have a similar structure in place as well.
Well, there are only three states entirely together, Connecticut, Oregon, and Arizona. And as Dr. Hauser testified this morning, Arizona has abolished its PSRB. So that leaves two states with similar systems, Connecticut and Oregon. So it's not a system that's used throughout the country. We have not, because we were not tasked with providing what the alternative would be. This morning, I said in my role in the task force that while I disagreed with the idea that there be a new task force to study the PSRB, I thought constructing a work group that would determine what the alternatives would be. Representative Steinberg made a very good point this morning that when we start talking about taking apart the PSRB and substituting some other system, that needs to go before the judiciary. And that was the reason for putting in the task force recommendation. So I understand that, and I understand that it's something that judiciary has to work with. I don't have the answers for what the new system would be. I think if you bring someone like Monty Rattler, who has tremendous knowledge of how the PSRB works, into some kind of a work group or task force that can talk about what it should be substituted with, I think that's going a really long way.
I think that one of the problems with the PSRB and one of the reasons that the task force, with the exception of Dr. Hauser, recommended that it be abolished is because it's not patient-centric. It's not full of positive recommendations for patients. Its sole purpose, until the recommendations you have made in the bill, was for community safety. And you've tried to rectify that by your new language in the bill. But again, that's not patient-centric. That's not recovery-based. And if you look at Mr. Gaylor's testimony, what it seems to me he's really talking about is keeping people in the system at Whiting, whether it's the new Whiting or the building that's there now, but keeping them there for as long as possible to try to sustain some kind of sense of community safety, something that's going to make the community safe. Well, I'm not sure what's going to make a community feel safe short of recovery. And again, Dr. Pettit and I talked earlier this morning about victims and have we looked at what the victims need? And as I said this morning, I think the victims need to see that recovery is taking place so that when people do go out into the community, and even the PSRB, the woman who spoke on behalf of the PSRB said it made sense for temporary leaves to be decided by treatment providers and not the PSRB, but so that victims can feel safe when someone goes out into the community because they know they've been at a treatment oriented environment. I hope that helps somewhat.
Thank you so much. That helps at least. I recognize where you are at, and I wanted to ask Representative Steinberg ask a question or comment.
Thank you, Mr. Chair. Nancy, thank you for spending so much of your day with us today.
Happy to do that.
Yes, I was wondering when the name Shahadi would make it into our testimony today. His circumstances, we'd like to believe, were extreme. And if it were not for the advocacy of his brother Al Shahadi, there's a real question whether we would have known about it, which was sort of the loose thread that led to so many other things that came about subsequently. It would be wonderful in any healthcare setting to have such an effective advocate who is willing to go the extra mile to make sure that justice is done, and more importantly, change occurs. And I think that the only silver lining in the Shahadi episode, if you will, is that it has led us hopefully to be doing better as we are today. But Mr. Shahadi is also an extreme example in that he may not be somebody who can safely be returned to the community. Are you suggesting that we should have some structure other than the PSRB to take care of people for whom the prospects of recovery are more limited?
Well, I think part of the problem is when you talk about some other structure to take care of folks, that's because the structure at Whiting isn't working. And I think if you look at the recommendations that the task force has made with a new structure, a new building, but also treatment that includes meaningful activities and meaningful ways of living their life, then I don't know that I want to say that somebody might never be able to return to the community, but giving granting that is a possibility just for the purposes of this discussion, then Bill Shahadi deserves to live in a place that has more community-based services, that where he's not as contained as he was in the equivalent of a cell, where people have the opportunity to do some of the activities of daily living that the rest of us do, that have the opportunity to do things like cook. If you haven't toured Whiting, I know some of you have and some of you haven't, they admitted that the facility has no real positive rooms for community activities. And so that has got to be changed. And so if you have a new facility with folks who were trained in humane and dignified treatment, with folks who were, my dog agrees, with folks who were trained in how to help people live the fullest life they can, then that's not the PSRB. The PSRB certainly doesn't play that role at all, but it might be something to look at for the future.
Thank you. Yeah, but I still see there's a distinction between the function of the PSRB and what you described, which is a total makeover, a new paradigm for establishing quality of life, even for people who need to be in these circumstances, which is just fundamentally different than what we have to offer today.
I agree.
So
I totally agree.
I think you can have that kind of significant transformation, and it might be able to live side by side with a upgraded PSRB potentially, or something along those lines. Thank you, Mr. Chair.
Thank you. I see Dr. Pettit, and he's standing as well, so he's being healthy.
Yeah, actually on my stationary bike and try not to look like I'm bouncing up and down. Thank you, Mr. Chair. Mrs. Ellsberg, same sort of thought. The legislation, as I read it for the task force, doesn't include anybody who's a victim or victim's family. Do you think that would be an appropriate addition or appointment to that task force to represent their point of view, which is often left out?
That's a really interesting question that I will tell you honestly, we did not consider at the task force meetings. I sort of look at what happens when folks in the DOC system are being prepared for discharge. And I don't know that victims are included in helping prepare a prisoner or a person who's incarcerated leave DOC. Perhaps that should happen in both situations, both in the forensic situation and the DOC situation. I think that victims, I understand, because we've had some written testimony from victims who are scared. But I think we would also have similar testimony from victims, from folks who were incarcerated DOC, be scared. And there's also the philosophy of retributive justice, where, and I may be saying it wrong, so please forgive me if I am, but maybe that's a really great way for victims and the acquittees or the people who are incarcerated at DOC to get together to try to reconcile how they're going to go through life living together. So I wouldn't want to see victims having a veto over whether somebody who has a mental illness is going to be able to move into the community. But I think to have a better understanding of what mental illness is and perhaps what drove somebody to commit the acts they did might be a good kind of healing all around for both the acquittee and the victim. So it's certainly something worth spending more time thinking about and talking about. And I would love to have the input of the victims community so that we could understand that better.
I mean, I think it's an important, I think you referred to restorative justice, and I think it's important for them to evolve. And I was certainly not thinking about veto power, but I think victims and families want to know when things are happening, when things are changing. There's a system within DOC for people to be notified in terms of when there's a change in a prisoner status or before a trial, what's happening with that. And I'm not sure the exact same rights are accorded victims under the mental health system. And I think we should afford them the same abilities to know what's happening. And again, in the extreme cases when someone when someone is murdered, obviously that person has absolutely no voice left. No one, unless family or other people can stand up, they have no voice remaining. So I think, although, you know, I hear the intention here is to help people with mental illness, I think the families that have been victimized and that are left behind have to speak up for the people who have passed before them. So I thank you for your comments. Thank you, Mr. Chair.
Yeah, and just so you understand, that was not part of our charge as the task force, but I appreciate your comments. I think it is something that's relevant in the conversation, and it certainly makes me think of that there being some parity between the DOC system and the forensic system.
Thank you. Thank you so much for your testimony. We appreciate your time and all the work that you have done with the rest of the group for task force for us to get to this point.
And thank you very much.
Thank you. The two things we're going to have, we're going to ask one of the patients from Whiting, Nicholas Simmons, to join us. And as that happens, I'm going to ask our Vice Chair, Senator Kushner, to chair the public hearing. So Senator Kushner, yours, and go ahead, Mr. Simmons.
Okay, thank you. Again, my name is Nicholas Simons. I appreciate being here. I'm going to go a little bit off script. I have something written down, but I'm going to address something Ms. Allisberg said or miss her testimony. I've gotten a lot out of being at Whiting Forensics Hospital. I lived in Florida for 26 years, and I've lived in New Hampshire for 4 years, so I'm technically a New Hampshire resident right now. But I feel like a lot of the patients that aren't getting, I guess, their competency restored at Whiting, they're not trying. It's like you get out what you put in to it, and there's meetings there's groups every day. I've been to 3 groups so far today. You know, because I stay awake. I make sure I'm up for the groups. When I needed mental health treatment, individual treatment, I asked for that, and I got it. You know, I had a bad childhood. I'm not going to go into all that. You know, compared to similar institutional environments I experienced in Florida during my involuntary and voluntary stays. The staff and the overall procedural policies at Whiting Forensics Hospital are far superior to anything I've experienced. They're very professional and they're respectful. I didn't understand some of the policies that they have, but when I first got there, but it all makes sense to me now. And I don't make the staff's job harder than it has to be. When they recommended that I increase my medication, I did it, you know, and I saw results. I saw great results. I was under the assumption when I came to Whiting that, I didn't want to be here at Whiting when I first got here, but I thought I could have rehabilitated myself with the mental health services I was receiving in New Hampshire, but that assumption appears to be incorrect because my competency monitor, Melinda, and the chief psychiatrist on the unit, Dr. Peterson, were able to zero in on why the Honorable Judge McNamara sent me to Whiting, and very quickly and efficiently helped me regain competency. They said, you know, as long as I continue on the path that I'm on, I will be discharged at my next court date. So I want to actually thank the staff at Whiting right now, and I want to thank Melinda, I don't know her last name, and Dr. Peterson and Judge McNamara for the help I've received at Whiting, because I feel better than I have in decades. And when I first got here, I was an emotional wreck. You know, so in my opinion, when it comes to expanding the services Whiting Forensics Hospital has to offer by building a new facility whose design would incorporate spaces where the patients can engage in self-enrichment, creative activities, educational pursuits, vocational training, and training in independent living skills to facilitate a safe transition to life in the community, I wholeheartedly feel that it can only make a good thing even better. So I thank you for your time, distinguished members of Congress. I wish you well and God bless.
Thank you very much, Mr. Simons.
You're welcome.
Simmons, did I get that correct?
Actually, Simons, you got it correct. Thank you.
Thank you for your testimony here today, and I'm glad you're doing better. I just will recognize Senator Moore.
Thank you, Madam Chair. Mr. Simons, I want to thank you for that testimony and taking the time to give it, and I appreciate you recognizing that you may not have thought you needed the help, but the state did for you what you didn't see that you needed, and it worked out well for you. So congratulations on that, and thank you for the recognition that you've given both the state and the people who helped you get to that place. So I just want to let you know we appreciate that also.
I'd like to
Archives Regis, this is Representative Ryan. I have something on the.
Thank you. I'm sorry for the interruption. Go ahead, Mr. Simons.
Oh, I just wanted to add, yeah, I've been going to the same mental health treatment center for 3 years in New Hampshire. And like I just said, I feel better now than I have in decades. I don't want to put down the place I was receiving treatment at in New Hampshire, but Whiting did for me in a matter of like 3 weeks what they couldn't do in 3 years, literally.
Well, thank you for that testimony, and I appreciate you sharing that with us. Have a great day.
You too.
Thank you, Madam Chair.
Thank you. And I will recognize Representative Kennedy.
Thank you, Madam Chair. Mr. Simons, I too want to thank you for being here, for sharing with us your experiences, and I wish you continued success, strength, and God bless you, and thank you so much for being here. Thank you, Madam Chair.
Thank you.
Thank you. I don't see any other hands, but again, we appreciate you being here. We appreciate your testimony, and particularly wish you the best with your recovery and with your treatment.
Thank you.
Next up, we will hear from number 48 on the speaker's list, Jackie Santiago Nazario.
Thank you, Senator Abrams, Representative Steinberg, Ranking Members Wong, Summers, Pettit, and distinguished members of the Public Health Committee. My name is Jacqueline Santiago Nazario. I am the CEO at Compass Youth Collaborative, a nonprofit agency that works with high-risk youth in the city of Hartford. At Compass, we develop transformative relationships with the youth we serve. We provide them with the support and the opportunities that they need to become successful in education, employment, and in life. I am here to voice Compass's support of HB 5397, an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention and Advisory Council on Gun Violence Prevention and Intervention, as well as SB 477, an act concerning the public health of residents of the state. Gun violence meets the definition of a disease. It's as contagious, it spreads from person to person. Victims of gun violence are 59% more likely to become drivers of violence. Like other contagious and epidemic health problems, gun violence deserves treatment, and it deserves to be studied in a public health context. HB 5397 and SB 477 would fund data collection and study of gun violence and support evidence-informed community-based programs and strategies to reduce gun violence. Today, I'm thinking of Takai, one of the young men Compass serves. At 20, Takai says he has lost as many people to gun violence as years he has been alive. Imagine being 20 years old and losing 20 people to gun violence in a period of 5 years. 89% of the youth we serve have experienced the death of a family member or close friend due to gun violence. In 2021, it was the Hartford's deadliest year in decades. And in March of 2022, we're already ahead of the 2021 numbers. But gun violence isn't just the body count. The trauma caused by gun violence doesn't just affect the victims, it affects their friends, their family members, neighbors, and the community. When Takai first began working with Compass, he was disconnected from any positive role models. He had stopped going to school and had no vision for the future. Working closely with Compass's director of our Peace Builders program, Dean Jones, Takai has begun to understand his trauma and how it has impacted his life. Compass gave him a safe space where he could have moments of feeling free from harm. Compass also gave him the tools that he needed to become successful at securing employment. It's not been easy for Takai, and success doesn't look like it's a straight line. But
Excuse me, Ms. Nazario, your time is almost up. If you please summarize.
Okay.
Thank you.
But at Compass, we plan for the setbacks and use them as teaching moments. Takai has taken the security guard certification and he's getting his guard card, and now he can contribute financially to his family. Every year, Compass works with hundreds of youth like Takai using CBT or cognitive behavioral theory. We provide them with life-saving tools that help them become ready to succeed in education, employment, and life. We are a community-based violence intervention program, and we know it works. By advancing the initiatives outlined in this bill, you can help us build a community where our youth feel safe, live peacefully, and have the opportunity to reach their fullest potential. Thank you for your time.
Thank you, Ms. Santiago Nazario. And I don't see any hands, but I do want to thank you for your testimony and also for your service.
Thank you.
Next up, we have Tracy Sullivan, number 49.
Good afternoon, Madam Chair and members of the committee. My name is Tracy Sullivan and I reside in West Haven. I'm here in support of adding Representative Ferraro's complementary and alternative healthcare bill language onto the House Bill 5500 and act concerning the Department of Public Health recommendations regarding various revisions to the public health statutes. I won't repeat the comments that Representative Ferraro made this morning, but I would like to say that I am in complete agreement with everything that Representative Ferraro shared with you this morning about a bill to protect complementary and alternative healthcare services in the state of Connecticut. I'd also like to thank Representative Ferraro for the continued support on this bill. And I'd also like to add the following briefly. There's many modalities included in this bill. I am a Reiki practitioner, and that is why I am here in support of this bill. I've been working in healthcare since 1990 and volunteering and teaching Reiki classes to volunteers in the healthcare setting since 2011. In addition, I teach private Reiki sessions and Reiki classes for the general public. So time after time, I've seen the profound benefits that this service provides the community, especially the healthcare community. Reiki itself is a very gentle practice of hands-on or distance healing that promotes stress relief and relaxation and reduces anxiety. And it's common knowledge that anxiety is the basis for many physical, mental, and emotional illnesses. So there's also no tissue manipulation involved. And in fact, it can be done hands off without ever even touching the client. Also, when the pandemic started in March of 2020, I began offering a weekly online Reiki session for my students and friends and whoever wanted to join. And many of these participants have shared with me, and it still continues now on a weekly basis. Many of the participants have shared with me that this helped them get through the pandemic. So these practices are not only for physical healing, they're also for emotional healing as well. So with this bill, complementary and alternative practitioners will have clear guidance as to what type of disclosures are required and what activities are prohibited.
Excuse me, Ms. Sullivan, your time is almost up. If you please summarize. Thank you.
Okay, so if a complementary and alternative practitioner does not abide by the required parameters of the exemption, current laws that are in place, as always, there are current laws in place to address the situation. So finally, please support Representative Ferraro's legislation. There have been 11 other states in our country that have passed this, including Rhode Island and Maine. And thank you so much for your time and allowing me to testify today.
Thank you, Ms. Sullivan. I don't see any hands at the moment, but thank you again for being here. And we will move to the next person. We'll move to the next person on the speaker list, and I believe that will be Garrick King from Whiting.
Hi, Senator Kushner. My name is Garrick King. I currently am a resident of Connecticut. I am just turned 30 years old as of February 7th. I am in favor of continuing with certain services as far as me being a productive member of society and the outside of CVH Hospital, and I wish to continue more with the worry of victims on the other hand, because there is much need for reconciliation, because this is family, people that are my family, extended family, including my ex-wife, well, ex-fiance, forgive me. She wanted much reconciliation with the court. She's had to go through hoops to get so. I am also about what they were talking about earlier. One's for victims who want the reconciliation, because often enough, some victims don't want the same as the victimizer or that guilty party. And I was let go from a lot of things in my life because I missed out on opportunities because I struggle with mental health. As far as when I'm working a job, it got worse approximately at 2017 when I lost 3 members of my family to cancer. And I have been struggling with ever since. It's a mourning process that feels like it never ends. I am constantly struggle with my anger, which creates a not so well-lived life with people around me. Staff still struggle, but I struggle the most because I've just been dealing with that. I don't know how to open up the way I should, but it has still had much progress into rehabilitating me as I need to be. That would be the end of what I would like to say. Thank you.
Thank you for being here today, Mr. King, and thank you for sharing your experience with us. And we wish you well in your endeavors to seek treatment and to address and fully recover from your, the struggles that you're facing. So thank you for being with us today.
Thank you.
I don't see any hands for questions, so I will go on to the next speaker. Thank you. The next person on our list is number 52, Irene Scribello. I should know how to say your at this point, Irene. I know you well.
Yeah, no, that's okay. Hang on, let me pick the camera. Oh, it's not working. Can you hear me?
We can. Go ahead.
Okay. Senator Kushner and distinguished members of the Public Health Committee, my name is Irene Scribello. I live in New Milford, and I'm a volunteer with Connecticut Against Gun Violence. I'm testifying in favor of the language in HB 5397, an act declaring gun violence a public health crisis, and in support of SB 477, an act concerning the public health of residents in the state. Gun violence is an urgent public health crisis. It demands that the state invest more to save lives. Last year, gun homicides were the highest in 25 years, nearly double the level of 2018. Beyond the loss of life and the profound impact on communities that experience high levels of gun violence, it's also a tremendous economic cost. According to Everytown and Giffords Law Center, it's estimated that gun violence of all kinds costs Connecticut taxpayers between $60 and $90 million annually and carries a yearly societal cost of $1.2 billion. It makes fiscal and moral sense to invest in gun violence prevention programs. This bill will also benefit the community at large without infringing on the rights of law-abiding gun owners. I live in New Milford. There are a lot of hunters, and they, along with my state representation, are quite enthusiastic about their Second Amendment. This solution to address the root causes of gun violence problems should be and will be palatable to this audience if it's properly explained to them. Now, I have a quote from Boston University School of Public Health regarding a similar program that was introduced in Massachusetts. Despite the majority of gun owners saying that they support many gun violence prevention policies, 59% say that they think that gun control advocates want to take their guns away. And I've heard that many times. Among gun owners who said they supported universal background checks, 62% said that they nonetheless feel alienated from trying to take part in gun violence prevention because they perceive that gun control advocates are trying to eliminate aspects of the gun culture. A law like HB 5397 is a win for them. This department will focus not on taking their guns away from law-abiding citizens, but stopping violence by focusing on the root of the problem. Thank you for your time and your infinite patience.
Well, thank you, and thank you for being with us here today, and thank you for being kind for my really messing up your name bad. I apologize.
That's okay.
Thank you very much for testifying here today. I don't see any hands, so we will move on to the next person. And next on the list is Gail Litsky. Gail, are you with us?
Yes, I am. Thank you for the opportunity to testify. Can you hear me all right?
Yes, we can. Go right ahead.
I prepared a little something. So, I am currently 55 years old. I was acquitted NGRI and was admitted to the Whiting Maximum Security Building in October of 2014. I would like to briefly tell you regarding my experience. At that time, when I was admitted, Whiting Max had 2 units, specifically for males adjudicated NGRI. But I was placed in a competency admissions unit due to my female gender. All females were placed on that unit regardless of their legal status, be it competency restoration, NGRI, or civil commitments. I received virtually the same treatment as the competency patients. But while the competency restoration and the civil patients were discharged, I remained. I was physically assaulted unprovoked by some of these same patients that were later discharged from Whiting while I still remained in Whiting Maximum Security. My further frustration. In 2018, after 0 incidences of threats, violence, seclusion, or restraint on my part, the hospital applied to the PSRB for my transfer to a less restrictive building. The PSRB denied the hospital's request because I was not taking psychotropic medication, even though the clinicians testified I would be safe in a less restrictive environment. In 2019, the hospital again applied for my transfer. The PSRB approved my transfer at that time, even though I still did not take psychotropic medication. I then transferred to Dutcher Hall Building and have since, for my safety, resided as the only female on an historically all-male unit.
I'm going to turn off the sound on this. I'm sorry.
Representative Bryan, would you please mute yourself? Representative Bryan, we need you to mute yourself. Maybe the clerk. I'm sorry for that interruption. Please go ahead and.
Thank you. As of 2022, I still do not take psychotropic medication and have continued to maintain 0 incidences of threats, violence, seclusion, or restraint with clinical stability. In September of 2021, my latest PSRB in-person review. For the second time since my 2014 admission to the hospital testified no intention to apply to probate court to force medication, nor did they testify to any specific disability or dangerousness due to mental illness. With no articulation, the PSRB issued a memorandum of decision simply stating I was appropriately confined, given my lack of insight into the severity of my mental illness and the need to take medication to control symptoms. I'll repeat, with no articulation nor examples, I was appropriately confined. My clinicians frequently mention the PSRB relative to recommended treatment. It seems the
Excuse me, Ms. Litsky, your time is almost up. If you please summarize, thank you.
Okay, I will be very quick. Whiting Forensic Hospital needs oversight and accountability. Patient rights need to be protected, including appropriate and adequate care that fosters recovery or integration into the community. Victims need to understand those acquitted NGRI need to be treated, not punished. Often the PSRB stands in the way of what the clinicians have deemed beneficial to the patient. The adversarial process of PSRB hearings question and undermine clinical decisions and put a person's mental health on trial. Given the short legislative session, I support Race Bill number 450 as a step towards system reform with a focus on recovery and compassion. Thank you for starting the journey.
And thank you for your testimony here today. We really appreciate you taking the time to share your story with us and the conditions that you are facing and seeing there. I don't see any hands at this time. Again, thank you, Ms. Linsky, and we'll move on to the next speaker on our list. Next up, we have Faye Bernadette West, number 54. Faye, are you here?
I am. Hello.
Hello, go right ahead.
Okay. So good afternoon, Senator Kushner and distinguished Public Health Committee members. Thank you for the opportunity to speak on behalf of House Bill 5500. My name is Faye West, and I'm a physician licensed to practice medicine in the state of Connecticut. I am board certified in anatomic and clinical pathology with subspecialty board certification in transfusion medicine and blood banking. I have 15 years experience overseeing apheresis procedures, including blood and platelet collections in Connecticut for the past 5 years. The COVID-19 pandemic challenged blood centers in Connecticut and nationwide to provide adequate blood and platelets for hospitals. Members of the committee, please consider the following information regarding the proposed language in HB 5500. Every 2 seconds, someone in the U.S. needs blood for trauma, cancer, childbirth, and blood disorders like sickle cell disease. Last year in Connecticut, over 60,000 donors gave just over 110,000 units of blood. At the Farmington headquarters, greater than 16,000 apheresis platelets were donated. Still, we need to increase our platelet collection capacity at our 2 new blood donation centers in Milford and Greenwich to meet the growing hospital's needs across Connecticut. Blood's limited shelf life requires continuous replenishment. Platelet shelf life is 5 days, which is why we operate our Farmington Apheresis Center essentially every day of the year. Donors are drawn by highly trained professional staff who are longstanding members of AFSCME, who have the safety and well-being of both the donor and patient in mind. In the recent blood crisis, hospitals had to make difficult decisions about who received blood and who had to wait, and they worked closely with us in the medical office to maximize blood resources. We believe the current public health code in Connecticut could be better aligned with FDA regulations and blood center accrediting agencies. We understand the Commissioner of Public Health has the ability by statute to waive certain regulations in the interest of public health while maintaining the safety of patients and state residents. We recommend the proposed language in HB 5500 be adopted and be effective upon passage so the Commissioner of Public Health can have the same opportunity to waive certain regulations for clinical laboratories, such as we are in Red Cross. We are prepared to work with the Department of Public Health to update these procedures in the long term, but our concern lies with emergencies which can disrupt the blood supply suddenly. In closing, Red Cross is grateful to blood donors in Connecticut and across the nation who help alleviate the blood crisis in early 2022. We remain committed to saving lives, and thank you for supporting our biomedical and humanitarian mission in Connecticut. Thank you.
Thank you. I see Representative Pettit has a question for you.
Thank you, Madam Chair. Thank you, Dr. West. Couple quick ones. So you feel that there is a significant need that's not being met for timely plasma donation in the state of Connecticut at this time?
I'm specifically speaking about platelet donations, which we collect by apheresis, which is an automated method. And the main reason that I'm bringing this up is that we have a rather antiquated oversight system in Connecticut where we require the physician to be actually on the premises for an apheresis collection. And to my knowledge, this is not done in any other state. And in fact, physicians routinely see the apheresis collections of healthy donors and remotely with, telemedicine and all the current advances that we have for communication, as well as patients, which we don't do. But, you can also see and supervise patient apheresis remotely.
And most of these patients that come in for platelet apheresis are, they make multiple visits. They're selected because of a specific type. Are they people, like many people for blood drives, who donate repetitively? Do you often have frequent flyers, or is it a different group every time?
Absolutely. We have very committed donors, and these are healthy people, and they qualify in every capacity that's been set forth by FDA regulations, as well as other state and local regulations. But they are healthy donors, and they are repeat donors many, many times. And it's amazing to see donors who have, when I review their records, over 200 donations during their lifetime. So they're very committed, and they do save lives.
So then I said to one other person earlier today, so to cut to the chase, the public health purview of safety, you don't feel that there's any significant safety issue raised by not having a physician on site when these apheresis collections are done?
Not at all, because we have very well trained professional staff who are on site and performing the collections. So my presence is not absolutely necessary for that to be done safely. And I've never seen any literature that states that it is unsafe to do it that way.
And just one more question. You do this at the Farmington site, you do this at multiple sites throughout the state?
Currently, we collect apheresis platelets just at the Farmington site, but we would love to have the opportunity to collect them at other sites and to meet the demand for Connecticut residents and patients, essentially, as the hospitals continue to grow and expand cancer programs and really catch up to a lot of healthcare that was neglected during the pandemic.
Thank you so much, Doctor. Thank you, Madam Chair.
Thank you, sir.
Thank you. Next up, I see Rep. D'Amico.
Thank you, Madam Chair. Thank you, Dr. West, for being here and testifying. So I have a follow-up question to the questions that were asked of you by Representative Pettit. So I understand that in Connecticut, the law requires a doctor to be present during the apheresis platelet collection, and you're telling us that no other state makes this requirement.
I'm not
right?
aware of any other state that makes that requirement, and I've practiced in other states prior to coming to the Red Cross and covered a wide range of procedures with telemedicine.
I see. And so earlier today, we heard testimony about regulations. Well, let me just back up. So are there other regulations other than not requiring a doctor to be present that you would consider to be outdated and should be done away with? In other words, what else are we talking about besides the requirement for a doctor to be present?
Yeah, there are other regulations that are a little strict or restrictive, I should say, and that would be requiring a higher level of staffing than that is required under the federal regulations. And so that also applies to the nursing and the trained staff that are able to do procedures, and they don't need nurses to do all of these procedures. And so just overall, these statutes are very strict. They are outdated, to be honest, and they're not consistent with other states. And they're certainly more restrictive and not updated according to the federal regulations. So I think if we can move towards updating, that would be really great, both for nursing staff restrictions and physician restrictions.
Yeah. And you don't see any health dangers? You don't see any downside to getting rid of these what you consider to be restrictive regulations You don't see any patient health problems happening as a result?
No, I don't, because again, we're not dealing with patients. We're dealing with very healthy donors who are vetted by a mini physical and a very lengthy blood donation history. And we look at them in multiple ways, which is the FDA's multiple layers of safety, in order to vet a donor as being fit for donation. And no, I have not encountered any issues with this, nor have I seen any published literature on this.
Okay, I appreciate that. Thank you very much.
Thank you.
Thank you, and thank you, Dr. West. I don't see any other hands at this time. So we will move on to the next speaker, Allison. And boy, Tilizak, how do you say your last name?
Chuck, Senator Kushner.
Okay, thank you.
Fine. Thank you so much for having me today. And thank you, esteemed members of the Public Health Committee. My name is Allison Tulishchek, and I'm a resident of Madison, Connecticut. I serve as the Director of Maternal Infant Health Initiatives for the Connecticut March of Dimes, a national organization that leads the fight for the health of all moms and babies. I'm here today to testify in support of HB 5500, an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. March of Dimes applauds Connecticut's collective efforts taken to expand doula coverage in Connecticut by establishing a doula advisory committee within the Department of Public Health to develop recommendations for requirements for the voluntary certification and certification renewal of doulas. March of Dimes recognizes the importance of increased support and capacity development for doulas, including doulas from racially, ethnically, socioeconomically, and culturally diverse communities. Making doula work sustainable and equitable is an important goal to ensure that women with the highest rates of adverse birth and maternal health outcomes have support before, during, and after pregnancy. Establishing a doula advisory committee will ensure doulas' voices are centered in this process, as well as create a workforce rooted in equity and inclusion. March of Dimes supports legislation that improves access to doula care as one way in which to help improve birth outcomes and reduce rates of maternal morbidity and mortality among women of color in Connecticut. In closing, I urge you to support HB 5500. Thank you for your time today.
Thank you. Thank you for your testimony, Allison. Much appreciated. I don't see any hands at this time, so we will move on to the next speaker on the list. That's number 56, Jill Kiddick.
Hi, thank you for having me today. I'm going to try to summarize the statement, I'm sorry that I'm in and out, that I submitted last week. In May of 2018, my offender, who currently resides at Whiting, stabbed me twice in the throat. She split my trachea almost in half and then repeatedly stabbed me throughout my upper body as I fought for my life. At the time of this attack, I was a Hartford police officer, and that was the last day I ever wore a uniform. For almost 4 years, I've been mourning the fact that my body is not mine as it once was before my offender attacked me. I have also waited for years for a trial to happen, but due to COVID, it only just completed last August. And here I am 6 months later, after my offender was committed to Whiting, seeing that a task force is attempting to change the rules on people like my offender who might get released without supervision. My offender who admitted her intent to murder me that day. It is abundantly clear that the end game is to eliminate and abolish PSRB. The individuals on this board hold a great collective responsibility on making the right determinations for both the equity and the public, and should not be removed from any of their current responsibilities. The decision to approve temporary leave for any offender, especially those of a violent act like mine, is not a decision that should ever just be made by a single person or the review of people who have different points of view. As a victim, I should be given the opportunity to speak to my position on such leave being given, but if there's no PSRB There is no victim statement. There is no clear standard or review of determination of leave for a victim and the victim's family and the public to understand. The idea that my offender could be free, even for a few hours, at the say of one voice is unacceptable unless you have endured what I have endured. You will never know the kind of sickening feeling that that idea gives me. But that is if I were even told she was going to be on leave. What if I was not notified by the one person deciding to grant her leave, and I look out my front window and she's standing in my front yard where my 2 baby daughters are playing? This task force has a responsibility to ensure that any and all proposed changes that are made after they have totally investigated and considered how each change affects everyone involved and everyone who may be affected by such a change happening, and make it crystal clear who is to be held responsible when it goes wrong. The proposed change by the task force for temporary leave is a reckless and irresponsible proposal that cannot be entertained. And I please ask you to reconsider removal of the PSRB. Thank you.
Thank you, Ms. Kiddick. Thank you for your testimony and for sharing your personal story, even though it was quite difficult for you to share and for us to hear. But we appreciate your being here today. I see Representative Pettit would like to speak or ask a question.
Thank you, Officer Kiddick, for taking the time and the strength to come and testify. You know, bringing back the memories of the day where you almost lost your life on a routine call. So thank you for that service. I brought up with several people that there's issues with victims being represented, both from the point of view of the task force, and as you noted there, in terms of notification when things are transpiring. You probably had some of that notification with the judicial system. Maybe not, but hopefully the people that are in this type of program will be afforded the same type of notice that's allowed for people who are in DOC. What specific suggestions would you make from a victim's point of view that you think, we have your testimony, could we just in short terms explain what changes you think need to be done? You mentioned that you don't want the decision being made by one person, that should be a group of people. What else would you add to that?
I understand that I don't understand the workings of a medical facility or a detention facility. I've never worked in either. But now being on the other side of it and being a victim is very eye-opening. And there just needs to be checks and balances. And although, yes, I'm sure that there's a history of people being let down or things not going the way that they maybe should have gone with different boards and what have you, we can't just say, okay, we need to get rid of PSRB, but I don't have any suggestions on like what we should do instead. You need to be ready to give a suggestion, because it's very scary to someone like me that I'm a strong person, but I fear seeing my offender in the front yard because she hasn't finished business in my mind. We just need to make sure that people from inside the facility and out are allowed to give their input. Victims need to be spoken to. There's different levels of crime that have occurred to cause acquittees to be at Whiting. Some are not nearly as violent as mine, and that needs to be in consideration. They're not all the same. No one is the same. And the idea that there is not a board to invite me to come give my say and invite many other people to give their say collectively to make that decision is very, very concerning.
Well, I appreciate that, and I am sure that there are many of my colleagues on this committee who will join me in trying to represent the needs of victims as we attempt to adjudicate this issue. And I am very happy you're here for you and for your young daughter. So thank you once again.
Thank you.
Thank you. Again, we really appreciate you being here today and your testimony. I don't see any other hands at this time, so thank you for being here, and I'll move on to the next speaker. Next up, we have Kristen O'Neill-Herm.
Oh.
Good afternoon, distinguished members of the Public Health Committee. Thank you for allowing me the opportunity to speak today in support of HB 5397, an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention and an advisory council on gun violence prevention and intervention. My name is Kristen O'Neill and I live in Fairfield. I'm a volunteer with the Connecticut chapter of Moms Demand Action for Gun Sense in America, and I'm here today to speak on our behalf. I've also volunteered with Connecticut Against Gun Violence and several other gun violence prevention organizations. Gun violence has been a public health crisis for decades, but let's just look at the last few years. In 2020, 219 Connecticut residents were shot and killed with a gun. That is 219 lives cut short, 219 people who were denied the right to live a full and meaningful life. Additionally, 219 families were forever broken and traumatized. Countless friends, co-workers, mothers, fathers, sons, and daughters suffered irreversible harm when these victims were shot and killed. The ripple effect is long-lasting and long-reaching. The majority of these shootings take place in Connecticut cities. City gun violence is an overlooked epidemic in the state of Connecticut. Fairly confident that many of my neighbors in Fairfield do not realize that there were 21 gun homicides in Bridgeport in 2020. Many of us speak of the horrific school shootings that have occurred in Connecticut, but don't do much about the lives lost just miles from our own homes. And even if you can overlook this needless and tragic loss of life, gun violence takes money from Connecticut taxpayers. Gun violence costs the state about $1.4 billion per year, and about $60.4 million of that is paid by the taxpayers. This bill would finally declare gun violence a public health crisis in the state of Connecticut, something that has already been done in New York, Pennsylvania, Illinois, Colorado, and Washington. It would then establish an official Office of Gun Violence Prevention. One of the most important things this office could do is to collect data around gun violence and make the data publicly available. This would help ensure that all the prevention work that was data and evidence informed. The office would also help to mobilize state resources and much needed funding. Establishing an Office of Gun Violence Prevention would allow grant-making authority with a focus on funding and implementing of community-based prevention and intervention programs. This would include things like after-school care programs for at-risk youth and violence interruption programs, all strategies to reduce street-level gun violence. I've witnessed the importance of these programs in my former hometown of Stamford.
Excuse me, Ms. O'Neill-Herm, your time is almost up. If you would please summarize.
Sure. I was just going to say that there are many groups that do work like this in Stamford, Bridgeport, New Haven, Hartford. But from what I've witnessed, these groups can have difficulty accessing funding, and a state established office would provide one resource for these people in these groups to be able to collaborate, work more effectively, look for grant money, and for hopefully federal funding. Thank you so much for your time today. I really appreciate it.
Thank you, Ms. O'Neill. At this time, I don't see any hands. So thank you for being with us and testifying today. And we'll move on to the next speaker. That's Catherine Craig. Is Catherine with us?
Okay. My name is Katie Craig, and I'm a patient here at Whiting Forensic Hospital. I'm here on behalf of Bill 450. I was the chairman for Dr. Steering Committee for about 2 years before the pandemic. I'm not sure if they're proposing that they do away with the PSRB, but I think that would be a bad idea. I've been to PSRB hearings a number of times, and it is very sobering experience. It's like being scared straight. I only have the experience of the PSRB hearings from a patient's perspective. It's very scary. All eyes are on you, and it makes you realize how serious of a position you are in. I heard at steering committee that they were thinking about doing away with the PSRB and letting the CEOs sign off on transitional leaves. I think that would be a bad idea. I do think CEOs and COOs should have more contact with the patient. They have more contact with the patients. The CEOs and COOs, they come on our units, they know the people, they have more of a sense of what's going on in the hospital, whereas the PSRB only knows us on paper. The CEOs and COOs, they come to our codes, they come to our steering committees, they come to our field days. The CEOs have a more understanding of our patients. I think if the CEO and COOs have signed off on transitional leaves is a good thing. It's just one more measure to ensure everybody's safety. But if the CEOs, COOs, and the PSRB could sign off on transitional leaves, it would be a double whammy protection that everybody agrees on.
Thank you. Thank you for your testimony, Ms. Craig. I don't see any hands at this time, but we appreciate you taking time today to be with us and give us your voice and your opinion on this. Thank you so much. Next up, go to Alon Cohen. Is Alon here?
Hello. Afternoon, members of the committee and anyone who is listening. My name is Alon Cohen of Portland, Connecticut, and I ask that you consider opposing the following. Oppose SB number 477, specifically all of Section 7 seems corrupt, pure and simple to me. Members on the committee will be sending grants to organizations that they themselves are still part of while on the committee. The corruption shows itself in Section 7I, quote, to secure state, federal, and other funds for the purposes of reducing community gun violence. And later it says 4, establish and implement a grant program, and B, award grants and offer guidance to organizations or other entities working towards reducing community gun violence in the state, end quote. The fact that, quote, other funds, end quote, wording is used outside the state and federal funding of the grants shows that private people, possibly millionaires, billionaires, and foreign entities, whether government or otherwise, will funnel money through these funds, which will go towards groups that are associated with members of the committee. This looks like corruption to me. Also oppose HB number 5397. Gun violence is not a public health crisis. It is a social economic problem. The fallacy here is that if guns are considered a public health crisis, then why are knives, cars, and any other thing used in a violent act not considered a public health crisis? The other fallacy here is that gun violence used to protect oneself and or others legally in a self-defense encounter will still be considered a public health crisis, even though it should be reasonable to defend oneself from someone trying to kill you or someone else. Thank you for letting me speak in for the time that you've allowed me.
Thank you for your testimony. I don't see any hands at this time. So we'll move on to the next speaker, number 59, Andrew Reynolds.
Good afternoon. My name is Andrew Reynolds. I am the uncle of Jessica Short, who was stabbed 37 times by an escapee from CBH in 1989. I'm here to speak on behalf of supporting the Psychiatric Review Board. I think under Vanessa, there's been great improvements. I do have some questions about the continued notification of victims, as Dr. Pettit has mentioned, which in the current bill, there's no mention of any victims' rights. And also, I was wondering if anybody has recently read any of the testimony of the Psychiatric Review Board when they have had any testimonies. But this is very hard for me to speak. So if anybody has any questions of me, it might be easier.
Certainly, and we appreciate you being here, testifying, telling your personal story, and very sorry for the tragedy that has befallen your family. I don't see any hands at, oh, Representative Pettit.
Thank you, Madam Chair. Thank you, Mr. Reynolds. Over these past many years, can you describe, do you have knowledge of all the notification that's occurred over the past 30 odd years with your case?
In regards to all the psychiatric review board hearings, we've had an opportunity to give a victim statement, which we've always had. They've notified us. And I want to make it clear, I'm not against this entire bill as a whole. I think it does a lot of good. A new Whiting would be a good thing for everybody. But to keep us informed of changes, of releases, of transfers, it's very important. My sister, Jessica's mom, had a breakdown when she heard about this bill. And when she read there's no notifications. So I just can't tell you enough how this should be included, or the bill should be revised to include these notifications and victims' rights as a whole.
I thank you so much for that, and thank you again for your time and courage. I think people who haven't been in your position don't know how difficult it is to come and speak about these things even years later. So thank you so much.
No problem. I'd also like to give my sincere support to the officer who spoke earlier.
Thank you. If she's not listening, I'm sure someone will make her aware of that, and we appreciate you saying that and appreciate you being here. Thank you.
Thank you.
Next, we will hear from Jackson Middleman.
Hello. Members of the committee, thank you for welcoming my testimony today as we discuss HB 5397, which is of critical importance to the people of Connecticut and has implications for the nation as a whole. My name is Jackson Middleman. I'm 20 years old and I was born and raised in Newtown, Connecticut. I do not need to explain what happened in my town on December 14th, 2012 for you to understand the tragic loss it resulted in. As a college student, I noticed looks of pity or sadness when I simply tell people where I grew up. We were once recognized as one of the safest communities to live in America. However, this reputation was shattered when 21st grade students and 6 educators left home on a cold Friday morning in December and never came back. Although it felt as if we were going through this tragedy alone, the reality was that thousands of other communities like Newtown and countless families across the nation already knew our pain. As is heard throughout the gun violence prevention movement, we are members of a club that no one asked to be a part of. Pew Research reports that in 2020, more Americans died from gun violence than any other year on record, resulting in approximately 45,000 people who will be absent from family gatherings, classrooms, and their own futures. On face value, this may be just a number, but the impact of this violence is widespread, complex, incredibly painful, and most importantly, completely preventable. Almost 10 years after Sandy Hook, the federal government has yet to pass a single bill to reduce gun violence. The numbers have consistently risen and will continue to unless we take concrete action. I am a product of what has come to be recognized as the school shooting generation. Students around the nation have become victims and survivors before they get to be graduates, academics, and adults. Children learn how to block off doorways and stay quiet in the event that someone decides to walk into their school with a gun and inflict harm. In high school, I spent about as much time organizing vigils, rallies, and lobbying trips as I did doing homework and spending time with my friends. While this is now seemingly commonplace in our society, this is far from normal. We should not expect children to plead for their own safety for effective laws to be passed, as this is precisely the responsibility of legislators, governments, and committees such as these. The trauma we have inflicted on an entire generation of Americans with our inaction was and is troublesome. For reasons I've already spoken on and an immeasurable amount of others, I urge this committee to pass HB 5397 and create an Office of Gun Violence Prevention to proactively respond to threats facing Connecticut, establish community violence intervention programs, collect data on the public health crisis, and make us safer. We have the tools and the institutions to address gun violence. We shouldn't wait another minute to do so and save lives, and we can start by passing this bill. Thank you.
Thank you, Mr. Middleman. I will recognize Representative Berger-Javallo.
Jackson, thank you so much for your contribution to today's hearing. It may be just a number, the number that you threw out, the 45,000. It is not. I can assure you, it is not just a number. Too many of us, and I just want to reassure you of that. One of the things that you said, children should not have to plead for their own safety. And while you're not a child anymore, but I know that you were very active as a high school student, and having a daughter who is your age, who was working alongside your group here in Ridgefield, I can say that your pleading for your own safety has absolutely been the case, but now what you're doing is you're pleading for the safety of others, and that to me is the strongest level of advocacy that anyone can possibly perform, and that is advocating for groups who will come after they do. So I want to thank you very, very much for your words, but I want to thank you even more for your work, and I want to tell you that I personally will do whatever I can, because it is so important for you to know that you are heard by your elders and by those who are really thick of all of this too. So thank you very, very much. I really appreciate that you came and spoke to us.
Absolutely. Thank you, Representative.
Thank you. Senator Moore.
Thank you, Madam Chair. Thank you, Mr. Middleman, for your testimony. I empathize with you in many ways when you spoke of when they mentioned Sandy Hook, what they say. I feel that way about Bridgeport when people are giving testimony or trying to make a point when it comes to violence and poverty, that we get tagged. And we're human beings, and it is more than a number. And I want you to know how important it is that your voice be heard, and that we include the voice of young people who are really violently impacted by some of the gun violence that's taking place. I'm just going to look at what's going on in Connecticut. All over our urban centers, what's happening also, and individuals, instead of beefing with words or their fists, end up using a gun to take a life, right? And so I appreciate the work that you're doing, and I want you to continue to stay involved and to continue to have a voice. I don't know that necessarily I agree with the method in 5397, but I agreed in the content of what we're always all trying to be able to accomplish as a collective group of people. And I assure you, I have all the faith in the world that we will be able to sit down and come out with a bill that works best based on some of the testimony that we've heard and some of the language that we have, both in the governor's bill and in both of the other bills, 477 also. So I appreciate you. Thank you so much. Thank you, Madam Chair.
Thank you. And I don't see any other hands, but I do want to say, Mr. Middleman, that I too really appreciate your testimony today. I know you had some difficulty getting challenges with the technology getting here, and I'm glad you were patient, and I'm glad we were able to get you admitted to the room. I represent Danbury, and I've lived here for 30 years, and my children grew up in the public schools here, and so certainly the day you referenced of Sandy Hook shooting was a day that affected all of us so deeply, especially those of us that live in this community, and this expanded community touched all of our lives. My kids, all three of my kids knew someone who was killed in that shooting that day. And it hasn't gotten better. It just hasn't gotten better. So I appreciate your testimony here today. And I too will join the voices of my colleagues who have said that it's our responsibility to make sure that we move these bills forward and that we make a greater effort to make change real and possible, particularly for everyone in Connecticut, but it sets a model for the rest of the country as well. So thank you for hanging in there and being with us today.
Absolutely. Thank you for the committee's attention to this issue as well.
Take care. Next, we have on our list, Aaron Ramsey. Is Aaron here? There you are. Go right ahead.
Hi, how are you?
Doing well. Go ahead, Mr. Ramsey.
Thank you. Well, thanks for giving me the chance to be here. I got to keep my mask on because I'm at Whiting. I'm reporting from here. So, but our unit, and so, am I still on?
We can hear you, but your camera went off.
Camera. All right.
There. Now we can see you.
Yeah. So, yeah, our unit got COVID. That's why I'm got the mask on. But so I wanted to talk about mainly the PSRB having the patient's best interest at heart, not only society. There's a lot of people here that have put in the work to get out. And, you know, we've had many hours of therapy, we've done groups, and a lot of people are ready to go, and beds are being taken up for people that could benefit more from that. And so, you know, I knew nothing about mental illness when I was out in the community. All I knew was a little bit. My mom told me, you know, watch out for depression. Just make sure if you get real down, just wait it out. But nobody told me about psychosis. And unfortunately, that's one of the things I started to go through. And, you know, I was just a normal kid before. I played football. I was in the marching band. I had a lot of wonderful friends. I got into 2 colleges that I liked. And unfortunately, I ended up losing touch with reality. And I ended up here. And but now I know so much more about how to stay healthy. And that's a lot of the people here, they know that. And so it would be really good to push that forward, get some of these people out, free up some of the beds, and get more funding into the community, open more space there, because a lot of us are being told that, you know, they just don't have the space out there. So that's why we're being held up. And the other part was the new oversight board for the Whiting Hospital, somewhere we can bring our concerns to. People are really great here. We got a lot of wonderful staff and workers, but there are some who still treat us unkindly, and some of it still violating the law. And that's what happened with the Shahadi scandal, was people were not listening to the complaints and there was no repercussions. So I think that something outside the hospital would be much better suited to look into those grievances. And, yeah, so that's all I wanted to say. Thank you so much for letting me talk, and I really appreciate all the other people. I heard there was like 180 people that participated in this, so that's really awesome.
Well, thank you for testifying here today. We appreciate your input, and it's always important to hear from people who are involved in experiencing the life that we are now trying to legislate about. So really appreciate your testimony today. I don't see any hands, so we will move on to our next speaker, and that will be Andrew Woods.
All right, thank you.
Thank you. Go ahead, Mr.
Okay, thank you very much, Senator Kushner. Good afternoon, members of the Public Health Committee. My name is Andrew Woods. I'm the Executive Director of Hartford Communities That Care, and I'm actually here to testify on behalf of Senate Bill number 477, an act concerning the public health of residents of the state of Connecticut. Specifically, Section 7, which is establishing a commission on gun violence intervention and prevention to coordinate the funding, implementation of evidence-based, evidence-informed, community-centric gun violence prevention and intervention programs and strategies. As I mentioned, I'm the Executive Director of HCTC, where we started this organization back in 1998. And at the time, several years later in 2004, became one of 2 hospital violence intervention programs in the state of Connecticut. Our HVIP is a partner with St. Francis Hospital and Medical Center. The other is Yale New Haven Hospital, that currently operate 2 of the Connecticut's, these evidence-based HVIPs across the state of Connecticut. Since we've been doing our work here in Hartford, our team has responded to and supported over 1,800, primarily 1,800 victims of gun violence and their families, providing wraparound service support, mental health services, medical, you name it. connecting folks with services after being victimized, but also making sure that individuals who are exposed to violent crime are receiving services and supports. In the fall of 2021, I was also appointed the chair of the Connecticut Gun Violence Intervention and Prevention Advisory Committee that the General Assembly established under Public Act 2135, Senate Bill 1, an act equalizing comprehensive access to mental, behavioral health, and physical health care in response to the pandemic. This advisory committee recommended, among many nuts and bolts strategies, that the Connecticut General Assembly establish a commission on violence intervention and prevention to coordinate funding and implementation of these programs. And so why is this important that we establish such a commission? One, adding to the chronic and uniquely American problem of many thousands of non-fatal and fatal deaths every year, the past 2 years of COVID-19 related economic and mental health hardship have brought acute spikes in community violence across the state of Connecticut, within our cities, and certainly across the nation. Number two, here in Connecticut and elsewhere, investment has always been insufficient and uncoordinated. And number three, an effective approach to save lives is long overdue. These 3 points here is why many of us who are a part of the advisory committee that was established by the legislature last year felt it important to establish such a commission and to fund it and to fund the services that can operate under the purview, if you will, of commission members. So therefore, I strongly urge you to support and provide multi-year funding for this commission to work and produce and reduce community violence. I know that our colleagues are talking $5 million. I don't know, many of them are saying 5 million. I'm hoping that let lawmakers here can actually look at 5 million per year versus 5 million for just a one-time dip in the bucket. And so there I conclude my remarks. Thank you.
Thank you, Mr. Wood. I will recognize Senator Moore.
Thank you. Thank you, Mr. Woods. First of all, I want to thank you for introducing me to people nationally who are looking at this gun violence prevention and the work that you're doing collectively. I had no idea what a hobby was until I met you, and I had no idea how many people were really working together statewide in the way of organizations who are dealing with gun violence all over the state and nationally. I knew Giffords because I had met Representative Giffords in my first year, but I had no idea how hard you all were working to try and move this along to bring everybody together and get the funding. So you worked along with, how many other people were on the advisory?
I think it was approximately 15, I believe it was.
So they all had input into the recommendations that it's in section 7 of 477?
They all had input in terms of primarily recommending that there be a office or commission established. Okay. Now, how and why and under what circumstances, we really wanted to have that discussion primarily with lawmakers to really make us, for us all to collectively think about where and how such a commission might be established.
And what type of organizations were involved with the advisory?
Certainly you had frontline worker organizations, those that do evidence-based programs. You had mothers groups, which is our victim service support groups. You had folks within public health who are also a part, but you also had folks from the Connecticut Hospital Association. You had, we got input from many community-based and civic groups inside the community based on our outreach and engagement, including law enforcement, that provided us with a lot of feedback and input on what they believe would be practical solutions to reducing and preventing violence in our communities.
And I certainly respect the work of all those who came together to put that information into the report. But I would also ask you, because it is a work in progress and no first piece of draft is perfect, and we want to make it the best piece of legislation we can. I just would ask you, do you have any suggestions that would strengthen the bill?
Well, I think there's three things that stand out, and I'll go backwards from number where I ended at in my testimony, is where we're encouraging folks to allocate $5 million towards this work. we believe that, yes, that would be on some level appreciated, given that there's very little that's already committed to this work. But certainly, I would say that we would hope that the legislature would think about a multi-year investment at a minimum of the $5 million that's being suggested here today by many, including our colleagues. Number two, we talk about in the legislation, at least one of the versions, around the advisory committee versus a commission. And there are those of us believe that it should not be an advisory committee, it should be a commission, something that has the power, something that has more juice, if you will, something that can provide the kind of oversight and one that demands the respect and attention that something like this deserves. Number two, that the staff that would be hired to lead this effort. There's a suggestion here of an executive director and a couple of staff people. And there's one suggestion here that the commission members should actually be a part of the hiring and supervision of those staffers. I do not agree with that. I believe that any staff that's hired to administer and support the work of the commission should be staff that is hired by the state of Connecticut, whichever office those individuals would serve up under. So if it's judicial, whether it's Department of Public Health, wherever this commission will reside, if it's not a standalone, wherever it should reside, the staffing should not be, and by the way, I don't think we should be, commission members should have the responsibility and have to deal with or hire staff and then supervise them. I think they already have their hands filled with just doing the day-to-day work out in the communities, just dealing with the trauma and the significant impact violence has on the families and individuals that they're working with. And then of course, and so those are really the main three things that stand out for me in terms of that I would hope this, you as lawmakers would consider. Certainly a commission versus advisory. The hiring of staff and supervision of that staff and firing of that staff should not be that of a decision of commission members. And certainly to take a look at, more importantly, more than anything else, the investment of those resources be multi-year investment so that we can make a dent and make the progress that we all believe our communities deserve.
Thank you. I'll certainly go deeper into those recommendations to try and strengthen the bill to make sure that we're inclusive of the recommendations, especially as the executive director of an organization that does it every single day, but also as the chair for the advisory. And once again, I want to thank you really from the bottom of my heart for making me aware and bringing me into the group and enlightening me on what's going on in the state and what you're trying to do. And I want to thank you for the work that you do every day on the ground. I appreciate you. Thank you, Madam Chair.
Thank you, Senator Moore, and thank you, Mr. Woods. I don't see any other hands at this time, but I too want to thank you for being here and for presenting your testimony today.
Thank you very much.
Next up, we have Jermaine Belcher. Is Jermaine here? Oh,
Yes.
go right ahead, Mr. Belcher.
Good afternoon, Senator Kushner and distinguished members of the Public Health Committee. Thank you for the opportunity to present testimony today regarding support for Senate Bill 477, an act concerning the public health of residents of the state. Again, my name is Jermaine Belcher, and I am part of the Hospital Alliance for Violence Intervention, the HAVI. I'm the Senior Coordinator for Policy and Advocacy. The HAVI is a proud member of the Connecticut Hospital-Based Violence Intervention Program Collaborative. We are honored to serve on the Gun Violence Intervention and Prevention Advisory Committee created by the legislature in 2021. I'm here today in support of Senate Bill 477. It is critically important that we fund and sustain community violence intervention in cities in Connecticut. There are a variety of program models, including hospital violence intervention programs through outreach and trauma-informed care. What this bill does is create mechanisms to coordinate and fund programs and have an advisory committee to make sure that the approach is smart and sound and done correctly. This issue matters to me because for over 20 years, I worked in the space of violence intervention. I've seen up close the destruction of what violence and trauma has done to once safe and thriving communities, business districts, school districts, neighborhoods, and just as important, families. I have unfortunately had to console countless mothers, fathers, grandparents who've lost their sons, daughters, and grandchildren to senseless gun violence. When parents should be celebrating their children graduating from high school and college, they're spending their time burying their children. During the pandemic and over the past 2 years, we have seen an uptick in violent crimes across the US. Hospital violence intervention programs and community violence intervention programs have been stretched and have worked tirelessly to meet the needs of those impacted by trauma and violence. Organizations such as the Hobby have worked to support programs that serve victims of violence. It is imperative that programs that continue to provide vital resources to victims of violence continue to be supported and even expanded. The Hobby is heartened to see Senate Bill 477's proposed creation of a permanent commission on gun violence intervention and prevention, as was recommended by the committee. We are pleased that the committee we served on supported these efforts. It is my hope that Senate Bill 477 is supported and passed, as it is desperately needed. Again, thank you for the opportunity to address the committee. This concludes my testimony.
Thank you very much, Mr. Belcher. And I see Senator Moore has her hand up.
Thank you, Mr. Belcher. I don't think I've had the pleasure of meeting you, but I want to thank you for the work that you're doing. Could you just tell us a little bit about where the hospital meets the community and some of the things it does to support the prevention or the intervention? Is it pre-shooting, post-shooting? Where do you fall?
We support throughout the process. We support in the beginning, throughout the entire process. We want to be able to support hospital violence intervention programs and community violence intervention programs to be able to support victims of violence, not just when they come out to the hospital, but working to even prevent them from even coming to the hospital in the first place.
And so when you say prevent them from coming to the hospital in the first place, do you mean from being shot? Or I had also heard about having teams of people going to the hospital after the shooting.
Yes. So once a victim is seen out at the hospital, putting those supports in place to case management and wraparound services in place to be able to support families once they're discharged from the hospital, but even while they're at the hospital, but even working with those programs to create initiatives, if you will, to even keep them from being victims in the first place, whether it's through education, whether it's through working with community-based organizations to provide conflict resolution and things of that nature.
Thank you, because I think that's part of the holistic approach of everybody having a part in this to address it at different levels and to prevent it. And that's that prevention piece. Once you've intervened with something that's happened, that you're coming after to prevent it, and parents can learn and offenders can learn and the community can learn on how to prevent it from happening again. So thank you for your testimony, and I appreciate the work that you're doing also. Thank you. Madam Chair.
Thank you.
Thank you. And Mr. Belcher, I don't see any other hands at this time. We also want to thank you for being here today.
Thank you.
Next up, we have Ingrid Justin.
Good morning, Senator Anwar, Representative Steinberg, and distinguished members of the Public Health Committee. My name is Ingrid Justin. I'm from Colorado, and I'm here today to speak in regards to raised bill SB 450. I come before you as the mother of Johanna Justin Hinich. She was just 21 years old in 2009 when she was shot down point blank as she served coffee at the Wesleyan College Cafe. The man who killed her is currently housed on the locked ward at Whiting Forensic Hospital. Long before singling out Johanna, he stalked other people. In spite of police intervention in New York City, he continued stalking Johanna for years before killing her. In his journal, he made threats against Wesleyan students, Jews in general, and Johanna's father. Besides being Johanna's mother, I'm also a family physician. I know firsthand that physicians try to discern what would be most helpful to their patient's recovery. We are, however, notoriously bad at predicting which patients might kill themselves or other people. Bill 450 is a necessary attempt to address the profound harm done to patients recently by abusive staff and inadequate facilities. However, the bill directly questions the need for a psychiatric review board. It would shift full control of patient release to the hospital. Release decisions will compete with need for hospital beds and staffing issues. The primary concern of caregivers should be the well-being of their patients. This new role and the power that comes with it will inevitably compromise the honesty and healing that occurs between patients and staff. In its focus on repairing genuine injury to patients, Bill 450 fails to recognize or even mention several groups who have also suffered grievous harm. Family members of both victim and perpetrator, as well as the community at large. There is neither mechanism for support of these people in this bill, nor a way to receive their input into decisions about impending transition off locked wards or release. Most importantly, family members would not even be informed of impending transition or release. As Johanna's mother, I would not be informed about the release of the man who killed her. Many of us are at great risk ourselves, having been previously specifically threatened. These are not theoretical threats or free speech. The man who killed Johanna has a proven track record of following through on his threats. An independent review board must be a separate entity from hospital systems and pressures. The PSRB, with 37 years of experience, ensures adequate plans for successful patient transition into the community, as well as representing the interests of the community at large and victims. It is a known and tested entity. SB 450 unnecessarily recreates a system that already works very well. As the mother of a victim and as a family physician, I urge that the PSRB remain intact. Thank you.
Thank you for your testimony, and let me just acknowledge your loss and the tragedy of that loss. And something that is very hard to hear, and I'm, can't imagine living it the way you have. So if you being here and telling your story today, I see Representative Pettit has his hand up.
Thank you, Madam Chair. Thank you, Dr. Justin, and also very sorry for your loss. I remember that very vividly. So you again, like others, have suggested that notification's a big issue, to be sure that victims are notified. I've asked other people in terms of the task force whether they felt that victims should be part of the process as well. Do you have any thoughts on that, or other places where victims and victims' family can be involved and feel like they have a say in some of this?
Right. Actually, I think the PSRB does a great job at making sure that all groups are represented. They also provide incredible support over the years. This has been going on for a long time. Every 2 years, I or family members write letters, make statements at board hearings. So I think that is a very necessary part, and sometimes can give insight into either the patient's condition, if it happens to be a family member, or other issues that might be going on. I did want to mention one other thing, if you don't mind, and that is the lack of community resources for patients transitioning out of care has come up several times. And clearly, funding of this would be an expansion of this would be a very helpful way to expedite release of patients and opening beds, so that it is not a PSRB issue that there are no or limited transition resources. That is actually a separate issue that needs to be addressed separately. Thank you.
You were muted, Representative Pettit.
And I was just say thank you, and yeah, the paucity of resources is an issue we're tackling in a number of other bills. I'm sure you're facing the same issues when you try to make referral to mental health resources where you practice. They're probably far and few between, and you're having a hard time getting people in. So, but thank you very much for taking the time and testifying today.
Thank you very much.
Thank you, Dr. Justin. I see no other hands, so we'll move to the next speaker now. Next up, we have Thomas Connor. Hey, Thomas, are you there? There you are.
Can you hear me?
Yes, we can. Go right ahead.
Good afternoon, ladies and gentlemen of the committee that is underneath the Senate. On behalf of a patient in Whiting Forensic Hospital, there definitely is lots of good things in here. You know, and in regards to the bill, I have read through it, I have looked it over. You know, the whole thing on a new building, absolutely, you know, great idea, great, you know, stuff, but, you know, a shape of it, the space, you know, but also in regards to a new building, hoping that COVID doesn't last much longer, but the whole factor of people at another building that's kind of our sister building, Dutchers, being brought down here to our library activity center / lower gym for quarantine issues, and then subjecting our staff, FTSs, nurses, and stuff like that, to have to work downstairs in the COVID unit, and then still have to come back and work on their regular units and stuff, and subject us patients to getting it, and then have the rest of the building go on quarantine, all the other units, because it's gotten exposed. You know, you know, and you know, speaking as a patient under, you know, some of the stuff that has been taking place in this building with safe wards, as I'm pretty sure you guys have heard about, that it seems that sometimes, you know, staff aren't completely heard by some of the administrators at times. You know, and there's a bunch of times that, you know, these guys are working 16 hours a day, overtime, 8 of them, and they gotta go home, take a shower, go back to bed, and get up in the morning to come back here and have family time, and they don't. You know, and you know, a whole other piece of, you know, the staff and stuff of that is when there was a shutdown of a certain unit. You know, we were down staff as it was, and they said they wanted to hire 42 staff members, and in all reality, they only hired 15 for what they could. And it was one of those things where we needed more forensic treatment specialist staff than we needed more nurses, and we ended up getting more nurses than we did FTSs. And we're still under lots of fire of having not enough staff to help run the building, let alone have to subject our staff to go downstairs for a quarantine unit.
Thank you. Is that all you had to say to us today?
That is it.
That was a lot. I wasn't trying to say is that all, but I wanted to make sure you were finished. You have your testimony was very much appreciated by us. We know that we need to hear from folks who are there and who are experiencing this, and your perspective is a big part of what we need to have in order to figure out the best way to move forward with these bills. So I don't see any hands, but I do want to thank you very much for your testimony here today.
And I thank you all for listening to me.
Thank you. Have a good day. And next up, we will hear from Maya Friedman.
Distinguished members of the Public Health Committee, my name is Maya Friedman. I'm a resident of Stamford for 20 years and a member of Connecticut Against Gun Violence. I am gratified that there are 3 bills raised this year to address the crisis of community gun violence in our state. I support House Bill 5397, an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention. This week, the Stamford Advocate reported that a series of shootings over a 5-day period in 8 Connecticut communities left 7 people dead and 2 others wounded. That's this week's news. In 2014, A shooting was prevented in my niece's high school, described in my written testimony. The preparedness of 2 individuals prevented a mass tragedy. In 2015, my cousin and her students at Delta State University were on lockdown for hours while police searched for a gunman who murdered 2 people and killed himself. On October 27, 2018, 11 people were killed by a gun-wielding, hate-filled fanatic at Tree of Life Synagogue in Pittsburgh, my hometown. I grew up in Congregation Dor Hadash, the target of the shooter, where my parents and I are still active members. Had my father not been late for services that day, he would have been among those murdered. The experience engendered a visceral sense of fear and trauma in my extended family that persists. If these 3 incidents over 4 years could happen in my family where no one owns a gun, no one is safe. What all of these incidents have in common is the use of a gun in an act of violence that is often fatal. We can no longer address these as isolated incidents of domestic disputes, accidents, suicides, mental illness, COVID-19 related stress, or revenge. We can no longer dismiss them as mere criminal behavior or pretend that they do not happen in Connecticut. We need to recognize this public health crisis for what it is and address the common element in all of these incidents, the bullet as pathogen. That is why we need an Office of Gun Violence Prevention. I hope you will support a generously and ongoingly funded, evidence-based Office of Gun Violence Prevention within the Department of Public Health using the language of House Bill 5397. The lives of your families and the families of your constituents depend on what you do. Thank you.
Thank you, Ms. Friedman. I don't see any other hands. I don't see any hands raised right now for questions, but I do want to say how much we appreciate you being here today and your testimony. Thank you very much. Next up, we have Brian Anderson.
Good afternoon, Chairman Kushner, Chairman Steinberg, and members of the Public Health Committee. I'm Brian Anderson. I'm a legislative director for the Council for AFSCME Red Cross Workers. Section 39 of House Bill 5500 abolishes language that mandates protections for the public at blood plasma donations or plasmapheresis centers. This section wipes out the public protection language and replaces it with the commissioner's discretion. This protection language was created to make sure the public protection of plasma sites is solid. Language protecting donors should remain. No doubt, we could wipe out whole sections of the Connecticut General Statutes for lots of departments and replace it with language stating that a commissioner's discretion would serve. But doing so will weaken the legislature as a branch of government and signifies that a statutory requirement is insignificant. Our union seeks to cooperate with Red Cross management despite some very rocky labor relations in the recent past. Red Cross management's desire to remove the MD requirement is not without some merit, as we currently have licensed staff performing apheresis procedures who can evaluate a donor's condition and make the necessary determination of the need for medical care. If there is a problem, the RN can assess the situation and discuss it with an MD on call and follow up with his or her recommendations. Yet eliminating the requirement for an MD in conjunction with removing the requirement for licensed RNs or LPNs would seriously jeopardize the health and safety of our apheresis donors. Red Cross workers have done an excellent job of making plasma and blood donations safe. Our members regularly assist donors who have adverse reactions. Reactions can be minor, such as fainting, or be major, such as arrhythmias, falls in arterial blood pressure, or arterial sticks. Even fainting has led to some serious injuries from falls. It is vital to have a registered or licensed practical nurse present. Our members feel that language mandating public health safety standards and statute is vital to protect the public. Thus, we urge you to reject Section 39 of the bill as it is currently written, and I'd be happy to answer any questions.
Thank you, Mr. Anderson. I see Representative D'Amico.
Thank you, Madam Chair, and thank you, Brian, for coming to testify today. So we've heard testimony earlier today before you came to give your testimony that these regulations were outdated, not necessary, were detrimental to economic development here in Connecticut, and so on and so forth. So I was heartened to hear some your testimony talking about some of the problems that could ensue as a result of these procedures. So I take it that you would argue that these plasma collection procedures are not as safe and maybe safe, are not as trouble-free as some people would care to characterize them. Would that be fair to say?
I think it would be fair to say that. I think that while it's a safe procedure, it's safe while there are adequate safeguards. I recently looked at a federal study that said that 2% of folks having apheresis have some sort of adverse reaction. Blessedly, most of those are minimal reactions, but we have had cases of major troublesome reactions. And the blood and plasma business, sadly, it's a big money business. For-profits like the New York Blood Center, and an executive spoke from them today at the hearing, make big profit from plasma. It's a competitive business. And I think where there's a competitive business that aligns so closely with the need for public health standards, it's got to be regulated. The blood business is well over a $2 billion a year business. And while it's life-saving, it's vital. It's got to ensure protections for those who step forward to donate.
So thank you. I appreciate that. And I guess one other question that comes to mind, I have not yet had a chance to delve into, the specifics here, but a couple of times, as I said, people who testified prior to yourself have mentioned that these regulations in Connecticut are outdated and it would make sense to go to the federal regulations. Would you have enough knowledge to be able to tell us just briefly what is the difference between the Connecticut regulations and the federal regulations? I understand it has to do with a doctor being present and RNs being present. Are there some other regulations that we should know about, that we should be considering here as we contemplate this bill?
I think what you should consider is the fact that often the state does a far better job of regulating than the federal government does. I don't buy into the federal regulations being more wise or more strong. I'm used to the states being the bellwether that the federal government follows rather than the reverse. I guess I toss out one to you in my mind. The federal minimum wage is still $7.25 an hour. If they're so up to date, why are they so behind? I think Connecticut does an excellent job, and the feds time and again have adopted things that Connecticut did first.
Fair enough. All right, thank you. I appreciate it, and thanks for your time. Thank you, Madam Chair.
Thank you. Next up, I see Representative Pettit has hand up.
Thank you, Madam Chair. Thank you, Mr. Anderson. When you speak to your members on the front line, do they feel that having an RN or APRN on site when they're performing apheresis or plasma donation is adequate, or are the frontline folks are the people who are saying that they feel like they need a physician in attendance?
They're saying they think an RN or an LPN is sufficient. A lot of these centers, I think they have to be within a certain mile range of a hospital. There can be a physician on call if they need a call in. Our folks feel those are sufficient protections. We do try to cooperate with our employer, and we do understand the pressure that the Red Cross, which is a nonprofit, has come under from New York Blood, which is a for-profit. And we do wish to cooperate with our employer. At times we are at odds, but we want to make sure that the regulations don't get greatly diminished.
All right, that's what I thought I heard you. So you would be, I'll put words in. You think your frontline workers would be happy if the language were to indicate that an RN or APRN had to be present? Currently, it occurs at Farmington, which is obviously fairly adjacent to Yukon Medical Center, so they're very, very close to emergency services. So as long as we didn't give carte blanche to DPH to rule any which way, if we made specific recommendations, you would be more comfortable with that?
Dr. Pettit, I absolutely think our folks would be cooperative with something that did that, that kept the LPN or RN requirement.
All right, I appreciate that. Thank you, Mr. Anderson. Thank you, Madam Chair.
Thank you. And thank you for your testimony here today, Mr. Anderson.
Thanks, Madam Chairman.
Next up, we have Marty Isaac.
I'm here.
Go right ahead.
Good afternoon, distinguished members of the Public Health Committee. My name is Martin Isaac, and I live in Trumbull, Connecticut. I am a board member with Connecticut Against Gun Violence, and I'm here today to speak in support of HB 5397 and SB 477 that include provisions to address the crisis of community gun violence in Connecticut. There is an urgent need to act, and I'm asking you to support the creation of a permanent gun violence intervention and prevention office. Over the years, this legislative body has passed strong gun laws to protect the populace, and it's worked. As ranked by the Giffords organization, Connecticut is ranked 3rd in their gun safety index and 45th for gun death rates per capita. That is not a surprise. Strong gun laws yield lower death rates. And while on a comparative basis, that sounds good, last year, gun homicides in our state were the highest in 25 years, nearly double the level in 2018, and this brutal carnage demands a response. The primary issue we need to address is the violence in our cities. It does not often make the news, but day after day, month after month, our city residents are terrorized by shootings and death. The sad fact is, it does not have to be this way. Years ago, we did not understand how to stop violence in our cities. Carnage was unanswered because seemingly there were no answers. That is not where we stand today. Connecticut needs to invest in intervention and prevention mechanisms, evidence-based programs with a proven record of success. These programs work because they are aimed at individuals at high risk of perpetrating or being victims of gun violence in high violence communities. Many of you in this room are familiar with one such program, Project Longevity. The good news is that there are additional programs that are even more effective. Hospital-based violence intervention and violence interrupters have proven track records of reducing gun violence. We have a moral calling to act, and I would like to thank my senator, Senator Moore, for being a leading voice for change. Financially, it is equally compelling to act. It is estimated that gun violence costs Connecticut taxpayers somewhere close between $60 and $90 million annually. Every dollar invested in saving lives saves money too. While I commend the governor for directing DPH to establish gun violence prevention and intervention program and for allocating $3.6 million from the American Rescue Plan to fund the program, it is simply not sufficient. I urge the legislature to establish an Office of Gun Violence Prevention and to permanently fund this initiative. I appreciate the opportunity to testify today. Thank you.
Thank you. I don't see any hands at this time, but Mr. Isaac, I do appreciate you being here today and your testimony.
Thank you very much.
Next up, we will go to Joseph Crispin. Is Joseph with us? Go ahead, Joseph.
Good. Can I be heard?
Yes, you can. We can hear you. Go right ahead.
I'm here to testify on Senate Bill 450. And to piggyback off that, Senate Bill 1059, the PROTECT Act, and being the reason as is, I have just finished serving a 4-year sentence in the Department of Corrections. So I want to say 75% of that incarceration was spent in solitary confinement, causing multiple mental decompensations, hospitalizations, and to a point where now I'm at Whiting Forensic Hospital for an adequate discharge planning that the Department of Corrections could not provide after having me in solitary confinement for so long with no adequate form of treatment. This also resulted in about 9 lawsuits against the Department of Corrections, which would save a lot of taxpayers' money in the process if reform would be actually put forth to try to avoid some of these issues. So henceforth, since my transfer over here to Whiting Forensic Hospital, it strongly bothers me that those same issues I'm encountering, that I have encountered in DLC, I'm encountering here within Whiting Forensic Division Hospital. And those stretch out to more state constitutional violations than I can count, and more federal US Constitution violations than I can count. And since my stay here, which has now been 3 months, I have requested for adequate discharge planning. I have tried working with my treatment team, asking them, look, what are we doing? I've been here 3 months. What services are available? What options do I have? And the same response I get back is, in the beginning it was, we don't know. I don't know how treatment providers don't know what to do to provide adequate discharge planning. Then further, as of just recently, I was then told we're waiting for psychological testing. So now here I am 3 months later, now it has changed and echoing that now you want to do psychological testing. And I'm here 3 months now after my incarceration. As a father, it bothers me. I haven't seen my son in 4 years. And he still asks us, when is daddy coming home? Those are not answers I could provide him, because at this point I feel like I'm on ice with nothing being done. And since my stay here, because of these multiple issues, this is not my first encounter with Whiting Forensic Division Hospital with these issues. I actually have a lawsuit against this place. And with that being the case, since I have arrived here, I've been blocked to exercise my First Amendment right to freedom of speech, to be able to access the government for redress in those lawsuits. They have blocked me from having the necessary copies to be able to file motions in response to those cases. I have brought it up to administration's attention. It was allegedly resolved through the Grievance Patients Committee. And in the process of it being resolved and me being allowed the adequate copies, it was backtracked in reverse by the CEO, Jose Greco, who then—
Excuse me, Mr. Kristen, but your time is almost up. If you please summarize. Thank you.
All right, well, what I'm trying to say is that there is a lot of violations within this facility that should be strongly readdressed. And I feel that, I mean, the bills are reasonable, I read it, but it needs to be more specific as to patients, because it only addresses PSRB, but not voluntary commits like me or other patients in Whiting under different standards. So therefore, those are the patients slip through the cracks of having adequate treatment or issues adequately addressed as I. That'll be all. If anybody has any questions.
Thank you, Mr. Kristen. I think it was really important to hear from you about what your experience is, and you raised a lot of concerns that I think will be noted by the committee, and we'll have an opportunity to think about and discuss further. I don't see any other members of the committee that have their hands up at this time, but I do want to thank you for taking the time to be here with us today and to share your story and your concerns. Thank you very much. Next up, I am going to turn the chair over to Chairman Steinberg. And Chairman Steinberg, we are on number 67, Bill Spear. Go ahead, Mr. Spear. We're here, and Representative Steinberg, our chairman, will take up chairing the committee meeting or the public hearing after you finish your remarks.
Okay, thank you, Senator Kushner. I was waiting to be recognized by Chairman Steinberg, but I'll go ahead now. Thank you, Chairman and members of the committee. The Plasma Protein Therapeutics Association would like to provide support with modifications for Sections 1 and 39 in House Bill 5500. PPTA represents the manufacturers of plasma-derived therapies and the collectors of source plasma, which is donated by plasmapheresis. Donated source plasma is the starting material for plasma-derived therapies that treat more than 125,000 Americans living with rare chronic conditions. These therapies are often the only treatments available for patients. The clinical need for plasma protein therapies has been steadily increasing for many years, with serious access issues reported as recently as the summer of 2019, despite a record number of donations in 2019. The pandemic has had a dramatic negative impact on plasma donation. In 2020, donations dropped nearly 20%, despite the opening of many new donation centers. PPTA is worried that recent drops in donations could lead to patients having difficulty accessing their plasma-derived therapies. PPTA would like Connecticut's help in preventing patient access issues. There are over 1,000 source plasma donation centers in the U.S., yet none are located in Connecticut. Connecticut has regulations from 1989 that require a physician to be on site during plasmapheresis. This standard has not been the norm for more than 30 years, and I don't know of any state that requires it. We appreciate DPH's statements earlier in this hearing that they do not object to ensuring that these regulations on plasmapheresis are modernized. This is not surprising since PPTA members have been encouraged by our discussions with DPH, and we believe we are close to a solution on this issue. We look forward to continuing to work with DPH. Our concern at this juncture, however, is that more immediate relief is necessary to begin allowing plasma donation centers to open in Connecticut as they are in surrounding states. Our preferred approach would be to modify House Bill 5500 to harmonize Connecticut laws with federal laws. The federal laws are followed in most of the states, and millions of donations are annually made safely under these standards. The safety of plasma donation is similar to the safety of blood donation. A bill harmonizing New York law with federal law was recently signed by Governor Hochul. Harmonization would encourage the opening of donation centers in Connecticut. The average donation center employs more than 50 people and provides more than $4 million to the local economy. Communities in surrounding states have benefited from the opening of new centers. 5 years ago, there were only 2 plasma donation centers in the Northeast. Now there are 24. I thank you for your time and consideration of our comments.
Thank you, Mr. Spear. You're not the first to make mention of Section 39 as being potentially problematic. Others have suggested we don't need it altogether. What's your point of view on how best to deal with Section 39?
I would amend it to harmonize with the federal laws as the language that we provided to you, sir. I believe it was a month ago through our lobbyist. The harmonization would maintain the concerns. I heard Mr. Anderson just minutes ago who said that we need to make sure that the process is safe with adequate safeguards. But then the safeguards he was mentioning are covered by the federal standards. So I was a little confused. The federal standards are found in 21 CFR 630.3G, which requires a phys sub to be on site or someone trained for emergent situations. That's also found in 630.5. We're happy to provide this information to the membership. In addition, it's my understanding that Dr. Becker will be testifying later, and he did a study. He was part of a team that did a study on donor adverse events. And those donor adverse events showed that the adverse events for plasma donation are very similar to blood donation. So, and that's basically one adverse event per 15,000 donations. So I was a little surprised by Mr. Anderson's statement that they're 2%. That's just not the case with what our members see. I don't know why that would be. Dr. Becker would be the best person to answer that kind of question.
We'll certainly address that to him. Is it your understanding that DPH can accept the changes to Section 39 to bring it into conformance with federal law?
My understanding is they have a little concern with the level of individual on site. I was not privy to the discussions, but our lobbyist was, and a few of the member companies. Mr. Anderson mentioned having an LPN on site. Well, that's the federal standard, or an EMT on site. My understanding is DPH may want a little more accredited individual, someone with greater training on site. We don't think it's necessary, and I don't want to speak for DPH, but that's my understanding. That's why I think we're close. The question is it RN, LPN, EMT? We think that the federal standards that are followed in pretty much every state show the safety of this. And we think Dr. Becker's study shows the safety of this. People talk about real world evidence. We have 50 million donations in 2019 where it was safe. And that's what they looked at. Now the donations are down to 43 million, which is what has us concerned with patient access. Getting to your question earlier, Chairman Steinberg, to Bill Zabel, which is, well, what's the need for Connecticut? We need you to be part of the solution. We need donations wherever we can find them, because frankly, patients are dependent on it. And you'll hear later from Jamie Sexton with IDF, and she can better explain that because she represents one of the patient groups.
Thank you. This is really very helpful. Representative Pettit has a comment or a question.
Yeah, not much more, but it sounds like, as I spoke with Mr. Anderson, if we have an RN, APRN, or EMT on site, that will fulfill the issues in terms of safety and appropriately trained people. So I guess we'll have to have further discussions with DPH. So thank you for your testimony.
All right, thank you, sir.
Thank you. Seeing no further questions, we'll move on to Diane Miller, number 68, followed by Alvin Wilson over at Whiting.
Good afternoon, Chairman and members of the committee. Thank you for the opportunity to provide testimony to the Joint Committee on Public Health in support of Representative Ferraro's complementary and alternative healthcare language to the bill HB 5500. My name is Diane Miller. I'm an attorney and director of law and public policy for National Health Freedom Action and National Health Freedom Coalition. The Action is a 501c4 nonprofit corporation working to protect maximum health options for consumers. We work to protect the right of people to access the healthcare practitioners that they want and the broad range of healing arts that resonate with his or her own decisions regarding health and wellness. We respond to calls year-round from individuals and groups throughout the country who wish to protect access to their practitioners. We have worked with groups in over 30 states regarding complementary and alternative healthcare laws. Connecticut citizens would like practitioners who are providing non-invasive methods of healing and healthcare services to be protected, similar to how other states have protected these practitioners. National Health Freedom Action supports the addition of Representative Ferraro's complementary and alternative healthcare proposal to be added to HB 5500 because it would protect access to thousands of traditional, non-invasive, complementary and alternative healthcare practitioners providing their services to health seekers in Connecticut. The language provides clear guidelines for the use of an exemption for those practitioners who avoid a specific list of prohibited conduct and who give out disclosure information listed in the bill, such as contact information, education, and training. If a complementary and alternative healthcare practitioner does not abide by the required parameters of the exemption, then current law will be in place, as always, to address the situation of unlicensed practices. Consumer protection is enhanced with this proposal. There are many types of healing vocations and small businesses with diverse backgrounds. It is important and helpful for consumers to know about their practitioner and what services they have to offer so they can choose what they would like to experience. The more information a person has, the better. There's a broad range and variety of these gentle healing practices used in Connecticut, such as aromatherapy, healing touch, reflexology, and Reiki, and most often practices by small businesses practitioners. Research shows that over 1/3 of the population is now using some form of these practices. The problem comes when the practices of these methods that are not conventional can technically be considered in violation of health occupation laws for practice without a license, even though they are not practicing a conventional healthcare profession because of the definitions in the Practice Act.
Excuse me, Ms. Miller, your time is almost up. If you please summarize.
Right.
Thank you.
I think Representative Ferraro earlier mentioned how this bill works. And we believe that his proposal goes a long way in protecting consumer access to these broad domain of healing modalities. Thank you so very much.
Thank you for your testimony. We appreciate it. Been very consistent across all those supporting this bill. I don't see any questions, so have a lovely evening. Probably a better one than we're going to have, but
yeah, good luck.
Thank you. I appreciate that.
You're a wonderful committee. Thank you.
We'd like to think so. Next up is Alvin Wilson at Whiting, followed by Kristen Minahan Anderson.
That's you, sir.
Hello, how you doing? My name is Alvin Wilson. I'm here to support that 450 bill that y'all trying to get to pass for this place. So, a new facility and
Hi, baby.
Sorry for the interruption, Mr. Wilson. That was temporary. Please continue.
So I was here to check on the hat that, I think that's a great bill that y'all got going for to build a new facility and, make things better for the patient that y'all have here, because it's more than a prison than a hospital. It should be treated as a hospital, not a prison. And maybe the new place y'all will have a procedure where you can get better wages to people that work here so they can be more motivated to do their job, to help the patient. Having problems at your house and trying to come to work is hard. You start with giving them a better pay. They work from there to give them the need and support the needs to take care of the patient here, because they don't have nothing to take care of the patient but themselves. It's tools they need. They can't do anything for the patient. You know what I'm saying? They're not being given that. So everything is mixed up here. It's like running around in a zoo somewhere, nothing in order. You put it all in order and get it right. By first starting off, raising a little pay so you help the family do everything. Then we start from here, buy the equipment they need to provide the patient that comes here. They got things listed they don't even have. A booklet, you come here, they got not a handbook or nothing because they can't afford to buy the paper. That's sad. Y'all not providing with the things they need to take care of the patient. So they treat them more like a prison because everybody getting upset. What more can they do? So we'll hopefully the bill will pass and y'all can give them the thing they need to move forward and make this a better place.
Well, thank you, Mr. Wilson. You made some excellent points, and we really appreciate your taking the time to give us your perspective, with your personal experience. It's really important to us to hear from you. So thank you so much.
Thank you too for calling.
Yeah, I don't see any questions, so have a great day. We appreciate it. Thank you again. Next up is Kristen Minahan Anderson, followed by Lisa Geller. Is Kristen here? There you are. Yes, please, go ahead.
Good evening, distinguished members of the Public Health Committee. The testimony that's been provided today has been incredibly impactful. My name is Kristen Minahan Anderson. I'm a dental hygienist in the state of Connecticut for 30 years, an educator for 17, and the current president of the Connecticut Dental Hygienists Association. I'm speaking in favor of amending House Bill 5500 to include the administration and monitoring of nitrous oxide analgesia by the dental hygienist. Dental fear and anxiety have been an extensively researched problem, and it has only gotten worse since COVID-19. Research shows that between 50 to 80% of adults in the United States have some form of dental anxiety. More than 20% of those patients avoid seeking care, and up to 15% avoid treatment altogether. Untreated dental disease has been found to negatively impact overall health, putting vulnerable populations even further at risk. Prior to my time at the University of New Haven, I was a public health coordinator at the University of Bridgeport Dental Hygiene Program. I took students out into the community where we worked with these diverse populations, and we truly saw the need to initiate preventive care earlier on. But many of these individuals were just riddled with fear. Many research studies speak to the effectiveness of nitrous oxide analgesia, including the American Dental Association that stated the use of nitrous oxide analgesia is safe and effective, and it's a means of managing patient fear and anxiety related to dental care. It allows for the patient to be calmed and to be rid of apprehension, and it does not promote the loss of consciousness. Dental hygienists have been administering nitrous oxide analgesia since 1971 in the United States. There have been no reports of adverse effects or any initiations of malpractice suits. Currently, dental hygienists are approved to utilize nitrous oxide in 35 states. It's truly time Connecticut catches up with the rest of the country and allows dental hygienists to provide this service. Providing this service could dramatically improve those with fear seeking preventive treatment, and it would improve their overall health and not just their oral health. Please consider amending House Bill 5500 to include the administration and monitoring of nitrous oxide by dental hygienists. I thank you for your time and consideration.
Thank you for your testimony. It's something we will take a look at. I don't see any questions, so have a good evening. Next up is Lisa Geller, followed by Christopher D'Angelo at Whiting.
Senator Abrams, Representative Steinberg, Ranking Members Wong, Somers, and Pettit, and distinguished members of the Public Health Committee, thank you for your time today, and thank you to everyone who testified before me on this very long day of testimony. My name is Lisa Geller, and I'm the State Affairs Manager at the Educational Fund to Stop Gun Violence, a national gun violence prevention organization that takes a public health and equity approach to all of our work. I'm also a graduate of the Johns Hopkins Bloomberg School of Public Health, where I graduated with a Master's of Public Health degree in health policy. I'm here today to support HB 5397, which would declare gun violence a public health crisis and establish an Office of Gun Violence Prevention and Advocacy Council on Gun Violence Prevention and Intervention within the state of Connecticut. This bill would allow Connecticut to treat gun violence like the complex public health crisis that it is, and it would help position the state to receive millions of dollars in future federal violence prevention grants. Gun violence inflicts an enormous burden on the state of Connecticut. In 2020, which is the most recent year of CDC data available, there were 219 gun deaths in the state, which was nearly 30 more deaths than the year before. In 2020, 50% of gun deaths in Connecticut were suicides, 46% were homicides. Much like the rest of the country, Black Connecticuters are disproportionately impacted by the public health crisis of gun violence. In 2020, Black Connecticuters were 4.5 times more likely to die from gun violence than white Connecticuters. In fact, guns kill more Black men in Connecticut than car crashes, falls, and suffocation. Gun suicides have remained at a persistently high level for the past decade, and nearly 90% of firearm suicide decedents in the state are white men. In short, the entire state is impacted by gun violence, and we need a coordinated and comprehensive approach to tackle this epidemic. HB 5397 would do just that by acknowledging gun violence to be a public health crisis and by establishing both an Office of Gun Violence Prevention and an advisory council to educate the public to address the problem. The office will collect and disseminate data on gun violence in the state, make recommendations for how best to ameliorate the crisis, educate the public about policies and programs to reduce gun violence, and coordinate funding for gun violence prevention programs, all with a focus on community violence, intervention, and prevention. The advisory council will be critical in making recommendations to the office on how to use a public health approach to reduce gun violence. For example, the council could recommend that the office encourage responsible gun ownership by promoting safe and secure gun storage, and could recommend educating the public about existing gun laws in Connecticut, like the state's extreme risk protection order. Connecticut's evidence-based gun violence prevention laws only work if they're equitably and efficiently implemented. Connecticut leads the country on so many policies and programs to prevent gun violence, and it's imperative that you continue to lead by supporting HB 5397. I appreciate the opportunity to testify before you today and hope you will vote to pass 5397. Thank you, and I'm happy to answer any questions.
Well, thank you for your testimony. It was very direct, very focused. We appreciate it. Made a strong case. I don't see any questions or comments, so thank you for taking the time to share with us today, and have a lovely evening. We're next up back to Whiting with Christopher D'Angelo, followed by Linda DeGudis, if I have that correctly.
This is Director of Nursing Nigel Rodney at the Dutcher facility for Christopher D'Angelo. He's refusing to testify this time.
All right, thank you for that. We will keep moving then, Ms. DeGudis, and we'll figure it out from there.
Okay. Good afternoon,
Representative Steinberg, and members of the Public Health Committee, and thank you for the opportunity to speak in favor of Race Bill 5397, which provides a major step forward in addressing the public health problem of gun violence in Connecticut. The bill includes several important provisions that can be used to decrease the toll of gun violence on individuals, families, and communities using a public health approach. By way of background, I've worked in various aspects of gun violence treatment and prevention for my entire career, and was director of the National Center for Injury Prevention and Control at the CDC at the time of the Sandy Hook killings. I'm currently on the faculty of the Yale School of Public Health and also do work on prevention of gun suicide in veterans. Based on my experience, I'd like to comment on the strengths of this bill and how important it is for it to become law in Connecticut as a key component of the effort to prevent gun violence. Taking this public health approach is critical to change the focus from putting a Band-Aid on the problem and sewing up the wounds of people who survive while ignoring the true impact of gun violence. It's about going upstream and figuring out how to stop the violence from occurring in the first place. And it is also about work that involves a range of perspectives, including people who work to decrease the risk factors for gun violence, as the public health approach is broad rather than narrow. Beginning with stating that gun violence is a public health crisis is important in that it doesn't take this issue and put the responsibility solely in the hands of law enforcement and criminal justice systems. Establishing an Office of Gun Violence Prevention with specific objectives and expectations sets up a process that can ensure that a true public health approach is taken. The requirements for data collection and dissemination, for evidence-informed community interventions, and coordination of funding provide a strong basis for implementing effective strategies. Accurate and timely data will be crucial to the evaluation of the impact of program initiatives and to a useful research repository. Connecticut already participates in the National Violent Death Reporting System, which is run by CDC and includes data on deaths due to gun violence. Its experience with this data system, which includes law enforcement and medical examiner data, may aid in the design of the data systems that have been mentioned. And the funding for community-based initiatives is crucial, as is inclusion of community representatives in order to ensure that evidence-informed strategies are adapted and implemented in ways that are relevant to and accessible to the community. These programs optimally will focus on upstream, primary, and secondary prevention strategies rather than having a major focus on what to do after the violence has already occurred. Because if that's what we focus on, the violence will continue and there will be more people impacted by it who will need an ever-growing number of resources. While the resources are important to people who have been impacted by gun violence, only focusing on tertiary prevention, we don't have evidence that some of these interventions have a major impact on preventing future gun violence. With respect to secondary intervention, which would take place after the identification of risk factors, there is evidence for the effectiveness of risk factor identification and intervention. For
Excuse
example,
me, Mr. Kudish, your time is almost up. If you please summarize. Thank you.
I will. I would say in summary, the initiatives have to include the concept that as research and evaluation inform practice and programs need to inform research and evaluation. I would like to reiterate that Ray's bill is an important and essential step in preventing gun violence in Connecticut, and a priority needs to be placed on primary and secondary prevention in taking a public health approach. Thank you.
Thank you for your testimony today. I don't see any questions. We will move on then to the next person on the list, which is Jessica Van Heinterich, if I have that correct.
Hello, Van Hentenrich, but thank you. Good evening, Representative Steinberg, esteemed members of the Public Health Committee. My name is Jessica Van Hentenrich. I serve as co-founder and doula for Full Circle Doulas LLC. As doulas, our mission is to provide well-qualified professional support to families at great times of change in their lives. We wish to provide this support through sharing evidence-based knowledge and comprehensive care. We're a team of birth, postpartum, end-of-life, and death doulas. We stand in support of House Bill 5500 and act concerning the Department of Public Health's recommendations regarding various revisions to the Public Health Statutes, Section 40. We support the intent of establishing the Doula Advisory Committee and ask all doulas be taken into account, including end-of-life and death doulas. The verbiage in the bill refers to doulas only as they relate to pregnancy. This policy is crucial to all doulas in Connecticut. A death doula is a trained non-medical professional who provides physical, emotional, and informational support virtually or in person to the dying person and or their caregivers before, during, and after death. On average, hospice healthcare workers see patients and their caregivers only 40 minutes per day. Racial and income level health disparities affect dying people and their caregivers as well, from access to medical services and respite care to bereavement support and funeral services after the death of their loved one. There are heartbreaking circumstances families face when these two realms meet in the case of terminal pregnancy, stillbirth, and maternal death. The United States has the highest rate of pregnancy or childbirth-related deaths in the developed world. The United States is also one of only 13 countries in the world where the rate of maternal mortality is now worse than it was 25 years ago. It is extremely important that birth doulas are cross-trained at the very least in bereavement support. As related to birth and death, a doula works as a member of a client's multidisciplinary team. The intention of the doula relationship is to tap into and develop a family's abilities to make decisions for well-beings of themselves and their family. We welcome any questions to ensure doula certification is inclusive to all doulas. If there should be a decision made to add an end-of-life doula to the Doula Advisory Committee, we would gratefully appreciate that opportunity to represent this important part of the doula field. Thank you for the opportunity to submit this testimony regarding the doula profession. In closing, we urge you to support and amend HB 5500, an act concerning the Department of Public Health's recommendations regarding various revisions to the Public Health Statutes, Section 40. The consideration for expanding on the verbiage and inclusivity of this committee and legislation is deeply appreciated.
Thank you for your testimony. We really do appreciate your focus on the role that doulas play. I don't see any questions or comments, so I want to thank you for your testimony. We will next move to Jamie Sexton. Welcome.
Thank you, Chair Steinberg and esteemed members of the Public Health Committee for allowing me to address you today in support of House Bill 5500 with modifications to update governance of plasma collection facilities in the state, leading to the collection of source plasma in Connecticut. My name is Jamie Sexton. I am the Director of State Policy for the Immune Deficiency Foundation, where I have the privilege of representing the estimated 2,700 Connecticut residents who are diagnosed with a primary immunodeficiency, or PI for short. Individuals with PI have one of over 400 rare disorders in which a person's immune system fails to function properly because of genetic or intrinsic defect. The COVID-19 pandemic has given those of us with fully functioning immune systems a glimpse into what it's like to live as someone with a PI, living in constant worry of exposure to unseeable pathogens. But that fear, which is slowly diminishing for many of us as things begin getting back to normal, is a way of life for those living with PI. Fortunately, many individuals in this community can live healthy, productive lives if they receive lifelong immunoglobulin replacement therapy, or IG, that replaces the antibodies the body is unable to produce sufficiently. However, because IG derives from human plasma, it cannot be produced without a continuous supply of source plasma from donors. In fact, it takes approximately 130 human plasma donations to produce enough immunoglobulin to treat an adult with PI for 1 year. As a result, the PI community relies upon an adequate number of plasma donors and donation centers across the country. Unfortunately, the same pandemic that has given a greater understanding of life with a PI has also threatened the availability of the very treatment on which members of this community rely. Following a 20% decrease in source plasma donations from 2019 to 2020 alone, it's more important now than ever that states address outdated restrictions on the collection of source plasma, which do not align with federal standards and inhibit the collection of this vital base ingredient of so many life-saving treatments. That is why this legislation, which will update governance of plasma collection facilities in the state, leading to the collection of source plasma in Connecticut, is so important to my organization and the patients we represent. This is a necessary modernization since Connecticut currently has no source plasma donation centers and thus no local donors supporting state residents who rely on plasma-based therapies. This has created a reliance on plasma collection elsewhere and contributes to the global plasma supply strain. The modernizations brought on by HB 5500 with the appropriate modifications will enhance the supply of life-sustaining therapies for patients facing serious medical conditions, including those with primary immunodeficiencies. Thank you for your time, and I'm happy to answer any questions you may have.
Jamie, thank you so much for your testimony. Others have alluded to your expertise in this area, so we appreciate your insights. But I think you covered it pretty well. I don't see any questions or comments. It's starting to shape up. So thank you so much for your testimony. We will move on next to Bridget Prince. I'm sorry, Representative Miko. Late breaking news.
Yes. No, thank you, Mr. Chair. Sorry, I was a little slow on the draw there. So Ms. Sexton, thank you very much for coming to testify. So I appreciate everything you had to say. I'm just curious to know, based on past experience, can we expect that if Connecticut does waive these regulations and bring Connecticut's regulations into conformance with the federal regs, that we will see an uptick in the number of people who come forward based on the availability of these facilities? Has that been borne out in other states that you're aware of?
Are you referencing more people that would come forward to donate?
Correct.
Unfortunately, being on the patient side, I'm unable to answer that question. I'm a staff person of one of the companies that owns the plasma donation centers or runs them. I represent the patients that rely on the therapies that are created from that donated plasma. So that I should be able to provide, but it's certainly something that we can try to track down for you.
Okay, very good. Thank you. I misunderstood your connection there, but I appreciate the good information. But yeah, that would be something that I'd be interested to know if there was a correlation there. But thank you, appreciate it. Thank you, Mr. Chair.
Absolutely. Thank you for the question. It's certainly something we'll track down for you.
Great, thank you.
We look forward to getting that additional information. I think all the members of the committee would appreciate it. Thank you for that, Representative Miko. Moving along, thank you again, Ms. Sexton. We have Bridget Prince, followed by Nilda Zuleta at Whiting.
All right, thank you. Thank you, panelists. Wait a minute, I have a reading here. Let's see, let me get up to the top. Good afternoon, Senator Abrams, Representative Steinberg, ranking members Wong, Summers, and Dr. Pettit, the Honorable Marilyn Moore. This is definitely a pleasure, as well as distinguished members of the Public Health Committee. Thank you for this valued opportunity to share my testimony. My name is Bridget Prince, and I am a lifelong resident of Connecticut, except for the years that I honorably served in the United States Army. I am testifying in favor of HB 5397, an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention. I'm also supporting SB 477. Let's see, 40 years ago, and I am speaking on behalf of Veterans for Black Lives Matter. 40 years ago, I entered the Army, having served with Vietnam veterans and working with troops of every military conflict since then. As a veterans advocate for the past 35 years, I can assure you that PTSD and suicide tendencies are at an all-time high. I get this information from employees at the Veterans Hospital and journalists in the media. Needless to say, the current war is an aggravating factor as well as a trigger to many veterans and service members. In fact, today, the Pentagon announced that the reinforcement of mental health and suicide prevention measures are taking place. Suicide among active duty members has jumped 16%, but that's not the full story. Unfortunately, as a disabled veteran in the urban community, I have also experienced the tragedies of urban gun violence. Therefore, I would like to speak on behalf of some of the victims of urban gun violence. First and foremost, I do represent Veterans for Black Lives Matter. Unfortunately, I come here today with a very sobering statistics. Veterans suffering from mental illnesses, to include post-traumatic stress disorder, depression, anxiety, psychosis, schizophrenic, and substance abuse, just to name a few, are the leading victims of gun violence. Sadly, our brave men and women who we send around the globe and who are fighting foreign conflicts, because the United States of America are the mighty defendants of victims of crimes against humanity. And I'm proud to say that. However, when these same warriors come back to our communities, a lot of them have chosen to use that same gun or a gun similar to take their lives. In the 2021 National VA Suicide Report, 70% of male veterans and nearly 50% of female veterans choose a gun as their method of death. So gun violence is definitely a public health crisis. Gun violence is the result of the diminished mental capacity of the individual holding the gun.
Excuse me, Ms. Prince, your time is almost up. If you please summarize. Thank you.
Absolutely. This is what makes gun violence a public health crisis. Unfortunately, the number of veterans standing in the street, holding the sign and begging for help far outnumbers the programs, affordable apartments, transitional housing, VA wraparound services, mental health services offered in the state of Connecticut. Thank you.
Wow, Ms. Prince, really covered a lot of ground in a short period of time. We really do appreciate your advocacy, as you've done for years, and your insights into how we can make this happen. Really appreciate it. I see Representative Kennedy has a question for you.
Thank you.
Thank you, Mr. Chairman. Actually, more of a comment. I just want to thank you, Ms. Prince, for your service to our country, and for, as Chairman Steinberg said, enlightening us to a lot of, you gave us a lot of information regarding our veterans and what they're going through. So I really do appreciate that. And I hope you'll continue your advocacy work. Thank you so much. Thank you.
Thank you so much. Thank you for your time. I do appreciate it.
Wait, there's more. Representative Berger Givallo, followed by Senator Moore.
Thank you so much, Ms. Prince. I actually would say the same as Rep. Kennedy. My mother was an Army nurse in Vietnam, and it took her many, many, many years of my asking as a child to share the experience and what she had learned from the veterans. And for you to be able to articulate that, first of all, articulate so much in such a short period of time, but to do it with such heartfelt advocacy. I kind of wish my mother had been listening just now, because I know she would love to hear that and see how you were able to communicate that to us. So thank you very, very much for sharing.
Appreciate that. Thank you.
Ms. Prince.
Senator Moore.
Thank you, Mr. Chair. Ms. Prince, thank you for your testimony. And I thank you for your service and the work that you do. As you were speaking, I had a moment of drifting back. I am a child of the 60s. My friends did go to Vietnam. I have a son who fought in a war. And I thought about all those people that I knew, that their personalities completely changed and they became different people when they returned. You know, this bill will not address specifically veterans. And it really is not about the handling of guns, but more of trying to coordinate it. I wanted to know, have you gone before the Committee on Veterans to give testimony on any of this or ask for legislation?
No, I haven't, but I would like to.
So in the next session, you should think about that and talk to some other veterans to see what's missing that they would like to see from the state of Connecticut, and bring that to the Committee on Veterans to discuss. I think it's really important. And you're really the first person who I've ever met through this hearing to talk about that in a committee. So I think that would be great if you followed up next year in January, sought out the Commission on Veterans, or even the committee that serves veterans, to offer some solutions. And thank you so much.
Well, I definitely want to thank Connecticut Against Gun Violence, because they have really been on top of that situation also. They brought me into that and wanted me to work with them as a veteran because they know those statistics. So they've really been involved with it also. So I want to thank you and thank them. Thank you.
Thank you, Senator. Thank you for your testimony.
Thank you, Mr. Chair.
And for all
Thank you, Mr. Chair.
Appreciate it.
Next up, we have Nilda Zuleta at Whiting, followed by Jim Welch.
Hello, public health. Can you guys hear me today? Hello.
Yes, we can hear you. Please proceed.
A stepping stone, sort of like a bridge, a connection to the outside world, a way of communicating with the hospital to meet ends. Bill 450 allows us to have a voice, a chance, a program designed to help, being on an extended stay or discharge, an application to a better way, a vision and a prayer within Section 17A-565 for 2022, leading towards your success, challenges, concerns, questions, address, expedite this new development can enlighten your road to many directions. Mainstream using patience as the first to experience the message, a gateway to freedom, back to the community by filming the truth. In your case, the facts, the evaluations, and the time. And that's all I have for today. That was all.
Well, thank you. Very succinct, pointed testimony. Very, very helpful to us. Can't thank you enough for taking the time today. And we will take your words with great consideration.
Thank you.
Next up is Jim Welch. And also next up is Senator Anwar taking over again as chairing this committee.
All right. Good evening, members of the committee and distinguished members of the Public Health Committee. I have a real appreciation for the length of this hearing today. I started my career as a legislative intern with House Majority Leadership in 1979. So it's a pleasure to be back. I'm here, I'm a lead investigator and attorney with Disability Rights Connecticut. And we've been involved in investigating and advocating for people with disabilities at Whiting and at Connecticut Valley Hospital. We quickly saw the legislature enact Public Act 1886 in response to some of the horrific abuse and neglect situation that occurred at Whiting in 2017, where they came out in 2017. Part of that legislation was the creation of a legislative task force, which did a lot of work, and including our agency provided testimony from our investigations at Whiting with many recommendations and findings. And to come full circle, the task force has issued its report. And here in a short session, this is the first response to the recommendations of the task force. And we appreciate the effort of the General Assembly and the Public Health Committee. Some important elements of the bill that could benefit people with disabilities that we represent: converting an advisory board to an oversight board with a special emphasis on investigation of abuse and neglect allegations, removing PSRB interference with some clinical decisions about patient movement, providing for the initial examination of any equity committed to DEMIS to be conducted by persons independent from DEMIS, planning for construction to replace the outdated Whiting facilities, and recognizing for the first time that concern for inequities, safety, and well-being is a primary concern for the courts and the PSRB. With respect to construction of Whiting, and you do have my written testimony, but you have heard an emphasis on creating community-based options for people who are ready to have support in a less restrictive environment. There's often a backlog of getting appropriate service providers available to folks, or people have to return because the providers are no longer able to serve them. So that's it's not in this bill, but it's an important thing to keep in mind. Additionally, as to the last element, which is the step, ensuring that the interests and the rights of the person with disabilities are taken into account by the courts and the PSRB, we would acknowledge that the legislation does provide for a step in the right direction, but it does not necessarily comport with the integration mandate of the Americans with Disabilities Act. And we would be happy to discuss that and share language with the committee at some future, at a future time. The real issue for us is we want to make sure Connecticut complies with the ADA. It is the supreme law of the land. It does deal with the issue of whether if someone poses a direct threat, it deals with public safety, but it also recognizes that people should be supported and served in the most integrated setting appropriate to their needs.
Excuse me, Mr. Welsh, your time is almost up. If you would
All
please
right.
summarize. Thank you.
Just quickly, as a result of our investigations and advocacy, an important element that we've discovered is hope in recovery and in treatment. And a lot of the people I deal with every day seem to have lost hope. And I think this legislation implementing the task force, some of the task force recommendations will be helpful toward that end. Thank you.
Thank you so much for your testimony, Mr. Welsh. And I not only everybody who is there at Whiting is going to be hopeful about what we are looking at and the path we are hoping to be able to move towards. All the legislators are also hopeful that we will be able to get there. Thank you so much for your testimony. I do not see any questions or comments. With that, we'll move on to the next one on our list, which is number 77, with James Icobelis with the Connecticut Hospital Association. Welcome.
Well, thank you. Good evening, Senator Anwar and distinguished members of the Public Health Committee. My name is Jim Icobelis. I'm the Senior Vice President of Government and Regulatory Affairs at the Connecticut Hospital Association, and I'm pleased to be here this evening to testify in support of Senate Bill 476, an act concerning the Office of Healthcare Strategies recommendations concerning community benefit programs provided by hospitals. This is an issue that we're pleased to say that we are aligned with Executive Director Vicki Veltri, who testified earlier today. It's an issue that we worked on during last session, worked through with the Office of Health Strategy and other interested parties, came to an agreement, but came to an agreement a little late in the session, and it didn't make it through the time crunch at the end of the session. So we're here again this year in support of Senate Bill 476. And what this bill does, it aligns our state reporting requirements with the federal requirements, and then does more. And then provides what I'll call a Connecticut twist or Connecticut information on it, requiring hospitals to provide additional information concerning community benefits and community health activities in which we are really proud of the work that the hospitals are doing. So this bill takes the federal framework and requires hospitals to provide their community health needs assessments and their community health needs implementation plans to OHS. Then the additional information, which I talked about, is the Connecticut details, is demographic information concerning health status and health disparities and health equity, description of the meaningful participation across the spectrum, extraordinarily important. And then what are the barriers? What are the barriers hospitals are finding to achieve some of these goals? And then how can the state help? And then additionally, we also will then annually update progress on the implementation plan, updates on the implementation plan, and the financial resources expended to get there. And then it also adds requirements on the Office of Health Strategy to provide information related to how the state can help. What are the barriers the state can work on with hospitals to help patients and help those community benefit organizations and hospitals. As Executive Director Veltri noted, there are two changes that we are proposing. They're not changes to the agreement. They're sort of translation things that happened from the OHS proposal into the bill. One is the leaving out of a word. The second has to do with how we describe for-profits being part of this conversation. So they were translation from the proposal into the actual bill, and LCO did a yeoman's job in crossing all the T's and dotting the I's with two small sort of technical things there. And we are supportive of the bill, and we look forward to it passing this year, and I'm happy to answer any questions.
Thank you so much. I must say, when I was looking at how this bill has progressed, the Hospital Association has been very forthcoming and has been a partner, and I was very excited to see that, even though it's a responsibility on the part of the hospitals, but appreciate the fact that everybody played very well together to come to this point.
Thank you, Senator. We, working with Executive Director Veltri, she was encouraging us all to provide a more fulsome picture of what is going on. And that's what this bill actually does. So we look forward to that picture being painted, but then it ties it into a lot of the work that is going on in the state. OHS should use this community benefit information for their facilities plan, for the state health plan. So it does tie it all in together. And actually, we are very proud of the work that we've done with Office of Health Strategy and other stakeholders. So thank you.
And the other states have really benefited from similar policies, and then we're hoping we'll see the same in our state as well. So seeing no other comments or questions, we thank you for your testimony, and we'll move to the next person on our list, which is Tara Volpe. Tara Volpe, you are on.
Thank you so much. Senator Anwar, Representative Steinberg, and distinguished members of the Public Health Committee. My name is Tara Volpe. I'm the Director of Outreach for Connecticut Against Gun Violence. I am thrilled to see the interest in the legislature to support funding for community gun violence prevention organizations to decrease the violence in our Connecticut cities. HB 5397, SB 477, and SB 16 all have aspects designed to do just that. I am testifying in support of Section 7 of SB 477 and the language in HB 5397 because they both have critical elements. Both bills are designed to combat root causes of community gun violence. Because of my job, I spend a lot of time listening to community members talk about their experiences living in areas where the fear of gun violence is a daily reality. I have heard the deep concerns of mothers and fathers about the safety of their children. I have heard the anger that is rooted in generations of absolute heartbreak because the epidemic of gun violence has existed in our Connecticut communities for decades, and not enough has gotten done to resolve it, especially from the prevention side. I have heard the haunting wails of mothers who have lost their children, and I have heard the stories of children who, in the middle of the night, watch out their windows as first responders arrive to crime scenes to investigate until an ambulance can come and remove the deceased gunshot victim from the concrete and drive them away, leaving the bloodstains for that child to walk by on their way to school the next morning. When people tell me these stories and they say that they feel that their state and country has forgotten about them, I believe them. Because what I have come to understand is when you live in unaddressed daily gun violence, you cannot unsee, unexperience, or unfeel the inaction around you. 118 people were murdered by gun violence in the state of Connecticut last year, and that is a slow mass shooting. Gun deaths happen in and around our state at that rate every year. And I personally believe that if this level of gun violence were happening in communities like mine or Greenwich or Richfield or Darien, more would have been done about it long ago. It is time for the slow mass killing of Black and brown people to matter to all of us. That is why I support the proponents of the bill under the leadership of Senator Moore to work together to merge both the best aspects of both SB 477 and HB 5397. Those points would be declaring that gun violence is a public health crisis, data collection, establishing an entity with staff that centers community gun violence as a public health issue, as Connecticut did with COVID, allocating funding that is equal to the magnitude of the crisis, starting with $5 million in fiscal year 2023. And
excuse me, Ms. Volpe, your time is almost up. If you please summarize. Thank you.
Last sentence. And most importantly, creating an advisory council made up of various stakeholders, including those closest to the issue, to ensure fair accountability. Thank you so much for allowing me to speak today.
Thank you so much for your testimony, and thank you for helping us look at the various bills and then coming up with the, for lack of a better word, a dream bill with the parts of all of them in this way. And speaking of getting the dream bill, we'll have Senator Moore. She has a question or comment.
Thank you.
Thank you, Tara, for your testimony. It seems quite fair and well thought out and considered of the communities that have the greatest impact of the type of gun violence we're talking about and not mass shootings. Is there anything that you see that could be included that's not mentioned in either one of the other bills, not in 5397 or 477? Is there anything that you see that's lacking? I'd appreciate your comment.
Thank you. It's good to see you, Senator Moore. There really isn't anything that I mentioned. I did write notes because that's how I am. I do just think that it just needs to be said that the problem is so serious that there does need to be like professional staff doing this work, like tackling this issue. The issue deserves it. The people impacted deserve it. And the state should have done this long ago. I wonder, like, if we had done this work before, what would be now, right? And we can't go backwards. We really have to do this work now. And I believe that we can do it. You know, I believe that we can come up with a dream bill.
Thank you. And I appreciate the work that's been done for so many places and so many people. I say this over and over again. There are people doing this work every single day. And I believe that we did the best that we could creating that advisory to make sure all the voices were heard, both the House and the Senate, majority and minority leaders got to appoint people along with the Department of Public Health. We tried to make sure that everybody had an opportunity to put some, whatever they thought was important in the bill and to vet the information in the advisory report. And you know, I forgot to mention, I didn't hear anybody else mention this, that at the very end, we brought in a youth group to talk about what they saw and what they needed. So I think we did a really great job, and all of the members of the advisory did a great job in making their recommendations to the state. So thank you.
Yeah, and I heard you mention today that youth should be part of this going forward, and I think that's a good idea too.
Thank you. Thank you, Mr. Chair.
Thank you. I have Senator Julie Kushner who has a question or a comment. Go ahead, Senator Kushner.
I just have a comment. First of all, Senator Moore has been so invested in this work for so long, and I just really cherish our friendship because she keeps me on my toes and keeps me informed of the important issues. But I also want to just say that, you know, Ms. Volpe, Tara is a constituent of mine and someone who I see you here so often on Zooms and previously at the Capitol, and your dedication to this work is just, you know, really heartwarming to me. I've gotten to know you well through this process, and you know, you bring so much to the work. So I really appreciate seeing you here today and hearing your testimony. Thank you. Thank you, Mr. Chair.
Thank you, Senator.
Thank you. And I have Representative Berger-Givallo. She has a question or a comment.
Tara, thank you for all of the work that you do and for your advocacy. And one of the things that you said was, you mentioned your community, my community, and others that don't see the community gun violence. And maybe if we had, more would have been done up until this point. It is our job as legislators not just to come here and do this work, but to also go back into our communities and engage our constituents. So maybe it's not an answer you have for us right now. Of course, my dog is singing. She's been quiet the entire time. And now that my speaker, Jarvis, please. When we go back to our communities, how do we engage the people who are so active and understandably passionate about school gun violence? That's how they came to the conversation, right? That's how most of us really started it. How do we bring them to this conversation about community gun violence that may not cross over ever into their own communities? So maybe it's not an answer you have right now, but maybe it is something that you can provide for us, or that we can work together with you to get, because I think that you're absolutely right, and part of the way that we get this done is to bring our communities into the conversation.
Yeah, I think that's really important. And one thing that I've been using to help people in communities like mine understand what it must be like for folks who live in these communities, that there are people that are afraid to let their children go outside and play, right? And so we all went through COVID together, and there was a time that the vast majority of us were very afraid, right? Well, we have the luxury and the privilege of now moving beyond that, right? but there are folks that are still living in fear of something else, and it's gun violence. And I think that COVID did a lot of things, but it also provided a lens. And that lens was like a level of fear that we were all, potentially going to get hurt, or somebody we love was going to get hurt. And when I kind of bring those 2 points together with folks in my communities, they understand. It's the beginning of an understanding.
I really appreciate that. It's a way to make it relatable, and that's obviously a necessary first step. So thank you so much again for all that you do.
Thank you all. Take care.
Thank you, Mr. Chair.
Thank you. Thank you, Ms. Volpe. And thank you for sharing with the need for empathy. And with empathy, you start to believe and live with other people and everybody, and each and every person. It becomes not them, it becomes all us. And when it's all about us, then we actually make policies to take care of each and every one of us. Thank you for
all. Thank you all so much.
And thank you. The next one on our list is Molly Voigt. Ms. Voigt, welcome.
Thank you so much. Good evening, distinguished members of the Public Health Committee. My name is Molly Voigt. I'm the Senior State Legislative Manager at Giffords, the gun violence prevention organization founded by former Congresswoman Gabby Giffords. I'm here to testify today in support of the language in HB 5397, which is a critical step forward to continue to address the gun violence epidemic in Connecticut. I want to start by thanking this committee, the bill sponsors, and all of the fantastic advocates who have testified in support of these critical bills today. And I also want to thank the state for being such a leader in gun violence prevention and intervention policy, and for continuing to work to address this public health crisis. I know I'm not the first person to tell you today that our nation faces a serious public health epidemic related to gun violence, and that Connecticut is no exception. Across the nation over the past 2 years, we've seen a spike in homicides and shootings corresponding with the outbreak of the COVID-19 pandemic, including in Connecticut, where gun-related homicides have nearly doubled from 2018 levels, and where gun homicides in 2021 were at their highest level in 25 years. This is not a reflection of the lack of efficacy of the laws that Connecticut has passed, but instead is reflective of how serious this epidemic has become. There is a clear and urgent need to respond to gun violence with every available resource, and most importantly, supporting community and public-based solutions. That's why Giffords strongly supports HB 5397, which would center the issue of community violence as a public health issue and allocate funding to support a much needed Office of Gun Violence Prevention. This office would serve to collect data, make policy recommendations, and most importantly, from our perspective, would create and administer a grant program to fund Connecticut organizations that use community-based initiatives to reduce gun violence through prevention and intervention strategies that I know you've heard a lot about today. These grants would support public health-centered approaches like hospital-based violence intervention programs, street outreach, the list goes on. I know you've heard a lot about these already today. In my work at Giffords, we've supported states across the country in expanding their work to address community violence, and it's been very encouraging to see that states across the nation have taken this public health crisis seriously. And we know through that work that supporting community violence intervention and prevention solutions really works, based on evidence from other states that have implemented robust support for these programs and solutions. Given the urgency of community violence and the promising fiscal outlook in Connecticut with the projected budget surplus and funds available through the American Rescue Plan Act, now is the time for a coordinated statewide approach to truly meet the moment. That's why we urge you to support these critical bills and the creation of the Connecticut Office of Gun Violence Prevention. Giffords works with state administrators across the country who implement state-level community violence reduction programs, and we're available to assist in any way that is helpful, including sharing best practices and lessons learned from other states. Given the crisis of community violence and the unique fiscal opportunity in Connecticut, the time to act is now. Thank you so much for your time and consideration, and I'm happy to answer any questions.
Thank you so much for your testimony. Thank you. And seeing no comments or questions, we just wanted to thank you for coming up and speaking to us. The next person on our list is one of the patients, Ray Smith, who's going to be the next. Please go ahead, Mr. Smith.
Um, um, kind of nervous here. I'm listening to everybody and they're talking about gun violence and how bad it is, and that's true. My aunt got ran over by some young males this year, and it was all about gun violence. They ran her over and running from police officers with a gun, and there's nothing that can bring her back. And I'm glad that you guys are here to express your gun violence. I didn't get to go to a funeral or anything. I wish that there weren't any guns, and especially the city of Hartford. The city of Hartford is known for, for guns. I worry. I have 4 kids, and one lady was saying just before I said anything, she was saying, guns were bad, and how can we stop it? I'm in a facility. I'm in a facility is part of a jail facility, and there's nothing that I can do from stopping my son from going outside because I'm locked here, and every day I say to myself, what can I do to keep him from going outside? And I shouldn't have to feel that way. And that's all I have to say right now.
Thank you so much for your testimony. We truly appreciate it. Seeing no comments or questions, we again thank you for your testimony. We'll move to the next person on our list, which is Harold Olsesi. Took a leap of faith in my pronunciation.
Hello, committee members. I hope everyone can hear me tonight. It's Harold Olsesi. It's okay. I just wanted to speak about my experience in a Connecticut nursing home. What I have to say, although I have no way to prove what I witnessed, is the incontrovertible truth. I'm a paralyzed quadriplegic. I suffered and I survived a year at a nursing home at the age of 39. During my time there, I was tormented psychologically and physically, and I witnessed most horrific aspects of human morality. Just a few examples of what I saw. Inadequate meals to the point where diabetics and people like myself with colostomy bags could not eat. My family had to substitute my diet. A lot of us went to bed hungry every night. Constantly running out of medication, getting medication late, necessitating us having to take opioids in order to break through the pain. Far too aggressive physical therapy where I was injured twice. I was assigned a new physical therapist, and they put me on a sliding board covered with someone else's feces. Harassment by staff and crafty retaliation that they would not get caught, such as putting things out of my reach. I reported several people for harassment, and they were never reported or reprimanded. Nothing was done. Call bells were put out of reach deliberately. They were not answered, sometimes up to an hour, necessitating me to use my cell phone to call the facility front desk and ask where everyone was. There was an infestation of gnats and other insects brought in by the appalling living conditions of one resident who ended up controlling the wing. Highly aggressive treatment of elderly, including my roommate, where he would actually cry out in pain, and people were deliberately left in soiled diapers. I had to train nurses and CNAs how to empty and change my colostomy bag, as well as make the facility aware of difficulties that come with spinal cord injury. Yet they did not listen to me, which led to horrific Foley catheter changes, hospital trips, and on one occasion I had to override the APRN, who was in charge of 130 patients, by calling the emergency physician, telling him precisely what I needed as I was going through the throes of autonomic hyperreflexia. Harassment by nurses and other staff who demanded I take a shower, despite my inability to do so, as well as being castigated by what I was prescribed by a team of surgeons upon my return from one of my many hospital trips. Constantly being told that everything was being documented like I was a prisoner, and I had to sit up in my chair, or that I could not get up in my chair at all. I was not rotated every 2 hours, which led to immense nerve pain and skin breakdown. No monitoring of many fall risk patients, one of which was mentally handicapped. And I was
Excuse me, Mr. Alcessi, your time is almost up. If you please summarize. Thank you so much.
All right. I guess I could just summarize by saying that there's serious problems in Connecticut's nursing homes. We just saw another one close down. Getting out of there took every ounce of my strength and my family, and I would have never made it out of there without them. The company that's called Allied, which pays caregivers, is an absolute nightmare, and they didn't pay people during the COVID pandemic. Yet the state still renewed their contract, and I'm still having issues with them today. And I am just so fortunate that I had people there to help take care of me, because with the conditions there, I would have never survived. And I do hope that legislation can be passed that will help aid disabled people. And I've heard a lot today about the disabled and the ADA, but I have not heard a lot about people that are physically disabled and they have nowhere to go. There's nowhere for us to go. There's no places for us to live. And I was very fortunate to get one of the very few accessible apartments in this state. And we need to work on that as well. And I hope that my testimony is heard and is taken to heart. And I thank you for listening.
Yes. Thank you, Mr. Alsace. Thank you for your testimony. We have heard you loud and clear. I just mentioned that for individuals who are experiencing quadriplegia, we as a state can do better, far better than what we have. And that's a specific area where I've had to take care of a number of patients with quadriplegia, and there was essentially no place which was very focused and good at this in the entire state. Can I ask, are you willing to share which nursing home you had the bad experience in? I may have missed the name.
Yes, it was Glendale, Naugatuck. And the state inspected it twice and nothing changed. It got worse. And it's been sold. And many people left and came and left, and the administration has changed so many times. But I agree with you.
Thank you so much. And I have Representative Kavros DeGraw, who has a question or a comment.
Hi, Harold. I just have a comment. Thank you, Mr. Chair. I'm the one that you've been corresponding with on Twitter.
Thank you very much.
To say, I'm glad you made it today. And I just am grateful that you were here, and I'm so sorry for what you went through, and it was incredibly courageous for you to tell that story today. And just know that we are listening, we do hear you, and we hope to hear from you again and speak with some of our disability advocates so that this does not happen to anyone else. So thank you for being here today and for being so courageous.
Thank you, ma'am. And thank you for all your help as well. Thank you.
Thank you. Seeing no other questions or comments, we move on to the next person on the list, is Glory Norvit.
Yes, thank you, Chair Anwar and the distinguished members of the Public Health Committee. My name is Glory Norwit. I'm on the board of Connecticut Against Gun Violence. I'm also the chair of the board of Connecticut Against Gun Violence Education Fund. I'm also on the board of the Center for Empowerment and Education, a nonprofit which provides crisis intervention and support services with regard to domestic violence and sexual assault. It's very encouraging that the bills that have been put forward in this committee and others that include provisions to address the crisis of community gun violence in Connecticut, HB 5397, SB 477, and SB 16, all have elements worthy of your consideration. I am testifying in favor of Senator Marilyn Moore's bill, SB 477, for it to move forward and include language that is part of HB 5397. I believe the solution should include 5 key components: declaring that gun violence in Connecticut is a public health crisis to bring it the attention it needs, housing the solution in the Department of Public Health where it can have the greatest impact, establishing an ongoing advisory council with voices of those most impacted by community gun violence and other stakeholders to ensure accountability, including a robust data gathering and research capacity to drive evidence-informed grant making, and appropriating ongoing funding commensurate to the magnitude of the crisis, starting with $5 million in fiscal 2023 for operating expenses and grant making. Senator Moore has played a critical role in addressing the public health crisis of community gun violence, and I thank her for her advocacy. Gun violence is a public health crisis here in Connecticut and throughout the United States. Connecticut needs to invest in dedicated full-time staff to oversee efforts to prevent gun violence on a sustained basis. The staff would engage with community leaders, executive branch agencies, public health policy experts, gun violence prevention advocacy organizations, and others who have a stake in the health of our urban centers. States and larger cities around our country have established similar offices of violence prevention with dedicated staff. My father was shot in the face at point blank range by a person who stormed an education facility holding a bag full of guns. The shooter shot 3 people before he left the building, then carjacked someone's car and was chased by police before being caught. Gun violence has a tremendous economic and mental health cost. My family knows this. Someone is murdered every 3 days in Connecticut. Many other families know the cost of gun violence. Every day in the US, 316 people are shot. Every day in the US, 106 of those people die. Every 16 hours in the US, a woman is shot dead by her current or former partner. How many people need to be shot before we get serious about this crisis? And how many people need to die before we get serious about this crisis? I thank all the members of the Public Health Committee for listening to my testimony.
Thank you so much, Ms. Norwood, for your testimony, and thank you for being here with us. I'm so sorry what you experienced. And then thank you for channeling the energy in a positive way to make sure we protect everyone. I have Representative Berger Giballo who has a comment or a question. Thank you.
I know it's getting late, so I don't want to take too much time. I just want to say thank you first, Glory. Glory is a constituent of mine, and I have seen firsthand how hard she works in all of her advocacy across all of the boards on which she serves, and how she gets that powerful message back into her community. But more than any of that, I just want to thank you for sharing such a personal experience about your father and about your family. I am moved always when we hear something so personal, but especially when it's someone who you know. And I will be honest, it was something that I didn't know about you. So thank you very much for that. And we appreciate all that you do.
Thanks.
Thank you. And Senator Kushner.
I just also wanted to say hello to Glory, another friend. I know you from your work in the Women's Center, and I too was really glad to hear you're working on this really important issue. So it's great to see you here tonight, and thank you for your testimony.
Thanks.
Thank you. And seeing no other comments or questions, we want to thank you for coming to testify today. And we'll move to the next person on our list, which is Mr. Patrick Farley. Mr. Farley, you're on.
Okay, thank you, Senator Anwar and representatives of the committee. My name is Patrick Farley. I'm from West Hartford. I am active with Connecticut Against Gun Violence, just as a volunteer, citizen, activist, and indivisible CT. I'm testifying in favor of HB 5397, an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention. I've been personally touched by gun violence. A friend of mine's daughter was murdered with a handgun. Just read in the paper this morning, a woman was died being shot a few days ago while gardening. It's just, it is an epidemic, the gun violence. And I understand homicides are on the rise. So the question is, how can this not be a public health issue? This bill, there'd be many organizations that would benefit from this bill, preventing gun violence. HB 5397 will provide a director, grant administrator, staff, which will help the state, federal, get state and federal funds to these organizations that are doing this work. They already know what to do. They just need help with money. And that's what I have to say. And I thank you for listening to my testimony.
Thank you so much for your testimony. We appreciate your words. Seeing no other comments or questions, we will move on to the next person on our list, which is Ethan Rodriguez Torrent. Ethan, please go ahead. You're on.
Hi, can you hear me?
We hear you, but we cannot see you.
Oh, I'm sorry. I think okay, can you see me now?
Yes, we can.
Okay, thank you. And thanks for the committee for sitting through a very long hearing and actively listening and asking questions to everyone who has spoken, and we all definitely appreciate that from our representatives. My name is Ethan Rodriguez Torrent. I grew up in Southbury, Connecticut. I've been in New Haven for over a decade now. I'm here to speak in support of HB 5397, which would establish an Office of Gun Violence Prevention, and also SB 477, which would fund community gun violence prevention programs. As you are very well aware, the state has there are a lot of gun violence prevention programs in the state, some state funded, some private, some nonprofit. There are gun buybacks, there are gang call-ins, there are violence interrupters, there are limits on assault weapons, there are safe storage requirements. The list goes on, and in fact, it is a very good list, and it's one of the things that keeps Connecticut one of the safer states, relatively speaking, in the country. But I think we are very far from being able to say, great, mission accomplished, we're doing a great job. As you've heard already in this hearing, gun homicides more than doubled between 2018 and 2021 in the state. We haven't seen this level of gun deaths since the mid-1990s, with the exception of obviously 2012 and the tragedy at Sandy Hook. Similar trends have been seen in urban areas around the country, as have been seen in New Haven and Bridgeport these past few years, and Hartford. The problems is that the programs we have to the programs that we have rely on volunteers, they rely on donors to fund the nonprofits that administer them. There's shifting institutional priorities. Something that's funded one year might not be funded the next year. I think what we need, and what some of the representatives on this wonderful committee have alluded to, is we need a way to kind of holistically look at gun violence, the causes of gun violence, and which programs are best suited to preventing gun violence. Obviously, the key word here is prevention. There's no way you can bring back someone who has been a victim of gun violence. You can't bring back any of those children who, family members have spoken on behalf of so passionately today. We want to prevent gun violence, and the question is, which of these programs is useful, which is helpful? What we need is a permanent, standing, ongoing either commission, or I'm not really sure, honestly, of the technical difference that's been discussed here, but we definitely need an ongoing office or commission that actually has dedicated staff dedicated to addressing this. Given that the legislature, despite having a Democratic trifecta, is not really willing to seriously take a look at the easy access to firearms around our society, so given that there will be firearms available fairly easily throughout Connecticut, ongoing, we're going to need to look at a multifaceted approach to preventing the access to those firearms from turning into violence.
Excuse me, Mr. Rodriguez Torrent, your time is almost up. Thank you.
Certainly. My point is simply, with the budget that we're looking at, 300 million tax cuts have been proposed, and it's only $5 million a year that's been proposed on an ongoing basis to fund this office. I think it's the least we can do for our communities that are affected. Thank you.
Thank you so much for your testimony. Thank you for taking the time. I do not see any question or comment. We appreciate you coming over and speaking to us, even though it's virtual, but it's useful. Thank you.
Thank you.
And the next person on our list is one of the patients at Whiting, Keith Murdowski. Mr. Murdowski, you're on.
Can you hear me?
Very well. Welcome.
Why, thank you. Can you see me?
Very well.
Oh, great.
Thank you.
I volunteered to come here because of a false arrest. And I noticed throughout the years through false arrest, there's over 20 fault lines, and they put the heat on once during the whole entire winter time, not in the middle of a blizzard. And you know, it's like I've called the commissioner's office and I said, I can save you $5,000 to $10,000 a month on electricity. That I've invented 7 perpetual power inventions. One of them is get 3-phase electricity for $0 a month. And basically, I am a doctor with over 10,000 cures. There's 10,000 cures and one umbilical cord. To make it over 10,000, TYK2 drug is a type 1 diabetes cure. Forskolin is a health food that's a type 2 diabetes cure. Now, I can also help the blind to see and the quadriplegic to walk. Now, they inject robots with lights in the back of the eyes, and then the blind can see again. Now, they take a microchip, they put it in the brain, and a small plastic piece with 2 wires and in the spine, and a quadriplegic can walk again. The major technology channel that I subscribe to is Hashim Al-Galafi. You got to spell it right, otherwise you just get some person, not the over 5,000 videos of technology. Basically, I've had my say, and you know, they use #2 iron to shield the radiators. Now there's an inlet and an outlet on each side. Now the middle starts to heat up when scientifically the ends are supposed to, one end is supposed to heat up first. I hear that they get over $5,000 a head here for insurance, and they're too cheap to put the heat on. You're lucky you don't catch a lot of cold. Thank you very much.
Thank you so much for sharing your testimony. We truly appreciate you waiting and sharing your thoughts. Seeing no comments or questions, we will move to the next person on the list, which is Prabisha Bhandari. Ms. Bhandari, you're on.
Dear Senator Anwar, Senator Kushner, and esteemed members of the Public Health Committee, Save the Sound expresses its support for SB 476, an act concerning the Office of Health Strategies recommendations regarding various revisions to community benefit programs administered by hospitals with amendments. Clear reporting that ties community benefit programs to needs identified by communities is critical to ensuring communities know how these funds are spent and can hold hospitals accountable for improving health outcomes. This integration is crucial at a time when we are experiencing an increase in climate-related health issues, such as poor air quality resulting in higher asthma rates. These climate-related health issues are impacting all of Connecticut, and especially state-designated environmental justice communities. A 2020 Connecticut Health Foundation study found Black children and teens are 5.5 times more likely to go to the emergency room for asthma than their white peers, while Latinx children and teens were 4.5 times more likely than their white peers. There are many factors that could influence this study, and a clear indicator of these outcomes can be attributed to the state's reliance on predominantly fossil fuel buildings, aggravating the air quality of the state. Federal community benefit regulations have been strengthened by state law in 29 other states, including every northeastern state except for Connecticut. The Community Benefit Program was created to ensure that nonprofit hospitals, which are exempt from both state and federal corporate income and property taxes that would otherwise fund local resources, are properly contributing to their communities. This bill helps ensure that community benefit dollars address health disparities and that nonprofit hospital reinvestments stay local to support needed community resources. And we believe that it should go further through funding initiatives that reduce emissions from hospitals to ensure healthier communities. The healthcare sector, one of the nation's largest industries, is responsible for nearly 10% of all greenhouse gas emissions, hundreds of millions of tons worth of carbon each year. Hospitals make up more than 1/3 of those emissions, according to a paper by researchers at Northeastern University and Yale. Save the Sound strongly recommends these dollars fund improvements to the energy efficiency of hospital infrastructures and help the hospitals transition to renewable thermal heating and cooling. Energy efficiency creates more savings than any other single fuel source. By reducing the demand for energy, energy efficiency relieves pressure on the electrical grid, reduces our dependency on fossil fuels, and lowers families' bills. To sum up, reducing the carbon footprint of hospitals in our state will reduce air pollution on a macro scale, allowing residents to breathe healthier air. Thank you for the opportunity to testify in support of SB 476.
Thank you so much for your testimony, Ms. Bhandari. Appreciate you coming in and sharing your thoughts. They're well thought out. Appreciate that. Okay, seeing no other questions or comments, we move on to the next person on our list, which is Samantha Liu. Samantha, you're on.
Good evening, esteemed members of the Public Health Committee. I truly appreciate your time tonight. My name is Samantha Liu. I am testifying today in my role as the Policy Analyst and Advocacy Specialist for Health Equity Solutions, and also to offer my perspective as a member of the Doulas for Connecticut Coalition. My colleague Karen Siegel will testify later today on SB 476. So HES is a nonprofit organization with a statewide focus on promoting policies, programs, and practices that result in equitable healthcare access, delivery, and outcomes for all people in Connecticut. Doulas for Connecticut Coalition is a collaborative of doulas, community voices, grassroots advocates, and community organizations and allies. We center our work on experiences and voices of Black women and women of color in Connecticut to ensure access to training and utilization of culturally responsive doula care. Thank you so much for the opportunity to testify today in support of HB 5500, specifically Section 40, to establish a doula advisory committee. As you all surely know, Black and Indigenous and Latino families in Connecticut continue to face inequities in birth-related outcomes. We commend the work of the Department of Public Health, this proposal today, and are grateful for the department and all of your continued support of doulas in our state. HES believes it is critical to move forward with a certification program in Connecticut. The Doula Advisory Committee's recommendations and the active involvement of doulas mean that Connecticut already has a solid foundation on which to build an inclusive certification process. Last legislative session, Public Act 2135 codified the definition of a doula and required the Department of Public Health to convene a scope of practice review committee. That committee determined that Connecticut should establish a voluntary doula certification program based on criteria to ensure that doulas who wish to obtain certification can practice safely and meet the standards of competent doula care in Connecticut. HES is strongly committed to advancing doula-informed policies to ensure these policies truly address the needs and also avoid unintended consequences for doulas in Connecticut. For these reasons, we wholeheartedly support HB 5500, and HES strongly supports the inclusion of doulas in this doula advisory committee. And again, truly appreciate the opportunity to speak with you all this evening, and I'd be happy to take any questions.
Thank you so much, Ms. Liu, for your testimony, and thank you for supporting the doulas. We hear you loud and clear. I do not have anybody asking a question or a comment this time. I appreciate you coming in, and we'll move on to the next person on our list, which is Sheila Hennessy. Ms. Hennessy, you're on.
Good evening, Senator Anwar, Representative Steinberg, and distinguished members of the Public Health Committee. My name is Sheila Hennessy, and I am the chairperson of the Psychiatric Security Review Board. I would like to outline the methods of the board this evening. Once a Superior Court determines that a person is not guilty of a crime due to mental disease or defect, that court sets the length of commitment, or rather confinement, and commits the equity to the jurisdiction of the board. The board holds an initial commitment hearing, having received information concerning the equity in terms of background, family, education, psychiatric history, and criminal record. At the hearing, the board receives sworn testimony from members of the Quiddy's treatment team concerning his or her diagnosis and treatment plan. At that hearing and at all successive hearings, the Quiddy receives proper notice of the hearing and of his or her right to attend, is represented by counsel, has an opportunity to be heard, and the assistance of an interpreter if necessary. Notice is also given to the victim of the crime or their representatives who have indicated that they wish to be notified and may wish to make a statement at hearings. The board meets twice monthly, and at each meeting usually has 4 full hearings with testimony and questions, as well as hearings on matters which have been stipulated to by the state's attorney and the defense counsel. Thereafter, the Quiddy has a mandatory review hearing at least every 2 years, at which the board receives sworn testimony from the treatment team, which includes the treating psychiatrist and psychologist, a social worker, any individual therapist, and usually a consulting forensic psychiatrist. At every hearing, regardless of its nature, the team is questioned by the state's attorney, the Quiddy's attorney, and any of the members of the board, who each bring their individual strengths in their areas of psychiatry, psychology, probation oversight, victims advocacy, and public representation. Additionally, and usually during those 2-year spans, the board will hold hearings with the same testifiers on all applications for transfer to a less restrictive setting from maximum security, for temporary leaves, which may be in a stage 1, in which the Quiddy leaves the hospital on daily leaves for treatment in a community health setting, returning to the hospital each night, or a subsequent stage 2, in which the Quiddy proceeds to spend up to 7 nights in the community facility. If the leaves are successful, an application for conditional release will be filed, which, if granted, will result in a discharge from the hospital, and the Quiddy will be placed with a community health provider and have additional freedoms.
Excuse me, Ms. Hennessy, but your time is almost up. If you please summarize. Thank you.
Thank you, I shall. Such as more time in which in his or her own custody, the use of public transportation, and often will seek voluntary or paid employment. Each step requires a hearing before the board and sworn testimony from clinicians, both in and out of the hospital, who are involved in the Quiddy's ongoing mental health treatment. The aftermath of each hearing results in the issuance of a memorandum of decision prepared by the executive director, which outlines the precise detail for the Quiddy's and the treatment providers, all of the terms and conditions relating to the Quiddy status. Very briefly, the board determines the level of confinement based on these hearings, which are each thorough and detailed. There is no formula for the timing of these stages, which are based upon the Quiddy's progress and success in treatment. Some patients may remain in a maximum security setting, for instance, if their response to treatment is slower and there are incidents of violence or such a lack of cooperation with treatment that there is little or no advancement possible. I've attempted to outline the board's responsibilities and method of operation in carrying out its statutory mandate, and I thank you for the opportunity to address you this evening, and will be happy to answer any questions you may have.
Thank you so much, Ms. Hennessy, for your testimony. I see no questions or comments. We appreciate you coming in and sharing your experience and your work with the PRBCs. Thank you. And
thank you, Senator.
The next person on our list is Lance Stewart, who is at the Whiting facility. Mr. Stewart.
Hello, my name is Lance Scott Stewart. I'm the executor of the estate of Dr. Lance Lee Stewart, and I vow that what I say today is the truth respectfully voiced to the Senate and the House of Representatives and General Assembly on this sunny but cold day in Connecticut, 28th day of March, 2022. I hope you all got your invitations to the Dr. Lance Lee Stewart Memorial for a signed dedication. I'm here to amend the raised bill number 450 for the Connecticut grown cannabis application for the Department of Mental Health and Addiction Services, as well as a motion for impeachment, including but not limited to Attorney William Tong and Vanessa El Durante is the Commissioner of Department of Children and Families. So the raised bill 450 states that there shall be a membership, a panel that will be appointed by Governor Lamont, the governor standing, and I'm willing to serve as a person without a psychiatric disability of whom has received an inpatient service at and in a psychiatric hospital if Governor Lamont shall appoint me. So in raised bill 450, as chapter 17A highlights patients' rights, still to this day, the dark ages of psychiatry eclipse the potential for new facility to date, as arbitrary drug prescriptions are weaponized with administrative abuse, malpractice against one of the most vulnerable populations in society, the discredited. To be associated with a mental health facility defames the patient disadvantageously, as threat of prolonged incarceration here is often leveraged against the patients. The patient's best interest and basic well-being is bottlenecked into a compromise as a conditional release. Psychiatrists force medicate patients or threaten them with a probate court assigning them in a psychiatric healthcare conservator to follow through with said threats, resulting in allergic reactions such as dystonia, retardative dyskinesia, diabetes, thyroidism, and EPS, extrapyramidal side effects, leading to emergency interventions. The repeated complaints by patients suffering from these reactions are voiced to the psychiatrists to prevent this perversion of science, often mollified and unheard as their peers observe their decline fearfully. This administrative abuse is followed by derelict duty incessantly. This arbitrary issuance of drugs must be forbidden, and not only because it is a violation of patients' rights, but also because it fuels the opioid pandemic. The forced medication creates an unbalanced element of chemicals previously in balance in the patient's brain, and the treatment spikes to an end. The patient cannot access medication, thus leading to the illegal drug dependency, perpetuating this problem of drug abuse in the community. And psych doctors are recommending street access to psych drugs and recommending for them to get these drugs any way possible if their treatment ends. Prior to H456, one must ask, what are the root causes? You might ask, why would somebody become a patient in a facility like this? And why does a mere association with a facility like Whiting Forensics Hospital discredit a patient so disparagingly? Perhaps
excuse me so much, but your time is almost up. You're going to have to summarize. Thank you.
Summary, exactly. Perhaps judicial influence is the question is paramount to the 2021 Connecticut practice book. Pursuant to the 9th article, the state of Connecticut Constitution, impeachment is paramount. I would like to motion the use of medical marijuana here because the undercut is simple. To build a new Whiting Forensics Hospital on this fault line of malpractice claims is wrong. Please scrutinize the clemency and coercion of the interdepartmental influence of Whiting Forensics Hospital. Out with the old and with the new. The only way we can start fresh is a name that emulates excellence. I suggest that you can call
Thank you, Mr. Stewart. Thank you. Thank you. Your time's up, but we truly appreciate your testimony and many of your recommendations. I know some of your recommendations my colleagues would agree, but we appreciate listening to your testimony. Seeing no questions or comments, we will move to the next person. And as we to the next person, the chairing of this public hearing would move to Representative Jillian Gilchrist. But before she starts, we'll ask Mr. Ladislaus Sakarko to come and testify.
I'm here.
Okay, please go ahead.
Thank you, Senator. Thank you for this opportunity to testify before the Public Health Committee. I'm here to testify about SB 477 and House Bill 5397. My name is Laddie Saharko, and I'm from Chaplin, Connecticut. I am a gun owner, a taxpayer, veteran, and a voter. I have specific concerns with both bills, and I do hear implications for possible end rounds around the Second Amendment. Not one witness here has said legal gun owners don't call gun violence today, not one. The Department of Public Safety is charged with all issues pertaining to ownership and use of firearms and includes background checks that look into all criminal behavior, enforce existing law. The root cause of gun violence is not guns. We heard impassioned testimony today that violence is the result of depression and anxiety. It is a mental health challenge. At least 2 other agencies are charged with finding those solutions. DPH already collects data on already injuries. I have to ask rhetorically, is this committee considering commissions to deal with knife violence, bald fist violence, hammer violence, or how about this one, harsh words violence? Nope, only gun violence. I have concerns about the language of one of the bills that says, quote, allow the commission to accept any gift, donation, or bequest for the purpose of performing their duties, unquote. Today, Mark Zuckerberg funding of vote harvesting mules in multiple states' election commissions is spawning liability lawsuits against cities and states today. Private funding of government function is influence peddling at its most egregious. If Connecticut taxpayers and voters have not funded law and rulemaking and enforcement, those efforts violate the public trust. Will this commission accept money from the NRA and similar NGOs to establish universal gun safety training as part of a middle school curriculum to reduce gun violence? Boys and girls at a young age can be given positive experiences with guns, learn that guns can be used safely for their intended purposes, and that guns are deadly when improperly used or handled. There is no hiding that this legislation could be directed at making gun violence a boogeyman around which a mass formation is created. The general public already has significant errors and gaps in knowledge about guns based on lies spun by the likes of Michael Bloomberg, big NGO money. I mentioned mass formation and fear, and I point to the Department of Public Health and other state entities for abject failure to deal adequately with the pandemic. How many needless deaths, a generational childhood development problem, high school and college education interruption, closed and lost forever businesses, exodus of residents to friendlier states, not to mention the loss of public trust in you, the legislature, and in the state and its agencies. With 196 orders in total, each of which carried multiple specifications, you made us more fearful, and more than 10,000 people died
Time is
anyway.
almost up. If you would please
And now
summarize.
this committee, you want us to expand the portfolio of Department of Public Health into an area where a state commission already exists for which DPH has no expertise. The commissioner acknowledged in her testimony this morning, such that it has to bring in the big guns and money from outside government. Listening to Mr. Schiesel's testimony, it sounds like these bills are a tail trying to wag the dog. And according to Ms. Rassian's testimony, Connecticut is 5th lowest in the United States.
Thank you,
Aren't
Mr.
these
Sotaro.
bills
Can
a
you
solution
summarize,
in search
please?
of a problem?
Thank you,
I'm
sir.
done. Thank you.
Thank you, sir. Thank you for your testimony. I don't see any questions. Thank you for your time tonight.
Thank you.
Next, we will hear from number 91, Derek Reeves.
Good evening.
Good evening.
I'm here to put forward a clear and strenuous objection to the bills 5937 and in part House Bill 477. Right out of the gate, the falsehood displayed within the title of 5937 is a long conversation by itself, but I only have 3 minutes, so I'll adhere to basic common sense. At what point did we decide as a society that a life being taken by a firearm took precedent over any other implementation of causation in a person's demise? When did being killed by a firearm, and a specific firearm, become more heinous, more hurtful, more mentally and emotionally painful to those close to the victim than any other manner of nefarious death? If this is truly about violence, why isn't there a health epidemic declaration on knife violence, SUV violence, the murder of a man's wife and children in a botched home invasion? I don't have to reveal the politics behind this agenda with this proposed legislation because it's clear to me. With regard to HB 477, I'm not opposed to the concept, because who doesn't want to facilitate those who need help in the capacity that the bill refers to? But the title of the bill is hiding an ominous and questionable expenditure. Section 7 477, that is, established a committee to study gun violence intervention and prevention. And how these commissioners who are unelected are chosen gives every indication of a majority with a one-minded agenda that now has millions of dollars in public funding to push a singular point of view under the guise of health and well-being. No decent moral person would be against reducing violence, but when it's used as a prop to cover up other intentions, then I must call it out. You want to reduce gun-related crime, but you never ask those well-versed in firearms for any iota of input. Enacting gun control, and this is what this is, regardless of the colorful and misleading titles of two bills in questions, through a backdoor to circumvent the Constitution by declaring only gun violence as an epidemic, which is not only disturbing, but once again underhanded. I speak to the constitutionalists and gun owners. The people pushing this are going to do what they're going to do. Remember the public backlash from the Tolls Initiative. We need to have the same energy. March 14th, I spoke at that public hearing for Governor's Bill number 16. I call for unity among us. We the people, because the attitude of this doesn't affect me, was not a pedestal to stand on. Declaring gun violence an epidemic is going to have a direct effect on you. I say again, unite or accept the consequences of inaction. Thank you very much. I'll take any questions.
Thank you, Mr. Reeves. I don't see any hands raised. Thank you for your testimony and your time tonight.
Thank you very much.
Next, we'll hear from number 92, Peter Luchis. Mr. Luchis, are you with us? If not, we'll go on to number 93, Karen Siegel.
Thank you, Representative Gilchrist, and good evening, esteemed members of the Public Health Committee. I thank you for sticking with us this evening. My name is Karen Siegel. I'm testifying today on behalf of Health Equity Solutions, where I serve as the Director of Policy. HES is a nonprofit organization with a statewide focus on promoting policies, programs, and practices that result in equitable healthcare access, delivery, and outcomes for all people in Connecticut. We submitted extensive written comments, and I aim to use this time to explain why we believe community benefit regulations to be such an important opportunity for advancing health equity, and to respectfully urge you to both strengthen this proposal and pass it. Health equity requires embedding community voice in decision-making and addressing the economic disparities exacerbated by medical debt, and community benefit laws can do just that. These requirements were designed to ensure nonprofit hospitals contribute to the well-being of their communities in lieu of taxes. Community benefit has been noted by national experts as one of a small number of promising options for addressing racial inequities in medical debt. 29 states have passed similar laws, and Connecticut's the only northeastern state that has yet to do so. The benefits are very clear. States with any form of strengthened community benefit law saw increases in community benefit spending that would translate to, based on our calculations in Connecticut, that would translate to $100 to $160 million in additional spending each year. Connecticut has seen a decline in community benefit spending over the past 5 years, and Connecticut hospitals spend more on internal financial contributions and less on community-based activities than the national average. Approximately 75% of community benefit spending pays hospitals back for treating people who are uninsured or enrolled in Medicaid, which does not account for federal grants to offset those costs. HES strongly supports Senate Bill 476 provisions that link community benefit programs to needs identified in community assessments, that increase transparency and create a summary report and comment period. And we respectfully make 3 recommendations. First, to have a more inclusive definition of meaningful participation. Second, to adopt a universal financial assistance application that patients can submit to any Connecticut hospital. And third, to explicitly embed health equity, demographic data, and standardized calculations of financial assistance in the reporting. Connecticut deserves a strong community benefit law. Senate Bill 476 takes important steps, but it would be a missed opportunity to not also adopt the recommendations included here and increase the potential for these programs to promote health equity in our state. Community benefit statutes have enormous potential to address disparities in medical debt, foster collaboration between communities and the hospitals in them, and to create a more transparent, equitable, and innovative health system. I thank you all for the opportunity to testify this evening, and I'm happy to take any questions.
Thank you, Ms. Siegel. It's good to see you. Thank you for your testimony. I have a question. Can you tell us, when you're saying specify race, ethnicity, and language data in reporting requirements, how does what you're recommending differ from what's currently in 476?
We're really just looking for some minor changes in the language to clarify that the reporting would include race, ethnicity, and language data. It specifies demographics, but it doesn't detail that. And we find that people often choose not to report that data unless they have absolute confidence in it, and it's often incomplete. And so we would really like to see that be part of the reporting. And the reason for that is that we can't say these processes are advancing equity if we can't measure that that's what they're doing. So that's really what we're looking for, is to make sure that the reporting truly results in meaningful collaboration with communities and that they have the information to do that.
Great, thank you. I appreciate it. I don't see any other hands. Thank you for your testimony and your time tonight.
Thank you.
All right, next we will hear from 93B, Robert Shapira.
Good evening. My name is Robert Shapira. I've been a Whiting Forensic Hospital patient since 2003. The following is a list of problems I noticed at Dutcher, which is the step down to Whiting Max. There are no single rooms. There are no individual light controls. There's no way a patient can secure his domicile and property. There's no patient to staff intercom system. There are too many blind spots. All rooms need to be visible by staff from a central location. Windows cannot be opened by the patients. Hallways and doors need to be wider as per JCAH requirements. There are no curtains for the windows. There is no computer room on the units. There is no direct access to a courtyard. There is a shower room with 4 showers, but only 1 patient is allowed at a time. There's only 1 washer, 1 dryer per unit for 24 patients. There's no centrally located ice machine. The treatment room is small. There are no visiting rooms. There are no comfort rooms. Phone calls are not private. There are recreation areas on the units. No recreation areas on the units, excuse me. The elevator is constantly breaking down. I suggest an additional elevator. Break rooms for the staff are lacking in simple conveniences. TV rooms are poorly designed. There are blind spots for staff supervision for shaves. Restraint and timeout area rooms are in a public area. Better connections for patient TVs with antenna on the roof is needed. There is no on the unit dining rooms. And finally, there's a lack of jobs. Jobs teach responsibilities and life lessons and overall improve the function of the hospital. Thank you for the privilege of your time.
Thank you, Mr. Shapiro, for your time and your testimony. I don't see any hands. Thank you again. All right, next we will hear from number 96, Jonathan Perlow.
Good evening, everybody.
Good evening.
Senator Anwar, Representative Steinberg, Representative Gilchrist, and distinguished members of the Public Health Committee. My name is Jonathan Perlow, and Director of Communications for Connecticut Against Gun Violence. Last year, following the drive-by shooting of 3-year-old Randell Jones, Senator Moore forcefully and passionately called on the state to get serious about the crisis of community gun violence. We're grateful to her for focusing the legislature and the governor's attention on this public health crisis, an issue for which CAGV has advocated a solution since 2020, when we launched the Connecticut Initiative to Prevent Community Gun Violence, which now includes more than 50 Connecticut and national partners. You've heard from quite a few of them today. It's encouraging that 3 bills have been put forward this session that include provisions to reduce street-level gun violence. All have provisions worthy of your consideration. CAGV would like to see SB 477 move forward, including language that's part of HB 5397. We believe the bill should include 5 key components that others have spoken about today. I will focus on just one, the funding. The bill needs to commit to ongoing state funding commensurate to the magnitude of the crisis, starting with a fiscal 2023 allocation of $5 million from the general fund. States around the country have established similar offices of violence prevention. According to data provided by OLR, per capita annual spending on violence prevention programs in the 7 states that have state-level offices or dedicated program funding ranges from $300 per 1,000 residents to $3,600 per 1,000 residents. Comparable annual spending for Connecticut, based on the average per capita funding across those 7 states, would be about $4.5 million. based on a similar analysis we did of the 19 jurisdictions, mostly cities, that are in the National Offices of Violence Prevention Network. Spending in Connecticut comparable to the average per capita spending of those programs would be about $4.3 million annually. So both comparisons are consistent with annual funding similar to the $5 million called for in HB 5397. It's also relevant to note that according to the National OVP Network, the full-time equivalent staffing for their offices averages 12 from a low of 1 in Washington State to a high of 35 in Washington, DC. Hopefully we're at a point where there is consensus that more needs to be spent on anti-violence programs to complement our strong gun laws and law enforcement efforts. With the potential for significant federal funding, it's important the state has the capacity to secure its fair share. Just today, the Biden administration announced that it is calling for $500 million in FY23 for community violence intervention programs. States across the country are investing in the organization capacity to support violence prevention programs. So should Connecticut. Thank you for considering my testimony and your work to make all communities in Connecticut safe from gun violence. Thank you.
Thank you, Mr. Perlow, for being here and for the work you do.
Thank you.
I don't see any hands raised. Thank you for your testimony and your time tonight.
Thanks so much for your time.
Next, we'll hear from 96B, Ling Wu.
Hi, my name is Ling Wu. I was immigrated to United States when I was 14 years old. On my teenage year, I worked most time in school and restaurant, and my life wasn't happy. I attend suicide. That's how I get in here. The incident happened. Somebody passed away. I served 0 to 35 years under the board. I'm really fortunate have been here for getting help, but right now it's just a long journey after being restore my sanity. It's just never seen when getting out of here. I'm just hopeful, grateful, and hopeful one day getting out of here. I mean, it's been long. I spent almost 1/3 of my life being locked up. I know anybody family have to do this, but my parents always tell me, pray to God. I don't know. It's been a long time. I know what I done is huge mistake, and I think that every day what I done, I know it's beyond imagination. It's just still feel like dream, like yesterday, even 10 years before. So I know taxpayer pay $500,000 every year. That's a lot of money investing in somebody from other country. But all I can say is that give me a chance. I'm doing very well right now, and there's just don't seem to like the poor PSR people. I don't know what standard they have. It seems like there's all kind of restriction under there, even though we clearly guilty by reason, not guilty by reason insanity. They're here for treatment, not for punishment. I mean, I'm not violent. I never have a fight in the system. Never been, and even been assaulted a couple times. I never fight back. I don't know what PSRB had say about being put in here, even as a result of health. I don't know, just take it too long. I wish abolish PSRB. That's all I want, because I don't know what standard to put on it for. That's all.
Thank you, Mr. Wu. I don't see any hands raised. Thank you so much for your testimony and being here tonight.
Thanks. Bye.
Next, we'll hear from number 98, Sean Reeves.
Good evening, Senator Abrams, Representative Steinberg, Ranking Member Wong, Summers, and Pettit, and distinguished members of the Public Health Committee. My name is Sean Reeves Sr. I'm from New Haven, Connecticut. I am co-founder of Sport Academy, and the word sport is an acronym which stands for Street Poet Cipher Road Truth. I am also an employee of Connecticut Against Gun Violence Education Fund. It is very encouraging that bills have been put forward in the committee and others that include provisions to address the crisis of community gun violence in Connecticut. HB 5397, SB 477, and SB 16 all have elements worthy of your consideration. I am testifying in favor of the language in HB 5397, an act declaring gun violence as a public health crisis and establishing the Office of Gun Violence Prevention, because it incorporates 5 important components that should be present in whichever bill is voted out of your committee. It declares gun violence a public health crisis. It houses the solutions in the Department of Public Health, where it can have the greatest impact. It has mechanisms to include voices of those most impacted by community gun violence. It includes a robust data gathering and research capacity to drive evidence-informed grant making. It calls for funding commensurate with the magnitude of the crisis. I believe gun violence is a public health crisis because it has destroyed the lives and the quality of lives of the people of color for decades. This matters to me because I lost my firstborn son and namesake, Sean Jermaine Reeves Jr., to community gun violence in 2011. He was only 16 years old at the time. I fear for the lives of myself, my remaining children, and all the other community members that I live around. Gun violence is an urgent public health crisis that demands the state invest more to save lives. Last year, gun homicides were the highest in 25 years, nearly double the level in 2018. Racial justice cannot be achieved if Black people experience gun violence at far higher rates than white people. Connecticut victims of gun homicide are disproportionately people of color. Approximately 56% of the state's gun homicide victims are Black. However, only 10% of the state's population is Black. Young Black men in Connecticut are almost 39 times more likely to be murdered with a gun than similarly aged white men. I'll end my testimony here. I want to thank you, the committee, once again for listening. Sincerely, Sean Reeves, Sr. Thank you.
Thank you, Mr. Reeves, and I'm sorry for the loss of your son. I appreciate that you've taken that tragedy and are using it to try and save others. So thank you for your time and your testimony tonight.
Thank you.
Don't see any hands raised, so we're going to move to number 98B, Everton Robertson.
This is Nigel Rodney, Director of Nursing at Dutcher Facility on the Whiting campus. Everton Robinson is choosing not to testify this time.
Okay, thank you so much for letting us know. Next, we will hear from number 99, Robert Santiago.
Good evening, everybody. Senator Abrams, Representative Steinberg, ranking members Huang, Summers, and Pettit, and distinguished members of the Public Health Committee. My name is Robert Santiago, and I'm from Bridgeport, Connecticut. I'm here today to testify in favor of SB 477 and the language in HB-5397, an act declaring violence a public health crisis and establishing the Office of Gun Violence Prevention. I would also like to thank Senator Moore for her leadership on this issue. I myself was a victim of gun violence on 5 separate occasions. I've been shot 5 different times. Till this day, I still deal with the aftermath of those actions. I'm in constant pain and I walk with a limp. One time I was shot in my abdomen and I was in a coma for a month. After that, I know everyone might think, well, what kind of activities this guy was into that this happened so many times. But in reality, it's just another hour, day, week, year living in the city of Bridgeport. A good example of my first encounter with gun violence was at the age of 8. I saw an older kid get hit by a stray bullet on a basketball court. He lived, but for an 8-year-old, that's something to live with for the first time seeing someone get shot. Gun violence is an ongoing problem in our cities for generations, and from my understanding, my experience, I never had help or known of anyone getting help from seeing any of this trauma. I have 7 daughters, a bunch of nieces, nephews, little cousins that I don't want to see or go through this violent actions like me and my parents went through, with no help in sight. Don't get me wrong, I never in my life thought about things like this until I started to show up at meetings at hang time. Those meetings opened my eyes to the big problem we have and how much pain and anxiety I had built up inside. It gave me an outlet to talk and say what I finally had built up in my mind for years and years and years. So yes, I do believe that programs like Hang Time can help, and we need people like those in places that can help us heal. I would like to thank the committee for giving me the time and your attention. Thank you. Robert Santiago.
Thank you, Mr. Santiago. And I'm just so happy you're here.
Thank you.
Thank you for using your experience to try and help others. I really appreciate it.
Yep.
We have a few hands raised, so don't go anywhere.
Oh, wow.
First go to Senator Moore. Go right ahead.
Thank you, Madam Chair. Thank you, Mr. Santiago, for your testimony. You know, you hit it on the nail on the head when you said, I was wondering also what's going on that you would get hit that many times by bullets. But the sad commentary is that you do live in Bridgeport and you're always at risk, because we have the highest numbers of people who may not die from bullet wounds, but shots fired on a constant basis. Many times it's just about being in the wrong place at the wrong time, and the wrong place could be sitting on your front porch.
Yes, that's
I have
true.
my own stories within my family of people being shot that had nothing to do with the incident, but also the generations that it impacts for future, for trauma. I know that when your daughters see you and know that what you've been through, that affects them mentally, right? And now, although you've been through it, I'm concerned about your daughters, that they have the same type of support that the children in Sandy Hook had, who witnessed horrible things. And our kids in our community witness it every single day. Their parents don't want them to go out and play. In Bridgeport, in a park, the kids were playing, getting ready to do baseball practice. Shots were fired. There was about 30 some kids who scrambled. The governor came down the next day to look at the park. We're trying to figure out what can we do to protect our children, and the trauma for them hearing shots fired and not knowing what to do. So, it is a very sad commentary that I totally understand what you're saying, and I've witnessed it over and over again here in Bridgeport. And I just can't believe that we haven't done more. Once again, I'm not talking about taking away guns from gun owners who have them legally. I'm talking about putting into place programs to pull our kids off the street, to get them involved in something else where they could be safe, but also to support all those groups that are doing the great work on the ground. The young man before you who does the sports program in Bridgeport, I'm really impressed with him, and told him in another call that I've got to come to Haven and see what you're doing, because there's a lot of good people doing good work. But the problem I see is that they're not coordinated. We don't know what's being funded. We don't know what needs funding. And this work that we're doing in Senate Bill 477 would help us pull together what is it that we need to do and how do we best use our funding. I mean, I keep reading there's a boatload of money coming into Connecticut. I want to make sure that our communities that suffer the highest disparities in health get their fair share to address it, because this is a once in a lifetime opportunity for us to get it right. And, I don't know who's going to be here next year or how long I'm going to be in the legislature, but I want to make sure that while I'm here, that you all know that I've listened to your concerns. I understand them, I live with them, and I'm going to do as much as I can to make sure that this bill gets out of committee and we start to address these problems, not just for a year, but a long-term strategy through this commission. So thank you so much for your testimony. I truly appreciate it. Thank you, Madam Chair.
Thank you, Senator. We have some more questions or hands raised. Representative Zupkis, go right ahead.
Thank you, Madam Chair. Thank you, Mr. Santiago, for coming. Boy, God has a plan for you. Just know that. But I want to ask you a question. If you could say two things that would help fix the gun violence or get to the root of the problem, what would those couple of things be that we could do? Because there is not one person here that doesn't want to help in working on this. And so I would like to know from you if there were a couple of things that could really make a difference. What would that be?
A place for kids to go and a class to let kids know at a young age about guns, the life that it takes and how dangerous they are, how fundamental they are. Give them an insight on them, because when we're young, we don't know. Most of the kids don't know anything about guns. We find them on the streets, or our older brothers have them, our cousins have them. They go to jail. We end up finding them, and then they're ours. We really don't know anything about them, but just how to load them.
That's a great point. I grew up in a family of hunters, and I knew from an early age, you don't touch them, what they were, what they did, and was educated on them as the same way I do to my children. And that's a very valid point. So thank you. And if you think of other things, please let us know, because you're in it, you lived it. And so, again, every one of us want to make a difference in this. And I would encourage you to share your thoughts on what you think would make the difference. So thank you.
All right, thank you.
Thank you, Representative Zupkis. Thank you again, Mr. Santiago, for being here.
Thank you.
Oh, wait, there's one more hand. Hold on. Representative Berger-Javallo, go right ahead.
Sorry, my hand disappeared. Thank you, Mr. Santiago. I don't really have a question for you. I just want to thank you for sharing your story and for making it something that, even if it's not something that is necessarily relatable to each of us, at least it's something that we can really understand, we can hear, and it's sort of tangible. My own brother-in-law was born and raised in Bridgeport, and the stories from him and from his siblings are not unlike some of the things that you've experienced, although I don't believe any one of them has experienced them nearly as frequent with the frequency that you have. But what strikes me is, for me to go visit him, it's a 30-minute drive. But his life, his experience growing up, and mine, and the way my children are growing up in Ridgefield, Connecticut, they're worlds apart. And so I want to thank you for bridging those two worlds a little bit with your story. It's something that so many of us need to hear and so many of us need to understand, so that we can begin to try and help to solve this problem in your communities and not just think of ours exclusively as we look at gun violence. So thank you so much for this.
Thank you too.
Thank you again. Have a great evening.
All right, you too.
Next, we're going to hear from 99B, Timothy Baldiga.
Hey, good morning, or actually rather good evening, everybody.
Good evening.
Sorry, I just woke up. My name is Tim Baldiga. I'm 27 years old. I'm a writer. I'm a programmer from Webster, Massachusetts. I'm staying here at Connecticut Valley Hospital. I'm currently staying on the competency unit in Dutcher. And I'm here also researching CVH. This is my first time admitted to a hospital like this, and it's been a very novel experience. I've been treated well. The hospital here is very modern, but I still feel like on some level I'm being held as something of a political prisoner, and I can't deny the fact that I feel like there is some degree of corruption that is going on here. And that's something I'd like to talk about this evening. The experiences, though, that I've had here interacting with the staff, the doctors, and my fellow residents of Connecticut now, in this shared time of international turmoil going through the start of the conflict in Ukraine, it's been absolutely priceless. And I'm really amazed at some of the abuses that I've seen here, some of the things I've witnessed, and some of the things I've experienced. I'd like to share those. And I expect that this part of my life is something that I'm going to be reflecting on probably till the day I die, just because of how poignant it's been and the just unbelievable experience that it's been being here and seeing the world change. So just to make it clear, I don't support any sort of new construction or development on this campus here at CVH, and I recommend that no new construction takes place. I think that, on a high level, corruption all over the world hurts people's mental health, old and young. And I think it develops what I would argue is probably one of the worst delusions, which is tyranny. There have been all sorts of horrible procedures that have gone on in this hospital, and although things have modernized quite a bit, there's still a certain degree of, I would say, abuse of power. I think adding to this hospital plays into some of the corrupt misconduct that has occurred here and that still occurs here. And just to give you a brief understanding of what it's like in the court competency unit, I mean, we get to go outside for maybe 30 minutes a day as we work on, or as most of us work on trying to understand what laws are in Connecticut and how the court system works. Yet patients or clients here don't have access to a law library within this unit. On December 5th of 2021, I wrote a letter to DOJ. I described this unit as the root of a dystopian society, just in the way that information is handled and kept from patients here. Later on the 16th.
Excuse me, your
Yes?
time is almost up. If you would please summarize. Thank you.
Yeah, definitely. I just want to say later on the 16th, I wrote to the Joint Commission. I described the treatment here as alien. And on the 25th, I wrote to the Department of Health and Human Services that this unit is pilfering from the disabled and profiting the state. I think funds should be used in other settings. I think our towns need to be funded. I think recreation departments need to be funded. And most importantly, I think the community college system needs to be utilized better. I think vocational education should happen there, not on this kind of campus, not in this kind of setting, and certainly not under medical supervision. And that basically summarizes what I have to say. I also just want to say thank you for legalizing cannabis in this state, and I hope that at some point alternative treatment like CBD will be considered by some of the medical professionals here. And I appreciate any sort of work to allow schools and, again, community colleges to develop health and wellness systems as they see fit for their community. Thank you.
Thank you, Mr. Baldiga. We do have a question. Representative Havros DeGraw.
Thank you so much, Madam Chairwoman. I just wanted to ask, because you said you're a writer and you said that you're in the competency unit. If you're comfortable sharing, like, how did you get there and like, why are you there? And I think that it probably benefits us greatly that you are a writer because you're able to communicate so effectively.
Yeah, thank you. And I'd be happy to answer that question. In brief, I'm here because I was found incompetent while I was briefly in jail at Osborne Correctional Institution. I was found competent after the 60 days, and I feel like I was fairly competent before I was admitted here, although I was forced to stay here because I wasn't allowed to return to my home in Massachusetts.
Okay, thank you very much for expanding on that, and I'm sorry that it has been a traumatic experience for you. But I appreciate that you're here to share with us today what you've seen. Thank you.
Thank you, Representative. We do have another question. Senator Summers, go right ahead.
Yes, good evening. I was wondering if you might be able to share, so you were at a correction facility and then you were sent to, were you sent to Whiting for a competency hearing, or were you sent to Dutcher, which is the step down unit?
I was sent to Dutcher. Yep, I was sent to Denver, which is part of Whiting Forensic Hospital.
Right. And then at Dutcher, which is a less restrictive environment than some of the other parts of Whiting, you were found to not be competent, and now you've had to stay there? Is that what you're saying? I just want to make sure I understand.
Yeah, definitely. And I appreciate you asking that, Senator Summers. I was found competent after the 60-day period, and then I was involuntarily committed because of the hospital's refusal to return me to my home in Massachusetts or find a less restrictive setting. And I'm still being denied any sort of alternative aftercare.
So I just want to be clear. So you were sent there for 60 days and you were found to be competent. However, you are not able to return to your home or hospital in Massachusetts because of, can you explain why, or can you not explain why?
Yeah, to my understanding, the doctors and specifically the social workers here have been unable to locate any sort of alternative aftercare or any sort of care in a less restrictive setting, and they refuse to do so.
So I have to tell you, we hear that, frequently, where someone is ready to be put in a placement in a less restrictive environment. However, they cannot find them a space. So they are forced to stay in the hospital under the conditions and rules that apply there until they can find them a space. And sometimes it takes quite a long time. So that's what you're experiencing now. I just want to make sure that I'm clear on that.
Yeah, to some degree it appears to be so, although typically, and I think it's part of the patient bill of rights, the hospital is required to put together a discharge plan.
Right.
And the hospital has failed to do that for me.
So you haven't had a discharge plan put together with a plan, right? They are supposed to do that. Do you have an advocate there, a patient advocate that you can speak with or that you can talk to?
Yes, I do have a patient advocate, and they have been helpful in addressing some of my complaints, and I'm still trying to work with them.
Okay. Okay. I was also struck by, you said you're allowed to have out time, space, or time, which is 30 minutes a day. Is that what you said?
That's right.
Okay. And that's it. There's no real recreation there, so to speak. Is that correct?
Yeah, that's correct. I mean, we certainly have access to televisions at certain periods of the day, but a lot of what we do is restricted.
Do you have access to internet in the facility that you're in right now where you can have an ability to research?
To my knowledge, we don't. We do have access to like a FaceTime call system, and certainly we can make calls to friends or family who might be able to help us out. But it's very unfortunate that there isn't something like a law library or some sort of reference resource that we can get information printed out to help us in our court cases, criminal and civil.
Well, thank you very much. I appreciate you sharing your story with us today.
Thank you.
Thank you, Senator. Thank you, Mr. Baldiga, for being here and for your testimony. Have a great evening. Next, we're going to go to number 92, Peter Luchis. Mr. Lucci.
Yeah, hello. Yes. Can you hear me?
Yes, we can.
Yes. Hello. Thank you. Dear committee members, dear chairman, while I support programs aimed in helping Connecticut residents who are suffering from mental health problems, I do oppose Bill 5397 for the following reasons. We do have a public health crisis. It's a mental health crisis, and it's been on the rise in a number of years. And I attribute a lot of it to the breakup of the family unit, which has left financial instability, anxiety, isolation, and loneliness and despair. And we need to reach out to get more caseworkers and doctors dedicated to helping those residents suffering from mental illness. I was looking at a report by Kaiser Family Foundation recently, and in Connecticut, 66% 164,000 adults with mild mental illness, 75,000 adults with moderate mental illness, and 37,000 adults with serious mental illness in the past year did not receive, I'm going to repeat, did not receive mental health treatment. And that's the Kaiser Family Foundation. And that's really disturbing. We do have people out there that need help. And when you add these numbers up, it's a substantial number of people that have not had help. Regarding the violence in Connecticut, over the past number of years, 37% actually violent crimes had decreased from 2010 to 2020. And I'm looking at this and saying, well, what is the root cause of a lot of the violence? And I think that there's no accountability, no deterrent to those who do commit or want to commit acts of violence. Between 2017 and 2021, statewide arrests decreased by 28%, with the biggest drop occurring in 2020 and 2021. And that source is from the CRMVS, the Criminal Motor Vehicle System, which is part of the state Connecticut Judicial Branch Service. There are many gun laws on the books, which protects our citizens from illegally purchasing firearms. And my question is to all of us, and I include myself, why aren't the current laws being followed? I read, and every day we see it in newspapers and TV. Prosecutors are not prosecuting, criminals are being released, and courts are not holding those breaking law accountable. It's almost like the Wild West, where lawlessness prevails, and it makes no sense at all. And I'm getting these facts from the OPM, which is the Governor's Connecticut Department of Correction survey. In fact,
excuse me, Mr. Lucchese.
I'm sorry,
your time
say
is
again?
almost up. If you please summarize. Thank you.
I'm sorry, say again, please.
Your time's almost up, Mr. Lucchese. So if you could just summarize.
Sure. We do have a problem with mental health. I think anyone who wishes to cause harm to anyone has some type of mental illness. It may be mild or severe, but these are the people, and these are where the funds need to be addressed to help our residents. Some people we know, some people we don't know, but these are the people that really need our help and our outreaching, and not really penalizing law-abiding citizens by putting more commissions and more restraints and more gun control laws out on the books. So we all are on the same page. We all want to help people. We all want to see this violence reduced and stopped. And I think working together, we can certainly see this as a reality.
Thank you, Mr. Lucchese. Thank you. We do have a hand raised. Representative Kavers-DeGraaf.
Thank you, Chairwoman Gilchrist. I just have a comment because I think that we want to be really careful not to stigmatize people with mental illness as we have this discussion. First of all, I'd like to point out that one of the bills that we are actually have a huge bipartisan working group this session is HB 5001, which we voted out of committee last year. And so that will be addressing a significant portion of mental health issues that we see primarily in children, but also in adults and in the workforce. And I think you should also check out NIH, that stands for the National Institutes of Health, because there's a study there that I think you would find really interesting about the fact that people with mental illness are actually more likely to be victims of violent crime than to actually perpetrate violent crime. So I think that we just have to be really careful when we are discussing mental illness, even in regards to community violence, because we are really trying to end the stigma around that, and to put out false information can be really dangerous and harmful both to the people who are experiencing mental illness and their families. Thank you so much, Chairwoman.
Thank you, Representative. I don't see any other hands. Thank you so much for your testimony and your time, Mr. Lucchese.
Thank you.
Next, we have number 100, Mario Bruno.
Thank you, Chairwoman Gilchrist, I'm sorry, and distinguished members of the Public Health Committee. I am Mario Bruno, and I'm the CEO of the American Red Cross in Connecticut, and I'm here to support HB 5500, Section 39. My 30 years with the Red Cross include emergency health services in Spain, and in the past 25 years with the American Red Cross in a variety of roles. I've responded to disasters such as Hurricane Sandy and Floyd in the Northeast, Harvey and Maria in the Southwest and the Caribbean, wildfires in California, as well as some man-made disasters like the September attacks of September 11th, and unfortunately the Sandy Hook shootings. And all of these disasters do have some commonalities, including the need for a stable supply of blood in these locations. As you know, the Red Cross is a worldwide humanitarian organization dedicated to alleviating human suffering, and that includes the generosity of more than 60,000 blood donors right here in Connecticut, where we are part of the State Disaster Response Framework and the Governor's Unified Command, and as a result, we've been active partners in the state's pandemic response, including our partnership with the Department of Public Health to educate our residents about COVID-19 vaccinations, and especially in underserved communities. This partnership is crucial to the healthcare system of the state, especially as it relates to blood and platelet collections. The collection must be maximized in our state and across the nation, as the supply of blood may be compromised when a state is hit by a disaster, a storm, or a terrorist attack. HB 5500, Section 39 includes language that would allow the Commissioner of Public Health to have greater flexibility in responding to emergency situations like the blood crisis that we've had through this pandemic. The Red Cross would have been able to collect additional units of platelets in 2 of our blood centers in the state, one in Milford and one in Greenwich, if our medical director could have remotely supervised these 2 locations, something that happens across the country, and as mentioned before, is only a requirement in Connecticut at this point. This one piece of regulation from the 1980s only takes place in Connecticut, as I mentioned. We're fully aware and agree that all waivers granted by the Commissioner must ensure the safety of our residents and patients, which is the same standard that we maintain each and every day at the Red Cross, in alignment with FDA regulations and recommendations by the Association of American Blood Banks. We're also fully aware that we would need to have the right discussions with the union representatives to ensure that any waiver makes sense for our patients and our daily operations. So I respectfully ask you to support HB 5500 so that we can continue to work with the Commissioner of Public Health and public health staff to continue providing blood and platelets to the residents of Connecticut in the most effective and efficient means possible. Thank you for your time, and I welcome any questions.
Thank you, Mr. Bruno. And we do have a hand raised. Senator Anwar, go right ahead.
Thank you, Madam Chair. Mario, good to see you. Thank you for all the work that you do and your entire team does, and especially in the recent past, your support to Ukraine and in your team from Connecticut, some of them who are already physically in Ukraine right now. We cannot thank you enough. And in the beginning, I was worried if this bill would be okay with you, and I was thinking of calling you to make sure you were going to be okay. But I saw your name on the list and I said, well, we'll hear, and I'm glad we're also in agreement. So thank you so much. And thanks for being here.
Thank you, Senator. Absolutely. We are very proud of our work in Eastern Europe as well as here at home. Thank you.
Thank you, Senator. Thank you again, Mr. Bruno. I don't see any other hands raised. Thanks for your testimony and your time tonight.
Thank you.
Next, we'll hear from 101, Margaret Watt.
Hi, good evening, chairs and committee members. I'm here tonight as the Public Policy Chair of NAMI Connecticut to support and comment on SB 450, which is based on the recent Whiting Task Force report. NAMI Connecticut strongly supports implementing the recommendations of that report and ensuring continued oversight of the hospitals in Connecticut. There are heartbreaking testimonies on this bill that you've heard today, the stories from a mother whose daughter was killed, from an officer viciously attacked in the line of duty. At the same time, those of us in the advocacy community have heard many heartbreaking stories of individuals whose mental illness has led them to extraordinarily long sentences, harsh conditions, inadequate treatment, and at worst, the long-term abuses such as what Bill Shahadi went through. So the intent of this bill is to take steps to better balance the protection of both the public safety and the rights of individuals with severe mental illness, which means it's really critically important, and we do support it. In terms of the components related to the PSRB, the Whiting Task Force was asked to make recommendations about the PSRB and did. All but one of the task force members recommended abolishing it. Connecticut is an outlier, one of only 3 states to even have a PSRB. So we do ask that you reconsider the need to create another task force with the same mandate as the one that just concluded its report. If necessary, maybe a work group that would include some members of the original task force, which might allow work to continue without the lengthy delays that we would anticipate that seem to go along with forming task forces these days. But whether it's a task force or a work group, it's essential to include the voices of those who've experienced the PSRB, such as people you've been hearing from tonight. There are people who've been institutionalized far beyond the length of time they would have served if they'd been sentenced in a regular court. The language in the bill recommends a 10-person task force, one of whom would be an acquittee. It's asking a lot to assign one person to speak about their personal experiences to a panel of professionals who have had the power to put them behind locked doors for potentially years, let alone to give that one person, as an individual, the responsibility for representing everyone behind locked doors. So therefore, we ask that you increase the number of, on whatever this is, a task force or whatever, increase the number to 3 individuals who are current or former acquittees, so that you have a breadth of experience and a breadth of ideas proportionate to that represented on the legal and clinical side of the membership. It's basically about the concept of nothing about us without us. So relatedly, that's why I emailed all of you last week about the fact that the RBHAO bill moved out of this committee to the LCO without apparently fixing the part where it removes people with lived experience from the state mental health board. I have to say that I am concerned about the lack of representation of key stakeholders in important behavioral health efforts like these. And in fact, on that topic, just this morning, I did hear some of the discussion with Ms. Alsberg about this bill regarding whether victims should be represented in the task force or work group. And I've been thinking about that myself. It does make sense to use a restorative justice approach. We need to listen to all stakeholders. But in the current bill—
Ms. Watt, your time is almost up. If you please summarize. Thank you.
You bet. In the current bill, victims may not be present, but they are amply represented by a large group of legal experts. We cannot say the same for the acquittees, so it is essential to modify at least that aspect. Thank you.
Thank you, Ms. Watt. We do have a hand. Chairman Steinberg.
Thank you, Madam Vice Chair. Margaret, good to see you. Yeah, I have to admit, I'm curious. I like your idea of seeing if the expiring Whiting Task Force would be willing to take on new responsibilities. I'm willing to bet they've probably already gone through the ringer enough. I don't know how many of them would sign up for another round. But, you know, remember the good old days or better days when the RBHAOs and the RACs covered the waterfront, so to speak, in both looking at prevention and programs, but most importantly, the oversight monitoring component, which we are now challenged to maintain. I believe you once made comment that that's the kind of oversight that Whiting needed if we were to make sure that what happened in Whiting would never happen again. My question to you is, short of another workforce, do you have a model in mind of something that could replace the PSRB? Is there something easy for us to look at, even as we might wait for a deliberate process to identify it?
So short answer is, I don't know exactly how other states structure this, right? But they do have different models in place. They don't have PSRBs, but I was listening to Ms. Hennessy earlier from the PSRB talking about all the procedures and the steps and stages that they go through to try to assure, protocols and try to respect people's rights. But I was just listening to it and there was no mention of the voice of the individual, the voice of lived experience, the voice of recovery in there. And the processes are just long. I've talked to people who have gone in for competency hearings and just been there for sort of ridiculously long periods of time because the structures aren't adequate to even move people through like the young man that we heard a little while ago, the guy who's at Dutcher who can't go back to Massachusetts. I mean, it is a broken system, right? I do think, you're going to hear from Kathy Flaherty, and I don't know about Paul Acker, who were on the Whiting Task Force. I know Kathy's talking in a little bit. They have looked at other ways that we could do some of this. And I do think this bill 450 has accepted a lot of the recommendations they made, which is great. But they did even say, as a committee or as a task force, we don't need the PSRB. There was only one voice that thought we needed a PSRB. We need a new restorative, recovery-oriented model. We do need to balance the rights of the individual with the rights of public safety. And people shouldn't, in a society like ours, shouldn't be lingering behind closed doors forever. When Ms. Hennessy was talking, I was thinking, what about Bill Shahadi? Did he go through all those every 2-year review processes? And where was his voice? Because he was being abused for an appalling amount of time, egregiously. So there was no protection afforded him. And the PSRB's role hasn't been to protect people. It's been to protect the public safety only and exclusively, to the extent that people who have needed sometimes medical treatment couldn't be moved out to a regular hospital because, you had to wait for the PSRB hearing. I mean, these are the things that the bill is really moving to address. I think what we should be assuming is this is not a one and done, that this is going to come back and there's going to be need for more attention.
Yes, it does sound as if we have miles to go yet. Though I continue to hope maybe there will be a way that we can establish complementary oversight processes whereby maybe PSRB continues to look at safety, whereas we have an accompanying oversight organization that focuses on the recovery model that you and others have espoused. Thank you, Madam Vice Chair.
Thank you, Mr. Chair. And thank you, Ms. Watt, for being here and for your work. Next, we will hear from 103B, Frank Tompkins.
How you doing?
Hello, go right ahead.
Yes, I have, I think that we should build a new building because we need more girl units. You know what I'm saying? It's because you're mixing girls with boys. What I think is that for mixing girls with boys, it's it's gonna cause a problem. One day in the week, it's gonna end up causing a problem. But yeah, and on the other point, I pretty much have to say is that you guys have been helping me a lot. I've been, I have some good staff. You guys helped me a lot. You helped me become who I really want to be, a father to my kids. You know what I mean? So hopefully when I get out of here, I'll probably be better than I was, than I actually was. So thank you.
Thank you, Mr. Tompkins, and I hope you are better when you get out, and I'm glad you're feeling like a better dad to your kids. I don't see any hands raised, so thank you for your testimony and your time tonight. Next, we will hear from 104, Sarah Cohen.
Chairwoman Gilchrist, ranking members, and distinguished members of the Public Health Committee. My name is Sarah Cohen, and I'm a resident of Hebron. I'm also a movement organizer with March for Our Lives, and I'm testifying in support of HB 5397. I'm 20 years old, and I'm part of the school shooting generation. I was 9 years old when a gunman entered a movie theater in Aurora, Colorado, and killed 12 people. Less than 6 months later was the Sandy Hook massacre. I realized then, at 9 years old, that gun violence was not confined to movie theaters or schools, nor was it somewhere far away. The active shooter drills in which I participated in And the weeks, months, and years following the Sandy Hook shooting felt increasingly important. When no one knew if we were huddled silently in the corner of our classrooms as a drill or because someone was trying to hurt us, I wasn't worried about who I would play with at recess or what I would have for dinner because I was afraid those things would never come. My experience is not unique. There are hundreds of thousands of young people in our state who have grown up in a world where gun violence is normalized. So many of the gun deaths in our community never even make the news. We're not asking for thoughts and prayers, for sympathy, or even solidarity. We're asking for action. The lives of too many of our classmates, neighbors, friends, and family members have been taken by bullets. During my lifetime, the CDC has reported a more than 48% increase in gun deaths in the US. While Connecticut has made great strides toward preventing gun violence, this issue still plagues our communities. Our state's rate of firearm death per capita remains greater than or equal to our neighboring states. As gun violence continues to worsen, with 2021 being one of the deadliest years yet, it is imperative that we do everything in our power to end this epidemic. Gun violence is a public health crisis, the magnitude of which statistics alone cannot express. We cannot quantify the physical, mental, and emotional toll of gun violence that overwhelms those left behind. Establishing an Office of Gun Violence Prevention within the Department of Public Health is crucial to providing a more holistic view of gun violence in our state and afford attention to all incidents of gun violence, not just those that make headlines. The experts within this office will evaluate the efficacy of our state's current gun violence prevention strategies and use this data to recommend improvements. It will ensure stable and reliable funding for violence prevention and intervention programs, funding generated in part by federal grants. While there are multiple bills in this session that address community gun violence in our state, HB 5397 is perhaps the most comprehensive yet, and I therefore urge you both personally and on behalf of March for Our Lives Connecticut to support HB 5397. Thank you again for the privilege of your time, and I welcome any questions.
Thank you, Ms. Cohen. Thank you for your advocacy and for being here tonight. I don't see any hands raised. Thanks for your testimony. Next, we will hear from number 105, Guthrie Dinda.
Good evening, Madam Vice Chair and other esteemed members of the Public Health Committee. My name is Guthrie Dinda, and I'm a resident of Lebanon. I'm testifying tonight against HB 5397 and SB 477, although I understand the concern for the outbreak of violence over the last so many years. I think there's two methods to reduce this violence, one being proactive, one being reactive. I'm a child of DARE, and I remember the importance that program had on me, and I still remember everything I learned in that. So I think we can apply that to today and the violence we see, teaching our children what to do when they come across a firearm, how to handle a firearm, and more importantly, the value of life. I think that will hold a heavy weight on reducing violence coming through the ranks of children. But I also think as a reactionary measure, we can hold criminals to the tough sentencing of crimes involving firearms and other methods of violence. Let's see. A task force made up, as this bill states, I think is destined to further remove freedoms from law-abiding citizens, while criminals will continue to break laws and then walk out when their charges are dropped. I believe the plan should be to educate children on the safe use and handling of firearms and to hold criminals to the strictest of punishments. Let's use laws we already have instead of adding more that will have little to no effect. Thank you.
Thank you for your testimony, Mr. Dinda. I don't see any hands raised. Thank you for your time tonight.
Thank you.
Next, we'll hear from 105B, Anthony Deuse. My apologies if I said your last name incorrectly.
Hello. My name is Anthony Deuse. I was committed to the Department of Mental Health and Addiction Services before the creation of the PSRB, which was created July 1st, 1985. I was grandfathered under the PSRB without the ability to fight or contest that decision. I understand that the legislator, officers, and legislators intended on doing a good thing with the creation of the PSRB. I had a vision of war. It was terrifying for a 28-year-old young man to have this vision, especially after serving in the United States Marine Corps for 4 years during Vietnam. None of these things are taken into consideration today by the PSRB, by the judicial system of the state of Connecticut, including the state Supreme Court, including the appellate courts. They all just keep adding more time. My original sentence was not to exceed 25 years, which was effectively over. March 21st, 2010, the PSRB asked for and successfully received 3 additional years. After that 3 additional years, they asked for and successfully received another 4 years. After that, 5 years. After that additional 5 years, the PSRB asked for and successfully received 4 more years. After that 4 more years, which just was over this month, the PSRB again successfully asked for and received another 5 more years. I am currently 13 years past my 25 years, and the PSRB extended my 25 years to 43 years. Now to be concluded 5 years from this month. I'm a Vietnam era veteran. I would have been the first one to tell you a long time ago, things like this can't happen in the United States of America. I would have been the first naysayer. And look at this. My own country shits all over me. Forget the language, but it's the truth. They denied me the ability to pay my last respects to my dying mother in 2003. My family didn't want me to go there in handcuffs and shackles, which was okay with the PSRB. So then when we asked if I could go to her deathbed privately, because she was hooked up to machines, she was already brain dead. She was already hooked up to machines and all. I wanted to go privately in handcuffs and shackles with the police and the staff. And they said no. They didn't give a reason. They just said, no, you can't do it. Your intention for creating the Psychiatric Security Review Board for the protection of the public has gone amok so far. That pendulum has swung so far, you slash up even us vets who put our lives on
Excuse me,
the
Mr. Diaz, I'm sorry to interrupt, but your time is almost
I've
up.
interrupted, and that's fine. But you're not going to fix this situation in these little capsules. You don't even listen to the wedding task force, for crying out loud. All of them, except for one, are saying this PSRB thing is going amok. It went awry. It's not on the tracks anymore. Nobody's listening. Us PSRBs, we got no say. So it's routine to add time, add time. If this was DOC, it would be called double jeopardy, and it has already been ruled unconstitutional. So why do we discriminate against those that are supposedly a disabled class protected by the ADA? This is what you've got. I know you didn't intend it, but that's what it is. My name is Anthony Dias. I'm a United States Marine veteran who was honorably discharged.
Thank you so much, Mr. Diaz, for your testimony and your time tonight. Next, we will go on to 106. Toby Simon. Mr. Simon, yep, there you go.
Thank you. Chairman, ranking members, and distinguished members of the Public Health Committee, thank you for giving me the opportunity to testify in support with modifications of sections 1 and 39 in House Bill 5500. As a senior medical director for CSL Plasma, I certainly appreciate the current bill language that would grant the Department of Health broader waiver authority for regulation related to clinical laboratories. But we do believe that more specific language to harmonize Connecticut statute with federal law is needed to provide the clarity and consistency of regulation in order to operate plasma collection centers in Connecticut. CSL Plasma operates one of the world's largest networks, 300 plasma centers, more than that globally. We are a subsidiary of CSL, bearing a global biotherapeutics company, and our collections are used for the sole purpose of manufacturing life-saving plasma-derived therapies, and we operate in more than 40 states. I will say that Connecticut regulations are currently among the most restrictive we see in the US, and we believe do not reflect advancements made in technology and processes for plasma collection. For example, as been discussed earlier, the requirement that a physician be present on site at all times during which plasmapheresis occurs is essentially at all times of the operation. Every other of the more than 40 states in which we operate allows for the use of what the FDA terms physician substitutes, as defined in federal regulation, allowing the center medical director to delegate specified duties. And this model has been employed safely for decades and allows for more efficient alignment of healthcare personnel. In addition, we were part of a study that I helped author, published in the journal Transfusion, detailing adverse events among source plasma donors at 513 plasma collection centers in 41 states over a 4-month period. The analysis of more than 12 million donations showed an adverse event rate of just 0.16%, lower than that reported for whole blood donations, further demonstrating the safety. We began our discussions with the department in summer of 2018. We were encouraged by that engagement. Of course, we recognized the pandemic interrupted everybody's plans. And our industry has also experienced the strain of COVID as plasma donations decreased about 20%. So expanding these plasma collections is really critical for patient care, and Connecticut can serve as a partner in the goal of ensuring no patient in need of plasma-derived therapy need worry about access. Harmonizing Connecticut and federal regulations would allow us to operate with certainty and with consistency and operate safely. We ask that Connecticut adopt more specific language to provide this harmonization, similar to what recently passed in New York. And I appreciate this opportunity to provide our perspective on House Bill 5500. We're proud of our commitment and record of safety, and the modifications we seek maintain the commitment to health and safety for our donors and for patients as they reflect the standards put forth by the federal government and employed with documented success in so many other states. And we think that now is the time for Connecticut to make this commitment to patients who rely on plasma-derived therapies. Thank you.
Thank you, Mr. Simon, for your testimony. You make it all sound like it's under control and we can get this done. So that's comforting. I don't see any questions, so thank you for hanging with us into the evening, and we appreciate your testimony. Have a great evening.
Thank you very much.
Next up is 108 Warren Stevens, followed by 108B Abraham Israel over at Whiting. Welcome, Mr. Stevens.
Good evening. Dear Public Health Committee members, I'm Warren Stevens of Southington, Connecticut, CCDL outreach member and spokesperson for the Southington Sportsmen's Association and Bell City Rifle Club, representing several thousand voters, and we are single issue voters when it comes to the Second Amendment. Gun control laws do not impact crime. We are adamantly opposed to SB 477 and HB 5397. While we're at it, there's no such thing as gun violence. It's another made-up, self-serving term. The real problem is crime, criminals, the mentally ill, and the violence they cause. The time, money, and effort should be spent on that and not another two laws that will eventually only impact law-abiding citizens. SB 477, page 229 on, establishes this 21-person committee on gun violence. It's non-elected, appointed people. They can accept donations. We don't know how they're chosen. These radical and somewhat dangerous anti-gun groups in Connecticut have lobbied and spent large sums of money on their propaganda to sway opinion to yet more gun control. If these groups or these people are in charge, donations will be swayed, the data will be skewed to further their agenda, and we all know it's to end gun ownership. This thing smacks of corruption before it's even started. HB 5397 declares gun violence a public health crisis. The ongoing crisis establishes the Office of Gun Violence Prevention Advisory Council. This is more than a mouthful. It's simply two solutions in search of a problem. Neither will impact crime, and it's a backdoor attack, as we all know, on the Second Amendment. State of Connecticut would be better off investing in more law enforcement money, getting tough on crime, helping the mentally ill, and prosecuting criminals. Per the Department of Public Safety website, between 70 and 80% of gun crimes in Connecticut are not even prosecuted. That's what the state needs to explain to the victims of violence. New Hampshire and Maine have constitutional carry. None of the bans we have here on ghost guns, assault rifles, all these made up terms, they don't have these violence committees, yet they are consistently ahead of Connecticut on lower crimes with firearms. Connecticut, with all of its laws and restrictions, don't keep us safe. Many gun control advocates testified today that gun control works, and then on the next breath, they've stated 2021 was a record year for shootings. I'm glad they said that, because that's an admission and confession on their part that their gun control policies have failed, and it couldn't have come from a better source. I want to remind everyone it's an election year, and the nearly 400,000 gun owners will be going to the polls in November. Thank you for your time.
Thank you for your testimony. I could not agree with you more on just about everything you had to say. Seeing no further questions, we'll move to Abraham Israel, followed by Michelle Russo.
Hello. Hello. I was deciding whether or not to testify, but I decided I would come here to give my testimony about the resolution 450. The other laws that you were reviewing or discussing, I don't know, I haven't got a chance to even look at them. I only got the one from House Resolution 450, Senate Resolution 450. So on that, as far as that information, they're talking about reestablishing an authority that's above the PSRB, but some people want to eliminate the PSRB, but I don't. I think the PSRB saves lives, a lot of lives. You know, I don't know how many, but I would say hundreds of lives have been saved because the patients had the opportunity to go through a lot of training, and their needs were met. The basics and everything like that is all pretty much taken care of for the people. And maybe gradually they can come out into the public and be helpful, contributing members. I will say about gun violence or guns control, my dad, he served in the Navy for many years, and his opinion is that, at least I think I'm expressing it, is that the law, the Second Amendment was for the militias of the various states back in the 1700s. It's not related to the 21st century of high tech weaponry. And I think it's not bad idea to control the guns. One idea that I had was that they could, how they have armories in each state? They could even have armories in each city, and the people could keep their weapons there, and anytime they wanted to use them for practice or for other things, they could sign out, why did they take the gun that time? And then you never know, you might be able to save one life that way too, by making them keep their guns, together, something like a militia. I'm not talking about the National Guard. I served in the Air Force, and I grew up in the Navy. You know, I've been around weapons, and I know that nobody ever, you know, used one improperly that I know of. So I just wanted to say that, and I have to think about myself a little bit, you know, and my family. And I think that the PSRB is doing a darn good job most of the time. And I think if they establish an oversight over the PSRB, that's not too much. You know, you could have like a tribunal of judges, because they have the tribunal, but judges has to work on any matter that is under the law. You know, they have to.
Excuse me, Mr. Israel, your time is almost up. If you please summarize. Thank you.
Okay, I will. There's a lot of people whose lives have been saved because of the PSRB, and if they get a tribunal, a judge's tribunal above the PSRB, that would be great. But there are people who have suffered a great deal at the hands of mentally ill criminals. And you know, you can say mentally ill as if that's okay, but then the fact that they committed a crime, that's the problem. You know, it's, mentally ill people committing crimes and not getting the treatment that they need. I could even make a comment about the plasmapheresis. One more time, one more second. About the plasma, you know, Barack Obama, he passed a law, or they passed a law while he was in there, that's called the Precision Medical Initiative. And in that, anybody can join the Precision Medical Initiative. They could give. Okay. They could collect samples if the patients or the clients will authorize it, but they can't really take it if they don't authorize it. You know, really, I mean, they would.
Well, thank you, Mr. Israel. We really appreciate your testimony. I, for one, am impressed that you seem to have opinions about a number of bills that are before us today. You're a true Renaissance man, and we appreciate your input across the board. Thank you again for your testimony, and we will consider all of your opinions as we move forward with this legislation.
Thank you, sir.
Next up is Michelle Rousseau at Whiting, followed by Mag Morelli.
Representative Steinberg, Ms. Rousseau has opted not to testify this evening.
Thank you for informing us. So we'll move on to 110 Mag Morelli.
Right. Thank you, Representative Steinberg, Senator Anwar, and members of the Public Health Committee. My name is Mag Morelli, and I'm the president of Leading Age Connecticut, a statewide membership association representing not-for-profit provider organizations serving older adults across the continuum of aging services, including not-for-profit skilled nursing facilities and assisted living communities. Pleased to be here to testify on two of the bills before you today, and I'll summarize my written testimony. First, regarding Senate Bill 477, I'd like to speak to sections 1 and 2 of the bill, which relate to assisted living communities and dementia care, special care units and programs. Assisted living is state regulated, and all 50 states have some form of regulation or licensure for assisted living. Connecticut's model was designed many years ago and is considered unique among state models in that it licensed the Assisted Living Service Agency, the ALSA, and separately places conditions on the managed residential community, or the MRC, which is the actual building where ALSA services are delivered, the building where the residents live. This model has served the state well over the years and has allowed us to deliver assisted living services in a variety of settings, including the affordable housing setting. Our statutes related to assisted living have been amended over the years through the addition of specific laws governing the MRC, including contract requirements and resident rights, as well as requirements for dementia special care units and programs, often referred to as memory care units in the assisted living setting. An example of this is the recent requirement that these memory care units obtain DPH approval and that they employ an infection preventionist. While we have modified the assisted living model through these incremental changes, we recognize that there may be a desire to implement more comprehensive changes, particularly concerning memory care units. We can appreciate that perspective, but we respectfully ask the committee not to make these changes at this time and to first conduct a holistic review of the current statutory and regulatory construct that oversees the model. Toward that goal, we know that the ALSA regulations contained in the Public Health Code are scheduled to be revised by DPH. To assist in this effort, we would suggest that work be done now to conduct a thorough, holistic, and collaborative review of the regulations so as to assist in a swift revision of when DPH addresses them. Leading Age Connecticut and our members, many of which are national leaders in the field of dementia care, would be eager and willing to participate in such a review. And regarding House Bill 5500, I would like to speak to Section 36, which seeks to modify the staffing provisions for skilled nursing facilities included in Public Act 184. We respectfully request that as the committee addresses needed modifications to this statute, that you also amend the language related specifically to the new social worker staffing levels. We are proposing amending the language so as to enable DPH to apply the new social worker staffing levels proportionately to this nursing home's resident census. The Public Health Code has previously outlined required social worker staffing in proportional levels like this, and we request enabling legislation to continue this practice. We also respectfully suggest that the committee consider merging the substance of Senate Bill 371 into 5500, as we believe the issues are germane and we have worked with DPH in crafting the proposals contained in 371. Senate Bill 371 addresses modifications to the infection prevention of staffing levels and to the assisted living services provided in the affordable HUD assisted senior housing settings. We're very appreciative of the committee's support in approving Senate Bill 371, and we offer the idea of merging the bills merely as a suggestion. We thank you for this opportunity to testify on these bills and for your consideration of our opinion, and I'd be happy to answer any questions.
Thank you, Mag, for your testimony. Just help me out here. With reference to the ALSA in doing a review, prior to DPH actually doing a thorough review, who are you suggesting does that review? Are you saying the legislature should?
No, I would, Leading Age Connecticut would be happy to participate, maybe even lead it. I know that probably the association, the CALA would probably be interested. CHCF would probably also be interested. And then if there were legislators or if there was someone from DPH who would like to join us also, we'd be happy to do some type of collaborative review of all of the statutes so we know what we need to address. We've done this in the past when they previously were planning to change the public health code and revise it. And it took quite a bit of time and we did a lot of work on it. And it never went to fruition. So we never actually revised the code. So we know there's a lot there. We have the notes from the previous work. But it just seems that it's probably time to do a full revision. And we know that, to give us sort of a head start, we would be more than happy to do the revision.
Well, thank you for that. I guess if you're willing to roll up your sleeves, we should be as well. So we'll look into that. Senator Anwar.
Thank you. Thank you so much, Mr. Chair. I wanted to clarify and hopefully, Ms. Morelli, thank you for your testimony. And this is an important issue for me and a lot of people we represent. And during the pandemic, what we had seen was multiple stories where in memory care units, individuals were in that space and they were not fed because we were in lockdown. They did not get water. They did not get changed. And when the families tried to reach out and asked for specifics, they said, well, we are not governed by the Department of Public Health. You have no authority to ask us the questions. They were asked about the ratios of how many nursing staff people. Well, there's no requirement. So there's no governance of any kind of assisted living facilities. There's no governance or oversight systems in place for Medicare units. As a result, many people in our state starved. I have pictures to show you, and I could have probably brought them today if I had imagined that you would be against this bill, because I would not have imagined you be against a bill which is going to actually just say that the families have a right to know that their family member is being taken care of. They have a right to be able to understand if they have been fed, because when they were asked, whatever, I'm not going to mention names, like let's say Mr. Smith, did he drink water? We are not authorized to tell you. We're not required to keep that information. Can you get his weight? We are not authorized to tell you, and we don't have any requirement to do the weight. Did he get his medicines? We are not authorized to tell you, and we don't have a requirement to tell you. That is the answer to every question in memory care units in the state of Connecticut. And we as a state can do better. And I'm somewhat disappointed that you think that we should wait and do a study to prove that these people were dying from some other rash reason, and then the families were not informed. This is a very basic bill, which is saying that just treat the seniors, the ones who are in memory care units, as humans, as you would like parents or maybe ourselves to be treated in that manner. And we also want to have some ratios and understanding and communication with the families and with the individuals, and also make sure there's transparency around those. And I know that you have to represent the organizations that you represent, but I represent the community members and I represent the people who have lost their lives based on this issue. And so I feel firmly that this bill should move forward and this aspect should move forward. We will make a committee for you to refine it further if that's necessary, but I think the DPH should have a role in this effort as well. That's where I stand. I'm not conversing, I'm just sharing my frustration of what has happened. And I'm also sharing that I feel walking away from a responsibility at this time for allowing our seniors not to have basic care in some of these facilities is unacceptable to me. Thank you.
Can I respond to that, Senator? Do you mind? Because
sure.
We actually were very involved in the current requirements that are placed on memory care units in all settings that were placed in I think 2007. So we firmly believe that there needs to be some oversight of memory care units, and we were very instrumental in placing the first oversight into the statutes. The Department of Public Health, it's my understanding, they have authority over not only the ALSA, but then the ALSA is required to have oversight of the MRC. So there is state oversight of a licensed assisted living service agency. So it's upsetting to me that a provider said that they were not required to provide that information or were not overseen by the department. So, but I can't speak to it, to the specifics, but all ALSAs are overseen and licensed by the Department of Public Health right now. And and leading age members take very seriously the work that is done, the programming that is done, and the quality of the care that's done in dementia care units, not just in assisted living, but in nursing homes and other settings. And as I said, we were instrumental in putting the statute that's in place now. And we had worked on the public health code before, and we're happy to work on it now. So we're not opposed to this or the concept of high quality dementia care units. And we think that the consumers and the public should feel secure in knowing that there's oversight of these settings. And if there's not, then I think we need to work with the department to make sure that they have the manpower and the ability to be able to oversee them currently under the statutes that we have, as well as anything else we need to put into place. So I am very sorry. I didn't mean to give the impression that we were opposed to oversight of memory care units or to providing quality care in that setting.
And what this bill does is it codifies an expectations so that there's no confusion whatsoever for any place at any point for any patient in our state. That's what this bill would do, is that no out of state or in state from a national group or a countrywide group is going to be able to statement that we are not requiring this. Other states have been very forthcoming and protective of their seniors. And once we codify this, nobody would be able to walk away from our patients and our seniors to be able to say, hey, we're not supposed to, and you're not required to keep track of these aspects. So that's what this bill does.
And I just want people to understand that there is currently licensure of assisted living service agencies. And if anyone ever has an issue or a concern, that they can contact the Department of Public Health, because they do oversee this segment of the continuum. I think that's just an important piece of information that watching this hearing should know. And there should be full disclosure of what programming, philosophies, staffing. In the disclosure form, there should be disclosure of staffing that's currently in place in the memory care unit that's offered at that assisted living setting.
And that's what this bill does. Thank you so much.
And that's the current law also. So I think that, this would strengthen it. If you change your disclosure form, you should redistribute that to the families and to the residents, which makes perfect sense to be able to tell people if you've changed your philosophy, if you've changed your staffing, if you've changed some kind of programming that you're doing. When we put the original statute in, we required education and training on an annual basis of anyone who's working in a dementia care unit in any setting. So we have tried to strengthen this form, and we would like to work with you to make sure that everything is working the way we had hoped it was, and that the consumers are protected.
Thank you so much, Mr. Chair.
Thank you. Mag, perhaps that we can find a path whereby we can agree on some a number of basic common sense things to do now, while we also engage in the thorough, comprehensive review that you recommend. There may be some things that we find we really are in agreement on that we can move forward with in the short term, even as we do the rigorous review that you suggest. So perhaps we can take this offline and see if we can find some common ground in the coming days.
Absolutely. Absolutely. Happy to work with you.
Thank you. See no further questions. Thanks. Have a good evening, Meg. Next
Thank
up
you.
is Jacqueline Wyman, followed by Laura McDonald at Whiting.
Hello, my name is Laura Jean McDonald. I am a patient at Dutcher South Free. I have been here for 5 years. Before then, I was at Whiting Max down the hill.
Why don't you continue, Ms. McDonald, and then we'll let Ms. Wyman go.
Okay, I was at Whiting Max down the hill for 3 years and 3 months. Then I went to Dutcher. I've been here 5 years and 5 months. I am NGRI. My experience here hasn't been okay. I like Dutcher a lot better than Down the Hill, but Down the Hill does have a big courtyard, which we do not have a big courtyard up here. I like the fact that we do.
Is everything okay? It's possible they're frozen. I can't tell. Well, perhaps we can come back to Ms. McDonald in a moment. It does seem there may be some technical difficulties at Whiting currently. So Ms. Wyman, are you ready? We can't hear you. No. Must be the time of the evening when all the glitches come out. Nope.
She's muted now.
If you could unmute, let's give it one last try and then give it a shot. I'm sorry, we still can't hear you. We can only do so much about the technical challenges we have here. Perhaps we can come back to you. Why don't we go on to Dr. Mark Becker?
Good evening, honorable members of the Public Health Committee. Probably I said double check. Can you hear me okay?
We can hear.
Okay, good. Thank you. My name is Dr. Mark Becker, and I am testifying on behalf of Grifols to support modifications for HB 5500 to include language to address plasma collection regulations in the state of Connecticut. Thank you very much for this opportunity to testify. Grifols is a global healthcare company that develops medicines derived from plasma. I serve as the corporate medical director for Biomat USA, which is a Grifols company that operates more than 300 plasma donation centers in the United States, including centers in the states of Massachusetts, Maine, and Rhode Island. We proudly serve approximately 40,000 donors across our network of plasma donor centers each day. These centers are licensed and regulated by FDA, and all aspects of plasma collection are controlled by strict company standard operating procedures. Grifols does not operate any plasma donor centers in Connecticut due to current regulations that require a physician to be present at all times. This requirement is not in alignment with federal regulations, which require a physician to be associated with a plasma donation center and to provide medical oversight, but the physician is not required to be present at all times, as long as a trained physician substitute is on site during the donation process. A physician substitute is an individual, such as a nurse, like a licensed practical nurse or registered nurse, or an individual with emergency medical services background, such as an EMT or paramedic. Requiring a physician to be present at all times is difficult to comply with given the current nationwide shortage of physicians, and we believe it is unnecessary given the safety of the current plasma donation procedure. Grifols believes that HB 5500 provides an opportunity for Connecticut to revise state laws regulating the operations of plasma donor centers in the state to align with federal standards. Plasma donation is a low-risk automated procedure, and most donors do not experience any adverse events. As outlined by Dr. Simon in his earlier testimony, this was validated by an industry-wide study of donor adverse events that included 1.1 million donors who made 12.1 million donations over a 4-month period in 2018. The results showed that the rate of adverse events was 16 per 10,000 donations, or another way of saying that is 0.16% of all donations resulted in an adverse event. These types of events have been safely managed by non-physicians, such as nurses and EMTs in donor centers in other states across the country. We appreciate DPH's statements earlier in the hearing that they do not object to modernizing regulations around plasma collections. However, our concern is that we're hoping for more immediate relief to be able to open and operate donor centers in Connecticut. Based on the conversations with DPH last summer and fall, we were expecting language that would more closely align with federal standards. There is a critical
Dr.
need.
Becker, your time is almost up. If you please summarize. Thank you.
Yes, absolutely. There's a critical need for plasma donations, which has been compounded by the COVID-19 pandemic. I appreciate the committee's consideration of including language to address plasma collection issues in the state of Connecticut, which will allow us to open plasma donor centers and thereby provide state residents an opportunity to help us save lives. I'd be happy to answer any questions. Thank you.
Thank you, Doctor. Yes, Dr. Simon was right. He said you would have the data for us to gain some perspective. And indeed, the percentages of bad outcomes are very low. But could you give us some peace of mind? What were the kind of bad outcomes, even for that small number?
Yeah, thank you for the question. Really, the two most common types of adverse events are adverse events associated with the area in the donor's arm where the needle is placed, and most of those type of incidents were bruises. The other type of incident would be an incident that we would sort of describe as the donor feeling faint or lightheaded, and by far and away, these were, out of all of the events, these were the most common things that would happen.
Well, that's considered bad outcomes. The rest of medicine should do as well. It sounds as if there's plenty of experience that suggests that the risk reward is clearly on the side of the reward. Representative Carpino.
Thank you, Mr. Chairman. Dr. Becker, thank you for your testimony. Could you just, I appreciate you telling us those are the most common situations that occurred. Could you just tell us a bit about anything else that might occurred? I recognize those are the most common, but I'd be interested in learning what the outliers might have been, just so that we can understand the full potential.
Yeah, sure, absolutely. Well, the outliers would be falling into a category that we would sort of describe as an allergic type of an event. So of course, we ask donors about any allergies that they have. And most often when we prepare the donor for the plasmapheresis process, we use a product that has iodine in it to sterilize the skin where the needle will be placed in the arm. And so sometimes people could have an allergic type of reaction, mostly localized to that area. There's also a component to the plasmapheresis process in which we use something called sodium citrate. And sometimes people can experience a reaction to the sodium citrate that might be sort of described as tingling in the fingertips or tingling in the lips. So these are two other types of adverse events that we can see that don't happen very frequently, but certainly can happen.
Thank you. And I do hope that everybody's testimony today helps us be able to accommodate this. I see no reason why Connecticut needs to be an outlier and why we can't figure out a way to solve this problem here in the state. Thank you for your testimony, and thanks for waiting till 9 o'clock to share it with us.
Thank you very much.
Thank you, Representative. Yes, the land of steady habits seems to have steady habits in the wrong places. Senator Anwar.
Thank you so much. Thank you, Dr. Becker, for your testimony. I just wanted to share with you, I'm supportive of this bill. I've had conversations with your and other groups in advance, and we had discussions. I just wanted to have a gentle pushback on the packaging that we are modernizing things. Because what this bill is doing is it's saying that you do not have to have a physician present in the environment when this is happening. That is less oversight. It's not modernization. So nowadays we use the word modernization and we can try to package anything and sell anything. So I just want to caution you, because in future, removing all healthcare personnel could be considered a modernization by that argument. Just a thought. Thank you so much.
Thank you. Duly noted.
Thank you, Senator. Seeing no further questions, Doctor, thanks for joining us this evening, and we appreciate your testimony. Why don't we try Jacqueline Wyman again to see if her technical glitches have been overcome?
I don't know if you can hear me now.
We can hear you now. Congratulations.
Great. Should have gotten my son over here. He knows how to fix everything.
There you go. Our children when we do things.
I'd like to just address Senator Anwar, Representative Steinberg, Representative Pettit, and if I've overlooked anyone, I do apologize, and also members of the Public Health Committee. My name is Jacqueline Wyman, and I am a resident of Brooklyn, Connecticut. I don't know how much I can say, but about my trial, but it finally ended after almost 5 years on Thursday. I found out about this opportunity on Friday and got the information over the weekend. So it's a little choppy, and I'm also recovering from COVID. But you probably heard about my case because my assailant got 90 years committed to whiting. And although I didn't have a lot of time to go over everything, I'm here today to speak on the HB 450, an act concerning Connecticut Valley and Whiting Forensic Hospitals. And specifically, I would like to address the one thing that, again, I didn't have a lot of time to prepare, but the one thing that really frightens me more than anything is these proposals for temporary leaves. Leaves where they are let into the custody of the guardian, a relative, a friend, or even possibly alone. My concern is if a committee is let out on a temporary leave, friends, family, guardian, no one is going to, if this person goes off the rails while they're out, they are not equipped to deal with that kind of problem. That is something a professional has to deal with. In my particular situation, and I'm sure he's not the only one, but my assailant has been known for many, many, many years for being non-compliant on his medication. That is why on June 2nd of 2017, he was my neighbor. He pushed me into my apartment. He raped me repeatedly, and I was afraid for my life because he'd been off his medication. And it's my understanding, even now at Whiting, he's on different medication, but he still hears command voices. And I think it would be a gross oversight to assume he's the only person in there with these issues. So I'm very fearful of him or anyone really getting out. My assailant in particular, because he knows where I live. I know if he gets out, he is going to find me and he's going to kill me. Not exaggerating. I'm not an alarmist in any way, shape, or form, but I know that that's what's going to happen. And I also saw something about unauthorized leave, and I have no clue what that is. What is unauthorized? That means they can just go? Don't they have to get permission from someone? I mean, it just raised a lot more questions for me than answers, really. So I don't know what an unauthorized leave is. And when I was reading the bill, it didn't seem to explain what that was either. But this man is dangerous. And I'm sure there are other men and women in there that are dangerous too and should not be let out, especially they could easily overthrow family members, friends, go off their medication. If they're let out alone, who's supervising them while they're gone? You know, it's very frightening to me because these people some of them can be quite violent. And in my particular case, my assailant, he already said he was going to rape other women, and he just, I know he'll come after me. He's got nothing to lose. I'm glad he got the 90 years.
Ms. Wyman, I'm so sorry to interrupt, but you need to summarize. Thank you.
Sure. Okay. Yeah. So anyway, like I said, my concerns are if they go out on their own, who is supervising them if they go out alone? And again, that if they are let into the custody of a guardian, friend, family, whatnot, if this person goes off the rails, doesn't take their meds, starts acting out, these people are not trained like the professionals there to diffuse that kind of a problem. The other thing that is extremely concerning to me is that the notification I've been listening all day. I've been up here since 11 o'clock, trying to recover from COVID. But I keep hearing things about what if they come to the board, that notification, victims are not being notified. And that to me is absolutely crucial for the safety of the victim and just public safety in general. I mean, when they're out, how do you guarantee that this person is not going to affect public safety? As I said, there's more questions than answers for me in here, but I strongly want to thank you for listening to my story and my concerns. I'd like you to please seriously take these into consideration when you are voting on this bill. You know, these are the bad guys. There are many more people like me, victims of sexual violence, who may not be able to speak up for our rights. So I will do it for them and for my family, because I have 4 children and they can't afford to lose their mother. And I'm sure many other people can relate to that.
Well, thank you for having the courage to share with us your story, which offers an alternative perspective to much of the testimony we've heard. I have to say it's been very sobering to hear what can go wrong. And we are also sorry for what you've gone through and that you continue to be fearful for your life because of this individual. Yeah. I would say that you have remarkable composure for someone who's just concluded this recent chapter with the trial. Right. It's amazing to all of us, but it's really important that you share your story with us. So that
that's why I had a short amount of time. I said, no, I have to do this. I have to speak before you guys, even if I'm a little clunky with it or whatnot. It's just far too important.
Not clunky at all. All I can tell you.
Okay.
You know, even with COVID, you have more excuses than 100 people.
Yeah, I also have double vision from Lyme disease too. So actually, I'm disabled. So that was just another piece to the puzzle too that really made it that much more heinous of a crime.
Well, clearly, we're going to have to be very careful about what restrictions we would even contemplate loosening and providing the oversight. And I'm particularly taken about your point about notification of victims. That sounds like something we need to look at much more seriously.
Please, yes.
We have some questions, comments for you.
Okay.
Summers, followed by Senator Anwar.
Oh, okay.
Yes, good evening. And I wanted to say thank you for coming tonight. Thank you for sharing your story. You are amazing, very brave, and for keeping it all together after everything you've been through. I'm so sorry for all that you have been through. And I want you to know that this committee is very, very thankful for you sharing your story and your perspective, and to also give you peace of mind that it is not the intent in any way of this committee to allow any changes that would effectively allow someone who is unsafe to be released, to be able to know where you live, etc. That is not the intent here in any way, shape, or form. And we understand that there are crimes and individuals who create crimes that should never be allowed to be released. This is a process that we are going through because of sort of systemic issues that have been within this institution for many, many years. And we are looking at possibly, instead of having this PSRB, changing the way in which we treat people that are incarcerated in this facility. And we look at, if ready, depending on their medical stature, what the process is for them to be put through a step-down process, obviously with constraints, with monitoring, etc. We are not throwing, the baby out with the bathwater and saying, okay, that is not the intent here. It is to look at the situations that we have now and to improve upon them. And again, I'm sure you heard we are one of 2 states now that has this system of PSRB. Other states do it differently. So it is important that we evaluate the effectiveness of how other states handle these situations, how Connecticut could possibly move forward because of the past really startling and damaging issues that have occurred at these facilities. And that's what the intent is here. And I thank you for bringing the perspective of someone who's a victim, a recent victim, and has recently been through a trial, etc. And I know how harrowing those are, and how emotionally draining and just unimaginable they are, especially for the victim. So I do highly respect your perspective and you coming here. And I think you bring up some very valid points that need to be reviewed. But I just wanted to make sure that you knew that no one on this committee in leadership is trying to say that we don't want anybody to have oversight, that we want to let everyone out. That is not the intent in any way, shape, or form.
Okay.
And I appreciate you being here. It's very powerful. And I wish you the best going forward.
Thank you very much.
You're welcome.
Thank you, Senator. Senator Anwar.
Thank you so much, Mr. Chair. Ms. Wyman, thank you for your testimony. I think Senator Summers has said everything I wanted to say, much more articulate way than I could have. But your presence is very much needed because amongst the various testimonies that we have heard today, yours tells us that we need a Whiting.
Yes, absolutely.
We need a facility like this. And we, as a state, many a times people say, why do we have these budgets? Why do we have these aspects? The reality is no private organization can ever endure to have a facility like this. It is always the state which requires this. It is unfortunate that there are illnesses that we'll have that are refractory with no hope of a safe management. And we need a facility of this capacity to be able to keep them for a long, long time. There are people who would be in that category where there's no safe recovery plan for them. And there would be many who would be in the middle who would have some opportunity of improvement. In the right settings with the right management, there is hope for some of them to be able to have some role and in less restrictive environment and have a very controlled way of going out of the facility. But that's very well managed by individuals who are trained far more than anybody in the community to be able to make some of those judgment calls. And then that's why you have a super specialized facility for some of the most complex, difficult, and dangerous situations.
Yes.
I'm so sorry about what happened to you and what you experienced. I'm so sorry that you had to endure this. Organization may have prevented this in many ways, but your courage and your willingness to make sure that you come and make sure you protect yourself, your family, but all other people is heroic.
All right, thank you.
Thank you.
Thank you, Senator. Again, thank you for your testimony today. We can't thank you enough. We hope you have not only a good evening, but a good future.
Thank you very much. Thank you for your consideration. I'm sorry, I might jump in for just one quick second about the notification system. Will there be a way to find out when and if that's implemented? Because that's really important.
Well, I think that we would recommend that you follow the progress of this legislation,
okay,
which will make hopefully explicit our intentions.
Mm-hmm.
But as you've also heard from testimony from many today, we are only just embarked on a long road to really do what needs to happen at Whiting.
Right.
And some of these things are not going to happen overnight. It may be a while before some of them become sufficiently resolved for everybody's satisfaction. I see that Representative Pettit has a comment.
Thank you, Mr. Chair. Thank you, Mrs. Wyman. If you had a victim's advocate in the court system, they'd be able to provide you the details, but otherwise, we can have someone from the Office of Victim Advocate get a hold of you and let you know what that protocol is.
Okay, because I'll be honest with you, if he gets out, I'm gonna have to move. He knows where I live, so it's pretty scary. So I definitely want to know.
You should not have to move. We should be able to take care of people who are dangerous to others.
Yes, that's true. Okay.
Thank you again.
All right, well, thank you. Thank you so much.
Next up is Eric Torres, followed by Betsy Jett.
Good evening, Chairman Steinberg, Senator Anwar, Senator Kushner, and distinguished members of the Public Health Committee. My name is Eric Torres, and I'm the Executive Director of Elevate Bridgeport, a nonprofit education and mentoring program in Bridgeport. Our mission is to build lifelong, life-changing relationships with urban youth, equipping them to thrive and contribute to their community. I'm here today to show my support for SB number 447, an act concerning the public health of residents of the state, Section 7, to establish a commission on gun violence intervention. The developed committee and its recommended members under Senate Bill Section 7 will have the necessary expertise at a local level, I believe, to recommend evidence-based strategies to enhance the prevention, intervention, and response to reduce incidents of gun violence and address its effect on the community, and to work with citizens and community partners in developing programs or supporting already in existence evidence-based programs that create meaningful opportunities for positive nonviolent pathways for health and wholeness. Additionally, I believe Bill 477, Section 7 can function as a critical component to ensuring the checks and balances of the implementation of services by programs receiving funding for the prevention and intervention of gun violence. I'm confident that the anticipated Commission on Gun Violence Prevention and Intervention will provide additional oversight and accountability for those organizations receiving funding to reduce community gun violence in the state by requesting data that is consistent with the outcomes outlined in their proposal. Such support through a Commission on Gun Violence can ensure that best practices are made available in some of our most underserved and under-resourced communities to curb gun violence. Lastly, the proposed committee, as outlined in SB number 477, Section 7, in collaboration with community service providers, has the capacity to direct resources to organizations with boots on the ground that understand the communities they already serve with limited resources. As a former Bridgeport Public School educator, lifelong Bridgeport resident, youth advocate, and executive director for Elevate Bridgeport, I understand that the task before the Public Health Committee is vast, but the collaborative efforts outlined in SB number 477 will not only strengthen the state's steadfastness to curtail gun violence, but it will broaden our reach. So that is my testimony. I thank you for allowing me to share this evening.
Thank you, Mr. Torres. That very directed and efficient, and you give us great confidence that an evidence-based approach is going to work for us. I see Senator Moore has her hand raised.
Thank you, Mr. Chair. I want to thank you, Mr. Torres, for submitting testimony, hanging in there with us at this hour to give your testimony. It's really important that people who are on the ground doing the work, such as Elevate Bridgeport, provides information to this committee to understand the need for funding and collaboration and coordination of services. So thank you for the work that you're doing. Thank you. Thank you, Mr. Chair.
Thank you, Senator. Again, thank you again for all the work you do and for hanging with us, as Senator Moore said. Moving along, we will go to Betsy Jett, followed by John Perry at Whiting.
Good evening. My name is Betsy Jett, and I'm providing testimony on HB 5500 on behalf of the New York Blood Center. We're a nonprofit organization that collects and distributes blood to hospitals in Connecticut. In my capacity as Senior Vice President for Quality and Regulatory Affairs, I'm responsible for ensuring the quality and safety of that blood. I'm also responsible for ensuring that our policies protect the safety of blood donors. The New York Blood Center supports Section 1 and 39 of this bill, providing the Department of Public Health with the ability to waive certain regulations. It's critical that the waiver authority includes blood collection facilities and plasmapheresis centers as defined in state regulation. The waiver provides a bridge allowing us to continue to operate effectively until such time as these regulations can be updated to reflect current standards of practices for facilities that collect and process blood, plasma, and cellular therapy products. If it hasn't been made clear yet, in Connecticut regulation, the term plasmapheresis is used to include every procedure that is not a red cell collection. So it includes platelets collected by apheresis and cell therapy products such as stem cells and mononuclear cells intended for transplantation. Since 2011, New York Blood Center has been collecting cell therapy products under our plasmapheresis license in Hartford. These are personalized immunotherapy products collected from clinically stable cancer patients for autologous transplant. We relied on a previously granted waiver to perform these procedures without a physician on site until late 2021, when that waiver was rescinded. During those 10 years, we've had no serious adverse events at Hartford. Now the service is on hold indefinitely, and we ask our Connecticut patients to travel to New York for their procedures. Last year, we also opened a facility in Middleton. While our current license allows us to collect whole blood there, the on-site physician requirement prevents us from collecting life-saving platelets. So all the platelets we provide to Connecticut patients are collected in other states. We urge you to make the waiver provision effective immediately upon passage of this bill to allow us to collect blood, plasma, and cellular therapy products urgently needed by patients in Connecticut. We also urge you to begin work as soon as possible to modernize the regulation of blood and plasma centers. Revisions to account for the significant advances that have taken place since the 1980s will eliminate the need for the waivers that we've been talking about today. We believe that the federal regulations under the Food and Drug Administration are robust and adequate to protect the health and safety of blood donors and transfusion recipients. By adopting those federal standards by reference, Connecticut would ensure the safety of its citizens without the need for duplicative regulations that must be constantly maintained to stay current. Thank you.
Thank you for your testimony. Very consistent with what we've heard from some others today, and really appreciate your testimony. I don't see any questions, perhaps more a reflection of the advanced hour than your testimony itself, and we appreciate it. Have a good evening. I understand that Ms. McDonald at Whiting has restored connection, and that we also have John Perry at Whiting. So whichever wants to go first, McDonald after, then Perry, or Perry then McDonald, whatever you're ready for.
We have Ms. McDonald to finish your testimony. Go ahead, Mark.
Hi, my name again is Laura Jean McDonald. Good evening. How are you?
Great.
Finish up your testimony.
My testimony is the Wayne Forensic Hospital, I think, is a good hospital overall. I've learned a great many things. I've understood why I was arrested, what the charges are, everything. I have a lot of remorse. I am very mad at myself. I understand what I did wrong. I understand how I can make things a lot better for myself. I've grown to like myself, and I've written a lot of poetry. I would like to read a short one if it's okay with you. Is that okay?
Go ahead, quickly.
Okay. Yes? Okay, it says, do not judge me, you don't know me. How can you judge what you cannot see? I am a good person, I have good qualities. I am human. I may not be tall, I am who I am. I may be too loud, this makes me one of the crowd. I have fair skin, and I know where I begin. I love to laugh, I love to sing. I can do most anything. I can dance, I can hop. Things doesn't need to stop. I do not hate, I try to love. I pray for others, get healing from above. Do not judge what you cannot see. I am content with just being me. And that's a poem I wrote in 2010. And I just want to say, I think that everybody should be on the same page in doing what is good for the patients and the hospital. Thank you.
Thank you. Oh, I'm sorry, Representative.
I was just going to hand off to you, Senator Kushner. Thank you for your testimony, and now Senator Kushner is in charge.
Thank you, Representative Steinberg, our chairman. And thank you, Laura, for your testimony here today. We really appreciate it. I don't see any hands at this time. So we will move to the next person on the list. I believe that's John Perry. Is John in the room?
Senator Fisher, he is not, he's indisposed of at the moment. However, we do have Amanda Macy who's ready to go if you would like. If not, we can wait.
Sure, go ahead.
All righty. If Ms. Macy can come in, please. They can see you.
They can see you?
Yeah, they can see you. Hello.
My name is Amanda Macy. I used to work for the Legislative Office Building as a Bills and Documents clerk in the bill room. I'm here under like different circumstances. I was a property manager where I used to live and was kicked out because the neighbors were on drugs and they're senile and old. But I'm here also representing Bill 450. The system, meaning Whiting's Forensics Hospital system, works. It does need a new building, like for arts and crafts training and transitional help. I believe like some places, like there should be secluded areas where you could go listen to music, like a music simulation room, where there's like an iPad on the wall and you can pick your own music. And because music does simulate the soul. And 10 years ago, about 10 to 13 years ago, Whiting Forensics Hospital was supposed to be closed down for mistreating patients. I am one of them. I was here for 60 days, not on medication, and Dr. Landau took me to probate court for medication, and I don't believe I need to be on medication. And he had other patients on October 5th of 2001. His patients came at me and they were on medication that he prescribed to them. And I was a target in the beginning when I first got here, but it all transitioned into good behavior. These patients became friends of mine and stuff like that, and they told me why they were here also. And that's besides the point. But there's also number 3, some rehabilitation therapists disagree about overtime here. It's comp time, just like the state capitol has comp time. I didn't like comp time because, you know, that's taken away from my income. They do not get paid for holidays. and they don't work on holidays, so they don't get paid holiday pay. That's for rehabilitational therapists. And these people work more with you, like with arts and crafts. They like playing cards or dominoes with you and stuff like that. So it keeps your mind going, you know. I feel like there should be more places, not like this, but more places for transitional housing. So you can look for a job or help with life skills outside of here. It shouldn't be secluded. We are not children, we are adults here. I think we should be treated like adults and not patients. We have names and the doctors should go by that, even if they're prescribing medications or not.
Excuse me, Amanda, but your time is almost up. If you please summarize.
Yeah, one more thing. We should have math skills, handling with people's money, like their own money, and storage place, clothing and necessities. Doctors avoid patients' needs here, like they're in a rush to meetings, and that's all I have written down.
Okay, thank you, Amanda. Thank you, Ms. Casey, for sharing your testimony and your comments and specific details on things that you think we need to address. So I really appreciate your testimony tonight. I don't see any hands, as has been said, it's late getting off the evening. So I hope you enjoy the rest of your evening. I appreciate you being here today.
Sure. Thank you.
So, Mr. Perry's ready whenever the committee.
Next on the list, we are going to go to Jordan Fairchild. Excuse me.
Thank you, Senator. Sorry. Thank you, Senator Kushner. And good evening, Senator Anwar, Representative Steinberg, and distinguished members of the Public Health Committee. My name is Jordan Fairchild. I'm the coordinator and community organizer for Keep the Promise Coalition, which is a grassroots group of advocates with lived experience of mental health, addiction, and co-occurring conditions. Thank you for the opportunity to testify. Today, I want to talk about SB 450. We support this bill, which is a step in the right direction to address some of the problems at CVH and Whiting. These institutions were designed at a time when recovery from mental illness wasn't thought to be possible. And it really does show, considering some of the problems that have been occurring in these facilities for years, more than just the ones that have been reported in the news and have really gotten a lot of attention. This is demonstrated by some of the testimony that you've heard today, especially from those individuals who are currently or were formerly committed to CVH or Whiting. These individuals have been very brave to share their stories just about their experience there in general, and I want to commend them for that. As with any illness, the purpose of mental health treatment should be recovery. Hearing about some of these experiences today, which are really just a handful of all of the people who have been affected by this, it's hard for me to believe that CVH and Whiting are conducive to the purpose of recovery. These problems are very much systemic, and they require us to reimagine much of our mental health system. This legislation is a start to that process. Speaking of systemic solutions, we do support the task force's recommendations to abolish the PSRB, and we support the suggestion that others have made to create a working group and include at least 3 equities rather than a task force to look at accomplishing that. But in the meantime, we are glad to see that the bill would add the well-being of the equity to the priorities of the PSRB. I think it was a member of the task force this morning that said that decision-making should also prioritize recovery and take that in as a factor. We also support that recommendation. We also support the recommendation to invest in community services to support patients who are ready to receive that support in a less restrictive environment. This is the goal of recovery. We're also glad to see an oversight board established for Whiting. I'll just close by saying something that you've heard a few times today, which is that this bill is a good start. But that said, we do hope that in the future, some of the task force's other recommendations be acted on and that more can be done to rectify the wrongs and the situation that has occurred at CVH and Whiting. So thank you for the opportunity to testify today. I'm happy to take any questions.
Thank you, Mr. Fairchild. I don't see any hands at this time, but thank you for your testimony here tonight. I was made aware that my connection was choppy, and I hope it's better now. I switched computers. Good. So next up on the list is Ryan Seidel.
Good evening, and thank you, Co-Chairman Steinberg and Anwar and members of the Public Health Committee. I'm Ryan Seidel, Head of Market Expansion and Business Development for BioLife Plasma Services. BioLife is an industry-leading plasma donation network and part of Takeda, one of the world's largest biopharmaceutical companies with approximately 20,000 employees in the US and more than 80 in Connecticut. Thank you for the opportunity to share our support and recommended modifications to Section 1 and 39 of HB 5500. The language provides a pathway for source plasma donation centers to operate in Connecticut for the first time, and will help bring an entirely new sector of the life sciences industry that is expanding in other New England states to Connecticut. And as you've heard today, there's a growing demand of plasma-derived therapies to treat patients with rare, chronic, and complex diseases. And since plasma-derived therapies can only be produced using plasma from healthy individuals, source plasma donation centers are crucial to the manufacture of such life-saving and life-sustaining medicines. The safety and well-being of donors and patients is of utmost importance, and Takeda is committed to delivering the safest donation process from start to finish. The federal laws and regulations are the comprehensive standard for safety, quality, and operations, and will allow donation centers to operate according to safe, uniform, and well-established standards. Takeda operates more than 170 plasma donation centers in the US. We recently opened our first New England plasma donation center, and in the coming months, plan to expand further in the region. These legislative changes are necessary to eliminate the barriers to locating source plasma centers in Connecticut, and we're grateful for DPH's willingness to address our concerns, and we respectfully ask the committee act as quickly as possible in order to help industry meet the growing demand for plasma-derived therapies for the patients. We've heard a lot about the impact to patients in Connecticut, but I also wanted to comment there's also an economic benefit with the most up-to-date standards. When a new BioLife center is opened, we deeply commit to the communities that we also will live in and work in. And our state-of-the-art donation centers typically employ 50 to 70 highly trained people per center, many hired from the communities in which we're located. And the opening of just a few centers in the state could represent hundreds of jobs. And these skilled jobs include positions like phlebotomists, operations and quality managers, plasma technicians, medical supervisors, and nurses. The investment that BioLife makes is approximately $3 to $6 million in initial construction per location opening. And then we also establish partnerships with local municipal leaders, public officials, and work closely with the local businesses and suppliers to help foster a broader economic impact in that local community. So as a result of our openings, BioLife employees and our donors will infuse many millions of dollars annually into the local area. So thank you for your time and for your support, and I'm happy to answer any questions that you might have.
Thank you, Mr. Seidel. I'm not seeing any hands at this time. You know, as has been said, as it gets later into the evening, we get fewer questions, but we do appreciate your testimony here and what you brought in the way of information for us to consider. So we look forward to hearing from you again. And with that, we will move on to our next person on the speakers list. Thank you, Mr. Seidel. Next up, we have John Harmon.
Thank you. Senator Abrams, Representative Steinberg, Ranking Members Fong, Summers, and Pettit, and distinguished members of the Public Health Committee. My name is John Harmon. I'm from West Hartford and Indivisible, Connecticut, and I'm here to speak for House Bill 5397, the act establishing the Office of Gun Violence Prevention. As I read through the bill to prepare for this, two words stood out for me: data and research, because these are things I care about and were a big part of my career as a professor at CCSU. Data and research are necessary for good policy that produces results. I think there's general agreement that gun violence is something that needs to be reduced. And if we're going to dedicate public money and time, we need to make sure that they'll be spent wisely and effectively. The most expensive and time-consuming part of the research process is gathering and organizing the needed data. The data situation for gun violence is particularly scattered and poor. There are 13 national data systems managed by federal agencies, and even the best of them, the National Violent Death Registry System, gets data from only 16 states. And most large-scale epidemiological studies get information from only 100 emergency departments. Add to that picture that most data are aggregated at the state level, and it's not possible to measure effectiveness at the community level. This is not a problem where the federal government's going to step in anytime soon. And things need to happen at the state level and with your actions. To get around this data problem, researchers have sought other sources. The gun violence database uses sophisticated natural language processing tools on newspaper reports and crowdsourcing to document incidents of violence. It documents 70 incidents in Connecticut since the beginning of this year, right up to a shooting in Torrington 5 days ago. These incidents resulted in 16 deaths and 63 injuries. I got that information from just 10 minutes with the database. This is a rich pile of well-organized data that researchers more creative than I could use to suggest policy and measure its effectiveness. Traditional crime research depends heavily on 911 calls and crime reports, but there is research that shows these significantly underrepresent gun violence. In a study based in Washington, D.C. and Oakland, California, published in 2015, they found that gunfire incidents detected by the ShotSpotter system, which is widely used around the country, resulted in very low levels of 911 calls. They make a case for using this type of surveillance data to measure policy effectiveness. The second study by the same researchers found that juvenile curfews increased gunfire detected by ShotSpotter, while a traditional focus on crime rates and homicides suggested that the curfews were working when they clearly were not. These three studies are the tip of a relatively small iceberg. Establishing an Office of Gun Violence Prevention will allow for more research on how to reduce the rate of community gun violence in Connecticut, and I hope you will report this bill out of committee with a strong positive vote. Thank you, and go Yukon women in the Final Four.
Oh, no, you shouldn't have told me that. I was going to watch it. It's on recording when I got done here.
I was hoping I wasn't coming up during the second overtime.
Oh, no. All right. Well, thank you for your testimony tonight. I do see a hand. Senator Moore.
Thank you. And Bridgeport was lucky enough to host that. So go Bridgeport. Something positive. I love it. So thank you, Professor. I'm taking into consideration, strongly taking your advice regarding the data collection, because I understand that is one of the things that is really missing to know what's really happening here in Connecticut, other than incidental information. And we have the shot fired, the spotter here in Bridgeport. One of the things we don't have is, as we talk about who's being impacted, we really don't have data by race and age to know who's actually not only dying from it, but who is being shot. And that's important also. Just because, you know, there's a bullet fired, it hits someone and they're just as important, like the gentleman who told us had been shot 10 times. That information is important too, as to where is that taking place and how many times being shot, and we don't know. You know, if we get the data on someone dies, but we don't necessarily get the data on how many shots have been fired or where. So thank you for that. And I agree 100% that the data needs to be in the bill. So thank you.
You're welcome.
Thank you, Madam Chair.
Absolutely. Thank you. I don't see any hands at this time. Any other hands? So thank you, Professor Harmon, and we will move to our next speaker. Next up, we have Mary Bernstein.
Good evening, distinguished committee members. Can you all hear me?
Yes, we can. Go ahead.
All right. My name is Mary Bernstein. I'd like to thank you all, first of all, for your stamina. I'm from West Hartford. I'm a board member of Connecticut Against Gun Violence. I'm a professor and I study gun violence prevention efforts. First, I would like to thank Senator Moore for her critical role in establishing the Advisory Council on Gun Violence Intervention and Prevention that was part of SB 1, which was passed last year. Senator Moore's efforts laid the groundwork for an Office of Gun Violence Prevention. So I would like to commend the Senator, Andrew Woods, who chaired the council, CAGV, and all of the community-based organizations that have worked so hard on the Advisory Council and over the years to reduce gun violence in Connecticut. I would like to see Senator Moore's bill, SB 477, move forward, including language that is part of HB 5397. Gun violence should be declared a public health crisis to bring it the attention it needs. The office should be housed where it can have the greatest impact. Community members who are most impacted by gun violence should have an advisory role to ensure accountability. The office does not belong in judiciary, which some people today have suggested. Whether it is in public health or a standalone commission, it needs to have secure funding and must be independent of whatever administration is in office to ensure its continued existence. As a professor, it is critical that our solutions be evidence-based and include a robust data gathering and research capacity to drive evidence-informed grant making. In terms of why we need this bill, I quote from the Kerner Commission report on violence in urban areas published in 1968, which embraced 3 principles. And now I quote, to mount programs on a scale equal to the dimension of the problem, to aim these programs for high impact in the immediate future in order to close the gap between promise and performance, to undertake new initiatives and experiments that can change the system of failure and frustration that now dominates racially oppressed communities that experience high levels of gun violence and weakens our society. These programs neither probe deeper nor demand more than the problems which called them forth. There can be no higher priority for national action and no higher claim on the nation's conscience. End quote. I believe that racial justice cannot be achieved if Black people continue to experience such high rates of gun violence, much higher than that experienced by white people. Connecticut victims of gun violence are disproportionately people of color. Approximately 56% of the state's gun homicide victims are Black. However, only 10% of the state's population is Black. Young Black men in Connecticut are almost 39 times more likely to be murdered by a gun than similarly aged white men. And this does not take into account, as Senator Moore just said, the large number of people who survive their gun injuries, but whose lives are forever plagued by ongoing physical disabilities and mental health trauma. The Kerner Commission was published 54 years ago, and there have been few to no ongoing coordinated efforts to reduce gun violence and improve conditions in impoverished, segregated neighborhoods.
Excuse me, Ms. Bernstein, but your time is almost up. If you please summarize. Thank you.
Yep. When gun violence is part of the daily lives of people in certain communities, we need to ask why we allow that to continue. Mass incarceration will not fix this problem. We need to address the root causes of violence. Thank you.
Thank you, Ms. Bernstein, Professor Bernstein. I don't see any hands at this time. But thank you for your testimony here tonight.
Thanks.
Next, we have on the list, Roy Anastasio.
Hi, can you hear me?
Yes, we can. Go ahead.
Good evening, distinguished members of the Public Health Committee, and thank you for letting me share my thoughts tonight. My name is Roy Anastasio Burke. I'm from New Haven. I'm co-chair of the Do Not Stand Idly By Anti-Gun Violence team, which is also part of Connect, representing more than 30,000 citizens from a wide variety of faith-based organizations in Fairfield and New Haven counties. I testify in favor today of HB 5397 and SB 477, especially the intention to create a state office of gun violence prevention. In spite of our many effective and necessary gun laws, last year, as you've heard many times today and tonight, gun homicides were the highest in 25 years here. Clearly, we have urgent need for a new approach to end the ongoing scourge of gun violence. Rather than a decentralized approach through disparate, small, and underfunded efforts, a well-funded state office of gun violence prevention could coordinate efforts and employ the expertise and resources to intervene in hard-hit communities with targeted, evidence-based programs that work. For too many Connecticut children, especially, gun violence is a constant presence. To offer a personal example, my cousin is a dedicated elementary school teacher for more than 20 years in a Connecticut city. One student, just 12 years old, has already been arrested for armed robbery, his house pummeled with bullets from drive-by shootings, and he is a known gang member whose life has been threatened by another gang. Students are petrified to be anywhere near this boy in school. Can you please send him to another school, they plead? They will shoot him. They will come and shoot us. According to my cousin, the school's hands are tied, other than to remain vigilant. It costs too much to send him to another learning institution, and the school would be responsible. Community-based interventions that target potential perpetrators or likely victims have proven to interrupt the cycle of violence and might have prevented this troubled youth from needing to resort to robbery or gang activity. And I think you've heard a lot of testimony tonight and today on the costs of gun violence in our state. So let me just close by saying successful passage of these two bills will make a statement of our true priorities and finally help create a lasting solution. After all, our children are our future, and they deserve to grow up feeling safe so they can develop into the productive citizens we need. Thank you very much. Appreciate your time.
Thank you, Ms. Anastasia Burke. I don't see any hands at this time. Thank you for your testimony here tonight. We look forward to seeing you and hearing from you in the future.
Thank you all for your work. Appreciate it.
Next up, we have Brooke Shaney. Oh dear, we can't hear you, Brooke.
Wait, now can you hear me?
Yes, we can.
Awesome. So sorry. I have two mute buttons. My bad.
Go ahead.
Thank you. Hello, all. The good news is I'm speaker 123 and we only have 29 or less to go. My name is Brooke Cheney and I'm from Harwington, Connecticut. I'm a firearms instructor, a mom, assistant director of the DC Project, and a victim of violent crime. I'm here today to voice my opinion against Section 7 of Bill 477 and Bill number 5397. I am truly saddened by people's choice to focus only on gun violence versus the violence that occurs long before someone picks up a gun. Guns do nothing. They are pieces of metal. People cause violence. Per my written testimony, 76% of violent crime in Connecticut is without a gun, according to our Uniform Crime Report. Why would we look only at 24% of violent crime? A mother who loses her child to an errant bullet suffers no less than a mother who loses her child from a gang beating. My distress and opposition over this bill is that it doesn't do enough and is too myopic. Throughout the day, people have said this should be a no-brainer. It could be a no-brainer if we took the word gun out of the bill. It could be a no-brainer if you actually included someone like me, a gun owner and educator, in the conversation versus excluding us. If you wanted this bill to go through without any resistance, all you need to do is focus on violence as a whole. The obsession with guns versus violence keeps us away from addressing the root cause of violence. The gun community is the most giving and have some of the biggest hearts you will ever find. We are heavily involved in safety training, veteran suicide prevention programs, and many community-based programs. Imagine what could happen if we were able to work together, two passionate groups working for the same cause, violence prevention. Over the last decade, I have studied what truly helps prevent violence. It is community-based. It's that simple and that complex. As Representative Zupkis mentioned, is there a possibility to simply change the scope of the existing Gun Violence Advisory Board that was created in 2014 versus create a whole new one? Perhaps that money could get to the actual programs that are in need right now. I feel, listening to Senator Moore in her heart today, that she has an amazing handle on what programs are available that are waiting for funding. We have talked about a need for a holistic approach. I support that 100%. That would be including gun owners, not just people who see guns as killing machines. Violence is a problem and needs to be addressed. As long as you focus on the smallest portion, you're going to get the smallest return on your investment. Please consider losing the gun specification in this bill and help people who are at risk of violence now. I thank you for your time.
Thank you. I do see a couple of hands. First, Representative Pettit.
Thank you, Madam Chair. Thank you, Mrs. Cheney. So you would suggest, number one, a title change, but secondly, focus on overall violence. How would you structure that? Would you consider the same sort of task force or working group to look at causes of violence?
So there is tons of data out there already. As people have said, it is disparate and it's all over the place, and it's easy to get lost in the data. As far as violence prevention, I think much of what has been said today is absolutely on point as far as it needs to be community centric, and it needs to have a way to be measured as far as effectiveness. The challenge is figuring out when stuff doesn't happen is a much harder metric for anyone to figure out. So the FBI Gang Violence Task Force, for example, they've come up with a basic outline of how to prevent gang violence, but they constantly talk about how what works in LA is not the same thing that works in Houston or Chicago. And so having a centralized point of contact within Connecticut makes sense for what works in Hartford may not work the same in Bridgeport or New Haven. And so, yes, we absolutely 100% are for preventing violence, but as has been discussed today, it's about looking at the root causes. It's like making sure kids have those after school programs, making sure that someone can go home and has a meal. The community-based thing is the actual full center of violence prevention across all reports that I've ever looked at over the past decade. So I'm for a lot of the things that people are talking about. I'm just tired as a gun owner being vilified because how dare I want to have a firearm? And I just wish that we could look at violence prevention instead of saying that the gun is the cause of the violence, is what it feels like as a gun owner when we come before the committees time and time again.
I appreciate that response, and thank you for sticking with us for 13 plus hours to give your testimony. Thank you, Madam Chair.
Thank you. And I will recognize Senator Moore.
Thank you, Ms. Cheney, for your comments. I agree. You know, I'm not fighting a gun here. I'm fighting the people who, for whatever reason, are using guns to do violence. And I would be willing, and I heard Representative Pettit mention this to you, what is the answer to the violence? If you wanted to do a work group and start addressing that as a bigger issue, because we're all impacted by that in every community that is a problem, the violence, some form. If I believe there was a way to focus on an issue that big, I would tackle it. But for now, I think the issue that I'm really concerned is what I see in the communities in Connecticut that are being hit hard by not legal gun owners, not people who hunt. You know, it just came back to me when someone was talking about their father was a hunter. My father had a hunter and had a pack of dogs, hounds that they kept, and they would go hunting when I was a kid, right? That's not who I'm talking about. I'm talking about these kids are using, instead of, you know, when I was a kid, you got mad with somebody, you put up your dukes, you know, and you fought it out with your fist. Your mom and dad broke it up, or your friends, and you got in trouble. That's not what's happening anymore. I don't know why it's shifted from using your hands and words and why it's turned into guns. But I know that we have to get to the root cause of what's happening. And I believe the data collection is going to be really important. But I also believe we've got to fund these programs that are doing good work. They've been on here all day long talking about the work they're doing. Collectively, they're doing good work. Some of them are underfunded. Some of them just ask for donations all the time where they could be doing a better job. I'm hoping that this commission will look at this more holistic approach all over the state and say what works and what doesn't. Because you're right. When you say what works in Hartford may not work in Bridgeport,
You're right. And what works in New Haven may not work in Waterbury, but we won't know until we have a concentrated effort on trying to address it. And it is my hope that this commission would do that. So I agree with you in many places. And if you want to reach out to me and say, let's do a work group on violence, I would be there for you.
Well, thank you, Senator Moore. It's been wonderful listening to you throughout the day. And, I don't know you, I've never got to meet you yet, but I hope that that's something we can do in the future. And I just have to say, on a personal note, for me, it's like the death toll in 2020 of 157 deaths in Connecticut is a problem, absolutely. But there were 359 who died by suicide. And we're talking about so many things that are happening all at the same time. And it's really amazing how large the problem is, but at the same time, it really does come down to human basic needs. And
I don't know if you know this, but we've worked on suicide, and the Children's Committee has really good bills in the mental health on suicide also. And the number that you mentioned, 150 by gun, that's the number of deaths. That's not the number of people who've been shot.
Right.
That
No,
does a lot of
absolutely.
damage, right? So we want to consider that also.
Right. No, and the 359 were actual suicide deaths. And so for me, I focus on the larger number that we have. Like I said, I'm disappointed in the fact that when people talk about gun violence, it's a small percentage of the actual violence. And for me personally, especially as a gun owner, it's like, I would love to see us focus purely on the larger numbers, the suicide prevention stuff that needs to get done. As we've discussed part of today, the veterans that are dying, 22, nationally, over 130 people are dead today. They have died by suicide. And as much as gun violence is something that is a problem, we have bigger problems. And it's just like, I want to start at the beginning. It's like before they get to picking up a gun. And it's just, I mean, I know we all want to save the world, but eventually we'll figure it out.
For me, it doesn't matter if it's 157 or 350, it's a life, and each life is valuable. And no one knows what that person who died, for whatever reasons, by no fault of their own, they died, and you don't know what contribution they would have made. But also the collateral damage on how that results in trauma in families. I listened to a woman the other day tell me her story about her son was killed 20 some years ago, right? And she still feels the pain of that. That's not something you can put a number on. That's not something you can measure. But I think I bring hope to people when I talk about I'm willing with that, as I am willing to deal with anything that creates harm in our community. So I appreciate you, and I appreciate your comments.
Thank you, Senator Moore. And in my written testimony, one of the things I talk about is in SB 5397, how they talk about the mental health care for victims of gun violence. And one of my objections was the fact, well, what about those of us like me who are victims of sexual violence? Because just like the story you just told me, I was gang raped. And when I was like 13, 14 years old, and just 10 years ago, I was in a diner with my family, and one of the men who had done that to me as a child walked in and looked at me, and he smiled. I had no idea the effect of something that had happened so long ago would leave such a lasting scar. And this is why I wish we could actually expand the scope to take care of as many as possible that are victims of violence, and not just being myopic on gun violence. But I thank you for your time this evening. I'm sorry, we still have 28 more people to go.
It's a big elephant. We're just taking one bite out at a time to get rid of this, okay? We're here, but thank you. Thank you, Madam Chair.
Thank you. And Ms. Shaney, sharing your personal story like you just did is really important for all of us. And I'm sure it was hard for you to say that, but it does bring perspective to the issues that you raise about the depth of violence and how it's impacted people's lives. And I really appreciate you sharing that. I do see that we have another person who wants to ask you a question or make a comment. Representative Claritas Detria.
Thank you, Madam Chair. Thank you, Brooke, for your compelling testimony. I was reading through it, and it's some really it's amazing, amazing things. One of the things you said in your testimony is stop wasting time and money creating new programs and offices when we have existing programs with proven records of success. Do you have any specific programs in mind that you think have been very successful?
I believe that all the community-based programs that are currently out there, as far as I know, are exactly what we need. And like Senator Moore has mentioned throughout the day, I mean, they just need more funding. It's been proven time and time again is community-based, the people who are in the situations that are dealing with the situations who need the help and the support. So I don't know the name of the group, but earlier on this morning when they were talking about the Connecticut hospital group that was working, I think it was Bridgeport and Hartford, and they were working with other community-based groups. It's like something like that already exists. That's absolutely what we should be just funding. It's like, why create something to find out that we need to fund something like that? So,
and I think one of the other things we often do here in Hartford is we need to get rid of the programs that aren't working. Don't fund them anymore. Put the money towards what's working. And if it's not working, get rid of it and figure out what's working. But I also liked your PS at the end of your testimony. As long as we focus on a weapon of choice versus the casualty of violence, we will get nowhere, which I think just sums up everything. And I thank you again for everything. And we'll be listening to you and waiting for you. And we will continue working on this together. And hopefully you'll be part of the solution. Thank you, Brooke. Thank you, Madam Chair.
Thank you very much.
Thank you. And Brooke, I don't see any more hands.
Oh, yeah, apparently.
I couldn't see your hand in the background.
She's
blurry. Representative Zupkus.
Thank you, Madam Chair. It does blend in. That's amazing. Hi, Brooke. Thank you for coming and sharing your story tonight. I agree with you 100%. And, you know, you made me think about this is because I had said earlier, this is really violence, what we're talking about, and gun violence is part of it. But I remember in Hartford, somebody ran over a man and they left him in the middle of the street. Like people didn't even stop and kept walking by. And this had nothing to do with a gun. And there are so many incidents of violence that happens in the cities everywhere, but especially in the cities that don't even have anything to do with guns. And I think as legislators, it's our responsibility to look at all, and now's the opportunity. Let's take it and look at all of that violence and see how we can move forward and get to the root of it and peel back that onion and look at it as a whole versus one specific thing. So thank you for reiterating that and bringing it up.
You're welcome. And I just have to let you all know is, since I shared a horrible story, I grew up as a tree hugger. In that, literally, my family, we'd go out in the woods, hug the tree before we cut it down for firewood for the winter. And we would thank it for the wonderful wood that it was giving to us, that we were knowing that we were cutting a tree down, taking a life of a tree, but we were thankful for that tree for giving us warmth throughout the winter. And from there, it's like the flies in my house get caught and released. Just because I have a gun has nothing to do with violence. It's who I am. I believe all life is precious. It always has been precious. And the more, and someone else had said this, is like the more we focus on life being precious and the value of life, and every life matters, as Senator Moore had just said, it's like every life matters. It doesn't matter what color skin you have. It doesn't matter what neighborhood you are in. Violence is a horrible thing, and all types of violence leave scars, whether you can see them or not. So again, ladies and gentlemen, I thank you for your time and have a lovely rest of your evening.
Thank you, Ms. Cheney. And now I really don't see any other hands unless somebody else has a blurry background and I didn't see it. So I apologize, Representative Zupkus, but I don't see any other hands at this time. So we will move to the next speaker on our list. That is Holly Sullivan.
Hi, good evening. Can you hear me? Very good.
Yes, we can.
Great. Dear Co-Chair Doherty Abrams, Co-Chair Steinberg, Vice Chair Anwar, Vice Chair Kushner, Vice Chair Gilchrist, Ranking Member Huang, Ranking Member Somers, Ranking Member Pettit, and other distinguished members of the Public Health Committee. Thank you all for being here so late in the evening. I appreciate everybody's time. My name is Holly Sullivan, and I am the president of the Connecticut Citizens Defense League. We are a nonpartisan grassroots organization with over 43,000 members devoted to advocating for the rights affirmed by the Constitution of the United States of America, as well as the state of Connecticut. We are dedicated